Good evening, everyone. It gives me immense pleasure and pride to welcome you all to the first day of the Swasthyabodha National Seminar Paper and Poster Presentation 2026. Today marks the beginning of an enriching academic journey where knowledge meets presentation, research meets recognition, and ideas find a national platform. We are truly delighted to witness such enthusiastic participation from presenters across various specialties. On this special occasion, I would like to extend my heartfelt gratitude to our esteemed panel members. Their dedication, commitment, and tireless efforts, working day and night to verify the papers and ensure academic quality, have played a vital role in making this seminar possible. Their sincere involvement and professional evaluation process have strengthened the credibility and success of this program. I would also like to express our sincere thanks to the respected principals and professors from various colleges who stood with us, supported this initiative, and encouraged their students and faculties to participate in this national seminar. Your cooperation and academic spirit have been instrumental in organizing this event successfully. A very warm welcome to all the presenters who are going to share their valuable knowledge and insights today. Your preparation, confidence, and willingness to present on a national platform truly deserve appreciation. This stage belongs to you, and we are eager to learn from your ideas and research. Without taking much of our valuable time, let us now move forward to our first presentation of the day. Thank you all once again for being a part of Swasthyabodha 2026. Let the session begin with enthusiasm and academic excellence. Without much delay, first I would like to invite Dr. Saudi Belram Bhagile for the paper presentation.
Myself, Dr. Swati Bhagile. My topic name is Role of Jalaukavacharana in Puyalas, Acute Cystitis. Anatomy of the lacrimal apparatus comprises structure concerned with the tear formation and the tear transport, lacrimal gland and the accessory lacrimal gland, canaliculus, puncta, common canaliculus, lacrimal sac, nasolacrimal duct, and valve of Hansner. Acute cystitis, Puyalas, an inflammation of infection of the lacrimal sac leading to the painful swelling near the eye. Common causes nasolacrimal duct obstruction, bacterial infection. Symptoms swelling, redness, discharge, and watering. Traditional treatments oral antibiotics, warm compresses, and the surgical, that is a dacryorhizostomia DCR. Traditional treatment antibiotics, oral or topical, often first line of treatment. Surgical treatment, dacryocystorynostomy, DCR, is a permanent solution. Limitation. Surgery is invasive. Blood loss. Many old age patients did not get a fitness for surgery. Recurrences of infection can. What is Jalaukavacharana? Definition. Jalaukavacharana is a procedure where the medicinal leeches are applied to suck impure blood, promoting healing. Historical use. Mentioned in the ancient Ayurvedic texts like Shushu Samhita and the Charak Samhita. Modern revival integrated into some contemporary or complementary therapies. Mechanism of action. Leech saliva contains hirudi, which is an anticoagulant, reducing clotting. Vasodilation increases local blood flow to the affected area. Reduction of the inflammation helps drain stagnant fluid and relieving pressure. Role in Puyalas, acute cystitis. Recent studies, Dr. Chaudhary in 2016 show that leech therapy combined with Ayurvedic medicine reduce symptoms. Dr. Borje in 2017, pediatric case with leech therapy plus antibiotic resolved the infection faster. In Singh and Rajoria in 2019, explained biological mechanisms suggesting leech therapy support healing by the balancing blood flow. Case study example 1 by Dr. R. Chaudhary in 2016 to study the efficacy of Jalaukavacharana and the Shadanga Gugul in Puyalasa with special reference to acute cystitis. which published in the Journal of the Ayurveda and Integrated Medical Sciences. Design clinical treatment of the 16 patients with the Puyalas, that is acute aqueous cystitis, randomized into group receiving group first singly Jalaukavacharana, and then group second Shadanga Gukul, and group third a combine of both. Finding combination therapy showed the statistically significant reduction in swelling and the symptoms after the 15 days of the treatment. Case study example 2, Dr. Borje Swapnil and the Shelotwar Priyanka in 2017 study on the efficacy of the Jalaukavacharana leech therapy in the Puyalasa with special reference to acute aqueous cystitis, which published in the Journal of Indian System of the Medicine. Conducted on the 16 patients with the aqueous cystitis, compared leech therapy plus the oral antibiotic, that is Cipixin, with special antibiotic alone, found that the Jalaukavacharana combined with the Cipixin provided significantly better relief in the pain, swelling and the redness than antibiotic alone, and helped reduce recurrence of symptoms. Benefits and risk. Benefits: non-invasive approach, improve circulation and the reduce local inflammation. Risk: possibility of infection, allergic reaction to leech saliva, requires skilled practitioners. Patient monitoring, essential for the hygiene, avoiding secondary effects. Future research. Need for the larger randomized control trial on leech therapies efficacy, examine long-term safety and the recurrence rates, potential integration, combining Jalaukavacharana with modern ophthalmic care practices. Conclusion: Jalaukavacharana offers a promising complementary therapy for the Puyalas. Integrative approach combine traditional Ayurvedic wisdom with the modern medical care. Further evidence essential to validate benefits through systematic studies. References: Dr. Chaudhary in 2016, leech therapy for the chronic Puyalas. Dr. Borje in 2017, pediatric Puyalas case study with leech therapy. Dr. Singh and Rajoria in 2019, mechanism of leech therapy in Ayurvedic practice. And Dr. Bina in 2024, review on the Jalaukavacharana and its modern application. Thank you.
Thank you, Dr. Saudi. Thank you for the well-explained presentation. Next, I would like to invite Dr. Sindhu S. Kallapur for the paper presentation. I would like to invite Dr. Sindhu S. Kallapur for the paper presentation.
Hello everyone. Myself Dr. Sindhu S. Kallapur. I'm a PG scholar. I'm studying Shri Yogeshwara Rural Ayurvedic Medical College and Research Center in Chal. Sorry, I am not able to provide PPT and video because I have a kid at home. So you understand. So you please understand me. Mm, so my topic is a comprehensive literary study on the Garbha Varna according to the Ayurvedic concepts. So if you all are familiar with Garbha Varna, we have studied briefly in our UG days. Um, so I am going to tell you about the formation of Varna in the Garbha. Uh, Varna is the most important concepts in Ayurveda. It is said that it is formed in the sixth month of fetal development during pregnancy. It might or might not change after birth until death. It is determined on the basis of dominance of Panchamahabhuta and also influenced by Matruja, Rasaja, Satmaja, Atmaja, Garbharadhikar Bhavas. So it is the little bit introduction about the Varna. Is the form of abstract I have given you. Now, aims and objectives I'm going to tell how it is going to help for us in the upcoming future. Aims and objectives are to understand the factors influencing the formation of Varna in intrauterine life. And second one, to understand the Garbha Varna types mentioned by different acharyas. Third one, to understand the Panchabhautikatva of Garbha Varna types. Next one, material and methods. The source of the data. It is literary and conceptual study, and it has been taken from all Ayurvedic texts, Vedic and non-Vedic literatures. Also, references will be adopted from previous things. So, methods of collection of data is it is collected from Brihatrais, Lagutrais, Vedas, Upanishad, Vedic, pre-Vedic Indian literatures, modern textbooks, and some of the journal articles published on the concept. And I'm going to tell the conceptual review. Okay. So, in Prakasharira, Varna is the important topic. Acharya Charak has explained Varna Utpatti during the 6th month of pregnancy, as I have said before. Also, Shushruta has explained the same in Masanamasi Garbhotpatti. Garbharodhikar Bhavas mainly influence the Varna of fetus, and Acharya Charak has explained the Satmaja, Rasaja, Matruja, Atmaja, Garbharodhikar Bhavas, influencing the Varna of Garbha. And also, Wagbit says that Varna is derived from Satmaja Bhava. And Acharya Shushruta says that Ojas is also responsible for formation of Varna. And the types which are explained by Charak and Sushrut Acharyas, there are 5 types: Gaurava, Krishna, Shyama, Gaurava, Shyama, Krishna, Shyama. Krishna black, Shyama dark, Shyama Avadata, mixture of dark, and Theravadata, Gaurava, white or pale red. Krishna Shyama, bluish black. Gaurava Shyama, bluish white. Teja Mahabhut also contributes to the formation of Garbha Varna. Like with other Mahabhutas, different colors are formed. Gaura, Agni plus Jala plus Akasha. Krishna, Agni plus Prithvi plus Vayu. Prithvi, Agni, according to Shushruta. Okay. Shama, Akash plus Vayu plus Jala plus Prithvi plus Agni. Gaurava Shama, Jala plus Akash plus Agni. Krishna Shama, Prithvi plus Akash plus Agni. Okay. The Charak Vagbhat Sushrut Acharyas also say that Bharajaka Pitta is having the main role in formation of Varna. Okay. The dosha also imparts the luster to the skin and makes it radiate. The Brajak Pitta by Pasa helps to maintain the Varna. Okay. It is also said that Raktadhatu in its optimum quantity and quality leads to superior complexion. Okay. And in the gestation period, if mother indulges in sweet food such as milk, the Varna of Garbha will be wheatish yellow. If indulges in savory food like sesame, then black color of complexion happen. And if of mixed type of food, then bluish black color forms. Okay. And the Prakriti has also impact on Varna. It is said by Acharya Charak and Vagbha. That is, what is the Prakriti? Then the lusterless dry skin. Pittaja Prakriti, Gaura with freckles and black balls. Kaphaja Prakriti, fair complexion with luster, etc. Like example, a lotus or gold Varna. And it is also said that Garbhidi Manasati will influence the Sattva, Rajas, Tamas, and they further influence the Panchabhutikatva, which decides Varna. Okay. And the color of the fetus has an impact on the color of fetus when color of Shukra is Shukla like Dhritamanda. Fetus will have Gaura Varna. If Taila Varna, then we'll have Krishna Varna. If Madhu Varna, then we'll have Shama Varna. And the next topic is Conclusion. So, these are the information I have gathered for you people. Um, so, Varna is an important factor. So, it adds to the aesthetic of a human life. So, whatever we eat, whatever lifestyle, what are the parents' features and the Shukra properties and our Prakriti properties, Mahabhuta property, they all contribute to formation of the Varna in the. And for the references, I have collected from different Samhitas, Charak Samhita, and Sharma Arkadas, B. Charak Samhita, Shushu Samhita, Sharirasthana, and Vagbat Ashtang Hridaya Sutrasthana, Ashtang Sangriya Vagbat Sharirasthana, Ashtang Sangra Pandit Sudashiv Shastri, and etc. Thank you, Nanda.
Thank you, doctor. Thank you for the presentation. Next, I would like to invite Dr. Ankita Ramkrishna Bobade for the paper presentation. I would like to invite Dr. Ankita Ramkrishna Bobade.
So, vitamin D deficiency has emerged as a silent pediatric epidemic, contributing to rickets, impaired growth, recurrent infection, and long-term metabolic disorder. Despite adequate sunlight availability in many regions, including developing countries like India, prevalence remains high due to lifestyle transitions and nutritional gaps. Ayurveda describes comparable pathological entities under Asti Dhatu Kshay, Dhattvagni and Alpa Atap Sevan. However, no standardized Ayurvedic screening tool currently exists to identify at-risk children at an early stage. The present study aims to develop a standardized Ayurvedic vitamin D risk assessment scale, that is SAVDRAS, indicating classical Ayurvedic parameter with contemporary risk indicators. So the aim is to develop and propose a standardized Ayurvedic vitamin D risk assessment scale for early identification of pediatric vitamin D deficiency based on principles of Asti Dhatu Kshay and integrative clinical parameters. So the first objective is to design a multidimensional scoring system for risk stratification into low, moderate, high and severe categories to explore the applicability of SAVDRAS as a community level screening tool in school and pediatric programs. So these are the materials and methods. So the references are taken from various samhitas like Charak Samhita, Sushu Samhita and Ashtang Hridaya. A weighted scoring system was formulated for risk stratification. So here is the conceptual integrative screening tool for children, that is standardized Ayurvedic vitamin D risk assessment scale. So this model can be divided into 5 major domains. So the first domain is Nidan, that is risk exposure domain. Second one is Asti Dhatu Lakshana. Third, Dhattvagni and Rasa indicators. Fourth one is Bala and Vedic Shamatva. And last one is optional biomarker integration. So the domain 1 Nidan, that is risk exposure domain. So this score 2 contains less than 20 minutes sunlight per day, poor dietary intake of milk or ghee, and exclusive breastfeeding without supplementation at the age of more than 6 months. And the indoor lifestyle, that is screening timing more than 3 hours, dark skin plus minimum exposure and obesity each contain score 1. So this domain has total 9 score. Second one is Asti Dhatu Lakshana and symptoms, delayed dentition, delay walking, bone pain, each contains score 2. Then recurrent fractures, bow legs deformity, each having score 3 and dental caries 1. So this domain score is 13. Third one is Dhattvagni and Rasa indicators. So the poor appetite, frequent infections, and growth percentile less than 25th centiles. These features containing 2 scores, while fatigue and excess sweating contain score 1. So this total domain score is 8. Bala and Vedic Shamatva, the parameters like frequent upper respiratory tract infection, more than 6 times infection per year, and developmental delay, each score has 2, while poor stamina contain 1. So this domain score is 5. Last one is optional biomarker integration. Here we have to evaluate serum vitamin D level. So this score is like more than 30 Ng per ml score 1, 20 to 30 Ng per ml score 2, 10 to 20 Ng per ml score 3, and less than 10 Ng per ml, that is serum vitamin D level, so having score 4. So this total domain score is 10. So, here is overall assessment scale, that is standardized Ayurvedic vitamin D risk assessment scale, having domain 5 with score 45. Total score is 45. Now this total score is categorized into 4 risk model. Like those having 10 score, we can consider it as a low risk. The children, those patients containing score 11 to 20, we can categorize into moderate risk. Having a score 20 to 30 is a high risk category, and the score, those patients have score more than 30, we can consider it as a severe risk. Now again, this model can be innovated into a various form like digital tools or mobile based screening apps or school health screening integration or Anganwadi worker training model. So the result is like the Saudra's model provides a multidimensional assessment framework with a cumulative scoring range, categories children into graded risk levels. The scale integrates lifestyle factors such as inadequate sunlight exposure, dietary insufficiency, and indoor behavior with classical symptoms including delayed dentition, bone pain, developmental delay, and agnemandya. Conceptually, higher Saudra's scores correlate with increasing probability of biochemical vitamin D deficiency and clinical manifestations of Asthatukshaya. So the Saudras represent an innovative attempt to operationalize Ayurvedic diagnostic principles into a measurable pediatric screening tool. So it bridges classical Dhatu theory with modern nutritional epidemiology. It facilitating early risk detection before overt biochemical deficiency manifests. If validated, this scale may serve as a cost-effective screening instrument for school health programs and community-based pediatric assessment. So overall, the conclusion is this scale represents an innovative attempt to translate classical Ayurvedic concepts of Asthidhatukshaya, Dhatvagnemandya, and Alpa Atap Sevan into a measurable and clinically applicable pediatric screening tool. By integrating traditional symptomology with modern lifestyle risk factor and optional biochemical parameters, Saudras offers a multidimensional framework for early identification of children at risk of vitamin D deficiency. Ultimately, this scale bridges classical knowledge with contemporary public health needs, contributing towards integrative pediatric care and strengthening preventive strategies against the growing silent epidemic of vitamin D deficiency. So these are the reference taken from various samhitas, and in this advanced modern world, if we work collectively on our traditional system of Ayurveda by exploring conceptual innovations through the Ayurvedic lens itself, we can achieve greater success and relevance by integrating traditional knowledge into contemporary healthcare. Thank you.
Thank you, Dr. Ankita. Thank you for the well explained, wonderful presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Anuja Kurup M for the paper presentation. I would like to invite Dr. Anuja Kurup for the paper presentation.
All. Myself, Dr. Anuja Kurup M, working as Assistant Professor in Bapuji Ayurveda Medical College and Hospital, Shimoga. Today, I would like to present on the topic importance of Nasya in Visha Chikitsa. Coming on to the introduction, Ayurveda dedicated one of its branches as Akata Tantra or Damshra Chikitsa or Visha Gera Vairodhika Prashamana, which is solely dedicated to the concept and treatment of Visha. In Brihatrayis, poisonous substances, their poisonous effects, Vishavega, and their treatment is mentioned in detail. Acharya Charaka has explained Chaturvimshati Upakrama in the management of Visha. Nasya is one of these 24 Upakramas. Acharya Sushruta has also mentioned Nasya in Dashavita Upakrama of Luda Visha. Nasya is one of the Panchakarma which is best for Urdhva Jatrugata Roga. Urdhva Jatru Vikareshu Visheshat Nasya Mishyate. Nasya is the administration of medicines or medicated oils through the nose which destroy the vitiated doshas. As per etymology, Nasa is derived from the word Nastru, which means the only gateway to head. Ayurvedic classics has mentioned Nasa as the gateway to head. Nasa hi shiraso dwaram. A lot of medicaments are advised to be introduced through nose, which can influence the head directly, especially in unconscious conditions as well as in fatal emergency conditions like sannyasa, murcha, sarpadamsha, etc. Coming on to the types of Nasya, Acharya Charaka has mentioned Navana Nasya, Mavapida, Dmapana, Dhuma and Pradimarsha. Then Sushruta has classified Nasya, Pradimarsha, Shiro Virejanam, Avapida and Prathamana. Then Vagbhata have classified Virejana, Brahmana and Shamana Nasya. Then indications of Nasya in Visha. Acharya Charaka has mentioned in the fifth Vishavega, the drug or formulation used is Kakanda Shirisha Patrasvarasa. In eighth Vishavega, Kakantadya Yoga. Then in Sarpa Visha, Shirisha Pushpa can be used for Nasya. In Gera Visha, Amarda Grada can be used for Nasya. Then coming on to Acharya Sushruta, he have mentioned indicated in Nasya Dhuma Visha, Adivisha, Avaja and Madhyandika are the drugs being used. In Stavara Vishavega, 3rd and 7th Vega, Nasya is indicated. 7th Vega of Darvikara, Tikshna Avabeda Nasyam, and also in Mandali Vishavega, 7th Vega. Then 7th Vega of Rajimanda Vishavega. All these are mentioned for Tikshna Avabeda Nasya. Then in Pakshi Visha, Nasyam is indicated with the dosage of 2 Marsha. And in all Vishavegas, Maha Agada can be used for Nasya. Then Acharya Vagbhata has indicated in the 3rd and 7th Vishavegas of Stavara, Vishavega of Stavara Visha. Then all types of Visha, Chandrodaya Agada, can be used as Nasya in all types of Visha. 3rd Vega of Darvikara Sarpadamsham, 6th Vega of Rajimanda Vishavega, that is Tikshna Nasya is being specifically mentioned. Then in case of Luda Visham and Mushika Visha. Coming on to the discussion, Nasya Karma is important in Visha Chikitsa, which eliminate vitiated doshas from the body. Though its administration is from the nose, its sphere of action is whole body. Drugs used for Nasya Karma are either Vishakna or Doshakna according to increased dosha in poisoning. Indications of Nasya is not restricted to Urdhva Jatrugata Vyadhi only. Coming on to the conclusion, Nasya being an important procedure in Visha Chikitsa, has been broadly mentioned in 24 treatment modalities by Acharya Charaka, which is being mentioned in Visha Chikitsa. Nasya is one such treatment method which has been indicated in almost all the different types of poisoning, Stavara, Jangama and Garavisha. Nasya is specially indicated in Shirogada Visha. This shows the importance of Nasya Karma in Visha Chikitsa. Thank you.
Thank you, Dr. Anuja. Thank you for the well explained, wonderful presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I'd like to invite Dr. Prajkta Anil Inamdar for the paper presentation on the topic Vatarakta Chikitsa according to Shatkriyakal. I'd like to invite Dr. Prajkta Anil Inamdar.
Myself, Dr. Prajkta Inamdar, PG student from Sri Satyashree Ayurveda Mahavidyalaya, Nashik. My topic name is Vatarakta Chikitsa according to Shatkriyakal. Introduction. Vatarakta is a Vat-Pradhan disease associated with Raktadushti. It mainly affects the joints and has a chronic and recurrent nature if not treated properly. Shatkriyakal helps in early diagnosis, stage-wise Chikitsa, and prevention of complications. Aim and objective. Aim to study Vatarakta Chikitsa according to Shatkriyakal. Objectives to understand Vatarakta Sampatti, to correlate Shatkriyakal with disease stages, to plan Avastha Chikitsa. Materials and methods. The present study is a conceptual literature review. Classical Ayurvedic texts such as Charak Samhita, Shushu Samhita, Ashtanga, Madhavida were reviewed. Relevant references regarding Nidan, Sampatti, Lakshan, Shatkriyakal, and Chikitsa of Vatarakta were collected. The compiled information was systematically arranged according to the 6 stages of Shatkriyakal. Avastha-wise treatment principles were analyzed and presented. Nidan and Sampatti. The positive factors include Vataprakot and Raktadushtikar Nidan. Due to Vata, the normal movement of water gets leading to Vataprakot. This vitiated Vat and Rakta finally gets neutralized with Sandhi, causing Vatarakta. Role of Kshatriyakar in Vatarakta explains progressive disease development, helps in early intervention, stage specific treatment prevents chronicity, deformity, and reoccurrence. Shatkriyakal. According to Ayurveda, disease progression occurs in 6 stages known as Shatkriyakal. संचय प्रकोप प्रसर स्थान संचय व्यक्ति and Veddavastha. In Sanjana S, there is a mild accumulation of Vat and Vata. Symptoms are very mild, like slight stiffness and heaviness in joints. Treatment includes Nidan Parivarjan, Langhan, deep temperature, fluid, abdominal pressure, Then Pratyavastha. In Pratyavastha, Vat and Pitta become aggravated. Patient experience joint pain, burning sensation, and hands relief. Management includes Mridaslevan, Mridurpuracha, and Indaka, Tikta and Kasharas dominant diet. Then Prasaravastha. During Prasaravastha, vibrating heart spreads throughout the body along with Shweta. Symptoms include migratory joint pain, redness, tingling sensation. Treatment focus on Snehapal, Virachal, and Vartaprasadam drugs. Then Samsasya Avastha. In this stage, Dusha Samurchana occurs at Sandhi. Typical symptoms are severe pain, swelling, redness, and burning sensation. Bhattamakshan, Basti Chikitsa, and Shaman Anshudi are the main line of treatment. Vyakti Avastha. In Vyakti Avastha, once feeling manifested Vatarakta, severe pain, swelling, or pain. Management includes Shodhan according to patient's strength, Vata Agasti, and external therapy. Then Vedavastha. In Vedavastha, the disease becomes chronic and is classified into Uttana and Gambhir Vatarakta. Symptoms include chronic pain, joint deformity, and stiffness. Treatment mainly focus on the science therapy, long-term care, and lifestyle modification. It includes Icterus, predominant diet, and brutal. Reduce alcohol, meat, excess intercourse, sometimes sore foods. Conclusion. Vatarakta is Vat-Pradhan disorder associated with Raktadushti and Margavros. The concept of Shatkriyakal helps in understanding the stage-wise progression of the disease. Early identification of stages allows timely and appropriate intervention. Avasthayik Chikitsa plays a key role in preventing chronicity and complication. Thus, application of Shatkriyakal in clinical practice enhances effective management of Vatarakta. References Charak Samhita, Shushrusahita, Ashtamhridaya, and Madhavamila. Thank you.
Thank you, Dr. Prajkta. Thank you for the well-explained presentation. Next, we go to the another paper presentation. I would like to invite Dr. Divya Shriniwas Pogul for the paper presentation. I would like to invite Dr. Divya Shriniwas Pogul for the paper presentation.
A comparative study of Ayurvedic clinical assessment and conventional parameters in the patients of Vatarakta case series presented Dr. Divya Shriniwas Pogul, PG scholar, PG guide, Dr. Vishwanath Jagtap, Professor of Chikitsa, affiliation to Saptashungi Ayurvedic College and Hospital, Nashik. Hashtag background. Vatarakta is a Vatarakta predominant musculoskeletal disorder described in the Ayurveda, characterized by episodic joint pain, burning sensation, and redness swelling. Conventional diagnostic approaches rely on biochemical and imaging parameters, which may not always correspond with clinical disease activity. Introduction. Vatarakta is well described clinical entity in Ayurveda, attributed to pathological interaction between vitiated vata and rakta, resulting in characteristic joint manifestation. The disease is presented with severe joint pain, burning sensation, redness affecting the smaller joints. The classical Ayurvedic literature emphasizes the role of dietary indirections, lifestyle factors, Rakta Dushti, and in the disease causation. Ayurveda adopts different diagnostic criteria focusing on etiological factors, disease progression, and individual patient's constitution. And in the conventional parameters, the investigations may not always correlate with the symptom severity or disease staging. Despite the extensive classical description, limited studies have attempted to compare the Ayurvedic diagnostic assessment with the conventional parameters. In this case series that was assessed aim to comparatively evaluate the clinical assessment criteria of Ayurveda and conventional biomedical parameters in the patients diagnosed with Vatarakta and to analyze their correlation through a case series approach. Objective: compare Ayurvedic clinical assessment parameters with the conventional diagnostic parameters in the patients of Vatarakta. Materials and methods. Observational case series was conducted on 5 patients diagnosed with Vatarakta based on classical Ayurvedic criteria. Clinical assessment was carried out using Nidan, Lakshana, Upashaya Anupashaya, Samprapti analysis, and Roga Pariksha. And the conventional assessment included serum uric acid levels wherever it is indicated. Study design, observational descriptive case series, study setting, Department of Chikitsa, Sri Shatkriyakal Ayurveda Mahavidyalaya and Hospital. Selection criteria, inclusion criteria, presence of classical clinical features, patients aged between 30 to 65 years, which includes Lakshans of Vatarakta such as joint pain, burning sensation, joint swelling and redness. Exclusion criteria, diagnosed cases of rheumatoid arthritis and or septic arthritis, rheumatic or infective joint disorders, and the chronic kidney disease. Assessment parameters. Ayurvedic clinical assessment are Nidana, that is dietary and lifestyle factors contributing to the Rakta and Vata vitiation. Lakshana includes Shula, Shota, Raga, Daha, Sparsha, Asoshnita. Upashaya Anupashaya, Samprapti Ghatak analysis. Rogi Pariksha using Dashavidha and Ashtavidha Pariksha. Conventional assessment includes serum uric acid levels. Written informed consent was obtained from all participants. Confidentiality of patients' data maintained throughout the study. Total 5 cases are studied. The gender distribution is 3 males and 2 females. First patient is 45-year male patient, which have the MTP joint involvement of Uttan Vatarakta, which showed the serum uric acid level of 8.9. 52-year second patient is 52-year female patient, which involved the PIP joint of Uttan Vatarakta with serum uric acid levels 6.4, that is borderline, and the third patient is 60-year male patient of ankle joint involvement with Gambhir Vatarakta of uric acid level 7.1. Fourth patient is 38-year male patient of MTP joint involvement with Uttan Vatarakta with 5.6 serum uric acid level, that is normal. And for fifth patient is 55-year female patient involved the wrist joint with Gambhir Vatarakta with serum uric acid level 8.2. Then the comparative observation was assessed, in which the disease activity is depicted in 5 by 5 cases with the Ayurvedic clinical assessment and 4 by 5 cases in the conventional parameters. Etiology identification was present in the Ayurvedic assessment and it is not assessed in the conventional parameters. Disease staging is present in the Ayurveda clinical assessment and not staged in the conventional parameters. Individualization is comprehensive in Ayurvedic assessment and limited in the conventional parameters. Results: all patients demonstrated classical Ayurvedic features indicative of Vatarakta involvement. Elevated serum uric acid levels were noted in 3 patients, while 4 patients exhibited normal or borderline values despite the clinical active disease. Ayurvedic clinical assessment consistently identified disease activity across all cases. Hence, the discussion and the conclusion is Ayurvedic clinical assessment offers a comprehensive and sensitive approach for evaluating Vatarakta. Conventional parameters, though useful, may not independently reflect clinical severity. Integrating both systems may enhance the diagnostic interpretation and the individualization patient management.
Thank you, Dr. Divya. Thank you for the wonderful presentation. Next, we go to the another poster presentation. I would like to invite Dr. Pournima Kadam for the poster presentation. I would like to invite Dr. Pournima Kadam for the poster presentation on the topic Ayurveda approach towards cardiovascular diseases.
Good evening, all the panel members. I am Dr. Puurnima Kadam from Shri Saptashringi Ayurved Mahavidyalaya, Nashik. I am a PG student, second year PG student of Chikitsa department. My poster presentation topic is how Ayurvedic approach towards cardiovascular diseases. That how can we compare different types of Hridroga according to modern terminologies. First, Vata Hridroga, like we can see here, we can compare its symptoms to angina pectoris. In Vata Hridroga, lakshanas that are given as amyate, tudyate, niramayate, diryate, spotayate, patyate, all these symptoms can be compared to the symptoms of angina pectoris, like pressing, squeezing, or crushing pain in angina, weakness and fatigue, shortness of breath, pain occurs in upper back or both the arms, necks, etc. Then we have Pitta Hridroga. Its symptoms are compared to myocardial infarction. In Pitta Hridroga, we can see Daha, Josh, Dhummi, Murcha, Swed, Mukha etc. These symptoms are similar to the symptoms of myocardial infarction, somewhat similar to the myocardial infarction, like nausea, indigestion, excessive sweating, difficulty in breathing, pain to the radiating to the left side of the chest, left arm, shoulder, neck, etc. We have Kapha Hridroga. We can compare its symptoms to dyslipidemia or atherosclerosis. In Kapha Hridroga, symptoms are given like Gauravam, Kapha Sanstravan, Aruchi, Stamba, Agnimalda. All these symptoms can be compared to the symptoms of dyslipidemia, etc. Then we have Sannipata Hridroga. It includes all the symptoms mentioned above, that is, all the symptoms that are mentioned in Vata, Pitta, and Kapha Hridroga. Compared to we can compare the symptoms of Sannipata Hridroga to congestive cardiac failure or valve disorders, which include shortness of breath, swollen feet, chest discomfort, heartburn, left shoulder pain, etc. Then we have a we can compare its symptoms to bacterial endocarditis, which includes fever, tiredness, nausea, vomiting, muscle ache, reddish purple green nodules, or with pale center, etc. This is how we can compare, or we can approach towards the cardiovascular diseases according to Ayurveda.
Thank you, Dr. Pournima. Thank you for the poster presentation. Next, we go to the another paper and poster presentation. First, we go to the paper presentation. I'd like to invite Dr. Shweta Bandare for the paper presentation. I would like to invite Dr. Shweta Bandare for the paper presentation.
Hello everyone, myself Dr. Shweta Bandu Pandre. I am PG scholar of Department of Shalyatantra from Dr. Vijay Ayurved Mahavidyalaya, Patur, Akola. Today I am going to present a paper under the guidance of Dr. Gayatri Maule ma'am and Dr. Ganesh Belurkar sir. Topic of my paper presentation is an Ayurvedic approach to management of mashak with special reference to mole. Mashak is a term which covers the condition under modern science as moles. The lakshanas of mashak are as a fixed painless black in color elevated structure on skin that can appear all over the body. Moles can be benign or malignant, but most probably of benign type. Mashak are caused by imbalance in doshas, especially Vata dosha. As per modern science, mole, also known as nevus, a common skin growth that appear as a small dark spot. There are three types of moles according to modern science. First, common moles, second, congenital moles, and third, dysplastic moles or nevus. Moles can be affected by factors such as genetics, diet, and lifestyle. Materials and method used for this case are: a 27-year-old female patient came to OPD presenting complaints of multiple moles over body, large mole present over chin, and painless. Mole present over her chin was small in size before 2 months, but it was growing rapidly and was impacting her cosmetic purpose. That's why she came to OPD to excise the mole. She was not having any serious illness and family history was not significant too. General examination was done and she was presenting Vatapradhan Prakriti and Dushya involved in this case as Mansa Rakta and Twacha. Her Agni was Madhyam and she was presenting moles all over her body. Treatment selected for this excision of mole is Agnikarma. Agnikarma is an ancient Ayurvedic therapeutic procedure that uses heat to treat various skin conditions including mashak, moles. Agnikarma stimulates body's natural healing process leading to removal of mashak. Benefits of Agnikarma for mashak are minimally invasive, a relatively simple and quick procedure. Second, effectiveness can lead to significant reduction or removal of mashak. Third, minimal scarring, a minimal scar compared to surgical excision. While Agnikarma is an ancient practice, modern science is exploring similar concepts such as laser therapy, radiofrequency ablation, and electric cauterization for treating skin lesions and moles. This is the picture presentation of patient before Agnikarma and after Agnikarma. You can see a very minimum scar is present over her chin after the excision of mole with Agnikarma. Purvakarma, Atur Parikshan and Sambhara Sangraha. Pradhan Karma, patient was asked to lie down in a supine position. The site of mashak was cleaned with betadine solution and spirit. Avoid excess use of spirit as it can catch fire. Agnikarma Shalaka was selected and heated over gas burner. When Shalaka becomes red hot, introduced to mashak mole. Shalaka kept for few microseconds and then removed. Aloe vera gel applied immediately after the removal of Shalaka to neutralize the temperature. The procedure was repeated a few more times till the whole mashak is removed. Pashchat Karma, dressing is done at the excision of mashak. Mode of action of Agnikarma on mashak takes place in 5 steps. First, thermal injury to the mole or mashak, which leads to coagulation of proteins and cell death in the affected area. Disruption of blood vessels and lymphatic channels. Thermal injury triggers second step, that is inflammatory response, which increases blood flow to the affected site, bringing immune cells and nutrients over there, which stimulates the release of growth factors and cytokinins, promoting healing. Then phagocytosis and debridement takes place. Macrophages are activated to remove the dead cells and debris and to break down the mole's cellular structures. Fourth, collagen synthesis and remodeling. As wound heals, collagen synthesis is stimulated, which leads to formation of new collagen fiber and remodeling of skin's extracellular matrix. And last, mole removal. The combination of thermal injury, inflammatory response, healing process leads to removal of mole and improves the skin texture. Keeping in the view of increasing incidence of mole, this case study was conducted. Agnikarma was given in a single day setting. A commonly observed symptoms were multiple moles over body, painless and impact on cosmetic purpose. The results were assessed on visible features of mashak, that is significantly reduced mashak growth, reduced discoloration over skin and complete excision of mashak. Due to Ushna Guna of Agnikarma, Shita Guna of Vat gets resolved. Due to activated inflammatory response, healing gets faster and leads to growth of healthy cells. Then what we concluded after this case study? In this case, the commonly observed symptoms were multiple moles over body, painless, impacting on cosmetic purpose. Most of the symptoms were due to Vata Prakop and individual's lifestyle. The results were assessed on the basis of symptomatic improvement. Improvement was observed in the most of the symptoms due to effect of local heat. The benefits of Agnikarma treatment were observed that its minimal invasiveness, effectiveness and minimum scar formation. The symptoms of the patient were potentially relieved and cheaper and effective treatment modality was introduced after this case study. Thank you.
Thank you, Dr. Shweta. One more poster presentation is there. Next, we go to the poster presentation. I would like to invite Dr. Shweta for the poster presentation, and I will share the screen now.
Hello everyone, myself Dr. Shweta Bandu Pandre. I am PG Scholar of Department of Shalyatantra at College Dr. V.J.D. Gramin Ayurved Mahavidyalaya Patur Akola. Today I am going to present a poster having topic a role of Viddha-agnikarma in the management of Manyastambha with special reference to cervical spondylosis, a case study. Need for the study. The term Manyastambha originates from the Manya and Stambha, indicating stiffness at the neck region. Its symptoms are parallel to those of cervical spondylosis, which is a chronic degenerative condition of cervical spine that affects the vertebral bodies and intervertebral disc of the neck as well as the contents of the spinal canal. The objective of this study was to observe the effect of Viddha-agnikarma along with the Mahayogaraj Gugul orally in the patients of Manyastambha cervical spondylosis. Materials and method of this study are different Ayurvedic and modern textbooks, journals, research papers, articles are referred to study concept of Manyastambha and its correlation to the cervical spondylosis. Case report. 42-year female patient who is tailor by occupation came to OPD presenting complaints of pain in neck region, pain radiating to right upper limb, tingling and numbness in the right upper limb, neck stiffness and headache. Cervical spine X-ray was done and with the X-ray findings and symptoms presented by the patient, it was diagnosed as the Manyastambha, that is cervical spondylosis. According to Ayurveda, cervical spondylosis resembles Grivastambha or Manyastambha, which is a disorder of Vata dosha described by Acharya Charak in 80 Dnanatmaj Vyadhis of Vata. Vitiated of Vata dosha causes pain and stiffness at Manya region, causes restriction of neck movements. In Ayurveda, general line of management of Urva Jatrugat Rog and Nanatmaj Vyadhi such as Snehan Svedan Nasya along with oral Ayurvedic medicine were adopted for this case. You can see here the cervical spine X-ray of the patient, which is clearly shown spondylolistic changes in the spine. Samprapti ghatak for this patient are dosha vata kaf, dushya mansa rakta meda, asti, agni madhyam prakriti vata kafaj. Viddha-agnikarma, this is the procedure. Bahya Chikitsa. Viddha-agnikarma is a combined therapy of Viddha-karma and Agnikarma. Viddha-karma is a parasurgical procedure which removes the accumulated doshas in the human body via pricking procedure. The Viddha-karma is described under the Ashtavid Shastrakarma in Sushruta Samhita as a Vedan karma. Agnikarma is a parasurgical therapy used in Ayurveda for treating pain localized in skin, muscles, ligaments and joints using heat. Results. After 7 days of treatment, there was significant improvement in the symptoms of cervical spondylosis, that is Manyastambha, like neck pain, headache, pain radiating to right arm, neck stiffness and tingling and numbness over the right arm. The results were assessed on the basis of symptomatic improvement using visual analog scale. By pricking with needle, Vata dosha gets direction to move. That is, Mudha Vata gets its original direction to move in Srutas. Due to this, accumulated Vata gets reduced, which ultimately results into pain relief. Due to local heat given at neck region, spasm of muscle gets relieved and inflammation also gets reduced due to local heat. And Gugul has been indicated in the Vatavadi Chikitsa by Acharya Charkacharya. Keeping in the view the increasing incidence of the cervical spondylosis, this case study was conducted. The Vatahara treatment of Mahayograj Gugul and Viddha-agnikarma was given for 7 days. The results were assessed on the basis of symptomatic improvement using visual analog scale. The commonly observed symptoms were pain in neck, headache, neck stiffness, pain radiating to the right hand, tingling and numbness at the right hand. Pain and stiffness are due to spasm of cervical and suboccipital muscles. Numbness or tingling sensation are due to compression of cervical nerves passing through the affected structures. Gugul has been indicated in the Vatavadi Chikitsa by Acharya Charak. By giving Vatahar treatment orally and locally with the Agnikarma, inflammation is reduced and due to heat, spasm of muscles is relieved. Hence, a combined treatment of Mahayograj Gugul and Viddha-agnikarma shown a significant effect in the management of symptoms of Manyastambha, that is cervical spondylosis. And after this case study, a effective and cheaper treatment modality has been introduced to Ayurveda. Thank you so much.
Thank you, Dr. Shweta. Thank you for the well-explained paper and poster presentation. Next, we go to the another paper and poster presentation. First, I would like to invite for the paper presentation. I would like to invite Dr. Bhagishree Deshale for the paper presentation. I would like to invite Dr. Bhagishree for the paper presentation.
Hello everyone, myself Dr. Bhagyashree Bhaidas Desle, PG third year student from Prasuti Tantra Evam Stri Rog Department from Dr. D.Y. Patil Ayurved Hospital and Research Center Pune. For today's paper presentation, my topic is Ayurvedic perspective and management of Garbhapat in prone women, that is habitual abortion. Introduction to RPL. Definition: habitual abortion is defined as a more than or equal to 3 consecutive miscarriages before 20 to 24 weeks of gestation that affects 1 to 2% of couples worldwide. Nearly 50% of cases remain unexplained despite modern advances, associated with significant physical morbidity and psychological distress. Garbha Samagri are Ritu, Kshetra, Ambu and Bija. Ritu refers to Ritu Kala, the ovulatory phase when the uterus is physiologically ready for conception. Kshetra denotes the Garbhashay and Yoni Marga. A healthy, clear and receptive endometrium is essential for successful implantation. Ambu, nutritive fluids and balance of Jala Mahabhut ensures proper nourishment for the ovum, sperm and the embryo. Bija refers to healthy gametes, Shukra and Artha. Ayurvedic perspective. First one is Nidana. Bija dosh, defects in the gametes caused by aggravated doshas leading to inherent weakness in the zygote. Second one is Kshetra dosh, impairment of Kshetra making it unsuitable for implantation and fetal growth. Third one is Vata Prakopa. Vitiation of Apan Vat creates instability in the uterus, acting as the primary force behind expulsion. Samprapti includes Agnimandya, Dhatukshay, Vata vitation and Garbhapata. Weak digestive fire leads to the formation of arm and poor quality Rasadhatu. Dhatukshay, malnutrition of tissue results in Bijadushti and inadequate fetal nourishment. Vata vitation aggravated upon Vat increases uterine irritability and instability. Garbhapat, the weakened Garbhashay fails to retain the fetus leading expulsion. Modern etiological factors includes genetic, which are chromosomal abnormalities, endocrine, which are luteal phase defect or thyroid dysfunction or PCOS leads to recurrent abortions. Third one is anatomical, which are septate uterus, fibroid, cervical incompetence. Fourth one is immunological, and fifth one is infection like torch complex also leads to the recurrent abortions. Ayurvedic management protocols. First one is Nidan Parivarjan, avoidance of causative factors. Second one is Shodhan, biopurification before conception. And third one is Garbhasthaphan, fetal stabilizing measures. Preconceptional Shodhan. Why Shodhan? To correct dosha dushti and improve the quality of bija and kshetra. Key procedures includes basti, virechan and vaman. Basti best for the vata regulation. Uttar basti is highly effective for uterine pathology. Virechan for pitta disorders and blood purification. Vaman for kapha dominance. Rasayan and Vajikaran is equally important for Garbhasthapan. Enhances Rasadhatu and Shukradhatu. Key herbs are Shatavari, Ashwagandha, Guduchi and Falagrita. Ashoka improves uterine tone and acts as a hemostatic. Lodhra, which acts as an anti-inflammatory and strengthens the endometrium. Yashtrimadhu, which soothes the nutritive and boosts immunity. Falagrita, used orally or per rectum for nutritional support. Pathya, Ahar and Vihar. Pathya includes milk, ghee, rice, sweet fruits like pomegranate, grapes, soups, and lifestyle is also important for the healthy pregnancy, which includes rest, mental peace, gentle yoga, pleasant surroundings. And apatya like spicy, bitter, dry, stale foods should avoid in pregnancy. Lifestyle like excessive coitus, heavy exercise, long travel, stress should avoid in pregnancy. Scientific evidence and validation. Validation of classics. Modern pharmacological studies have validated the actions of traditional Ayurvedic herbs mentioned for RPL like Shatavari, Ashoka, Guduchi, Falagrita. Integrative approach combining progesterone support with Ayurvedic Garbhasthapan therapy has shown improved conception rates and live birth outcomes in clinical studies. Ayurveda provides a holistic framework, purifying the seed, strengthening the soil, and nourishing the roots to ensure the fruitful progeny. Integrating Ayurveda offers hope for women suffering from habitual abortion. References, these are the references. Thank you so much.
Thank you, Dr. Bhagishri. Thank you for the well-explained paper presentation. Thank you so much, Doctor. Next, we go to the poster presentation. Just a second, I will share the screen now.
Hello everyone, myself Dr. Bhagyashri Desle, third year PG student from Prasuti Tantra Evam Stri Rog Department from Dr. D.Y. Patel College of Ayurveda, Pune. For today's poster presentation, my topic is Throtorod in PCOS and Ayurvedic insight. Introduction: PCOS is a complex endocrine disorder affecting reproductive age women, primarily affecting Artavah Srotas. Causes of Strotarod in PCOS, which are dietary causes, lifestyle causes, and mental causes. Dietary causes includes heavy, oily, guru, ahar, etc. Lifestyle causes include sedentary lifestyle, divaswap, lack of exercise, and mental causes includes emotional stress, anxiety, disturbed apanvayu, and vata. The root pathology in PCOS, Meda Dhatu Vriddhi, Ama accumulation, and Kapha aggravation lead to hormonal imbalance, anovulation, follicular arrest, ovarian cyst. Samprapti Ghatak pathological factors are doshas, dushya, strota, agni, and strotorodha. Doshas, which includes kapha, vata, pitta, vitiation. Dushya, which includes rasa, rakta, meda, arta. Strotas, which includes artavaha, medovaha strotas. Agni, which includes mandagni, ama formation. And strotorod, which includes kapha and meda obstruct artavaha strotas. Strotorod lakshans are irregular menstruation, amenorrhea or scanty flow, weight gain, rheumatism, infertility, ovarian cyst in USG. Ayurvedic view of PCOS via Strotorodhan. Kapha meda accumulation in Artavaha Strotas, obstruction in Apanvayu, ovulation fails. Apanvayu's normal function of Artavaha Nirgaman is hindered. Result is formation of multiple cysts, hormonal imbalance, infertility. Chikitsa Siddhanta treatment principle in PCOS is AIMS, which includes remove Strotorod, balance doshas, improve Agni, normalize Artha Pravrutti. Shodhan Chikitsa, which includes Vaman for Kapha, Virechan for Pitta and Meda, Basti for Apanvayu and Vata, especially Tikta Kshira Basti. Rasayan and Garbha Samadhi Dravyas are also important in PCOS, which includes Ashwagandha, Shatavari, Guduchi, Falagrita, Shatapushpa, Churna. Ahar and Vihar is equally important in PCOS and which plays a very important role in PCOS. Light kapha meda pacifying diet is important. Regular exercise and yoga is important. Avoid divaswap excessive stress in PCOS. Discussion. In PCOS, kapha, meda and ama causes stotorod in artavah strotas, leading to anovulation, irregular periods and infertility. Ayurveda manages this through strotorodhan, agni deepan and dosha balancing. Conclusion is treating strotorod is key in PCOS. Ayurvedic management aims to remove these blockages, regulates agni and restore normal artava flow through Shodhan, Shaman, and lifestyle modifications. A holistic approach offers natural management by addressing the root cause. Thank you so much.
Thank you, Dr. Bhagashree. Thank you for the very structured paper and poster presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I'd like to invite Dr. Sanjana S for the paper presentation. I would like to invite Dr. Sanjana S for the paper presentation.
Namaste, very good evening to the respected jury members and the coordinators and my dear fellow presenters. I would like to welcome you all to my case presentation. Title of the case presentation is Kshara Sutra Application in Parisravi Bhagandara Case Presentation. And it is guided by Dr. Vishwanath Sharma, Professor, Department of Shalya Tantra, Sri Kalabhareshwara Ayurveda Medical College Hospital and Research Center, Bangalore. Pradhan Vedana, a 30-year-old male patient came to our Shalyatantra OPD with no comorbidities. Patient complains of pus discharge and itching in the base of the left side of the scrotal region, which was on and off in nature since 1 month. Mild pain and swelling at the base of left side of the scrotal region since 1 month was noted. Vedana Vrittanta, patient was apparently normal 4 years ago. Gradually, he started getting pain and swelling in perianal region. He consulted a folklore practitioner and got operated for the same, details of which is unknown. Got satisfactory results. Past 1 month, he gradually developed a pain near previous surgical scar discomfort increase, along with on and off pus discharge and itching. So pain was throbbing in nature, which increases on sitting and got subsided slightly after pus evacuation. The patient also experienced thick foul-smelling pus discharge, which was soiling his clothes and it was disturbing his daily activity. Hence, patient approached our hospital for further management. So, Vaikika Vrittanta, he was a non-vegetarian and clean meal protein, and there was an irregular food habit, and it was 6 to 8 hours, means 4 to 5 times per day, and 1 time at night. Next, Mala was regular and it was form stools once a day, and there was nothing significant regarding the Vyasana. And then occupation, he was a government employee who was sitting for 6 to 7 hours. So when we did the corrective examinations, first we took the patient in a lithotomy position. So on examination, we found that first is the location, that is the site. So the external opening which we noted at the base of the left side of the scrotal region, and there was only one external opening which was noted, and there was no any spouting granulation, and the discharge was zero urulate discharge from that external opening. So when we did the Pogul's rule application, so that is the external opening which we noted anterior to the anal canal, that is greater than 3 centimeter. So suspicion of internal opening at the posterior midline at 6 o'clock position was suspected. So on palpation, we noted there was a tenderness at the external opening, and then when we did the digital rectal examination, so we noticed that the sphincter tone was normotonic, and the internal opening was relocated at the 2 o'clock position, and then induration was also present at the internal opening, and there was a tenderness at the internal opening. So when we did the transrectal ultrasonography, and same thing was came in the report. So that is external opening noted at the left side of the scrotal base, and the long fistula tract measuring about 10 centimeter is noted arising from the opening at the base of the scrotum, and it is extending posteriorly abutting the perianal membrane, passing through the superficial transverse perineal muscles and anterior part of the levator ani muscle up to the lateral wall of the anal canal. It passes through both the sphincters to communicate with the anal canal at 2 o'clock position, about 1.5 centimeter from the anal orifice. So this was all the impression, that is, and there was no evidence of branching or deep extension of the fistula tract, and there was no collection noted in the perineal region or the rectal fossa. The result is a simple transfiltrate fistula having external opening at the left scrotal base and internal opening at the 2 o'clock position was found. So then we did all the CBC, that is routine examination, and then we took blood urea, serum creatinine, and serological tests, HIV, HbF, CLG, and urine. So all those were found to be normal, and ECG looks normal, chest X-ray also looks normal. So then we went to the Nidana Panchaka, that is Aharaja, Guru Abhishek Ahara, Akala Bhojana, and Viddha-agnikarma was found. And Viharaja Atyasana, so because he was sleeping as a government employee, he was sitting for a long time. And Pura Rupa, that is Shofa and Kandu was, and then Rupa, Pain and Pastistash, Upashaya, Ushna Jala, Abakaha Sweda, and Anupashaya was already in phases on setting for longer duration. So some practice, Nidhana Sevana, Tapapadana, Tirosha, Praputa, attains Atopathy, afflicts the Buddha Pradesh, Vatarakta norms are either vitiated by these doshas, and there will be Buddha Vidvadi, and continued Nidhana Sevana or improper drainage leads to the formation of the tract along with the Puyalas that we consider it as Baliram. So here Vivachedaka Nidhana is Parisavi Bhagundara and transfiltrate fistula. So Chikitsa Sutra. So here we get the reference from the Sushruta Chikitsa Sana, 17th chapter, Shriniwas Shweta, Kusha Dulkala Biruna, Nadi Marma Shritacharya, Charasutrena Tamchilyani, Chaskrena Buddhimad. So the treatment goes like partial fistulotomy followed by the Charasutra application under spinal anesthesia this time. So here we have used the Apamarga Charasutra. So we used to change it for once a week until the complete excision of the tract. Purva-karma. So informed consent was taken from the patient, application was done, and NTO was done from the night 10 p.m. itself, and then injection xylophane test dose was given, injection 30.5 ml IM was given, and prophylactic enema was given, and then some antibiotics were started, that is injection monosip 1 gram IV PT, and then injection metrogyl 100 ml IV, and injection pad 40 mg IV, and injection emicid 4 mg IV, and fluids we took RL, NS, and DNA. Pradhana Karma, that is under aseptic precautions and spinal anesthesia. So we took the patient in a lithotomy position. We have done the part painting and draping. Then we found the external opening just below the left scrotal base. So on rectal examination, internal opening at the 2 o'clock was found. So we introduced the slit procoscope, and internal opening was located in 2 o'clock position. Probing was done from the external opening towards the internal opening. So probe was inserted into the tract and fistulotomy was carried out and followed by Sharasutra acquisition was done. So dressing done, patient withstood the procedure well and patient shifted to post-operative mode and a hemodynamically stable condition. So this is how the probing which we have done. So that is from the left side of the scrotal base till the internal opening, that was in the 2 o'clock position we have taken, and then we have done the partial fistulotomy, and then that is the lay opening the fibrous fistula tract along the course of the rope to the artery. And then step 3, we have done that is partial fistulotomy done up to the level of the sphincters and followed by apomorphic Charasutra application in order to have a good healing process. Asatharma. So we waited the NTO till 8 hours, and then shooting regulation was done for 4 hours, and then DNS, RL, NS were the fluids which we used about 100 ml per hour, and then MSC4 which was given ISOS, and monocephalia and Japan 40. And terminal 1 antium 100 ml and was IVD of it. So this was the observation which was noted. So from the 23rd to 25th of February, we have given all the antibiotics, as well as along with that we have started our Ayurveda treatment, that is Tripala for the first and Anuloma days, where the complaints he complains of the pain at the operated side, and the same thing was continued further, and we have changed the upper work of Shara Sutra on 4th March, and then so the track length was for approximately 4 centimeters, and then when we did again Charasutra change on 11th, track length was 2 centimeters, and then again we have changed it on 18th. So the track length was approximately 2 centimeters, and on the 25th it was 1 centimeter. So then at the end, so we have changed on first, so that is the 0.5 centimeter was noted, and then we could see the complete healing of the fistula tract. So we have taken follow up on first, so where it showed the tract was healed completely with a little start mark. So thank you everyone.
Thank you, Dr. Sanjana, for the insightful presentation. Next, we go to the another paper presentation. I'd like to invite Dr. Rameshwar Fetkar for the paper presentation on the topic, a case report, application of Udumbar Charasutra in Fistula-in-Ano. I would like to invite Dr. Rameshwar Fetkar.
My name is Dr. Ranisha Bhujan Khedkar, third year PG scholar, Shalya Department. I am from Gramin Ayurved Mahavidyalaya, Pata, Akola. My guide and HOD name is Dr. Gayatri Mavalmad, Gramin Ayurved Mahavidyalaya, Pata, Akola. I am presenting case report of application of Udumbar Sharsutra in Fistula-in-Ano. Abstract. Fistula-in-Ano, known as Bhagile Ayurveda, is a painful and often recurrent condition where a small infected tunnel forms between the inside of the anus and the skin around it. It is usually started an anal abscess that doesn't heal completely, leading to repeated discharge, pain, and discomfort. Ayurveda considered Bhagandar one of the 8 major diseases of the difficult to cure. One of the most effective Ayurvedic treatment for this condition is Shastra therapy, a unique procedure that used to medicate thread to treat the fistula naturally and gradually. In this case, we have focused on the Udumbar Shastra, where the thread is coated with herbal extract from the Udumbar tree, that is Ficus racemosa, along with other healing herbs. This medication thread is placed inside the fistula tract, where it gently cut throughout the tissue and remove infection and promote healing at the same time. What makes Sutra therapy stand out is that it does not require major surgery, has a low chance of fistula coming back, that is recurrence, and help preserve the natural function of anal muscle, that is continuous, meaning better chance of full recovery without side effect like incontinence with the support of Ayurvedic medication. Introduction. Sutra therapy is a type of Ayurvedic direct surgical procedure. The great Indian Sannyas Sushruta described in his te- teaching how might be used to treat anorectal illness such as fistula. A fistula is characterized as persistent, gradually tubular tract made of fibrous tissue that has two aperture that allow communication between two distinct epithelium. Fistula-in-Ano gradually developed after an anorectal abscess and cryptoglandular infection. Common symptoms: pain, discharge, itching, and social embarrassment. Bhagandar, according to Shushu, can be divided into 5 subgroups according to following characters. The presence of doshas, the type, shape, shape of external opening, that is Bhagandar Pitika, the tract shape, and discharge character. In contrast, spark categorization list: supralevator fistula, extrasphincteric fistula, transsphincteric fistula, and low intersphincteric fistula. Examination and feeling. The main modalities of diagnosis are local inspection, diagnostic radiological imaging, probing, probe, that is probe, and digital vector examination, that is DI. These days, Fistula-in-Ano is diagnosed using the excellent method, that is TRUS, transrectal ultrasonography. Medical treatment is rarely effective in curing it, and surgical outcome of large anal fistula are well known. Surgery is required to cure low anal kind of fistula, which account for about 50% of cases. The primary side effects of surgery are anal continence, impairment, and recurrence. There are incontinence. Average 50% chances of anal fistula recurrence following surgery, according to report from several global centers. In addition, our great surgeons should state that in case of debilitated, weak female or kind patient, Shar Sutra can be used to heal fistula and with Chedan Karma, fistulatomy, excision of fistula tract. Among these Udumbar Shield is the most noteworthy. The current treatment method, Udumbar Char Sutra, has been proved to be successful because its property drain pus from the fistula, probing healing, and because it acts as an adjuvant therapy by preventing the recurrence of Fistula-in-Ano. Shield possesses a specific karma of Ksharan and Kshanan and is the most important among Kshar and Anusha due to its Chedan, Bhedan, Lekha, Tridoshagna and Visheshaka properties. Hence and objects. Erect, eradicates infection, decrease the infection, eliminate the entire fistula tract, preserve sphincter function that is continuous, minimize the tissue damage and promote the healing, prevent recurrence, minimize post-operative pain and morbidity. Case report. A 21-year-old man who was employed as an associate clerk in a private company and followed the vegetarian diet present to be outpatient department of the OPD Shalyatantra department at Gramin Ayurved Mahavidyalaya Patur in Akola with complaints of pus discharge, itching, pain, anal region since 2 months. Patient had no history of addiction. Upon inspection in the lithotomy position, one external opening was found at 3 o'clock position, approximate 2 to 3 centimeters from the anal verse or incubator junction. Was proceeded with normal peripheral skin per PR finding. The patient stated that 2 months ago he had appeared to be fine. Then he began to have pain in an he had pus, discharge and itching in and before 2 months and he went to outpatient department and was admitted to male surgical unit for additional care. Every routine inquiry carried out the order to make a preoperative assessment. No prior history of medication reaction, diabetes mellitus, hypertension, or TB. The result of blood, urine, and stool laboratory tests confirmed within normal range. The patient has a blood pressure reading 130 by 80. Local examination and excurating first discharge was observed at the 3 o'clock position. Sphincter tonicity was normal on the DRE. Proctoscopy reveals no abnormality in the anal region. The traditional lakshan of Bhagandar Pitika such as Gudumul, Roko, Jwar were observed. Bhagandar mentioned the Char Sutra as described by Sushma. Methodology probing and threading done with shafts under all aseptic precaution under local anesthesia given partly with the ring and institute solution. Probe inserted from the external opening at 3 o'clock comes out anal through anus and Shasutra ligated and probing threading done. Injection TP 0.5 ml give weekly interval were used to replace the Udumbar Shasutra with a new one using the road approach. To calculate the unit cutting time, a week length of the Shasutra was measured and recorded. That is the first image external opening at 2 o'clock or around 3 o'clock position. Then mm, we inserted probe from external opening and find the internal opening. And by using rain roll method, the chart sutra inserted from external opening and remove from internal opening and lighted done. After changing chart sutra, reveal the time chart sutra cut through the wound healed. In third image, result and discussion. Shar Sutra was changed on weekly interval with new Shar Sutra after applying 2% xylocaine jelly by red road technique till complete cut through and healing of the fistula tract. The length of Shar Sutra thread was recorded as process of cutting and healing on every third day of procedure. The wound was healthy and no pus discharge and no oozing present. Hot silk bath with warm water, lukewarm water was advised and dressing wound of betadine solution was daily, along with changing the the seed bath with warm water and dressing with Pranrupak tape were continued. The wound shows sign of good granulation tissue, epithelialization and contraction. The entire fistula tract cutting and healing process took 10 weeks. For the fistula tract example, the unit cutting time was 6 days per centimeter. Char applied to the thread has antibacterial and anti-inflammatory property because char is alkaline, it cauterizes death and make cutting and healing easier. Char Sutra alkaline. pH kept local infection under control, aiding in the healing process. The cutting is said to be caused by local action of cell, Udumbar shield, and the mechanical pressure of tight Sutra knot during the first 1 to 2 days after applying, with the remaining 5 to 6 days being spent kneading. The powdered turmeric, curcuma longa, reduces the activity of caustic and aids in the healing of wound. The use of insona powder promotes the regular bowel movements. In the case of traditional fistula, the risk of recurrent and extreme significant because simple and convenient to use sharp sutra require more time to heal and cut. People with this condition have mental disturbance. The chart sutra should be established medication composition for reducing and the fistula tract healing because hot seat bath and cleaning and smoothing property. Kudumbar and Haridra work together in Shavita, which is supposed to be special wound healing quality. It helps to keep wound clean and encourage wound healing. Conclusion. This case study shows that complete fistulotomy with Sutra application can be treat Bhagandar Fistula-in-Ano and promote the early healing without any anal incontinence complication. Therefore, based on this case report, complete fistulotomy with Sutra application is considered the safest and most effective treatment choice. Since this is a single case study, more cases are need to be drawn up from conclusion. I am taking references from this. You can see this. Thank you.
Thank you, Dr. Rameshwar. Thank you for the paper presentation. Next, we go to the Arshas related paper presentation. I'd like to invite Dr. Manjunath C. Gowda for the paper presentation on the topic paper presentation on Arshas.
Thank you, sir. Am I audible, sir?
Can you hear me?
Yes, sir. Am I audible to you, sir?
Yes, Dr. Audible. Good evening, Doctor.
Good evening, sir. I'll just share my PPT.
Okay, Doctor. And your screen is visible, Doctor. Please start the session.
Yes, sir. So, namaste, respected dignitaries. Thank you for this great opportunity on Swasthyabodha. Myself, Dr. Manjunath C. Gowda, pursuing my second year PG in Department of Shalyatantra at SKMCH and RC. My guide being Dr. Vishwanath Sharma, Professor Department of Shalyatantra, SKMCH and RC. So I have selected the topic ashes. So let us go know what is Arshas. The main definition with reference being Ashtanga Hridaya, Nidhanasthana chapter 7, 1 and 2 shloka. Arivat pranino mamsa kilaka vishesanti yat arshamsi tasmadichante gudam marga nirodataha dosha sattva mamsa medamsi sandusha vividakriti mamsa ankura panado kurvanti arshamsi tan jagugu. So what here Acharya tells is the term Arshas is derived from the he has given a simile such as Ari means enemy, Sranati to trouble. So it troubles just like as an enemy, which is very close. So Arshas, hence Arshas are called so because they trouble a lot in a person repeatedly like a close enemy. So Arshas are described as Mamsa Ankura, so which are fleshy, sprout-like uh, uh, lesions occurring in the Guda Bhaga, that is the rectal part. So these growth mainly obstruct the passage of stools, cause pain, discomfort, and bleeding, and disturb the normal process of defecation. So next we further go with the Nidana and Samprapti, which is the causes and the pathogenesis. Reference being Sushruta Nidanasthana, second chapter, fourth shloka. तत्र नात्मत्वां यथोक्तै प्रकोण विरुद्ध अध्यशन स्त्री प्रसंग उत्कटुकासन पृष्ठयान वेग विदारण आदि विशेषै प्रकुपित दोष एकशो दिशः समस्त शोणित सहित वा यथोक्तं प्रसुत प्रधान धमनी प्रदयोगत्व गुदमागम्य प्रदुष्य गुदवलि मांस प्ररोह अंजनायन्ति विशेषतो मंदाग्ने तत तृणकाष्ठ उपलोष्ट वस्त्रीभिः शोत उदक संस्पर्शनाद्वा कंदाः परिवृद्धि मांसादयन्ति तस् अर्षसत्यं शिक्षते. So here Mandagni, which we have to highlight. So let's see what the meaning goes as. Excessive indulgence in the following etiological factors, which leads to the aggravated of doshas, especially in individuals who lack self-control. So here mind also plays a very important role in causing that relates to gut-brain mechanism and frequently involving in activities that disturb bodily balance, such as consumption of incompatible foods, that is viruddhahara, excessive intake of food, adhyashana, excessive indulgence in sexual activity, atimaituna, sitting on heels, utkatakasana for prolonged period, excessive riding on atiyana, that is excessive riding on animals in the earlier ages of during the period of acharyas, then regular suppression of natural body edges, vega dharana. These are the major causative factors which lead to Arshis. So, just a basic example, what is Viruddhahara? So, we can't tell patients vague in a vague term. So, we can just give an example such as milk plus fish, which is highly Viruddhahara, and milk plus citric acid fruits such as banana with milk, which is the most diet been following in this era with this generation. They use oats with milk and with this pomegranate and all. So, which is highly incompatible, which is Viruddhahara. So that is why more of younger generations are people facing with hemorrhoids. So nidanas of Ashish. So again, just to give a pictorial example, Gurus Nidha Ahara, excessive oily fried food. Atiruksha, when we say people Atiruksha Ahara, we can't tell it in the layman language. So patient need to be told such as biscuits, rusk, which are Gramya Aharas, which are Ati Ushna in nature, and Adyashana that we can tell explained as overeating. Then Viruddha Ahara, which is again incompatible. Ati Vyayama, Chinta and Krodha, as gut brain mechanism also imparts in the formation of Arshas. So I considered stress and anger being the nidanas. Then pathogenesis, how it goes. So all these factors which lead to basic aggravation of Vata Pitta Kapha, or it may be in the dual combination or Tridoshaja, also associated with Rakta. These all together spread through the body and hamper the and movement through the dhamanis, through the blood vessels, and it leads to adogati of the doshas. Then it gets localized in the Buddha Pradesha. So mainly this is mainly all due to the weaker digestive fire, that is Mandagni, and when there is gradual pressure noted at the Gudavaga, it leads to formation of ursus, which is nothing but enlargement of the venous plexus at the Guda region, that is the in rectum region. So that is what ursus is. So now being the surgeon, we need to focus on Gudavalis, the folds of the rectum. So Ayurvedic concept that तत्र स्थूल आंतर प्रतिबद्ध धर्म पंचांगुलम गुदमाहु तस्मिन् वलय स्त्रीस्त्र अध्यमांगुलिंतरः. So Sambhutah Pravahini, there are the floors which has been explaining. Pravahini, Visarjini, Samvarini, Chaturangaletah, Sarvastri Angula Angula Gula Chitrataha, Shankavarta Nibaschapi. So this is the thing which again is an example which given by Acharya. Shankavarta Nibaschapi, Upari Upari Samsitaha, and Gajatalu Nibaschapi Varnata. The color will be of Gajatalu Niba. Some Prakirtataha. Romantebhyo Yavadiyardo Gudoshto Parikirtitaha Pratamatu Gudoshta Angulum Matre. Again, the reference being Shushruta Samhita, Shushruta Nidanasana, second chapter, 5th, 6th, and 7th shloka. So, how can we consider this as Gudavallis? That those are nothing but the rectal folds. When we go for the Ayurvedic description, the length of the Guda being 5.5 angulas and 9.9 centimeter. This is the portion attached to the large intestine. The number of folds, there are, I think, 3 folds inside the Gudavallis. The distance between the folds, each fold is separated 1.5 angulas. That is approximately 2.7 centimeter. The total length of all the 3 folds will sum up to 4.5. That is Pancha Angularda. That is 8.1 centimeter. But the length of the Guda being 5.5. So the position, these folds are located 1 angula, 1.8 centimeter above the anus. So this Pravahini, Visarjini, Samvarani from inside to outside, these are very important where the pile masses errors out, because based on this only the prognosis of the arches has been dealt. So this is a basic description of anatomy of the anal canal. Then further we'll see what. Then Acharya has told about the Shankara Upar Upari. The whorls will be like as of Shanka. That is why I took this image. And Gajatalonipa, the color of the rectal folds will be of the palate of the elephant. The folds resemble the spirals of a conch shell, that is a Shanka. They are arranged one above the other, Upari Upari. Their color is compared to the palate of an elephant. So Gudoshta being the anal lip refers to the lip opening of the anus, the outside fold, located about half angula, that is 0.9 centimeter above the hairline. So these are all anatomical structure. When we perform surgery, these are the most cruciate point which we need to know about what centimeter it occurs and what are the levels of internal pile mass and external pile mass. So that's why I consider this quotation. The first fold being the Pravahini lies 1 angula, 1.8 centimeter above the Gudahoshta. Functional description, Pravahini Valley, innermost, the Abhyantara, first fold from above and downwards, responsible for straining and initiating defecation. This is the major cause. Further leading to constipation, leading again, there will be more strain on the Guda Pradesha, leading to pressure and leading to hemorrhoids. Then Visarjini Valley, middle, Madhyama, located below Pravahini, responsible expelling the feces. Samvarini Valley, outer or Bahya, the lowest fold, responsible contracting and closing the rectal orifice, which is considered which in continence. So this we can consider Samvarini Valley, the outer one, which is the external sphincter muscles, which is voluntary in nature. That's why it is responsible for constricting and closing the rectal orifice post defecation. This is a basic description, the Pravahini, the propulsion of the feces, and the site of internal site, the Pravahini, Visarjini, expulsion of feces, and some which I had described earlier. So when we compare the Ayurvedic concept to the modern concept, definitely there will be valid reason to validate our shlokas as well. So these are the external sphincter muscles where Samvarini valleys are being attached to. Next. Purvarupa, that is the premonitory symptoms. Tesham tu Vavishatam Purvarupani Anyashra Ashraddha Kurchrita Praktir Amlika Paridaha Vishtambaha Pipasa Sakti Sadana Matopaha Karyam Udgara Bahulyam Akshano Shwayatur Antrakujanam Guda Parikartanam Ashanka Panduroga Grahani Podosha Shoshana Panduroga, there will be anemia. Grahani, as the digestive fire has been hampered. Kasa Shwaso Balahan Nidram Astandra Indriya Daurbalyam cha Jateshwantaneva Lakshanani Pravyaktarani Bhavanti. So when we translate it, there will be loss of appetite due to Agni Mandya, difficulty digestion, all starts from the Agni, then sore belchings as there is again the Agni Mandya, burning sensation and long stasis of food as everything is lead to Agni Mandya, where Acharya tells about. Trishna, flatulence, this is more of all GAT tract related symptoms. Emaciation, then let's come to after the Agni is hampered, then obviously food intake will be less. That's why it leads to emaciation, debility of thighs, which means the Sakti Pradesha, more of what do you say? There will the mamsa, the debility of thighs means there will be loss of muscle mass or the muscle mass in the thigh region, swelling around the eyes, weak, which again a Pandu symptom, weakness and loss of strength, giddiness, stupor, excess sleep, weak sense organs, cutting pain in anus. Yeah, this the other next main point is when there is pain, the patient comes to us. So cutting pain in anus or rectum, suspicion of anemia, as there is bleeding, duodenal disorder association, and cough, dyspnea, and overall body weakness. So overall GIT and gut-brain mechanism also is involved, and systemic involvement such as blood will be lost, so anemia. These are the major symptoms which I could highlight. Next, the signs and symptoms of next we'll go for individual ashes and how it looks and how it presents. So tatra marutat parishushka aruna viranaani vishama madhyani kadama pushpa tundikera nadi mukala suchi mukatani cha bhavanti itairupadrata sashulam sahatam upashayata kati prushta pashva made गुद नाभिप्रदेशेषु च अस्य वेदना भवन्ति गुल्म शील प्लीह उदराणि दीस् आर द डिजीजेस व्हिच इज एसोसिएटेड विथ वातज अर्शस् च अस्य तन्निमित्तेनेव भवन्ति कृष्ण द वर्ण ऑफ all the structures such as tvak naka nayana dashana vadana mutra purishascha purusho bhavati, all will be of black in color. So let's see. Dry, rough and hard in consistency, the nature of the pile mass, slightly reddish or mixed in color, irregular in the middle portion, shapes compared to Kadamba Pushpa. So these are the pictures which I tried to collect. Kadamba Pushpa, a bud, Mukala, and needle, Suchi Mukani, and associated symptoms such as passage of hard stools with severe pain, as there is a more involvement of Vata, Rukshatana will be more, and there will be more severe pain associated. And the pain radiates to waist, kati, pashva, waist, back, flanks, penile region, anus, and umbilical region. Hello.
Doctor.
I'm sorry, sir. There was a small technical issue. Then next, these are the pictures which have been taken from our OPD, where I've tried to compare where Acharya has told these are the live pictures. So this is how I feel the bud and the nadi mukula sort of vata sort of symptoms were present in these sort of pile masses with the patients. Then systematic vata features such as dark blackish discoloration of skin, nails, eyes, and teeth, and dark urine and feces, and generalized weakness will be there. Next, when you come to pitta charges, pitta nila, pitta anil, pitta nila grani, tanuni visarpani, pita avabasani, yakrit prakashani, shuka jigva samstanani, yava madhyani jaloka vakra sadrishani, praklinnani cha bhavanti, tairupadrataha, sadaham, sa rudiram mati saryate. There will be associated symptoms. Sir, aham atisari will be more. Jwara daha pipasa murchascha upadrava bhavanti. Pita, there will be yellowish discoloration of the other structures. Pita tvak nakanayana dashana vadana mutra purishascha purusho bhavati. So it will be thin, soft, and spreading masses. Color will be blue at the tip, yellowish like overall, and shape resembles like to the tongue of the parrot, as shown in the images, and yava madhyani, barley grain like bulge in the middle, and mouth of a leech. So the moist with exudation discharge. These are the lakshanas which we can see in the case of pittajarsis, and bowel features such as passage of loose stools. Atisarya will be there. Liquid stool mixed with blood, and more bleeding compared to vataja type. So these are the uh, pictorial live images of the presentation of pitta sort of ashes. There will be associated symptom with fever, burning sensation in body and anal region, and severe thirst, fainting or giddiness, and systemic pitta signs such as yellowish discoloration of skin, nails, eyes, teeth, mouth, urine, and feces. These are the patients were presented with fever. Post fever, after treatment of fever, they had come to an OPD. So I thought of comparing these sort of presentation of ashes to pitta type of ashes. Then Kafajarshis, Shleshmajani, Shwetani, Mahamulani, Stirani, Vritnani, Sniddani, Panduni, Karira, Panasa, bhavanti. Gostanakarani na bidyante na stravanti kandu bahulani. There will be a lot of itching cha bhavanti. Tairupadrutaha Shleshmana Alpanalpam Mamsa Davana. This is the major point. Mamsa Davana Prakasham Matisare. There will be, I'll tell in the further slide. Mamsa Dhavana Prakasham Matisarete. Shofa Shita Jvara Rochaka Vipaka Shiro Gauravani. Cha Asya Tannimittene Bhavanti. Shukla. There will be the color discretion be white. Shukla Tvak Nayana Dashana Vadana Mutra Purishascha Purusho Bhavanti. It will be white in color, deep-rooted and immobile. Round, unctuous and pale. Shape resembles like karira, panasasti, that is jackfruit seed, or ghostana, cow's nipple. Masses do not burst open. They no exudation or discharge from the lesion, but there will be lot of itching present in the cases of kaphaja type of issues. So associated symptoms such as diarrhea with stool mixed with the kapha, feces large in quantity resembling the mutton wash appearance. When we see a post like when we wash a mutton, the water which will be there, that is what in the shloka that mamsa davana atisari. This is the feature. And swelling edema will be there, cold, fever, which is this a systematic illness, loss of taste sensation, poor digestion, that is again overall agni, and heaviness of the head. Systematic features such as whitish discoloration of skin, nails, eyes, teeth, and mouth, and urine and feces may also appear pale or whitish sort of appearance. So these are the pictures which I tried to compare with the Kafaja sort of ashes. This patient in the third image, he had a lot of itching present, and the sister like he had diarrhea associated with a lot of itching. So that is why I thought of comparing this sort of images to the Kafaja type of ashes. Then we move on to Raktaja ashes, the fourth one. Raktajani Negroda प्रहोर विद्रुंब काकणांतिक फलसदृशानि पित्तलक्षणानि च यदा अवगाढ पुरुष प्रपीडितानि भवन्ति तद्यत्यर्थं दुष्टम् अनल्पसृक् सहसा विसृजन्ति तस्य च अति प्रवृत्तो शोणित अतियोगोपद्रवा भवन्ति. So this resembles the sprouts of negroda, banyan, coral or fruits of kakanantika, that is gunja. Shows features similar to Pittaja piles, that is reddish, inflamed, and which are sensitive in nature. Main symptoms, it almost resembles to the Raktaja type. Sudden expulsion of large quantity of vitiated blood along with feces, especially when stools are hard. Profuse bleeding episodes will be there in Raktaja sort of issues. Complications such as excessive blood loss may lead to secondary disorders, complications such as weakness, anemia-like features. That is what they are told in the case of Purva Rupa. There will be anemia and more of blood loss will be there. That is why there is anemia which been told in Raktaja sort of ashes. Next, Sahaja ashes. This is one of the ashes where I had not able to see, but let me try to compare in the further. I'll explain the further side. Sahajani dushta shonita shukra nimittani tesham doshata eva prasadanam kartavya vishesha taschaitani durdarshanani parushani pamsuni darunanyirtmukani tairupadritaha krusha alpabuk sirasanta तगात्रो अल्प प्रजाः क्षीणरेताः श्यामस्वराः क्रोधनो अल्प प्राणिन paramalashcha tata grana shiro akshini. There will be all sort of ENT sort of disorders in the case of Shahaja's type of ashes. Sasravana rogi satata mantra kuja atopa hridayopalepa uparochaka prabhuttabhihi pidiyate. These are congenital in origin due to vitiation of shonita, that is due to ovum of the menstrual blood and the shukra right from the side of conception. These are the type of arches which been occurring. So characters of pile mass will be depicted deep inside and difficult to visualize. Coarse in nature, dark brown in color, bent inwards. It is bent inward, troublesome and very persistent. So general symptoms they eat less due to discomfort, prominent network of veins visible over the body, and less progeny, reduced fertility, decreased semen quantity, feeble, weak voice, and irritable nature, and which get often irritated. So next, weak digest. Let's to summarize: weak digestive fire and poor digestion, poor strength and easy fatigue, laziness and low energy will be in the case of Sahaja ashes. All the symptoms such as of ENT, that such as nose, head, disorders of nose, head, eyes, and ears, flatulence and intestinal gurgling sounds, feeling of coating, heaviness in the cardiac region, and loss of taste. Now let's see the prognosis of Arshis. Sukha Sadhya, which is easily curable, that is recent in origin, single dosha association, involvement, small and superficial pile mass in strong patients are Sukha Sadhya, easily curable. Krishna Sadhya, which are difficult, but it can be curable, which are long-standing, that is chronic in nature, involving two or more two doshas and moderately larger masses. Yapya, manageable but not completely curable, such as again the chronic cases which are recurrent, bleeding, and in case of weak patients. Asadhya is where congenital patients, which I had not seen in my OPD, so I couldn't fetch more images on that. Congenital, that is Sahaja, deep rooted, involving all the three doshas, associated with severe complication and poor strength. Now let's go to the treatment part. Acharya is told in the same context where Aushadha, Kshara, Agni, Shastra. These are the major protocol steps to be followed in cases of Arshis. Aushadha, that is Achirakalaja, Alpadosha, Lakshana, Alpadosha, Alpa Lakshana, Alpa Upadrava. Then we can go for Aushadha such as Gandhakarashana, Trifala Gugulu, and the OPD basis in cases of first degree internal hemorrhoids. Then Kshara, the major golden treatment of us, Kshara being is used in Mrudu, Prasuta, Avagada, Uchrita Arshis, and Agni Karma, that is cautery for the external pine mass, which we use easily, we can cauterize it. Agni Karma, Karkasha, Stira, Prutu, Katina Arshis, we can use Agni Karma, which have been shown in the images. Then Shastra, ultimately Tanu Moolam, Uchritani, Kleda Yuktani, more of Kapha type of can be excised out. So these are the things which I could compare. This is a Kshara Karma which has been done, Agni Karma, Aushadha Karma, then Shastra Karma. Next, proceeding for the patients, all diet it is so Ashes is mainly though it is a surgical case, surgical disorder, it is all based on the Agni. So we have to focus on Apatya and Patya as well. So Ahara being Viruddha Ahara, Vishtambi Ahara, Abhishandi Ahara, Guru Ahara, Anupamamsa, Dushta Odaka, Dosha Prakopanna, Anupad Anupadesho Pashu, Pakshi Mamsa, Matsya, Tilakalli, Dadi, Ruksha Ahara, Karida, Bilvapatra and vihara. These are the ahara. So what we can tell for the patients such as junk food or processed meat, processed foods, those which are ruksha in nature, biscuits, rusk, where they skip meals and they just consume these sort of foods. This can be told to our patients, or these images can be shown such that these things should be avoided for maintaining a proper diet and increasing the agni so that hemorrhoids doesn't occur. Then vihara such as vegadharana, ati stri sanga, utkatukasana, prushtayana, atapasevana, ati jalapana, vamana, pasti. Then Anna Vargas, the main thing which we have to avoid is Goduma, all Ruksha in nature, Goduma, Raktashali, Shashtika Kulata, Priyangu Yusha, Shakavarving, Surana, Nimba, Patola, Punarnava. We can just tell these are the things to be avoided. Then Kshira Vargas, Shrunga, Balamula, Kusumba, Jiraka, Shali, Rasna, Chitraka, Ajakshira, Takra, Falavarga, Amalaki, Kapita, Aharopa, Varga, that is Palandu and Maricha. These we can just say in the layman verse, these are the vegetables or the fruits which should be avoided. Gomamsa, Mushaka Mamsa, Vanamamsa, Vanaramamsa, Ashwamamsa, and Hiranamamsa. These are to be avoided. And Mutravarga, again, Ajamutra, and Kudamutra, and Chataka should be avoided. Then Patya Ahara. What are the good foods like which are wholesome food which can be included? Barley, which are morely rich in fiber. Barley, Yava, wheat, or Shastika Shali, Purana Shali, Rakta Shali. These improve bowel movement and reduce straining. So main there will be no pressure as I told in the pathogenesis case. So since there is no pressure involvement and the Agni is good, easy passage of stools occurs due to this sort of aharas. And Patya vegetables mainly fiber rich diet and which are lagu for Pachana Kriya, which includes bottle gourd, rich gourd, pumpkin, drumstick, spinach, more of fiber-rich content, which helps soften the stool and supports digestion. Then patya fruits such as papaya, pomegranate, banana, figs, soaked black raisins, which are acts as natural laxatives, which are very most beneficial in piles, that is hemorrhoids. Next, Upadravas. The last being the Upadravas. This is the major point as post-surgery complications will definitely arise. So Shantyatva can definitely cause damage to pudendal nerve, Shofa, edema due to inflammation in the anal canal, Daha may be because of post-surgical fissure in ano, and Mada in early post-operative period hypovolemic shock due to reactionary hemorrhage or septic shock in later stages. Murcha, neurogenic shock may be also due to pain. Some patient does not tolerate pain. Some That's why we post on spinal or in local cases. Then atopa post-operative anal stenosis may come with this complaint. Atopa. Atisara, again post-operative anal incontinence. Patient may complain frequent small quantity unformed stools. Pravahini, patient may have to strain for defecation because the main reason we have to focus on anal stenosis, where there, in the case of complete hemorrhoidectomy, there will be more of anal stenosis, stricture of the anal stenosis. So we have to take care of that. Marana, that is rare, but we have to consider reactionary hemorrhage causing hypovolemic shock and which leading to death, and Shastra Karmottara Gudamamsa Sankocha. This is a thing where all the surgeon we have to focus definitely on this. That is anal stenosis. Next, thank you, sir.
Thank you, Dr. Manjunath. Thank you
Thank
for
you.
the well-structured presentation.
Yes, sir.
Next, we go to the another paper presentation. I would like to invite Dr. Jambavati is for the paper presentation on the topic conceptual understanding of Viddha-agnikarma in relation to intestinal obstruction. I would like to invite Dr. Jambavati is for the paper presentation.
Hello, sir. Am I audible?
Yes, Dr. Audible. Good evening, Doctor.
Okay, good evening. I'll share my PPT now.
Okay, Doctor.
Whether is it visible?
Yes, now visible, Doctor.
Okay. Myself, Dr. Jambavati S, Assistant Professor from Department of Shalyatantra, Shri Kalapairaveshwara Swami Ayurvedic Medical College Hospital and Research Center, Bangalore. Today I am here to present on the topic conceptual understanding of Viddha-agnikarma in relation to intestinal obstruction. These are the contents. Acharya Sushruta explained about Udara Roga in Sushruta Nidana 7th chapter and Sushruta Chikitsa 14 chapters. We all know that Udara is one among the Ashtamahagadhas according to Acharya Sushruta because of the severity of the disease. Viddha-agnikarma is the type of Udara Roga which is caused by the vitiation of Tridosha along with the Upalepa of Anna. Signs and symptoms of Viddha-agnikarma are very similar to the condition of intestinal obstruction. An attempt is made in this presentation to understand the concept of Viddha-agnikarma in reference to intestinal obstruction. Udara Nidana. Acharya Sushruta explains three main Nidana for the causation of Udara Roga, that is Durbalagni, Snehadi Mithyacharana and Ahita Ashana. Durbalagni is Mandagni and then Snehadi Mithyacharana is Panchakarma Apachara. If Vamana Virechana and other Panchakarma is not given properly, it may end up in Udara Roga, and Ahita Ashana includes all the type of Apatya Aharas. Udara Samprapti, Koshtat Upasnehat, Annasaro Nisrutya, Drushta Anilo, Vegan Unnanaha Tvachaha Samunnamya Shanaihi, Samantad Vivardamano Jataram Karoti. Meaning being, Nidana causes vitiation of Annarasa, expelled to Koshta by Vayu through the Upasneha. Tvak Samunnata, that is Vardhan of Chatara, causing the Udara Roga. That is, Annarasa is going to cause upasneha, coating in the koshta, causing the udara, that is unnata of the udara. Whenever we are considering specific type of udara, that is Viddha-agnikarma, Acharya explains the signs and symptoms as per the quotation. Yasya antram annair upalepa bala ashmabirva sahitaihi prutagva. That means Anna will get coated in the andhra, that is in the intestine, along with bala, that is hair, ashma, that is stone. It may be individually or all of them together in combination. It is going to cause sanchiyate tatra malaha sadoshaha kramena nadya miva sankarohi. So it is going to cause a coating and then it is going to cause obstruction in the intestine. Nirudyate chasyam gudam purishe niroti kruchradapi cha alpalpam. Because it is causing obstruction in the intestine, there will be difficulty in passing the stools. And then if at all even passing the stool, it will be passed in very small quantity. Hrunnabi madhye parivruddhameti, that is there is a swelling, that is there is an elevation between Hrit and Nabi, that is between the Hrit Pradesha and the Nabi umbilicus. Tacha udaram vitsamagandhikam cha prachardayan. And then patient will have the chardi, that is vomiting. It is vitsamagandhikam. Vitsamagandhikam means the vomitus will resemble the smell of the fecal matter. Baddha-gudi vibhavyaha. That means such type of udara it is called as Baddha-agnikarma. Actually, Acharyas has explained Baddha-Gudodara as well as Parisravi Udara as Asadhya. We find the Chikitsa, that is surgical procedure, explained in Sushruta Chikitsa 14th chapter. Snehana Svedana should be done below the Nabi Pradesha, and then the incision should be taken 4 angula left the Nabi Pradesha. After taking the incision, the antra, that is the intestine, has to be explored. A part of antra, that is 4 angula of antra, should be taken out and explored to check where the obstruction has actually happened. If the part which is taken is not, we are not finding any obstruction, exploration should be continued to take the next 4 angula of antra, and we have to find where the obstruction is exactly caused. After that, we have to remove the shalya. Whatever the shalya is causing obstruction, such as bala, ashma, mala, that has to be removed. After that, suturing should be done, and then intestine is placed back. Madhu and gruta is applied. Both are having good ropana properties, and wound should be sutured. This is the surgical principle that is given by Sushrutacharya. Whenever we are trying to understand the modern concept of intestinal obstruction, the definition goes as pathological interference with the normal progression of intestinal luminal contents distally. Whatever may be the cause, if there is any obstruction to the normal passage of the bowel movement, then it is called as intestinal obstruction. There is another definition, that is bowel obstruction or intestinal obstruction is a partial or complete blockage of a bowel that prevents the contents of the intestine from passing through. So it may be caused by mechanical, or it may be caused by other factors such as paralytic ileus. Whenever we are seeing the clinical features of intestinal obstruction, mainly they are explaining about 4 clinical features, that is pain abdomen, vomiting, constipation, and distension. Then whenever we are looking into the surgical procedure explained according to modern, usually we have to, name of the surgery is called as exploratory laparotomy, that is opening of the abdomen and then exploring. So midline incision is told, that means incision should start from the xiphoid process, then leaving the umbilicus, it should extend up to the pubic bone. Then layer wise we have to cut through, that is skin, subcutaneous fat, and the linea alba. After entering into the peritoneum, slowly we have to start exposing the organs, and then bowel is taken. A part of the bowel is taken, and then it is explored, and again another part of the bowel is taken. That is called as running the bowel. Systematically examine small intestine, ligament of Treats, to the cecum to look for the transition point to see where actually the bowel changes has happened. Then whatever is causing the obstruction, that is if at all a growth is causing obstruction, or any gallstone is causing obstruction, or any hair is causing obstruction, or any adhesions are there, that has to be relieved. If at all mechanical causes like gallstone or hair is causing obstruction, that has to be removed. Then we have to close in layers. First the fascia, then the muscular layer, followed by skin closure. Discussion. Udara Roga is considered among Ashtamahagadas due to the severity in signs and symptoms and difficulty in treating the condition. Whenever we are looking at the lakshanas of Baddha Gudodara, such as Nirudyate Chasya Gude Purisham Niroti Krichradhapi Chalpalpam, that is, they are telling about difficulty to pass stools, or even if passed, it will be passed in very little quantity. Or Pranabhimati Parivriddhameti means there is distension of abdomen between the Hridaya and Nabi. Vitsamaganditakam Prajkta, that is vomitus, which is resembling the fecal matter, are very similar to the clinical features we saw in the intestinal obstruction. They have told symptoms such as constipation, distension of the abdomen, vomiting, all are very similar. Baddha Gudodara is a type of Udara Roga. Though it is said to be asadhya, we find the explanation about the Shastrakarma. What we have to understand is the severity of the condition, as well as severity or the risk involved in performing such type of surgical procedures. Whenever we are cleanly looking into the surgical procedure explained by the Acharya, mainly the surgical procedure involved taking an incision below Nabi, 4 angula of the antra is taken out, it is explored. Whatever the shalya that is causing obstruction, such as bala, ashma, or mala, that has to be removed, and Sivana has to be done. Whenever we are looking at the contemporary surgical procedure, what is explained, that is exploratory laparotomy. Only the incision is slightly varying here. That is, they are telling about the midline incision. And then we have to go on exploring, and we have to remove the obstruction, whatever is causing the and abdomen closure. Only if you consider laparoscopy, it is keyhole surgery. A smaller incision of 5 mm or 10 mm will be done. But the main principles remain the same. Conclusion. Viddha-agnikarma is very similar in clinical features of intestinal obstruction as well as in the principle of surgery. Nidana explained in Sushruta, that is, he has told about Durbalagni, and then he has told about Panchakarma Mithyachara and about Ahita Ashana. So that is the contribution of Ayurveda in treating the conditions of Viddha-agnikarma. So Nidana Parivarjana can be considered as the first line of treatment, which includes correction of Agni following Patya and proper administration of Panchakarma procedures. The principle of surgery explained in Ayurveda and modern surgical procedure of explanatory laparotomy or laparoscopy are both same. That is incision, exploration, identification and removal of the foreign body and closure of the abdomen. So in this line we can understand. I thank Adveshta for giving me opportunity to present in Swasthyabodha. Thank you.
Thank you, Doctor. Thank you for the clear and informative presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. Next, I would like to invite Dr. Neha Praveen Kumar Bhagile for the paper presentation. Dr. Neha, are you there?
I'm here, sir.
Good evening, Doctor.
Am I audible?
Yes, Doctor, audible. Good evening, Doctor.
Yeah, good evening. Okay, I will share my screenshot.
Okay, Doctor. Your screen is visible, Doctor.
Can you see my screen?
Yes, Doctor, visible. Please start the session, Doctor.
Yes, good evening, all presenters and all the hosts. I'm Dr. Neha Bhagile. My topic today is the role of Prajnaprada as a hetu in causing disease. Unfortunately, I'm unable to go to my next slide. Just give me a moment.
Okay, Doctor. Hello, Doctor.
Yes, sir, can you support me that I have submitted all the my presentation format?
And please start the session, Doctor.
Okay. So my today's topic is the role of a Prajnaprad as a hetu in causing diseases. Next slide. So introduction. The definition of a Prajnaprad is the dhruti smruti vibhrashtam karma yat kurute ashubham prajnaparadham tam vidyat sarva dosha prakopanam. So whenever there is a Vishama Vigyan caused to the buddhi, it results in the occurrence of the improper deeds and it is called as a Prajnaprad. Then which deeds are considered as a Prajnaparadha? Then Acharya has given elaborate description about it in the 11th adhyay of a Charak Sutra Sthana, that is the Tisra Shaniya adhyay, and some of the list also given in the Katidha Purushiya adhyaya. So actions like Vegodirana, Vegodharana, Ati Stri Sevan, Ati Sahasa, Ayogya Panchakarma, to not follow Sadrutta, then indulgence in some substances, that was Unmada, then Akale Durdeshe Bhanam, and other acts which include under the Ati Yoga, Yoga, Mithya Yoga of Vani, Manas, and Sharif are known as the Prajnaprada. Next slide, please. Next slide. So to know about the Prajnaprada, we must to know the components of a buddhi. So Acharya has mentioned three components of a buddhi, that is the dhruti and shruti. They have also mentioned functions of these dhi, dhruti, shruti in Katidha Pushya Adhyaya. So about dhi, Acharya say, Visham abhinevesho yo nitya anitya hita hite jnaya sa buddhi vibhavsha samam.
Hello, Dr. Neha, can you hear me? Hello, Dr. Neha, can you hear me?
Yes. Some that was the connection. Can you share screen for me?
Okay, doctor. Now screen is visible. Please continue, doctor.
Yeah. So, if the person has a disturbed or vitiated dhi, he may not be able to differentiate between what is a nitya, what is anitya, and hitarthakari and ahitarthakari things. Then about dhruti, Acharya say, Vishaya pravanam satvam dhruti bhraushat na shakyate niyantum ahitartha dhruti hi niyamatmika. So the main function of dhruti is niyamatmika, means to regulate, to not indulge one's mind, to not allow one's mind to indulge into the ahitarthakari things. And third component of a buddhi is a smruti. So what does Acharya say about smruti? Is tattvajnane smruti yasyam rajo moha vrutatmanam dhrashyate sa smruti bhransha smartavyam hi smrutosthitam. So main function of the smruti is to recall whatever the past experiences he has been through his life. So in the future, he may save himself from again having those bad experiences. So thus the function of a buddhi, as stated by our Acharya, is Nishchayatmika buddhi, that is the one who decides. It is accompanied by the mind in the process of deciding. Then Acharya has considered the Prajnaprada as one of the basic Trivida Hetu of causing of a disease. And nowadays what we see that the Hetu of a Prajnaprad is often overlooked by many Ayurvedic physicians, maybe due to the lack of a time, lack of a skill, and non-compliance of the patient. Next slide. So the main objective of my today's paper presentation is to throw some light on the Prajnaprada and the interrelation of a mana and a buddhi in causing the Prajnaprada. Next slide. So review of the literature. What do we get from the Samhita about the Prajnaprada? First of all, to know the Prajnaprada, one should know what is the normal pathway of a perceiving a knowledge. It has been given in the 8th Adhyay of Charak Samhita, Indriyopakramaniya Adhyay, where Acharya say, Mana Purasarani Indriyani, Arthagrahana Samarthani Bhavanti. That is, when the mind is attached with the Indriyam, then only our Indriya can grasp the objects and the stimulations to our soul. Also, it is described in the Katidha Purushaya Adhyay of Sharir Sthan, where Acharya say, Indriyena Indriyartho hi samanaskena gruhyate kalpyate manasatu urdhva gunato doshato athva jayate vishaye tatra ya buddhi nishchayatmika vyavasyati tatha vaktum kartum va buddhi purvakam. Next slide. That is, when mind conjugates with the respective indriyas to gain the knowledge without the connection with the mind and indriya, are unable to perceive any stimulus. Latter, mind considers it whether it is a heya or upadeya. Means what? Whether this thing can be rejected or accepted. And latter, this produces the Nishchayatmika Buddhi about that Vishaya. Later, the Ahankara, that the ego of a person processes over it, and the person regarding that stimulus takes some step or speaks about that thing. Next slide. But when there is an imbalance of a triguna, that is the sattva, raja, and tamoguna, and when there is a ati yoga, ayoga, or a mithya yoga of any indriya, it vitiates this process of a jnanarjana, and it arises in the vishama vijnana, and that causes prajnaparadha. Then raja and tamoguna have been stated as a dosha, while sattva guna is stated as a guna of the mind. Now, how can we know that some person has a rajoguna increase in it? So, Acharya has stated in the fourth adhyaya of Vimansthana that one have to diagnose the person with the increased rajoguna with the sangha, raja sangena. Then sangha is what is sangha? Sangha means attachment to the worldly things or attachment to some excessive things about it. Then tamoguna. So tamoguna is identified with the moha. Moha, that is ignorance, that one person does not know what to do about certain things. That is known as a moha. And sattva guna is identified as a guna of the mind. So how to know that some person has a sattva guna increase? Sattva guna is identified as a avikara and nirmalta of the mind. Next slide. So modern view, there are certain concepts about Prajnaparadha that have been found in the modern medicine also. One is known as a behavioral disconnect, where there is a misalignment of one's actions with their conscious thoughts and values, and also self-regulation failure. In this case, there is inability to manage some impulses that leads to the instant gratification. And third case is a cognitive dissonance, where mental discomfort results from holding of the two conflicting beliefs and attitudes. During above mentioned conditions also, there is often seen that there is a conflict between prefrontal cortex, which is the seat of the logical thinking, and the limbic system of the brain, which is also known as the primitive brain. Next slide. So, results and discussion. From the above study, we found that the balance of a three dosha, three guna, and samyak yoga of a indriya are necessary for the samyak jnana. Any vitiation with the rajoguna, tamoguna leads to the improper perceiving of the knowledge. Due to rajoguna and tamoguna, the mind, the buddhi arises, also gets the vitiated by the influence of this guna, and it disturbs the functions of a three, dhruti, smruti, and it causes prajnaparadha. The same sequence also follows about the atiyoga, ayoga, and mithya yoga of indriyas that leads to the prajnaparadha. Next slide. Conclusion. So, imbalance of a tridosha, triguna, and atiyoga, ayoga, and mithya yoga of indriya are responsible for the prajnaparadha. It is one of the basic trivid hetu causing diseases. So, if any physician comes to the conclusion that the root cause of a patient's disease is in prajnaparadha, then he should consider Swasthyabodha Chikitsa along with the line of the treatment. Next slide. Thank you.
Thank you, Doctor. Thank you for the valuable, excellent presentation. Thank you so much, Doctor. Next, we go to another paper presentation. I would like to invite Dr. Prahlad R. Solangi for the paper presentation. Dr. Prahlad, are you there?
Yes, sir. I'm
Good
audible,
evening,
sir.
Doctor. Yes, Dr. Audible. Good evening, Doctor.
I will share my screen.
Your screen is visible, Doctor.
Good evening, everyone. My screen is visible, sir?
Yes, Doctor. Your screen is visible, Doctor. Please start the session.
Good evening, everyone. My name is Dr. Prahlad Solanki from Parul Institute of Ayurveda, Gujarat, final year PG scholar. My topic is resolving refractory urticaria, Sit Pitta through therapeutic bloodletting, Sira Vedana. Pitta is a systemic failure of the blood to handle toxin. The Ayurvedic diagnosis is defined as a Rakta Pradosaja Vyadhi, blood-borne disorder, involves the vitiation of Vata and Pitta dosa entering into Rakta Dhatu. The symptoms of napping is Kandu, Daha, Toda, Sotha or Vivada, intense itching, burning sensation, aching pain, and localized swelling and wheals, skin discoloration. While the presenting skin tissue, the pathology is rooted in Rakta blood impurities. The limitation of suppression and the goal of purification. These are standard care is the antihistamines. Our modern treatment is antihistamine. Act as a dam to provide the temporary symptomatic relief. Fails to prevent the recurrence. Does not address to the root cause. For our Ayurvedic approach to Sodhana, the act as a release of valve, eliminates the vitiated Rakta dosha, break the samprapti, and prevent the relapse. In this case study, explore the patient resistant to the conventional summon palliative therapy. The pathology of hyperreactivity. The stage 1 is the trigger, Vata and Pitta vitiation, heat, Guru, Tikshna, spicy food, and stress. The entry into the Rakta Dhatu, blood tissue contamination, and the reaction is Rakta Dushti, and last manifestation is a sudden onset of the rashes and burning sensation and itching sensation. Modern correlators mirror the release of the histamines and the inflammatory mediators responsible for the urticaria reaction. Sira Vedan. The Sira Vedana precision protocol for the biopurification. Definition: a specialized type of Rakshamokshana, blooding used when the vitiated blood is deep seated. Mechanism of action: the removal, the physical removes the impure vitiated blood. The balance Vata and Pitta dosha. Purification improves the circulation of the dermis. Reduction of lower histamine and allergic load. Restoration to promote the formation of fresh and healthy blood. The patient profile: 32-year-old male patient. Symptoms are the patient history: 3 months of recurrent itching, reddish, wheals, and burning. The triggers are exposed to heat and spicy food and cold season. The previously treatment antihistamine and Ayurvedic Samman Ausadi, but patient had temporary relief only. The constitution and cause: the Prakruti Vata and Pitta, Agni Vishamagni, irregular digestive fire, and root cause occurred at night, spicy sour food, and irregular sleep. Clinical findings: raised erythematous rashes, moderate itching, and mild edema. The protocol phase 1 is preparation, Purva-karma. The informed consent, full procedure explained and in consent obtained. The dietary preparation, the patient advised to take light food prior to the procedure. Site preparation, local area, median cubital vein region, cleaned with antiseptic. The positioning, patient seated comfortably with arm extended. Proper preparation minimize the risk and ensure the patient is hemodynamically stable. The phase 2, the procedure, the Viddha-agnikarma, the Viddha-agnikarma, medicine using the sterile disposable needle on the left median cuboidal vein. Vitiated blood is dark, withdrawal of 80 to 100 ml of blood. Subjectively indicated the immediate feeling of lightness in the body, the reduction of the burning sensation. Safety protocol: the procedure halts immediately upon appearance of pure blood and symptoms relief. Protocol phase 3, the post care and stabilization, Pashchatkarma. Immediate care: the aseptic pressing applied, mild pressure to stop bleeding, monitoring observation for dizziness, fatigue, BP and pulse stability. Result no adverse effect. Recovery regimen. The light food. Diet is light food. Use and mudga soup, a herbal support the Haridra Khand and Manjista decoction for 5 days. Uh, Clinical outcomes, rapid and sustained relief. Result achieved after 2 sitting at a 10th day interval. Reduction in itching can do 90% relief. Reduction in burning daha 95% relief. Sleep quality significantly improved. Recurrence rate 0%. Relapse in 4 weeks of follow-up. The why Siravedan suction where medication failed. The load reduction directly reduced the dosing load in the circulatory system, which oral medication could not reach effectively. Inflammatory mediators. The physical removal of blood correlates to the reduction of the plasma histamine concentration. Systemic reset. They act as a hard reset for the immune response, allowing the body to resume normal physiological function. Efficacy in Rakta Pradoshaj disorder. The improvement observed validates the classical Ayurvedic principle. Rakta Drushti, blood impurity, is effectively treated through Rakta Mokshana. Key takeaway: the effective for condition resistant to the summon, palliative therapy provides both detoxification and immediate symptomatic relief, improve quality of life by restoring sleep and reducing skin sensitivity. A safe minimal invasive intervention, the safety, no adverse effect, dizziness, infection noted in this case, compatibility, complexity, the minimal invasive performed with standard steroid needles. Cost and time requires only 2 sittings. Rapid result compared to the chronic medication use. Patient complaints high due to immediate relief of distressing symptoms, itching and burning. Reclaiming skin health through ancient science. Conclusion: Siravedan break the cycle of autoimmune like skin reaction by eliminating the root cause, vitiated blood, rather than masking symptoms. Further direction, recommendation for further clinical study with larger sample size to establish standard protocols for allergic and autoimmune skin disorder. These are references. Thank you.
Thank you, Doctor. Thank you for the informative presentation. Next, we go to the another poster presentation. I would like to invite Dr. Darshan Pradeep Akhade for the poster presentation on the topic Importance of Atyambabana as a Hedu in the Pathogenesis of Heel Pain. I'd like to invite Dr. Darshan Pradeep Akhade for the poster presentation.
Good evening, everyone. I am audible, sir?
Yes, Doctor, audible.
Okay, I am sharing my screen.
Okay, Doctor.
Is it visible, sir?
Yes, Doctor, visible, Doctor. Please start the session.
Good evening, everyone. Myself, Dr. Darshan Pradeep Akhade, PG Scholar, 3rd year, Department of Forognidan and Vikruti Vignan, R.A. Podar Medical College, Mumbai. Today, I am presenting my poster presentation topic on importance of Atyambana as a hetu in the pathogenesis of heel pain. Atyambana refers to the consumption of water in excessive quantity, inappropriate timing, or improper manner. That is during meals in excess quantity, immediately after a heavy exertion, without thirst or frequent cold water intake. Nowadays, patients are drinking too much water. Refraining from the patients are refraining from this social media stuff as well from some doctors, some GPs or some doctors. They do Atyambana for a good kidney filtration rate and for good metabolic rate. But unknowingly, they are giving an house for so much diseases. Attampan can be defined as a drinking too much water, whether hot or cold in early morning, that is after Brahma Muhurta. In Brahmapada, there is a classical reference of Ushappana, that is in the morning with the in Swaanjali quantity. But patient drink water in the morning after waking up, that is at timing 6:30, 7:30, 7 or 5:30 a.m. Also, drinking water at night after dinner before bed. or drinking water unnecessarily throughout the day. Some patients do Attampan just for weight loss. Uh, there are two guna of Jala Mahabhut or Apa or Jala. The one is a Shita Sparshot Apa. This is a reference from Charak Sutrastan 26 Adhyay. Due to Shita guna of Jala, there is an increase in Shita guna of Vata and Kapha, causing local pain or in heel pain. Second one is a very important, that is Jala Stambhanana Shreshtam, Charak Sutrasan 25 Adhyay. The Stamba property of Jala causes it is a main culprit for causing heel pain. Stambhan property of water leads to stiffness and swelling in the joint. This is the pathology, pathogens of heel pain on the basis of Attampan. Attampan, that is drinking excess water in the morning after waking up or at night in between dinner and sleeping, causes Agnimandya. This Agnimandya causes Amutpatti in the form of Dushta Kleda. And that is this Kleda, excess Kleda in Nirmiti in this Srotas. That is in the Rasta Raktas Sotas. The Ama Utpatti is in the form of Dushta Kleda, not in the there is an Jatragni but major part of this is Dushta Kleda. Excess Kleda accumulates in the bursa of joint, that is heel joint bursa, that is calcanear bursa, retrocalcanear bursa, subcutaneous bursa of medial malleus. Due to accumulation in bursa, it causes local irritation to it and leading to inflammation. This inflammation appear in dollar, calor, and rubor and stiffness in heel region, presenting as a persistent heel pain during walking, standing, or any work. There is one of my article is already published on the gut lung axis. That is, I have mentioned the disturbed gut microbiota can cause a systemic inflammation. This is a proven evidence that whenever there is a gut microbiota disturbs or gut flora disturb, it causes systemic inflammation and it causes increase in the inflammatory markers or say chemokines, cytokines in the blood levels. So whenever there is an Agni Mandya due to Attampan or any other hetu, it causes systemic inflammation, and this systemic inflammation in this is there is systemic inflammation in heel region causing dollar, calor, rubor. Symptoms in heel pain is sharp or pricking pain in the heel, or pain on first step in morning, pain aggravated by walking, morning stiffness or local swelling. If we take proper conclusion is this: if we take a proper patient history regarding Attampan, then it can surely help in any disease treatment as a Nidan Parivarjan. Thank you, sir.
Thank you, doctor. Thank you for the remarkable presentation. And next we go to the another paper presentation. I would like to invite Dr. Neelima Narkar Patil for the paper presentation on the topic Ayurveda approach on yoga during Garbha Masanmasik Vriddhi. I would like to invite Dr. Neelima Patil.
Yes, sir.
Good evening, doctor.
Good evening, sir. Sir, I am sharing my screen.
Okay, doctor. Your screen is visible, doctor. Please start the session.
Good evening, everyone. Myself, Dr. Nilima Patil, PG scholar, final year from Prasuti Tantra and Stri Rog department. I'm from SSTSC Sangamner College. My topic is about Ayurveda approach on yoga during Garbha Masanmasik Vriddhi. Introduction. Yoga is union of Sharir, Manas and Atma. Pregnancy is Garbhavastha with physical and physiological changes which can impact on maternal and fetal health. Prenatal yoga can be used to prepare mother's psychological condition in facing childbirth. Evidence suggests that the yoga during pregnancy is safe and feasible and acceptable to pregnant women. As we hello. Yoga is yes, sir. Yoga is as we all know, yoga is comprehensive system that uses physical posture, breathing exercise, and concentration meditation practices. The purpose of this paper is to evaluate the existing literature on yoga for pregnancy reviews about the types of asana beneficial for women in all stages of pregnancy and to make the recommendation for the direction of future research. Aims and objective: to study the role of yoga in pregnancy, to correlate yoga with Garbha Masanuvasik Vruddhi, to highlight clinical utility of yoga during uh, which trimester which yoga is beneficial for the pregnant woman. Ayurvedic perspective: menstrual state of mother affects the fetus. Yoga as non-pharmacological supportive therapy. Yoga during pregnancy promotes Sukha Prasava. Prenatal yoga will provide benefit to the biomotor component of the muscles being trained. It can also increase the cardiorespiratory endurance by increasing oxygen consumption. Prenatal yoga will have the positive effect of cervical dilatation and coordinated uterine activity during labor. The research have been conducted previously, such as research on prenatal yoga conducted by Chundrapat shows that a woman who do yoga will feel less labor pain than the woman who do not do prenatal yoga. Women who practice yoga are also reported to experience shorter deliveries, according to previous studies. Here is the Garbha Masanuvasik Vruddhi and yoga, which yoga focus. In the first month, according to Ayurvedic description, the fetus is about a Kalala Avastha, and the yoga focuses on the gentle movements and Sukshma Vyayam, as the placenta formation is not is in the process of continuation. In the second month, fetus is of Budbud Avastha. Yoga focuses on spinal mobility and relaxation. Third one, it's Pinda Avastha. Yoga focuses on stability, breathing awareness. In the fourth month, Anga Pratyanga, the form of the fetus, and the yoga focuses on the pelvic strengthening. In the fifth month, Mass Vruddhi, back and leg strength. 6 month, Bala Vruddhi, stamina and circulation. Seventh month, Chetna, pelvic opening. 8th month, Ojas instability, restorative yoga. And in the 9th month, Sampurna Garbha has been formed, and the yoga focuses on the labor preparation. Yoga in the first trimester. In the first trimester, the fetus is not completely stable as placenta is in developing stage. It is not fully developed. During this trimester, uh, avoid strenuous activity or yoga, which includes some movements which can cause strenuous activity. Pregnant women should do exercise that are light and easy. Some of the we can do some yogas during the first trimester which are light and woman can easily do. First is Sushma Vyayam. Sushma Vyayam includes joint mobility of all the joints such as ankle joint, shoulder joint, wrist joint, necks, and all. It improves the circulation, safe throughout the pregnancy, prepare the body for to perform other asanas. Uh, it is important to do Sukshma Vyayam first, as it prepares the body for uh, next asanas. Second is Uttana Padasana. In Uttana Padasana, one should lay straight back on the floor and slightly raise the one leg uh, slowly to up to the 90 degrees, and do same with the other leg. It tones the legs and improves flexibility, strengthen hamstring and pelvic muscles. What we should not do in this asana during pregnancy is do not move more than 90 degrees, that is put pressure on the belly. Supta Mastendrasana. Doing Supta Mastendrasana relieve pain from lower back and strengthen lower body muscle. It is general during pregnancy that their back hurts, their leg hurts. So during doing Supta Mastendrasana, it can relieve pain from lower back and other body muscles. Next is Baddha Konasana and Ashwini Mudra. By doing Baddha Konasana and Ashwini Mudra, one can strengthen their pelvic floor, hamstring, and lower back muscles. It also helps in constipation, which is the most common complaint during first trimester of pregnancy, and hemorrhoids. Uh, it makes birth canal flexible and strong. Next is Tadasana. By doing Tadasana, strengthens the leg muscle, knee, ankles, generate good balance in your body. Yoga in second trimester, from 4 to 6 months. Placenta is fully developed and pregnancy is more stable. Now, pregnant women can perform maximum asanas in this trimester. One should perform all the asanas that have been mentioned previously, and some other asanas that we are going to include in the next slide. uh, what should we focus on the second trimester is strengthening the pelvic floor and spine. Can perform and one should can perform previous asanas with few more asanas we are going to explain next. First is Vipreet Karni with the wall support. One can raise their legs up to 90 degree by doing the wall support. It refreshes your back and legs, relieves varicose vein. Varicose vein is also a common complaints during when one can develop varicose vein during the pregnancy. It relieves having a it relieves varicose vein and helps decongest swollen ankle. Swollen ankle is also most common complaint during second trimester and fit. To remedy an overlaced arch small of the back, press your lumbar region against the ground as well. A movement help raise the position of your. This asana also helpful for the back as female experiences so much back pain and complaints of back pain. Next is Veerbhadrasana. Expand the chest fully, allowing by doing this asana, uh, the chest uh, the chest expands fully, allowing the full and deeper breaths. Cure stiffness in the neck, shoulder, and back. Stretches chest, lungs, shoulders, neck, and belly. Strengthen shoulders, arms, muscle of the back. Strengthen the stretches thighs, calves, ankles. Reduces pains in the knees, back, tailbone from the legs. Back pain is also the most common complaint during pregnancy. It relieves that, and also shortness of breath. Doing this asana, when this asana expand chest fully, allowing the woman to breathe more. Next, yoga in the third trimester. In trimester, pregnant women should focus on asanas that helps to prepare body for delivery. Avoid prolonged supine, and in this trimester, the woman should avoid prolonged supine postures. In third trimester, woman can perform all the other asanas, and during doing that asana, one should not put pressure on their belly. This caution should be taken. And in last trimester, one should do the malasana, full squat. It strengthens pelvic floor, legs, thighs, and hamstring muscles. Helps your body to get into right position for the delivery. Helps lower back pain. Opens up pelvic area for the natural birth. Second is Baddha Konasana, which is we also call butterfly asana. It is most commonly advised asana during the last trimester of pregnancy. It strengthens muscle of thighs, legs, pelvis, which is good for labor. Facilitates the concent concentration, expansion capacity of buttocks and pelvic muscle. By suggesting this asana, we uh, the normal labor chances are increases. Clinical precaution and contraindication during while doing yoga in pregnancy. Avoid breath retention and forceful stretches. No inversion without support. Discontinue if pain, dizziness, or bleeding. Always practice under supervision. Conclusion. In conclusion, the present paper suggests that the prenatal yoga program results in benefits during pregnancy as well as throughout labor and on birth out. Thank you.
Thank you, Dr. Nilima. Thank you for the well-explained presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Rumali Premdas Kamble for the paper presentation. I would like to invite Dr. Rumali for the paper presentation. Dr. Rumali, are you there?
Yes, sir. Good evening, everyone.
Doctor.
Yes, sir. Just a minute. Server है.
Hello, Doctor.
Yes, sir. Sharing my screen.
Doctor, if you have any problem with sharing, we will share for you, Doctor.
Yes, sir. Myself, Dr. Rupali Kamre, PG Scholar, 3rd year, Department of Chikitsa. My topic is a case report, management of Mukhadushika acne vulgaris with Ayurveda. Abstract. The most prevalent skin condition affecting people today is acne, which affects 80% of adolescents. Acne vulgaris is a skin condition that shares similarities with the Ayurvedic text description of the diseases Mukhadushika or Yuan Pidaka. The condition known as acne vulgaris affects the pilosebaceous follicle and is characterized by both non-inflammatory, that is open and closed comedones, and inflammatory lesions, papule, pustule, and nodules. Sebum production, pilosebaceous ducts cornification, microbial involvement, and inflammation are the 4 main elements. Acharya Shushruth has mentioned the skin disease under Kshudra Rogas, and Mukhadushika is one of them. The facial eruption resemble like thorns of Shalmali. Dosh involvement is Kapha Vata, and Dusha is Raktameda. Keywords: Acne vulgaris, Ayurveda, Jalaukavacharana, Kshudra Rogas, and Mukhadushika. Introduction. The definition is the Shalmali thorn-like eruption on the face of adult due to vitiation of Kapha, Vata, and Rakta is known as Yuvan Pidaka or Mukhadushika. Shalmali Kantakara ityadina Yuvana Pidikaha Yunamanana Yuvananam Tasya Pidika Yuvan Pidaka. This reference is from Sushruta Nidanstan 13 chapter 36 number shlok. The main purificatory technique Shodhan Chikitsa for treating Mukhadushika is Vaman and Rakta Mokshan according to Ayurvedic scriptures. The comparison to various methods of Rakta Mokshan, Jalaukavacharana is lot more safer, simpler, and nearly painless. Hence, this study aims to describe the plan of management of Mukhadushika along with internal medicines. Nidan of Mukhadushika, Kalaj cause is Tarunya, Madhyana, Vasanta Ritu, Grishma Ritu, and Sharad Ritu. Viharaj causes are Veghavarod, Jagaran, Atinidra, Upavas, and Atap Sevan. And the third one, Mansik cause is Atishok, Krodha, Kshobha, Santap, and Swaha Parivartan. Okay, the case is a 20-year-old male came to the OPD of Chikitsa with cheap complaints of acne over face, bilateral cheeks, burning sensation over cheeks, that is daha, itching over cheeks bilaterally, kandu, and discoloration of skin, that is vaivarnia. In personal history, vitally the patient was stable. Occupation, he was a student. Bowel habits was he was constipated. Sleep was irregular and appetite was low. In Ashtavid Pariksha, Nadi at the time was 70. Stool, as we say, he is constipated. Urine was normal. Tongue, that jiva was sam. Speech was clear. Skin, sparshanindriya, if we see, so it was rough. Khara. Eyes was normal and the build was medium. Um, for this patient, we have planned sitting of Jalaukavacharana for 4 sitting with 7 days of interval with internal medicines, and follow up was 15 days interval. Internal medicines given to the patient are Panchanimba Churna, dose was 3 gram, BD with lukewarm water for 4 months, Mahamanjisthadi Kwatha 20 ml twice a day with 1 cup of lukewarm water for 4 months, Haridra Khanda 3 gram tablets twice a day with milk for 4 months, Trifala Churna 3 times a day with lukewarm water for 1 to 2 months, Kaishora Gugula 250 mg tablets twice a day with lukewarm water for 4 months, and Arogya Vardhini Vati 150 mg twice a day with lukewarm water for first 2 months. And this sources of leeches, a reputed biological product provider provided the Jaloka. Procedure of the leech therapy, preparation of the leeches. For the procedure, leeches were kept in Haridra gel or turmeric water. The leech was removed and placed in a vessel with cool, fresh water when it started to move rapidly or when it became active. Preparation of the patient: 1 day before leech therapy, blood test including BT-CT, HIV, HCV, and HBsAg were conducted to rule out any bleeding disorder or infection. Mild abhyanga followed by sedation, that is Bashpashvedan, over the face for a short period of time to improve superficial circulation. After that, the face was thoroughly washed with dry cloth to get rid of all the secretions. The patient was then made to lie down comfortably. Leech application: in order to apply leeches at a specific location, the active leeches were brought close to the pustule and papules. No need to lancet prick has arisen as leeches got self applied on affected side. A damp cotton pad was put over the leech when it was fastened to a side. At the time, a total of 3 leeches measuring 3 to 4 inches long were utilized, sucking 5 to 8 cc of blood each. Leech management: the leech usually separate from a site on its own within 20 to 25 minutes. Following that, Haridra Churna was applied to the leech anterior sucker in an effort to make it vomit. Patient management: the patient was watched for 4 hours for any signs of secondary bleeding. On the bite side, a sphatic bhasma was applied with little water. A while later, cotton gauze piece was placed over the site and tightly compressed to avoid any future bleeding. Pathya for the patient: green grains, wheat, fruits, primarily red grains was advised. Enough sleep at night, 10 to 15 minutes of breathing exercises per day in an open air was advised. Padabhangya every night before sleep. Washing the face before going to bed and after coming from the outdoor was advised. Observation and results: you can see here, before the treatment, the pidika, daha, kandu, and vaivarnya was in more quantity, but after the treatment he got relief from the symptoms. This is before and after picture of the patient. Improvement was visible after 15 days of treatment. The assessment of patient was done before and after treatment on the basis of relief of symptom. In the first follow-up, that is after 15 days, there was improvement in the signs and symptom. And after the 4 months of treatment, along with the internal medicine and Jalaukavacharana, patient got 90% of the relief from the symptoms of Daha, Shotha, Kandu, Vaivarnya, and new acne foundation. All signs and symptoms were resolved by the end of the treatment. The overall percentage of relief was found to be 90%. So the discussion is Mukhadushika is one of the Kshudra Rogas. In the present case, etiological factors were irregular meal timing, excess consumption of tea, consumption of spicy food, excess exposure to sun, habits like tobacco chewing and alcohol consumption. All the factors are causing provocation of Raktadushti, eventually which leads to Mukhadushika formation. Advice for the patient was to avoid the oily food, spicy, fried bread items, curd, fast food, and beverages. Avoid Ratra Jagran and Diva Swap. Daily 10 to 15 minutes of breathing exercises. Washing the face, that is Patha. Important part of the treatment was Nidana Parivarjan. And when it comes to Shodhan or treatment in Rakta Dushti, Rakta Mokshan recommended as the best option. So we followed the Shodhan, that is Rakta Mokshan. In the present case, Rakta Mokshan by Jalaukavacharana is considered. The complex mixture of several physiological and pharmacological active chemical found in the leech saliva like hirudin, belladine, apirase, hyaluronidase, calin, prostaglandin, proteinase inhibitor, a vasodilator substance, and anesthetizing substance, etc. are a few of them. In the same way as hirudin and calin, which have anticoagulant properties, control inflammation and promote gradual wound healing. Also, it has been established leech saliva contain analgesics, which may be the cause of the pain reduction. Okay. The drugs which we have used, this slide shows the properties of them. Like Panchanimba Churna has the property of Pitta Shaman, Kandugna and Kushtagna. Mahamanjisthadi Kwat is Rakta Shodhak and Varnya. Haridra Khanda, Kandugna. Triphala Churna is used as a laxative. Kaishora Gugula, which is Vrana Rupak, Rakta Dushtihar and Twaga, used in Twagavikar. Arogyavardhini Vati is Tridhoshagna, Kapha Pitta Hara, Vranashodhan, Kushtagna, Deepan, and Pachan. By this property, the result were achieved. Conclusion is that Mukhadushika is Kapha Raktaj Vyadhi, as stated in the Ayurveda classic. Jalaukavacharana is regarded as a primary therapy in Rakta Pradosha Vikar in conventional Ayurveda medicine. According to the case studies finding, Jalaukavacharana and Ayurvedic medicine are found useful in the treatment of Mukhadushika with a history of acne vulgaris. This study provides strong clinical evidence for the usefulness and potency of Ayurvedic treatments. The time-tested holistic medicine system of Ayurveda now has a fresh avenue for further clinical research of Mukhadushika. So these are the references. Thank you, everyone.
Thank you, Dr. Ribali. Thank you for the well-explained presentation. Next, we go to the another paper presentation. I would like to invite Dr. Gulnaz Sherkhan Patan for the paper presentation. I'd like to invite Dr. Gulnaz Sherkhan Patan for the paper presentation.
Myself, Dr. Gulnaz Sherkhan Pathan. I am BMS PG second year student, Department Stri Rog and Prasuti Tantra, SSTSC Sangamner. Nowadays, infertility is increased. So my topic is management of unexplained infertility through Ayurvedic treatment, a case study. Introduction. Reproduction is a biological process which plant and animals are capable of. If reproduction is not achieved, it affects the mental and physical health of couple and disturb their family and social life. Infertility is inability to conceive within 1 or more years of regular unprotected coitus. Infertility is prevalent problem affecting about 10 to 12% of couples worldwide. Unexplained infertility is earmarked to those couples who have undergone complete basic infertility work up and in whom there is no abnormality. The disease entity Vandhyatva is a closest approximation to unexplained infertility. The Ayurveda has best solution for infertility through purifactory procedures and optimizing the functions of reproductive tissues, that is Artav and Shukra Dhatu in both male and female. Case report. 28-old married nulliparous woman, her 36-year-old husband presented with complaints of inability to conceive, presented to OPD of our institute. In 8 years of married life, irrespective of unprotected sexual life, she has not conceived. On interaction with the couple, it is found that there were no contributing reasons for having conception. Her IUI attempts failed 6 times and IVF failed thrice. The lady's menstrual cycle were regular and bleeding period was for 4 days with dysmenorrhea on first 2 days. In the coital history, no abnormalities were detected, no contraceptive measures was adopted. Examination, the Sweet Pariksha, Prakriti वात पित्त विकृति वात सार मध्यम सहनन मध्यम सत्व आवर सात्म्य मध्यम आहार शक्ति मध्यम व्यायाम शक्ति मध्यम वय मध्यम प्रमाण मध्यम. On general examination, built moderate. There was no pallor, icterus, cyanosis, clubbing, edema, and lymphadenopathy. Patient is constantly worrying about the conception and was anxious and stressful. BP was 120/80, pulse 74, weight 58 kg, and height 152 centimeter. Systemic examination, CVS normal, CNS normal, RS normal, bronchovascular sound heard, per abdominal tenderness absent, no organomegaly, per speculum and per vaginal examination were normal. Investigation, the semen analysis her husband performed prior to IUI yielded normal results. All routine investigation including hematological biochemical reports were normal. Treatment given. On 14/7/24, अभ्यंगवित धन्वंतर तेल followed by बाष्पस्वेद स्नेहपान्वित फलघृत विरेचन 14 weeks. शमन औषधी, गंधर्व हस्त्यादि कषाय 3 teaspoon TDS, शतपुष्पा चूर्ण 12 gram OD. Treatment given on 17/8/2024, मुस्तादी यापन बस्ती, उत्तर बस्ती with फलघृत. The couple was advised to try for conception for next 3 months. And Shaman Aushadhi, Shatapushpa Churn 12 gram OD, Gandharva Hastadi, Kashai 3 teaspoon TDS, Kallanak Guda 5 gram BD. Treatment given on 7 December 2024, Anuvasan Basti with 13 ml Falagruta, 13 ml Kallanak Gruta, Nasya for 5 days, Abhyangavit Shirabala Taila, Shalishastik Pindasveda, Falagruta Pichu. Shaman Aushadhi, Sukumar Gruta 2 teaspoon BD, Garbhafala Rasa 1 BD, Darimbadi Gruta 2 teaspoon BD, Swarna Bhasma 1 tablet OD. Result, the follow-up consultation on 22 2025 showed that patient was pregnant. Her LMP was on 13 January 2025. UPT was positive on 25th 2025. She was reported feeling great. She underwent FTND in the 36 weeks of her pregnancy without any complication and gave birth of healthy baby boy, weighed 2.6 kg on October 2025. Discussion. Virechana finds its application in Vandhyatva, works on Oham as it does Dhatu Vidhushti and increases the potency of Oham. Vatanuloman was adapted to subside symptoms like dysmenorrhea, as Vata is mainly involved in Vandhyatva and Basti is Pramano Aushadha for all Vata disorder. Hence, Basti was given. Kalyana Ghrita is a Balya Mangalya. Phala Ghrita is a Prajavardhana. This combined the effect of all these treatment proved to be effective. Conclusion: infertility is becoming a burning issue since past decade in contemporary medicine. Treatment focuses on correcting the dysfunctions which are diagnosed based on diagnostic test in Ayurveda. For any case, correct diagnosis based on roga and rogi rogi pariksha and timely management with properly advised lifestyle and diet always yield good result. The present study concludes that the holistic approach of Ayurvedic system of medicine gives miraculous effect even in cases of unexplained infertility. Thank you.
Thank you for the insightful presentation. Thank you, Doctor. Next, we go to the another paper presentation. I'd like to invite Dr. Aishwarya Malaysia for the paper presentation. Dr. Aishwarya, are you there?
Yes, sir. Am I audible, sir?
Yes, Doctor. Audible. Good evening, Doctor.
Hello. Oh.
You are audible, Doctor. And your screen is also visible. Please unmute and start. Please start, Doctor.
Good evening, everyone. Myself, Dr. Aishwarya Malasure, PG Scholar, Department of Agadatantra, SDM Hassan. I am presenting the topic Toxic Chemicals in Routine Life, Their Health Impacts, and Ayurvedic Prevention. These are the contents. Coming to the introduction, toxic chemicals are the substances that can cause harm to the living organisms or the environment. Modern lifestyle is exposing everyone to various toxins through food, air, water, and daily habits, knowingly or unknowingly, which are causing various health impacts. Many of these chemicals, when used repeatedly, it interfere with normal body functions and lead to metabolic disturbances and other organ toxicity and all. What are the sources of these toxic chemicals in our routine life? That is food, water, air, household products, or the cosmetics. Coming to their health impacts, let's see about the chemical constituents present in the food. Like mycotoxins found in the moldy grains and nuts can cause liver damage and cancer risk. Acrylamide and polyaromatic hydrocarbons present in the fried foods are carcinogenic and neurotoxic, and pesticide residues which are found in the fruits, vegetables, and cereals known to cause endocrine disruption, neurotoxicity, and reproductive toxicity. And heavy metals which are found in the seafood, rice, and vegetables causes neurodevelopmental and organ toxicity. Bisphenol A and phthalates, which are found in the packaging plastics, causes hormone disruption. Nitrosamines, which are found in the processed meat, when it is heated, it turns into carcinogenic. Coming to the chemicals present in water, like arsenic contaminated water causes arsenicosis. Fluoride causes dental and skeletal fluorosis, which is majorly reported in Rajasthan, Telangana, and Andhra Pradesh. And nitrate causes methemoglobinemia in infants and gastric disorders, which is linked to fertilizer runoff. And uranium chronic exposure is associated with kidney toxicity and bone damage, which is reported in Punjab, Rajasthan, and Haryana. And lead causes neurodevelopmental damage in children. It causes anemia, kidney, and cardiovascular effects. And cadmium long-term intake results in kidney damage and bone demineralization, which is found majorly near the industrial and mining areas. Air toxicants like particulate matter 2.5 and 10, found in the vehicles, dust, and smoke. Then nitrogen dioxide released from the vehicle exhaust, and sulfur dioxide present in the coal and oil combustion. Ozone present in the photochemical smoke. Carbon monoxide present released from the incomplete combustion. Volatile organic compounds released from the paints and fuels are known to cause asthma, heart disease, airway inflammation, bronchoconstriction, and eye irritation, neurotoxicity, and majorly cancer. Coming to the household products and cosmetics, chemicals present are formaldehyde, which is found in the shampoos, nail polish, and cleaners, known to cause skin or eye irritation, respiratory problems. Phthalates, which is found in the plastic, fragrances, and personal care items, causes endocrine disruption, reproductive and developmental issues. Parabens, which is found as a preservative in shampoos, lotions, and makeup, causes hormone disruption. Synthetic and fragrances and volatile organic compounds, which is found in the air fresheners, perfumes, and cleaners, causes allergic reactions. And heavy metals found in lipstick, kajal, and older cosmetics, known to cause neurotoxicity, kidney damage. Toluene and solvents present in the nail polish and hair dyes has some nervous system effects. Coming, what's inside what we use. These are few products in daily life where I have highlighted the major toxins present in them. For example, almost all toothpaste contains fluoride, which is known to cause dental fluorosis. It is also banned for the children below 8 years, and when it is ingested in massive dose, it acts as a poison. Then sodium laurate sulfate, which is found in body soaps and shampoos, damages the healthy lipid layer from the hair root and the skin, which causes dryness and irritation. And palm oil, which is a bad cholesterol, and emulsifiers, which are found in the biscuits, are known endocrine disruptors. And sodium benzoate, which is added as a preservative in pickles and other products, when it is combined with the vitamin C, it converts into benzene, which is a known carcinogen. And talc, which is found in almost all powders, majorly contaminated with asbestos, which can cause lung cancer on chronic exposure. And D-transalithrin, which is a toxin found in the mosquito repellents, causes lung irritation and harmful for even aquatic animals when disposed into the water. Coming to the preventive measures in Ayurveda, we should follow proper dinacharya such as Danta Dhavana, Kavala, Gandusha, Tambula Sevana to ward off the oral toxins, and Abhyanga with Eladi Taila and Udvartana with Haridra, Manjishta, Sariva, etc. churnas, which are having Vishagna properties, can be useful in occupational toxic exposure. Savira Manjana and Tasanjana, which will be useful in ocular toxic exposure. And following the proper Ritucharya and undergoing the Ritushodhana will help to prevent the diseases due to toxic exposure and boost immunity. And Rasayana herbs such as Amalaki, Ashwagandha, and Shatavari can also be useful in enhancing the immunity and improving the body systemic resilience. Then Dhupana with Aparajita Dhumachurna and Agnihotra with Gogrita, Peoplewood, and other antitoxic herbs can be useful in environmental toxic exposure. Growing the household plants like aloe vera, lily, snake plant is also helpful in reducing the concentration of carbon dioxide in the air. And turmeric water, when it is used to wash the vegetables and fruits, it removes the pesticide residues. And Jala Nirvishikarana, which yoga, which is explained by Acharya Vagbhata, has antimicrobial effect, can be useful in water pollution. Planting different herbs like neem and tamarind has also been proved to reduce the chromium concentration in the soil. And using the cosmetics like face cleanser prepared from the Eshti Madhu, Manjishta, Chandana, lemon peel mixed with water, milk, or yogurt. And using the almond oil as a moisturizer, body scrub prepared from the tulsi, rose petals, and rice bran, etc. And lip balm can be used. Shatadota can be used as a lip balm. And traditional kajals prepared from the Sahadevi Mula Swarasa can also be used as a safer alternative rather than using a chemical-filled cosmetics. These are few Nityasevaniya dravyas having hepatoprotective and rich in antioxidants like Mudga, Gobrita, Yava, Amalaki, Madhu, Patola can be added in our daily diet. Then coming to the conclusion, Ayurvedic prevention through Dinacharya, Rutucharya, Shodhana, and Rasayana enhances the detoxification and body's resilience, and awareness of these hidden toxins in daily life enables the informed and healthier choice for the public. And also usage of Ayurvedic herbal and organic products help to reduce the chemical load and promote the sustainable health. Healthy lifestyle practices like wholesome diet, yoga, and mindfulness protect us against the toxin accumulation. Promoting the organic farming and eco-friendly practices ensure the safer food and healthier environment for future generations. These are the references. Thank you.
Thank you, Dr. Aishita. Thank you for the impactful presentation. Next, we go to the another paper presentation. I would like to invite Dr. Unmesh Kushalgir Gosai for the paper presentation. I'd like to invite Dr. Unmesh for the paper presentation.
Good evening, sir. Can I audible?
Yes, Dr. Audible. Good evening, Doctor.
I'm sharing my screen, sir.
Okay.
Sir, can you share, please? I am receiving some problem in sharing screen.
Okay, Doctor. Just a moment. Okay, Doctor. Please start the session.
Yes. Good evening to all. Sir, can I audible?
Yes, Doctor. Audible, Doctor.
Good morning, all. Myself, Dr. Unmesh Gosavi from DY Patil Ayurved College, PGD Scholar of Department of Kumar Bhutya. Then my topic is on Ayurved treatment protocol in children's. Children are the future of our generation, and it is our responsibility and duty to help them to grow, nourish, and cherish the ability and skill. In order to do that, the healthy is very important for them. Diagnosis and planning a treatment protocol in children is very specialized job, as children are tender, dependent, and incapable of expressing their problem and suffering. So, Acharya Kashyap had given Lakshana are there to understand the different signs given by the child for diagnosis of specific disease condition. Though Dushamala are same in adult and in children, but the doshas are not stable in this phase of life. Also, manifesting of this disease in them are not clear, so different protocols should follow for the diagnosis and treatment of the child. Uh, So the treating physician should begin the treatment of the child as soon as very early feature of disease are seen. That it should be started in Purvarup Avastha itself by seeing the Prakruti Hetu Purvarup Rup Upashay. There are some Aushadhi Gunas. The drugs prescribed to child should be Madhur, Kashyap, easily which is easily palatable, Laghu Mrudu, and sheath in properties. Exclusively Snigdha Ruksha, Ushna Guru, Amla, and Katu Vipaki drugs should be avoided and are considered as contraindicated in children. The drugs for Shirat should be mridu in nature and should not be chedaniya in action. There is ahar and sthanya importance given in our Ayurveda. The healthy child should be advised ahar, and we are opposite to dosha kal and prakriti of child. Asamanya should be stopped gradually and satmithing should be started. Ahar is called Mahabhaisha according to Kashyapa. The main is mother milk is considered very essential for the natural growth and well-being of the child, and it should be continued even if any food article are restricted in the disease. Uh, there are some aushadhi. Exclusively breastfeeding is important, which provides the nutrition to the baby, helps in lowering the infection in baby as it contains the natural antibodies and polyunsaturated fatty acids support efficient brain development. Antifungal effect is superior. The in Ayurveda, Dhatri and Balak Chikitsa is mentioned. That is to do the Chikitsa of Balak, also want to do the Chikitsa of Dhatri. In Shirat Shirannad Avastha, the treatment is divided to both mother as that is Dhatri and the child. The child should be given mild medicines such as growth and milk. In Annadavastha, treatment should be given to child only. Another method of administration of the drugs is advocated that thin layer of paste of medicine should be applied on the breast of feeding mother for a certain duration, and then after the baby can be allowed to suck the breast. Tapering of drugs, Acharya Kashyap has also advised very specially that drugs should not be continued even after complete cure of the disease. The dose of the drug should be tapered gradually and the maintenance dose to continue some time even after complete recovery, as this will prevent the complication and relapses. There are some Aushadhi matras which are given in Ayurveda according to the various acharyas. Uh, some are here according to Acharya Kashyap. Grita matra is given in Jat matra balak. You have to give like Kolasti Saman. Up to 20 days babies, we have to go half cold, म्हणजे cold अर्ध. 1 month, 1 cold, 3 months, 2 cold, 4 months, शुष्क आम्लक, 6 months, आर्द्र आम्लक. According to Acharya Sharangdar, for the 1 month, we have to give 1 rati. For 2 to 12 months, increase by 1 rati. 12 months, 1 rati. That is, we have to give 1 mass. 1 to 16 year, increase by 1 mass. 16 years, 16 mass. 16 to 70 year, continues same. 70 year, decrease gradually. Churna matra is given according to Kashyapa. Dipaniya churna, Agraparva anguli, that is 2 prasrut. Jivaniya churna, Dviguna, that is 2 prasrut. Virechan, half of the Dipaniya churna matra, that is 1 prasrut. According to Acharya Shushruta, शिरांना अंगुली परवार शिरांना कोल असते समान, अन्नात कोल मात्रा समान. And for the treatment, there is also need of pathya and apatya. Satme ahar itself is said to be a pathya for the child. Milk is a pathya for Shirad, milk plus Annat for Shirannat, and Anna for Annat. Bheshajkal, the ideal Bheshajkal for the drug administration to the kid is Prak Bhakta or Sabhakta. Toxicity of drug. Acharya Kashyap was very much aware of toxicity of drug when we use for prolonged period. He told the drug should not be used for long period in children less than 12 years of age, as it may lead to the toxic and undesired side effect and cause loss of strength and the life. Panchakarma. The main Ayurvedic practice which is told is Panchakarma, which can also be practiced in children. Panchakarma practice in children are not totally contraindicated and are practiced with special care in some specific condition in modified manner. It is the only technique to cure the disease from its root. Importance to make the stability of doshas, to flush out toxins from our body. Important in physical, mental, and social aspects. The first one is Snehan. Snehan, both Bahya and Abhyantar are safe for the children. Wheat in small quantities best for Abhyantar use, and Balatel Abhyantar is done in neonatal care as Bahya Snehan. Important prerequisite for Shodhan, it is both nutritive and therapeutic value, useful in neuropsychiatric and behavior problem, improve digestive capacity, removal of arm, metabolic waste. Abhyanga make baby sneak as it helps in myelination of nervous tissue. Swedana, on the other hand, should be avoided in the children. Only milder form can be used. Acharya Kashyap had advised Hasta Swed up to 4 months of age and Pata Swed in abdominal colic after 6 months. Importance of Swedans are elevated stiffness, relieve sense of heaviness. Shaktishali Pinda Swed mostly used in pediatric age group in global delay in muscular weakness. Another Panchakarma is woman. Rudu woman can be administered in child right from birth, even with Purva Karma. As child is already snigdha as meal is the main diet till Shiranna Day. Acharya Kashyap mentioned infant who vomits frequently will never suffers from the disease. Important. Infant who vomits whited milk don't get affected by any daivik or manasik vyadis. Pediatric age is the kapha prominent so that woman can be induced very easily. Virechana should be avoided in child. Virechan Sadhya condition should be treated by Basti. Mrudu Virechan drugs can be used with Snigdha Dravyas if at all required. Basti is the safe in children and can be used effectively even from newborn period. Matra Basti is most preferred. Basti acts like an Amrit in childhood clinical practice. Basti is said to be as an Ardha Chikitsa. Shir Basti used for weight gain. It gives significant result in nervous system disorder in pediatric age groups such as cerebral palsy, Guillain-Barré syndrome in delayed development. Not only helps in treatment but also is better to growth and development of child. Motor skill development, better myelination of the brain. Nasya, Pratimarsha Nasya is very safe and advocated in children if they administered by finger using or tail in 2 to 3 drops. Raktamokshan should not be used in children, though mentioned in some condition. Raktamokshan is excessive form is not good in pediatric age. Conclusion: a child should be treated with Snigdha Shit Madhur Aushadhi Lep and Parisheka. Panchakarma should be done cautiously in children. Children can be treated with different form of treatment with the specific doses. Overdose, toxicity, tapering of drugs should be followed according to Acharyas. Here are some references. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. Next, we go to the another paper and poster presentation. I would like to invite Dr. Ankita Bhattare for the paper and poster presentation. First, we go to the paper presentation, then we go to the poster. I would like to invite Dr. Ankita for the paper presentation.
Yes, sir. Yes.
Good evening, doctor.
Good evening, sir. Is my screen visible, sir?
Yes, doctor, now visible.
Yes. So good evening, everyone. My name is Dr. Ankita Fadare. I am PG scholar from Swasthyabodha department from Dr. Divya Patil Ayurvedic College. So today's paper presentation topic is Nidra as a pillar of health, Ayurvedic versus modern perspective. So, health in Ayurveda is not merely the absence of a disease, but a state of complete physical, mental, and social well being, as we know the definition of health. So, among the lifestyle factors described in Swasthavrita, Nidra holds a central place. So, in modern society, deep sleep deprivation has become common due to stress, technology use, and irregular routines leading to various disorders. Understanding Nidra through both traditional and contemporary perspectives can provide a holistic approach to wellness. So, what is the aims and objectives of this topic? It's to understand the Ayurvedic concept of Nidra, to analyze the physiological importance of sleep in modern science, to compare Ayurvedic and modern perspectives, to highlight preventive and promotive aspects of proper sleep. Uh, uh, let's see the concept of Nidra in Ayurveda first. Nidra is a natural physiological state where the mind and senses withdraw from external stimuli, allowing restoration of bodily functions. So, Nidra is defined as a Trayopastham, along with Ahar, Brahmacharya. So Ayurveda states that life is supported by three pillars, that is Ahar, proper diet, Nidra, proper sleep, Brahmacharya, that is types of the which Shlesha Nidra, Man due to fatigue, Agantuki Nidra, that is due to external, and Ratri Swabhav Prabhav Nidra, which is Nidra, strength and immunity. So, improved memory and intellectual, if we get a proper Nidra, emotional stability is the main benefits of getting a proper Nidra. Consequences of improper sleep, mostly we can see many immunized diseases and digestive disorders, depression, anxiety, obesity, or emaciation is found in patients with improper sleeps. Let's further on move on to modern perspective on sleep. Physiology of sleep. Sleep is regulated by circadian rhythm, that's internal biological clock. Then next is melatonin hormone, which is sleep-inducing hormone required for sleep. Sleep cycles, that is REM and non-REM stages. Functions of sleep, brain detoxification, and memory consolidation. Main function of sleep is hormonal regulation, that is growth hormone, cortisol, insulin, etc. Immune system strengthening and emotional processing is the main function of the sleep we observe. What happens if a patient or people are sleep deprived? Diabetes, obesity, cardiovascular diseases, reduced cognitive performance, we can see mood disorders, then decreased productivity is the major effect of sleep deprivation. This is a comparative analysis of Ayurveda versus modern science. Nature of sleep Ayurveda, it is not restored. In modern science, it's known biological, neurological. Importance mentioned as a pillar, and modern science, it suggests that it's an essential physiological need. Timing in Ayurveda, night sleep has been set. Benefits according to Ayurveda of sleep are strength, longevity, mental clarity, and similarly, in modern aspect also tells that it's all about memory, immunity, and metabolism. Disorders, dosha imbalance. If improper sleep is happened, dosha imbalance occurs, and according to modern aspect, hormonal and neurological imbalance is seen. Role of Nidra in disease prevention. It supports mental health, it enhances the immunity, reduces stress and burnout, promotes hormonal balance, and prevents multiple lifestyle disorders. Discussion. Ancient Ayurvedic wisdom aligns remarkably with modern research findings, while Ayurveda describes sleep through dosha balance and lifestyle regulation. Modern science explains it via neurochemistry and circadian biology. Integrating both perspectives can lead to a more effective health promotion strategy. Conclusion: Nidra is not merely rest but a vital biological and physiological necessity. Both Ayurveda and modern science agrees that proper sleep is fundamental for maintaining equilibrium in body and mind. In an era of increasing lifestyle disorders, re-establishing disciplined sleep routines can significantly enhance overall well-being. So, thus, Nidra truly stands as a pillar of health, bridging ancient knowledge with contemporary medical understanding. Given below are some references. Thank you.
Thank you, Doctor. Next is poster presentation.
Yes. Is my screen visible, sir?
Yes, Doctor. Your screen is visible, Doctor.
Okay. So this is my poster presentation.
Your paper presentation is visible, Doctor.
Paper is disabled, sir.
Yes.
Just a minute, sir. Is it visible now?
No, Doctor. Can you please try to share once again, Doctor?
Yeah. Is it visible now?
Yes, Doctor. Now visible.
Yes. So my poster presentation is on Ahar Vidhi Vishesh Aitani, 8 determinants of proper diet in Ayurveda. So basically, we see that this is a very ignored concept in today's time because everyone is in hurry to eat. No one follows the rules and guidelines given in Ayurveda. So, introduction: in Ayurveda, Ahar is considered as one of the Trayopastambha, that is three pillars of life, along with Nidra and Brahmacharya. Charak Samhita describes Ahar Vidhi Visheshaitani in Sutrasthan chapter 26. It refers to the 8 important factors that determine the wholesomeness or unwholesomeness of the food. These factors ensure proper digestion, absorption, and nourishment. So, first is Prakriti. Natural qualities of food substances. Example: Mash, that is black gram, which is Guru, Muk, the green gram, which is Laghu, light. It determines effect on doshas and should be matched individualized constitution. What kind of food we are eating is known as Prakriti. Then next comes is Karan, that is processing of food. How the food has been prepared, method of preparation includes in the process in the Karana process, which includes cooking, churning, fermentation, roasting. Example: raw rice, cooked rice is easier to digest. Curd. Um, Instead of curd, buttermilk is lighter, and processing can change gunas. So, Karan, that is processing of food, is important. The third stamba, which is told, is as samyog, that is combination of two or more substances. That is example of milk and fruits, which is viruddhahar, which is not good. So, what kind of food you are having with what type of combination you are eating it is important. So, proper combination enhances benefits, and wrong combination causes diseases. Rashi, that is quality of the food. There is two types of rashis introduced. That is Sarvagraha Rashi, that is total quantity of food, and Parigraha Rashi, that is quantity of individual items. So overeating causes arm formation, how much quantity you're taking in, and undereating can cause dhatukshay. Next is Desh, that is habitat or so geographical region food. We can see that many of the tropical fruits which are not produced in India or Maharashtra are being consumed by peoples uh, in the name of aesthetic diets and all, but which is not a good sign. So geographical region, climate, soil quality, these are the these includes under deshas. So examples of jungle desha, dry region, one should have light, uncautious food advised. In Anup desha, that is marshy region, lighter food is recommended. Next is Kala, that is time. Two types of Kala have been told. Nityak Kala, that is daily time, morning, afternoon, and Avasthik Kala, that is condition based time. Means what type of disease is happening, then what kind of food you should eat. At what age, what kind of food you should eat. So example, heavy meal at night causes improper digestion, seasonal diet changes. You should follow Ritucharya. Upyog Samstha, that is rules of eating. So it includes eating warm food, eating in proper quantity, not eating too fast, not eating too slow, eating after digestion of previous meal, eating with concentration. And the last eighth one is Upayukta, that is the consumer. Individual factors like Agni, Prakriti, age, Satma, health status comes under the Upayukta. Same food affects different people differently. So this all comes under the Ahar Vidhi Visheshaitani. That is, while eating the food, one should keep this 8 Ahar Vidhi Visheshaitani in mind, and consumption of food must be done. Thank you, sir.
Thank you, Doctor. Thank you for the well-organized and perfect presentation. And next we go to the paper and poster presentation. I'd like to invite Dr. Sheetal Raj for the paper and poster presentation. First we go to the paper presentation. Dr. Sheetal Raj, are you there?
Yes, am I audible?
Yes, audible, Doctor. Good evening, Doctor.
Good evening, sir. Good evening, everyone. Myself, Dr. Sheetal Raj, Associate Professor from the Department of Agata Tantra, NFO Ayurveda Medical College and Hospital, presenting before you an in vitro evaluation of the antitoxic potential of Shirisha Grahaduma in comparison with the activated charcoal. Please move on to the next slide. These are the contents of my presentation. Next. Visha Chikitsa is an important aspect of Ayurveda that deals with the prevention, diagnosis, and management of poisoning. The branch of Ayurveda is known as Agata Tantra, which primarily focuses on various types of poisons, their sources, mode of action, clinical features, and appropriate treatment measures. Poison described in Ayurveda include those of plant, animal, and artificial origin. Grihaduma is an antitoxic substance that closely resembles activated charcoal in both particle size and appearance. It is used in different kinds of poisoning, such as insect bites and cobra envenomation. Next slide, please. Shirisha is a medicinal plant regarded by Acharya Charaka as one of the most effective antitoxic drugs. It is a key ingredient in many antitoxic formulations and is indicated in conditions like rat bites. And it is also traditionally used to help revive a person who appears to be dead by poison. Next slide. Next slide, please. Next slide. Antidotes are the substances that nullify the effect of poison. And there are 4 types of antidotes: physical and chemical, and physiological antidotes. Next slide, please. Physical antidotes are those which nullify the effect of poison by its mechanical action. And activated charcoal can be considered as a physical antidote as it nullifies the effect of poison by means of absorption. Next slide, please. Activated charcoal is the most frequently employed method of gastrointestinal decontamination in the developed country, and this is administered in large dose. Its tremendous surface area permits the binding of many drugs and toxins in gastrointestinal lumen and reducing their systemic absorption. Next slide, please. And it is also mentioned in many studies that activated charcoal can elicit a substantial reduction in drug absorption in acutely poisoned patients. Next slide. And activated charcoal is given orally because of its ability to absorb substance and prevents the potentially toxic compounds from being absorbed across the gastrointestinal wall. Next slide. Here the materials and methods are Grihaduma, which is prepared from activated. Grihaduma is similar to that of activated charcoal in appearance and particle size. And here Grihaduma is prepared from Shirisha, and a physicochemical analysis of Shirisha Grihaduma is done with the activated charcoal. Next slide. And this is activated charcoal. Preparation of Shirisha Grihaduma is by 10 kg of Shirisha bark is prepared, and this is cut into pieces, and this is burned. And the steel vessel is kept inverted over the burning barks and powder which is deposited in the inverted vessel is scraped and collected. Next slide. So these are the materials which are used in the preparation of Shirisha Grahaduma. This is a Shirisha Grahaduma. There is 2 grams of Shirisha Grahaduma which is obtained after burning 10 kgs of the bark of Shirisha. So these are the parameters which are assessed. That is quantitative and qualitative analysis which is done for the comparison of Shirisha Grahaduma with the activated charcoal. So these are under quantitative analysis, iodine absorption, water content, ash content, volatile matter content, fixed carbon, tap density and bulk density were assessed, and under qualitative analysis, particle size was analyzed. Next slide, please. Moving on to the result. So in quantitative analysis, it is found that the iodine absorption is more in activated charcoal than in case of Shirisha Grahaduma, and water content is more in activated charcoal when compared to Shirisha Grahaduma. More in Shirisha Grahaduma than in activated charcoal, and ash content is more in Shirisha Grahaduma. Volatile matter content is more in Shirisha Grahaduma. Fixed carbon more in Shirisha Grahaduma. Tap density and bulk density, it is more in case of activated charcoal, and Hausner's ratio is almost the same in both the activated charcoal and the Shirisha Grahaduma. And here the particle size was, carbon particles are more crowded in activated charcoal when compared to Shirisha Grahaduma, and particle size is relatively smaller and well aggregated in case of activated charcoal, whereas it is larger, relatively larger in case of Shirisha Grahaduma. And the void space between the molecule is minimal in activated charcoal, where there is an aggregation of particles seen in case of Shirisha, and void space between the molecule is considerably higher. And surface area is visibly smaller when compared to Shirisha Grahaduma, but Shirisha Grahaduma is having an increased surface area in quantitative analysis, qualitative analysis. So these are the difference in particle size which is observed in case of activated charcoal and Shirisha Grahaduma. You can see that in the first picture it is less crowded, and the next one it is crowded. Moving on to the discussion, iodine absorption of Shirisha Grahaduma is comparatively less when compared to activated charcoal, which indicates that indicates less absorption of Shirisha Grahaduma, and there is a higher moisture content that can reduce the absorption capacity of carbon, and the water content is more in case of Shirisha Grahaduma. Next slide. And here the ash content. So ash content is also more in case of activated carbon, and ash content can reduce the surface area, and also it shows the impurities. Here the ash content is Shirisha Grahaduma is comparatively more than when compared to activated charcoal, and volatile matter can help evaluate the performance of activated carbon, and it also increases the absorption. And here the volatile matter in Shirisha Grahaduma is more when compared to activated charcoal. Next slide, please. Activated charcoal with a fixed carbon content more than 50% is considered as the best, and the Shirisha Grahaduma is having low fixed carbon when compared to activated charcoal. And Hausner's ratio, as I mentioned earlier, it is similar in both the activated charcoal and Shirisha Grahaduma. And here the Hausner's ratio shows an excellent flow property of the particles. And smaller particle size have larger surface area, which increases the absorption. And here the particle size in activated charcoal is smaller in comparison to Shirisha Grahaduma. Next slide, please. Next slide. Yes, coming to the conclusion, activated charcoal is commonly used in the treatment of various types of poisoning, including paracetamol, lead, and glorious superba toxicity. And Grahaduma described in Visha Chikitsa is indicated in several poisoning conditions. However, Ayurveda does not provide a definitive treatment for all forms of Visha, particularly Stavra Visha. Studies on volatile matter content and Hausner's ratio indicate that Shirisha Grahaduma has significant potential for poison absorption. Further research should therefore focus on in vivo studies within this framework. So with this, I conclude. Thank you.
Thank you, Doctor. Next, we go to
Yes.
the poster presentation.
Yes. Continuing with my poster presentation titled Viddha, an elixir in Visha Chikitsa. Every moment, human beings are exposed to a wide variety of poisoning, and it is imperative to have an advancement in science to protect our body from the harmful effect of poison. Viddha is the organ which is primarily affected by Visha, which results in death of an individual. Viddha can be considered as a universal antidote in Ayurveda, as it is Vishahara, Ojovarthaga, Vatapittahara, and it does Hridaya Varna and increases the longevity of a person. All the gunas of Visha are opposite to that of Ojas. So when a person is afflicted with Visha, Ojas is affected, and the seat of Para Ojas is Hridaya. So when a person is affected with Visha, Ojas is affected, which in turn affects Hridaya. Hridaya possesses all the gunas which can increase Ojas, so it can subside Visha, and moreover, Hridaya can act as antioxidant and free radical scavenger. Hridaya is like Ajay Hridaya, Amrita Hridaya, etc. can be used in Hridaya Varna. Hridaya can be used in different forms of administration, and there is nothing which is equivalent to Visha, sorry, Hridaya, which is equivalent to that of Hridaya, which can nullify the effect of poison. So moving on to certain conditions where Hridaya is indicated in Visha Chikitsa, Ekanayaga Muladi Neya, which is indicated in Vishaja Vrana, Pankti Prasunadi Nei in Vrana and Mandali Visha, Neeli Kadi Hridaya in Garavisha, Amalpuri Hridaya in all Visha, in all conditions, in all stages of Visha, Padadi Hridaya in Mandali Visha, Amari Muladi Hridaya in all the Vishas, Karalaka Amalpuri Hridaya in Mushiga Visha, Kotam Kumiradi Hridaya in all the Vishas. And when we consider the Sarpa Visha, Grudha Saindavadhara is used in Mandali Visha, Grudha Saindava Lepa in Rajala Visha, Tiktaga Grudha for Pana, Lepa, and Dhara in Mandali Visha, and Grihaduma with the Haridra, Dari Haridra, and Grudha internally and externally in all Visha, Tila and Sarshaba grinded along with the Grudha for Dhara in Karnika Padana. And certain other conditions of Visha, that is in Sarpa Visha, for Hridaya Varna, 1 Vilwadi Gulika with 1 tablespoon of Grudha to allay pain, Arkapatra Shweta, by dipping in Grudha, processed with the Saindava, to regain Agni, Vyosha with the Grudha in the first, second, and the third morsel of food, and to subside separation, Leba with Shadadoda Grudha. To eliminate the poison, Tiktaga Grudha will be continued 1 month after the treatment in case of Sarpavisha. And Shabdadodi Grida and the Jatyadi Grida for Vishaja Vrana, Neeli Daladi Grida is used in Luda Visha, Apamarga Kalka with the Grida in Mushiga Visha, and Grida with the Madhu for Pana in all Stavra Visha. Grida for Anjana if Arka or Snuhi Shira falls onto the eyes. So I repeat the same sentence which I mentioned in the beginning. Grida can be used in different forms of administration. There is nothing which is equivalent to Grida that can nullify the effect of poison, as it can be used in different stages and the different conditions of poison. Vinagradam Shamsanam Shastam, Pralebo Pojim Oshadam, Sarveshu, Sarva Avisteshu, Visheshu, Vinagradopama. With this, I conclude. Thank you.
Thank you, Doctor. Thank you for contributing valuable insights in this short period of time. Thank you so much for the paper and poster presentation, Doctor. And next we go to another presentation. Next, I would like to invite Dr. JSVS Nandakishore for the paper presentation. Dr. Nandakishore, are you there?
Yes, sir. Good evening, sir.
Good evening, Doctor.
Good evening. Myself, Dr. Nandakishore, final year PG scholar from NRS Government Ayurvedic College, Vijayawada. Today, my presentation topic is rationale behind selection of Ayurvedic dosage forms. First of all, we will discuss with basic introduction. Drug includes all the medicine intended for internal or external use, which aids in diagnosis, treatment, mitigation, or prevention of the disease or disorder in human beings. Coming to Ayurvedic part, Besaja, Tadeva Yuktam Besajam, Yada Arogya Kalpate. Basically is the one which helps in maintaining the health and cures a disease. Next, dosage forms. Dosage form is a physical form of a drug or combination of drugs prepared for administration to patients. Next, kalpana. Kalpana is the process or procedure which helps in transforming or helping in preparation of medicines either by single drug or combination of several drugs. Next, reasons for converting a drug into dosage forms. To make the drug palatable to the patient, to fix the accurate dose of the drug as per severity of the disease, to increase the potency of the drug, to increase shelf life, and to insert the drug into body cavities. Next, these are various dosage forms according to physical status of the product. Coming to liquid dosage forms, Swarasa, Kashaya, Hima, Fanta, Pramatya, all these are liquid dosage forms. Semi-solid dosage forms are Kalka, Avaleha, Lepa, Sikta, Taila, Malahara. And solid dosage forms are Churna, Rasakriya, Kanda, Gudabaka, Gugulu, Satwa, Lavana. All these are different dosage forms based on physical status of product. Next, coming to main topic, criteria for dosage form selection. The factors which are responsible for dosage form selections are based on requirement of particular chemical constituents, based on dosha dominance, based on agni of the patient, based on stage of disease, and based on patient's disease, shelf life, and practical considerations. Let's discuss these things one by one. Based on requirement of particular chemical constituents. If water-soluble extracts are needed in a disease, then Kashaya is prepared. For example, in Gudichi Kashaya, Gudichi contains phytoconstituents like tinosporin, tinosporide, magnoflorin, and polysaccharides. These phytoconstituents are water-soluble and dissolve easily in hot water during Kashaya preparation. If fat-soluble principles are needed, then Taila, Gruta, all are preferred. For example, Brahmi Gruta. Brahmi contains saponins like bacosides, alkaloids like brahmin, herpestine. These phytoconstituents are fat-soluble in nature and can be extracted easily during Gruta preparation. As Brahmi Gruta is prescribed for memory enhancement and cognitive functions, fat-soluble molecules plus Gigi medium can cross the blood-brain barrier easily and more effectively than water extracts. If volatile oils are to be used, then Churna or Hima can be opted. For example, Dhanyaka Hima contains volatile oils. These volatile oils, there is a chance of evaporation of this volatile oil on heating. Hence, Niragni Siddha Kalpana is chosen. Coming to based on dosha dominance, in Vata predominant conditions, the person have Ruksha, Lagu, and Seta qualities. Hence, dosage forms possessing Stigdha, Guru, Mrudu properties are preferred to balance these attributes. Like Taila, Avaleha, and Chetna Arista formulations have Stigdha properties and helps in nourishment and specifying Vata. In Pitta dominant conditions, Pitta exhibits Ushna and Tishna qualities, necessitating the use of cooling and soothing dosage forms like Hima, Grita, and Asva possess Sita and Mrudu properties. They help in mitigating excessive heat and sharpness, thereby restoring Pitta balance. In Kapha dominant conditions, person possess Guru, Snigdha, and Manda qualities. To counteract these qualities, preparations like Churna, Kvata, Fanta are preferred as they possess Lagu, Ruksha, and Tishna properties. Next, based on Agni. In Manda Agni, patient has very low power of digestion. Light and easily digestible preparations are preferred, which help in preventing Aushadha Ajirna. If we give heavy preparations like Avaleha, patient cannot digest all those things, Aushadha Ajirna may occur. That's why Fanta, Hima, and like Vata are preferred. In case of Mandagni, moderate digestive strength permit use of wider dosage forms. Selection is guided by disease stage and predominance. Hence, Kvata, Churna, and Vati are preferred. In Tikshagni, Avaleha, Gruta are preferred, which help in nourishing and prevent rapid drug elimination and ensure prolonged therapeutic effect. Next, based on stage of the disease. In Amavastha, therapeutic objective is Amapasana and Agni-repana. Hence, light and easily digestible dosage forms can be preferred like Fanta, Hima, Lagu, Kvata, Ushnodaka are preferred. In Dosha Pradhana or Niramavastha, Dosha Shamana and disease-specific management is the main objective. In these conditions, Kvata, Vati, Churna, Sneha are preferred. In Jirnavastha, Dhatu Poshana, Rasayana, and prevention of recurrence is the main therapeutic objective. Then Avaleha, Asava, Arista, Sneha, Rasayana formulations are preferred, which helps in to counteract Dhatu Kshaya, Srotarodha, and long-standing dosha involvement. Based on patient disease, in diabetic conditions, dosage forms like Asava and Arista should be avoided in larger doses and for longer duration, as they contain sugar and may worsen glycemic control. Hence, dosage forms like Kvata or Vati can be preferred. Then, shelf life and practical considerations. Like Swarasa. Swarasa is preferred when the rapid therapeutic action is required, especially in acute conditions. Kvata is preferred when water-soluble extract are needed. When there is need of external application and localized therapeutic effect, Kalka is preferred. In case of Pitta and Rakta predominant conditions and heat-sensitive principles are needed, then Hima is preferred. In case of early disease and patients with reduced strength, Fanta is preferred. When volatile and aromatic constituents are required, then Arca is preferred. Asva and Arista are preferred in chronic diseases due to longer shelf life and enhanced and palatability and enhanced absorption. Vati and Gutka is preferred when there is need of accurate doses. Avaleha is preferred in children due to its enhanced palatability and nourishing preparations. Gruta is preferred in Vata and Pitta disorders, chronic diseases, and conditions involved in mental faculties. Thaila is preferred mainly in Vata disorders and for external therapeutic applications. Then coming to same Dravya in different dosage forms. When we see Ballataka can be given in Ballataka Vati, Ballataka Avaleha, Ballataka Thaila, Ballataka Grita. But each dosage form can be indicated in different diseases. Coming to Ballataka Vati, it can be indicated in Suskashas. Then why Vati is preferred? Vati is dissolves quickly in GI tract and acts directly on Amasya and Pakvashaya, hence indicated in Arshas. Sushka Arshas are caused by predominance of aggravation of Vayu and Kapha. Vati are dry and compact preparations. Hence, they contain Lagu, Ruksha, and Tikshna in nature. Acts opposite to Kapha and Ama and helps in clearing Kapha and Ama. In GI disorders, Vata aggravation means Vata is blocked or obstructed by Kapha and Ama causing irregular bowel movements, constipation, and pain. Once obstruction is cleared, Vata starts moving in its normal gati. Coming to Ballataka Avaleha, can be indicated in chronic Kushta. Symptoms of chronic Kushta are Kandu, Vaivarnya, Dorbalya, Parusha. In chronic conditions of Kushta, Dosha Samuchana takes place. Dosha penetrates deeply into dhatus, especially like Rasa, Mamsa, Lasika, making it difficult to cure. Then Ballataka, which has penetrating nature, enters into Srotas, clear blocked channels of Tvak, Mamsa, Rakta dhatus, helps in Doshochana. Then why Avaleha form is preferred? While Doshochana, the Samanya dhatus, especially Rasa, Rakta, Mamsa, can also lose Bala. Patient may experience Dorbalya, Sosha. Then Gruta, Madhu components of Avaleha helps in Balyakara, preventing Dhatukshaya, Dorbalya, often seen in chronic Kushta. Ballataka Gruta. Ballataka Gruta indications Apasmara, Unmada, and other mental conditions. In both Apasmara and Unmada, the channels of heart are afflicted by vitiated doshas. Ballataka has Medhya property and helps in Manovahas Rota Shodaka. Due to its Ushna, Tikshna, Lagu, Sukshma properties, the afflicted channels by removing vitiated doshas. Why in Gruta form? Gruta carries Ballataka's Ushna, Tikshna Guna deep into Sukshma Srotas and prevent Rukshatva. Gruta, being Sukshma and Vyavahi, crosses blood-brain barrier easily and spreads quickly deeper into the brain channels. Coming to conclusion, Yogadapi Visham Dikshnam Uktam Beshjam Bhavet, Beshjam Chabdurjiktam Dikshnam Samadhyate Visham. Even acute poison can become an excellent drug if it is properly administered. Properly administered means the drug should be given in proper matra along with proper anupana, in proper route of administration, proper time, in proper dosage forms. If we miss any of this, it will act as a poison. Delivering the right drug in right form at the right time ensure optimum absorption and gives desired therapeutic outcome. Thank you.
Thank you, doctor. Thank you for the insightful presentation. Thank you so much, doctor. Next, we go to another presentation. I would like to invite Dr. Sakshi Srikant Jadhav for the paper presentation. I would like to invite Dr. Sakshi Srikant Jadhav for the paper presentation.
Yes,
Good evening, doctor.
good evening. Just a second. Is my screen visible?
Yes, doctor. Screen is visible, doctor. Please start the session.
Okay. Good evening. I'm Dr. Sakshi Jadhav, a final year PG student, Department of Chikitsa. Today I will be presenting on paper on Raktagat Vat in hypertensive emergencies, reinterpreting classical concepts in modern critical care. Hypertensive emergency is defined as a sudden and severe elevation in blood pressure accompanied by acute target organ damage, such as encephalopathy, myocardial ischemia, pulmonary edema, or renal impairment. Immediate blood pressure reduction using intravenous antihypertensives is essential to prevent mortality. In Ayurveda, it is not directly described as hypertension, yet clinical practice often correlates elevated blood pressure with Vat-dominant pathology among the various Vat disorders. Raktagat Vat, a condition where aggravated Vat localizes within Raktadhatu, offers a more precise interpretative model. Classical description in Charak Samhita explain that vitiated Vat entering Rakta produces symptoms such as pain, throbbing, discoloration, burning sensation, and circulatory disturbances. This paper examines whether hypertensive emergencies can be understood through this classical lens. So, materials and methods will be to study Vartagat Rakta and modern literature. In classical references describing Vat Prakop, Raktagat Vat Lakshan, Vatarakta interaction, and studying interpretative framework will be developed to identify parallels between both systems. So, in classical understanding of Raktagat Vat, Vat will be aggravated when excessive stress, irregular diet, Ruksha, Lagu, and Alpa Ahar, sleep deprivation, and mental strain. This happens, and after that, it will lead to Raktadhat. Uh, the Vat will localize in Raktadhatu, leading to severe headache, Shirashur, giddiness, visual disturbances, pulsatile sensations, redness or discoloration, and sudden systemic aggravation. The core pathology will involve the increased chalatva due to Vat, Rukshata, and Veg, forceful movement within the Rakta. In modern pathophysiology, hypertensive emergencies involve sudden elevation of systemic vascular resistance, endothelial dysfunction, increased shear stress, breakdown of autoregulation, and target organ ischemia, which will lead to severe headache, blurred vision, epistaxis, chest pain, acute pulmonary edema, acute kidney injury, and altered mental status. So, comparing the modern and Ayurvedic terms, severe headache in hypertensive emergency will lead, which is similar to Shirashur in Raktagat Vat, visual disturbances, which is similar to Vat affecting Rakta supply to Netra. Epistaxis is Rakta Dushti with Vat aggravation. Chest pain, Vat induced vascular spasm. Acute pulmonary edema, Vat induced circulatory imbalance. And renal dysfunction include similar to impaired Rakta flow affecting Mutra Vastutus. The increased pressure and forceful circulation seen in hypertensive crisis resemble aggravated Vat acting within Rakta Dhatu. So, hypertensive emergencies are acute life life-threatening conditions requiring immediate modern intervention. From an Ayurvedic perspective, the sudden escalation of pressure and vascular instability reflects Vat Prakop, Raktadushti, possible Strotorod contributing to vascular resistance. Stress, erratic lifestyle, sleep deprivation, and dietary irregularities, common triggers in hypertensive patients, are classical causes of Vat aggravation. So, Raktagat Vat explains turbulent circulation, vascular spasm, organ ischemia, and neurological manifestation. However, it is critical to emphasize that Ayurvedic management does not replace emergency antihypertensive therapy. Instead, Chikitsa principle may contribute in long-term vascular stabilization, prevention of reoccurrence, correction of underlying Vat imbalance, and rasayan for vascular health. So conclusion is Raktagat Vat provides a meaningful classical framework to interpret the hypertensive emergencies within Ayurvedic thought. The acute surge in vascular pressure and organ dysfunction parallels the description of aggravated Vat localizing Rakta Dhatu. While modern critical care remains the cornerstone of acute management, Kai Chikitsa principle may play a significant role in long-term stabilization and recurrence prevention. Integrative understanding enhances both conceptual clarity and clinical applicability. Thank you.
Thank you, Doctor. Thank you for the well-structured presentation. And next we go to the another paper presentation related to the Takradhara in psoriasis. I would like to invite Dr. Shanti Thomas for the paper presentation. Good evening, Doctor.
Good evening, sir. Good evening. Okay, let me open my screen, sir.
Okay, Doctor. Your screen is visible, Doctor.
Okay. Good morning. Today's my topic is related to Takradhara in psoriasis. Introduction. Psoriasis is a chronic skin condition that affects millions of people. Okay. Psoriasis is a chronic skin conditions that affect millions of people worldwide, which causes issues to both physical and mental health. The root cause has to be treated first to control the disease. This is where Takradhara treatment, an ancient Ayurvedic therapy, offers a promising result. By integrating holistic healing with deep-rooted Ayurvedic principles, these therapies can eliminate the symptoms and its reappearance. Psoriasis is usually caused from imbalance of body's doshas, particularly Pitta and Kapha. It's connected to accumulation of toxins or ama in the body. It's a procedure. Takradhara is a procedure in which medicated takra is poured into a continuous stream through thumb at a height of 12 angula over the body parts. The buttermilk is blended with certain medicinal herbs depending on patient's treatment requirements. Psoriasis is usually occurs from the imbalance of body's doshas, as I told earlier, particularly of Pitta and Kapha. It's a cooling, refreshing Ayurvedic therapy and which is effective in the treatment of skin disease, especially in psoriasis. Okay, materials and methods is based on different references in Ayurvedic text. What are the common causes and triggering factors in psoriasis? The main factors are genetics, hormonal changes, infections, environmental triggers, lifestyle factors, etc. The triggering factors may include skin injuries, infections. Lifestyle factors include smoking, excessive alcohol, high stress, climate change, especially of cold and dry conditions, and in certain medications that also cause continuous flare-ups. Then hormonal changes, that is during puberty and menopause, Those are another potential triggers. Then next, we'll see what are the effects of Takradhara in psoriasis. As I told earlier, it removes the toxins that it causes skin to smoothen, which reduces the inflammation, which improves the circulation, which calms the nervous system, and which balances both mental and emotional well-being. Next, we'll see what are the reference related to Takradhara. It's mainly indicated in Pitta and Kapha dominance. According to Ashtanga Hriday, Sutrasthan, Shirodhara with appropriate dravyas, which calms Pitta and Kapha, and which helps in resolving skin and neurological disorders. Another reference from Sushruta Samhit, Chikitsa Sthan, which explains related to the milk pouring in overheads, which cause an auspicious relief. Then according to Charaka Samhita reference, Takradhara can act as Deepanapajana and Kapahara and is very effective in skin disease. Next, we'll see what are the ingredients and its preparations. Milk, water, musta, amlaki, and other drugs also can be selected according to different disease conditions. In this preparation of Takradhara, 1.5 liters of milk can be added with 4 times of water, and it can be boiled with 100 grams of musta, clean and crushed musta, and it can be reduced to 1/4. And afterwards, musta can be sieved and can be allowed to ferment. Depending on the different conditions, we can use or select different kwadas. What's the mode of action here in Takradhara in psoriasis? Takra contains lots of lactic acids. It's a good vehicle for the transdermal absorption of drugs. Musta amlagi, those having an antioxidant properties and which act as kushtagna. Takradhara process is Shamana Karma, where dosha kopa and which relieves stress and induces good sleep. Dhara of Takra mixed with the drugs or forehead produce conduction and which act as tranquilizer, which gives in good sleep in case of psoriasis. Amlaki and Musta is having anti-inflammatory and antioxidant properties. It's very useful in psoriasis that controls scaling. Takradhara relieves insomnia, shiroru, bhrama, klama, etc. Those are associated with psoriasis. According to Acharya Sushruta, Stavanimarma is seen between 2 eyebrows and which act on these marmas, and it has some reflex action which helps to reduce the disease. The next will go to the discussion. Vitiated Vayu enters into the Rakta Dhatu is the cause of the disease. Here, the Rakta and Pitta have an inseparable relationship as the Pitta resides in Rakta. When the Pitta gets vitiated, it can vitiate the Rakta. As you know, Takradhara can pacify Pitta dosha and thereby it can reduce the disease conditions. During the process of prolonged Dhara of Takra mixed with the drugs, our forehead generate a conduction which acts as a tranquilizer and that induces good sleep. Here the Shita Guna of Takra is helpful in this action. Coming to the discussion part, Takradhara is discussion is continuing this slide. Takradhara is the unique procedure for different types of manasa doshas. When it is poured into a continuous stream over the forehead that stimulate the marmas. As we know, marmas are the vital energies of body. Marmas located in the head are Apanga, Varta, Shanga, and Ucheva, Simant and Stabani. Takradhara improves marma circulation, which in turn improves the blood circulation of brain. This reduces the psychological disturbance, which is helpful in psoriasis cases. Pouring Takradhara in entire body is known as Sarvangadhara, and Ekangadhara is focused on the specific affected parts. As Ayurvedic treatment is based on treating the root cause, Takradhara, by cooling, detoxifying, and rejuvenating properties, stands an excellent remedy for those suffering from disease. Let me move to the conclusion part. Takradhara is an effective cooling and refreshing detoxifying Ayurvedic therapy which bring down the equilibrium of doshas. In addition to that, it also addresses a variety of health conditions such as high blood pressure, insomnia, and premature graying of hairs. As psoriasis is a psychosomatic disease, the total Takradhara process helps in reducing the disease conditions. Takradhara treatment provides a holistic and effective approach for those suffering from psoriasis. Thank you. Thank you. Thank you all.
Thank you, Doctor. Thank you for the well-structured and thoughtfully delivered session. Thank you so much, Doctor.
Thank you. Thank you so much.
And next we go to the another paper presentation. Next, I'd like to invite Dr. Shweta Vishwanath Suryavanshi for the paper presentation. I'd like to invite Dr. Shweta Vishwanath Suryavanshi for the paper presentation.
10 minutes or 5 minutes, I'm stuck at traffic. I will be reaching home at
Okay, Doctor. Okay, Doctor.
Please, sir.
And next we go to the another presentation. Next, I would like to invite Dr. G. Kasturi for the paper presentation. I would like to invite Dr. G. Kasturi for the paper presentation.
A very good evening to respected dignitaries. Today I am going to present a topic on healthy aging. Here, aging refers to jara, which is svabhavika. Aging here is not prevented, but still it can be modified in the quality of life. What happens in the old age? There will be the dhatukshaya, agnimanyata, ojaskshaya, and vata dosha pradhana will be there in the old age. These are the common diseases or symptoms that can be seen in the old age. Related to the heart, there may be the palpitations, that is related to the hypertension, arthritis, or else joint stiffness. Then coming to the blood sugar levels, it may be raised, and decreased urine output, then memory issues. What are the general practices that are mentioned in the Ayurveda? Starting from dinacharya, here it is related to the daily routines, but here mainly we have to consider the sleep appetite and bowel. Then sadvrutta. Sat is good, vritta is conduct, good conduct. By these things we can prevent the memory issues or else maintain the health issues like hypertension, anything like that. Then coming to the ahara, mudga, yava and ghee. Mudga is easily digestible. Then coming to yava, it gives the strength, it gives the nourishment. Then coming to the ghee, gives the snigdhata, it increases the snigdhata to the body. Then coming to the panchakarmas, Here we can advise the Kshira or Matra Bastis. Then coming to the Nasya, Pratimarsha Nasya can be advised with Anutaila. Then coming to the Mrudu Virechana. In constipation, most old age people, they will be having constipation. To prevent or else to cure that, we are giving the Mrudu Virechana. We can give the Mrudu Virechana. Coming to the Sarvaroga Sadharanya Patya and Apatya. These are Patya. Mudga, Saindava, Amalaki, Shashtikshali, Kshira, Jangala Mamsa, Madhu, Trifala and Ashwagandha. All these can be given as Patya. Then coming to the Vihara, Snana, Vyayama, Nidra, Pratimarsha Nasya and Dantadavana. All these are considered as Patyas. Coming to the Apatya, Shushka Shaka, Shushka Mamsa, Kulatta, Kodrava. Coming to the Vihara, Ratri Jagarana, Divaswapna, Adhyashana, Ativyayama. All these should be avoided. These are systemically or Shrotas related. Classification and its treatment. This can be used as prevention also, promotive also, curative also. Rasava Shrotas and Raktava Shrotas. Here Vata Pitta imbalance will be there. Rasa and Rakta Kshaya will be there, which can be correlated to the hypertension, arterial stiffness, increased circulation. Here Arjuna Kshirapaka, Dashamula, Lagu Ahara and Sukoshna Anna, Pranayama. All these can be advised. Coming to the Mamsavaha, Medavaha and Astiva Shrotas, Astitatu Kshaya will be there. It may be resulting in the osteoarthritis or poritis, or sometimes stiffness of joints will be there, muscle wasting and then back pain. It may be also can occur. Then coming to the treatment, promotive or curative or preventive, Mahanarayana Taila, Abhyanga, then Abhyanga with Bala Taila also to increase the nourishment, Kshira Basti, then Laksha, Ashwagandha, Kshira, Grita, Tila and Yoga. That is mild to moderately it can be advised. Majja, Shukra and Manovashrotas. Here there will be the Vata, Vyana Vata aggravation, which can be correlated to the hormonal decline, memory depletion and insomnia. Here major rasayana like Brahmi, Shankapushpi, Mandukaparni, Ashwagandha, Shirodhara and Pratimarsha Nasya with Anutaila. All these can be done, which helps in preventing the old age diseases. Then Annavashrotas. There will be having Agni Mandyata and Apana Vayu aggression will be there. Decreased appetite, constipation and malabsorption will be there. Here we can advise them Trikatu Churna, Hingvastaka Churna, Mrudu and Snigdha Ahara and Mrudu Virechana. As I already mentioned, like Mrudu Virechana, which helps in constipation. Then coming to the Indriya. Indriya Balakshaya will be there. Alochaka Pitta disturbance will be there. And then Indriya, here we can relate it to the cataract formation. Then hearing loss, reduced taste or smell, which can be managed. All these Indriya problems can be managed with the Trifala Churna with Madhu, then Netra Tarpana, which helps in the vision problems. Then Pratimarsha Nasya with Anutaila. Then Kankola Arka. Recently there is a research done, Kankola Arka, which helps in the refractive errors. And cataract also. In cataract also it can be used. Here each dhatu is formed from the prior dhatu. Rasa dhatu. Rakta dhatu will be formed from the rasa. Rasa will be starting from which will be getting nourished from ahara rasa. And in that Sara Bhaga, essence Bhaga, it will nourish the Rasa Dhatu. Then it nourishes the Rakta Dhatu. Like that, each Dhatus will be nourished by the prior Dhatus. Then coming to the Rasayana. Rasayana, it is of three types, Kamya, Ajastika and Naimittika. Kamya, it is for longevity. Then Ajastika, it is nourishment, nutrition based. Then Naimittika Rasayana, disease specific. Kamya, that can be given for it can be given to improve the longevity. Then Ajastika, it is nutrition based. If something is there is depletion, it can be managed by the Ajastika type of Rasayana. Then Naimittika Rasayana, disease specific. Then coming to the Achara Rasayana, here all this Satyavadinam, talking to the truth, all this helps to regulate the mental attributes. Then there are two drugs that are mentioned in the Achara Rasayana, Kshira and Krita, which can be taken regularly. Then coming to the Rasayana therapy, here I have specified the each Rasayana and its function. Amalaki Rasayana, it helps in the oxidative aging. It decreases as it is having some antioxidants. It will reduce the oxidative stress. Then coming to the Guduchi, which helps in the autoimmune diseases. So in immune aging also it can be used. Then coming to the Ashwagandha, which helps in the neuromuscular aging. It as there is wasting, muscle wasting, it helps in the muscular mass, to improve the muscular mass. Then coming to the Haritaki, which helps in the gut metabolic aging. Actually, Haritaki, it does the Anulomana action. It does the Vatanulomana. So it clears the gut and helps the old age person healthy. Here oxidative stress, it can be correlated to the Dhatukshaya, mitochondrial dysfunction, that can be correlated to the Agni Manyata. Then fragility, Vata Vruddhi. Because of Vata Vruddhi, this can be fragility happens. Thank you.
Thank you, Doctor. Thank you for the well-explained presentation. And next we go to the another paper presentation. I would like to invite Dr. Shweta Vishwanath Suryavanshi for the paper presentation. Dr. Shweta Suryavanshi, are you there?
Yes. Good evening, sir.
Good
Myself,
evening.
Dr. Shweta Suryavanshi. One second, sir. I'm sharing the screen. I'm pursuing my PG in Chikitsa. So I have chosen the topic. My topic is role of Guduchi in the management of Vata. That Vata resembles the rheumatoid arthritis with joint pain in modern terminology, which includes symptoms like joint pain, swelling, stiffness. The pathology is that caused by ama accumulation and vata vitiation. Guduchi, that is Stenospora cordifolia, has Deepan, Pachan, Vatshamak, and Rasayan actions. So it integrates Ayurvedic principle with modern pharmacological evidence. Introduction. Armor accumulation due to impaired Agni and aggravated Vata localized in joints. So comparable to autoimmune rheumatoid arthritis in modern science. Guduchi, that is Amrita or Giloy, is a rasayana promoting immunity and rejuvenation. Described as Tridoshahara, Ampachaka, Vata Shamaka, modern study shows anti-inflammatory and antioxidant effects of Guduchi. So the material methods, I have used many classical Ayurvedic texts. Mostly the discussion of this Vata topic comes in Madhav Nidana. Also Charak Samhita, Sushuk Samhita and Bhav Prakash Nighantu. The databases I have used is PubMed, Scopus, Google Scholar, etc. So the results are Ampachna, which means Guduchi has prabhav, which helps in ampachna, that is digestion of ama, agni dipana, that is enhancement of digestive fire, vata shamana, that is pacification of vat, stoto shodhana, that is cleansing of channels, rasayana, that is rejuvenation. Guduchi properties support all the therapeutic requirements which are needed for the treatment of amvata. Also, it contains alkaloids, ditropenoid, lactones, glycosides, polysaccharides. It has anti-inflammatory reaction that decrease the TNF alpha and 1 beta. Immunomodulatory effects. It has also antioxidant activities, antioxidants which are free radicals in our body. So Guduchi helps in reducing that free radicals. It also has hepatoprotective and detoxifying actions. It has analgesic activity which reduce the joint pain. As we know, Amvata has main complaints like Artavarnata, Sparshasahatva, and Shul, which is mostly present in sandhis like kurpar sandhi, manibandha, etc. Mode of administration: the guduchi can be taken in many forms, like guduchi kvatha, which helps in arm pachana and vata shamana, because the samprapti starts from arm and vat. Arm and vata are the main things which causes the arm vata. Guduchi churna, which has digestive enhancement. Guduchi sattva, which has rejuvenative tonic. And also it can be used in the form of guduchi ghanavati, which is convenient for the long term use. Discussion: armor formation due to impaired digestion is key pathology of arm vata. So guduchi addresses the root cause and symptoms. As guduchi, we know guduchi Tinospora cordifolia is ushna, snigdha, and ushna viryatmak and snigdha gun. So it helps to decrease the vat symptoms. It enhances metabolism, it reduces inflammation, and rejuvenates the tissues. Comparable efficacy to conventional drugs with fewer side effects. Uh, uh, Antioxidant actions which protects the joint tissue. So guduchi is a potent herb from Amvata management. It has actions such as Ampachana, Agni Dipana, Vata Shamana, Rasayana. Overall, we can see these actions as we look into Samprapti, by its action it reduces the Samprapti at every step, and it reduces the inflammation, modulates the immunity, improves the joint function. Validated by classical text and modern research. It also offers a holistic, sustainable, and therapeutic approach, which is the biggest approach of Ayurvedic science. So here are the references which I have used. Thank you, sir.
Thank you, doctor. Thank you for the well-articulated presentation. Thank you so much, doctor. And next
Yes.
we go to the another poster presentation. Next, I would like to invite Dr. Rashmi J. Mishra for the poster presentation. I would like to invite Dr. Rashmi for the poster presentation. Dr. Rashmi Mishra, are you there? Dr. Rashmi Mishra, are you there? Dr. Rashmi Mishra, are you there?
Hello.
Please unmute.
Hello.
Good evening, doctor.
Good evening, sir. Sir, I'm not able to share my screen.
Okay, doctor, we will share for you. Just a moment, doctor. Please start the session, doctor.
Good evening, everyone. I am Vaidya Rashmi Mishra. I'm a third-year PG scholar from Department of Kamar Bhritya, Sumatbai Ayurved Mahavidyalaya, Pune. Today, I am presenting a conceptual comparison between the classical Ayurvedic protocol, that is Navjat Balak Paricharya, and the modern NRP, that is Neonatal Resuscitation Program, that is given by American Heart Association. So, neonatal stabilization is in the first few minutes is very critical. Modern medicine calls this as a golden minute. Interestingly, Bruhatrai has described the structured protocol for immediate newborn care centuries ago. My objective is not to claim equivalence, but to explore whether there are conceptual parallels exist between these two systems. So, our Bruhatrais have had different opinions on what should be the first step of this resuscitation. Acharya Charaka has given Pran Pratyagaman to be the first step, Sushrita Mukha Vishodhan, and Vagbhat as an Ubha Parimarjan. So, based on my understandings, Pran Pratyagamana should be the first step, because prana is none other than life, cardiorespiratory function. So Charaka has given resuscitation of the fetus as striking stones nearby the ears of this child, and then Shitodak, Ushnadak, Mukha Parishek, sprinkling hot and cold water. And if the baby does not stabilize by that, then there is Krishnaka Balika Kshup fanning, which is nothing else but maximizing the oxygen around this baby. Vagbhata has given many signs and symptoms of asphyxiated child, and for its revival, he has given Balatel Sechan, Ashmavadan at Karnamul and Dakshin Karna Mantrocharan. These actions are nothing but stimulating sensory pathways, respiratory centers in brain, and thermoregulation. Similarly, modern NRP also begins with warmth, positioning, clearing airways, and stimulation. Both of these systems prioritize initiation of respiration as prana, and this is the first life-saving step in neonatal resuscitation. Then the second step would be Mukha Vishodhan. A specific sequence has been given as an Talvoshta Kantha Jiva Pramarjan with Anguli, and the Anguli should be Suparilikit and Suprakshalit, and it is often done with Sandhav Sarpi. It is done for Kantha Vishuddhi and Lagav, and clinical prevalence is to prevent aspiration, clears airway secretions, and maintain airway patency. Similarly, modern NRP also clears airway, and we do a mouth and nose suctioning to clear the secretions. Then the next step should be Nala Chedan. A detailed description of Nala Chedan has been given as cutting the cord at specific distance. Charak and Sushrut has given the distance to be 8 anguli and Vagbhata as in 4 anguli distance. And then we should minimize the bleeding, and to prevent infection, Kushtatel Sechan has been given. It is similar to delayed cord clamping given in NRP with sterile techniques. Additional to that, Charaka has given Lodhra, Madhu, Priyangu, Surdaru, Haridra, Tel Sechan and Avachurnan also to prevent the infection. Then Acharyas has given Snana, like Snana with Shiri Vruksha Kashaya, Sarva Gandhodak, Tapta Rajat Nirvapan and Kafita Patra Kashaya. In the Acharya's time, there were no radiant warmers or other methods to prevent hypothermia. So they used to give warm water baths to prevent hypothermia and to focus on thermoregulation. Rajat Nirvapan also helps as an immunomodulator because skin is the first contact for any newborn. So to provide immunity, Rajat Nirvapan was used. Then the next step was Jalaukavacharana. Madhu, Sarpi, Ananta Churna used to Lehan was used in the Jalaukavacharana procedure. It enhances the Ayushya Bala and Medha of the child. As per modern science, the child should be exclusively breastfed because considering neonatal gut immaturity and dysbiosis, we don't give anything else than exclusive breastfeed for the first 6 months to the child. But what is important to know is the intent of the acharyas to prevent hypoglycemia and to provide immunity. Because in the modern NRP also, we give vitamin K prophylaxis, BCG and OPV immunization, hepatitis B administration. So here the objective is to strengthen the neonatal resilience, which is comparison in both of the systems. Then the breastfeeding. Acharya has stated in Ashtanga Hridaya that Matureva pibes stanyam tadbalam deha vruddhaye. Modern NRP also emphasizes on early breastfeeding, skin-to-skin contact, and colostrum. This is a major area of convergence because both of this system understands early feeding and supports immunity, bonding, physiological adaptation, that is Vatsalya and Sneha, described in the in our Ayurveda science. And also there are many techniques for infection control such as Dhupan with Sarpi Nirmuk, Maniratna Dharan and Raksha Karma with Pilu, Badar, Nimba Parushak Shakha and Shom Vastra. So this presentation does not claim that Navjat Shishu Paricharya replaces modern NRP because NRP includes positive pressure ventilation, chest compressions, advanced life support, but it demonstrates that the ritual, Navjat Balak Paricharya is not just mere rituals, but it is an rational thinking of our acharyas, and it shows the understanding of physiological priorities. People consider Ayurveda as a pseudoscience, but all these protocols show that the Navjat Balak Paricharya is actually the blueprint foundation for the modern NRP because both of the systems have many similarities like airway, umbilical cord care, then immunity and breastfeeding. So takeaway point from this presentation is airway care, umbilical cord hygiene, early feeding and immunization. In many rural parts and resource-limited settings in India, delivery facilities are not immediately available. ASHA workers are the first point of care in such facilities. So under the National Health Mission, if we train ASHA workers in these all aspects of Navjat Balak Paricharya like airway awareness, clean cord practices, and incorporating Ayurvedic knowledge of Kushtatel Sechan, Lodhra Madhu, Priyangu Surdaru, Haridra Kalpa, Avachurnan, then maintenance of warmth, early breastfeeding, immunization, we can strengthen community level newborn care. So I hope this presentation avenues for integrative neonatal research, reinterpretation of classical text in modern context, and evidence-based evaluation of traditional practices. I have given the references of my presentation at the end of the slide. Thank you so much, sir.
Thank you, Doctor. Thank you for the well-explained presentation. And thank you so much, Doctor. And next we go to the another paper presentation. I would like to invite Dr. B. Venkatalakshmi Padmavati for the paper presentation. I would like to invite Dr. Venkatalakshmi Padmavati for the paper presentation.
Good evening, everyone. I'm Dr. Divya Padmavati, PG Scholar of Chikitsa Department. Today I'm going to present on importance of Vata in Mansurogas. As we all know, mental disorders are increasing rapidly in today's stressful life. According to Ayurveda, these conditions were explained thousands of years ago under the concept of Manasrogas. The classical text emphasizes not only herbal drugs but also Snehakarma, especially Vrutta, as a primary therapy for the mind. According to Ayurveda, mind functions through three qualities, that is, Sattva, Rajas, Tama, Iti Guna, Manasa, Shweta. Sattva, Rajas, and Tamas are the fundamental qualities of the mind. When Sattva is dominant, the person has clarity, stability, and proper judgment. But when Rajas and Tamas become aggravated, mental imbalance occurs. These vitiation-related gunas obstructs the manosrotas, the channels responsible for mental functioning, and causes many disorders like Chitta Udveda, Avada, Asmara, Vishada. Now we will see why Gurta is important. Among all the snehas, Ayurveda considers Gurta as the best for brain and mind because of its unique properties. That is, Samskara Anvartana. Gurta observes the qualities of herbs processed in it without losing its own property. And Yogavahi. It carries active components deep into the tissues, even subtle channels. Because of these features, medicated ghee acts as a drug delivery system, which something the modern pharmacology recognized today. The explanation of yoga vahi in modern correlation, like the cell membrane is mostly made up of lipids, so as the sneha, which is lipid soluble, it dissolves active phytochemicals, which enhances the absorption of those through the cell membranes and acts like a biological drug delivery system. The clinical importance of it increases the potency of the hertal formulations required in Sneha Kalpana preparations, especially useful in neurological and psychological. These are some of other important features of Rutai. It causes nausea, improves memory, cognition, promotes intelligent perception, and also it acts as rasayana. How it shows the effect on many Mahashrotas is Gurta directly influences mind, pathway, and higher mental centers by its subtle, that is, Sukshma Gunam, cooling and stabilizing property. and also it promotes sattva. In disorders like Purnima, depression, insomnia, emotional instability, we can use the Grita. Why Grita? Modern science surprisingly supports the classical observations. There is a lipid rich and crosses the blood-brain barrier easily. So herbs processed in Grita reaches the brain more efficiently compared to water-based preparations. It acts as a lipid-soluble drug carrier, increasing bioavailability of phytochemicals. How we can administrate Grita in brain disorders or through Nasya or internal administration, that is oral administration, is an article where mentioned Grutha can cross the blood-brain barrier and the importance of Grutha in drug delivery system. And the neurochemical actions of Grutha are antioxidant activity, anti-inflammatory effect, neuroprotective action, neurotransmitter modulation, and the clinical application of Kruta is anxiety disorder, depression, epilepsy, neurodegenerative diseases, memory impairment, behavior disorders in the children. Some of the medicated keys are Brahmi Kruta, which increases memory and concentration, Kalyanika Kruta in psychiatric disorders, Panchagavya Kruta in epilepsy and psychosis. And today I want to conclude that Kurta is not merely a dietary fat. It is a specialized therapeutic substance designed for the brain. It nourishes the nervous tissue, balances the doshas and gunas, enhances cognition and memory, acts as a natural drug carrier, supports mental stability. Therefore, Kurta holds a unique and irreplaceable role in the management of Mansarovar. Understanding this concept helps us integrate Ayurveda with modern neuroscience and develop safer treatment for mental health disorders. Thank you.
Thank you, Doctor. Thank you for the remarkable presentation. And next we go to the paper and poster presentation. I would like to invite Dr. Nagkrishna Balaji Kumpalwar for the paper and poster presentation. First we go to the paper presentation. Once again, I would like to invite Dr. Nagkrishna Balaji Kumpalwar for the paper presentation.
Hi everyone, my name is Dr. Nagkrishna Balaji Kompalwar. I am BMS MD scholar, student of Science and Siddhanta, currently studying at Yashwantrao Chavan Ayurvedic Medical College, Chhatrapati Sambhajinagar. Today I am going to present a paper on topic Nyaya. So what are the Nyayas? Nyayas can be defined as expression of general truth or principles. They are specifically used when characterizing a situation. So Nyayas are the logical reasonings which can be used to describe or explain some events or some situations. So what are the Nyayas used in Ayurvedas? These are Shilaputrak Nyaya, Kapinjal Adhikaran Nyaya, Gunakshara Nyaya, Gobali Vardhan Nyaya, and etc. We will see one by one in detail. So the first one is Shilaputrak Nyaya. So we all know Shila means stone or rock and Putra means sun. So as a artist carves a stone and make statue from it. Now the stone is origin and the statue is the result. Okay. So where this statement can be used. For example, Sushtu Sharistan, Sushti Utpatti is described. It is from Mahat, Ahankar is derived. From Ahankar, Indriya is derived, and etc. So here, the Shila Putakna can be used as a good example. As an artist derives a statue from the stone, the Shila. Similarly, Indriya is derived from Ahankara. Ahankara is derived from Mahat. So other examples are our body is derived from Panch Mahatmas, or the Aushad is made from minerals, Panchalas. The next one is Kampinjal Adhikaranya. So Kampinjal is a type of bird, also known as Gauratitta. So during ancient time, when the yajna is performed, the person is asked to give the bali of Kampinjal bird. So they used to say Kampinjal Alabed. So in this statement, it is not clear that how many birds should be given as a bali. But the statement itself is a plural statement, Kampinjal Alabed. So plural means not one, it is more than two, or plural form. So where this statement can be used as logic. So example in Charak Chikitsa Sthan, Grahani Adhyay, for describing Chitra Kadivati. The slok comes Chitrakam Pipli Mulam Doksharo Lavunanicha. Here Charak does not state how many Lavan should be used. It just says Lavunanicha. We know it is a plural. And so we use Panchalavan. So the Gunaksharanya. So Guna means insect, worm, which bores holes in wood. So and Akshar means letter on the side. So insect, which means on wood, it accidentally makes a design. It doesn't will to make that design or a specific pattern. It just made accidentally. So where this situation can be used. In Charak Sutrastha, Virvajiviti Adhyay, Charak says, Udaiva Yuktam Vaishajyam Yada Arogya Kalpate. So in this shloka, a Vaishaj will give a medicine, good medicine, the good results are obtained. But sometimes a Vaidya without knowledge use some medicine and by chance, accidentally, it works. So it is our it describes as the Yadruchika, right? By chance. Something works by chance. So here the Gunaksharanya can be a good example of that. So the next one is Chatrino Gachanti Nyaya. So Chatri means umbrella. So Chatrino Gachanti, people are walking with umbrella, a group of people. So in this, if 100 people walk with umbrella and in that people, two people doesn't carry umbrella. But we say generally that a group of people is walking with umbrella, ignoring that two people. So, for example, in a class of 90 students, 88 students are good at exam or study. So we say that the class is good, ignoring that 2% student. So when these nyayas are used in our granthas, in Charak Sutrastham, Sasiti Adhyay, this nyaya explains about how Apathya in Hemant Ritu. So while explaining the Apathya, as Shishir and Hemant Ritu Chala are similar. So only Hemant Apatya is this love from which we have to derive, we have to live or we have to accept that The Shishir Rituchitra can also be same as Hemant Rituchitra because these two Ritus are similar. So next one is Suchi Katahanya. Suchi means middle and Kataha means front. So a man goes to blacksmith and asks to prepare a suchi and a pan. So the blacksmith makes suchi first and then it makes the pan because suchi is easy to make and pan takes a much longer time. So similarly in Charak Sutrasthana, Dirgha Jiviti Adhyay. So Dravya are explained, Jangam, Avvid, Arthu in this arrangement. But while explaining, Charak explains Jangam Dravya first and then Parthu and then Adbhid because Adbhid Dravyas are many or they are more in numbers. So here Suchi Kataha Nyaya can be a logical explanation to this. So the next one is Go Bali Vardhan Nyaya. So in Go Bali Vardhan Nyaya, Go means cow and Bali means buffalo or bull, sorry. So here the many times we say go as a cow and bull. For both we use go, but it literally means only cow or god. We should take all the meanings similarly. For example, in Charak Sutrasthana, for Ayurveda, Charak describes Anantapara. Here the Anant means limitless. Paranya means without boundary or beginning. So here, without a boundary means we should take without beginning, also without an end. Or Ayurveda doesn't have an end, means it is also doesn't have a beginning. So the next one is Stringa Grahikanya. So string means cow horn and grahi means to hold. If there are many cows and we have to tell about a specific cow, so we have to hold the one cow's horn to show that we are talking about a specific cow here. So uh, for example, this can be used in Sahitas. Most of the Vyadi in classical texts have similar signs and symptoms. So, while describing a specific Vyadi, we have to rule out the differential diagnosis of the specific Vyadi. So, we can understand better about that Vyadi. So, these were some Nyayas used in our Sahitas. So thank you so much for giving me this opportunity for the paper presentation. Thank you.
Thank you, doctor. And we go to the poster presentation.
Hello everyone. My name is Dr. Krishna Balaji Kompalwar, BMS MD scholar, a student of second year on Siddhanta, currently studying at Yashwantrao Chavan Ayurvedic Medical College, Chhatrapati Sambhajinagar. So I am here to present a poster on the topic Sharir Indriya Sattva Atma Sanyogo Dhari Jivita. So this is a slok from Charak Samhita Sutra Sthan, first Adhyay, 42 number slok. So what does it specify? It specifies the definition of life. So let's see the detail. The life is a composition of Sharir, Indriya, Sattva, and Atma. So until there is a coordination between these four, the life goes on. When one of these ceases, the life stops. So let's see one by one. The first one is Sharir. Sharir is the body. It is a physical form or physical structure. So in this physical structure are indriyas, mind, atma, etc. resides. So one may can see the Sharir as a vessel in which all the components necessary for a life is being stored. So the second one is Indriya or the sense organs. These are the tools for perception and action. So Indriyas are two types, five Jnanendriyas and five Karmendriyas. Jnanendriyas are sense organs, eyes, ears, nose, tongue, skin. And the Karmendriyas are one, three, heart, five, and focus. So these Indriyas connects our mind with the external world. These are the tools of deriving knowledge from outside world. So it connects the soul mind with the external world. The third one is mind or sattva. Sattva is responsible for the mental functioning and decision making. It acts as a controller of the senses. So whatever five indriyas, that is non-indriyas and five karma indriyas, acquire knowledge from the outside, this knowledge is being sent to the mind for processing. This is very good processor of our body. So it processes the information, and the result is of that information is being sent to the Atma. But the action is taken by our body, and good, bad, etc. emotions are the result of this processing of this information. This result is felt by the Atman. Atman is so it was a consciousness, a divine or subtle energy which resides in our body. So the Atman is of two types, universal consciousness and the self-consciousness. Self-consciousness is also part of universal consciousness, but because of self-identity, and different or individual from the cosmic self. So, the self is the observer or the witness, uh, which doesn't change. We just experience the world, experience the changes. So, body changes from time to time. So, in our childhood, the body was small. As we grow, body becomes larger. Then the cell, the Atman, remains constant. The constant entity within us, we refer it as Atman. So let me take you a slok from Bhagavad Gita. It states, it explains beautifully the coordination between all these factors, the Sharir, Indriya, Sattva, and Atma. Shlok goes like this. Brahmanim Brahmanam Viddhi, Shariram Ratudev cha, Buddhim tu Sarthim Viddhi, Manaha Tanurmai cha. So this explains, imagine a chariot on five horses in which a passenger has been sent from the different driver. So the passenger, we can refer it as a soul, the Atman. The body is the driver. the vehicle itself is a carrier. And the intellect, buddhi, which processes the information, it decides the direction of the horses or where the carrier is going. The mind, mana, anger, whims, or the race, which controls the spaces, and the senses and the influence of the five horses, which pulls the carrier. So direction of these senses, indriyas, can be controlled by our mind. Right? And this all journey is experienced by the passenger or the Atma, which sits silently inside the carrier or inside our mind. So that's it. Sharir Indriya Sattva Atma Sanyogo Dhari Jivitam. This is the definition of life according to Ayurveda. So Ayurveda also states that good habits through good food and Rutucharya, Dinacharya, Aushadhi, Yoga, Visha, the coordination between all these factors can be and this is the secret for living a long and beautiful life. Thank you so much for giving me the opportunity to present this paper. Thank you.
Thank you, Doctor. Thank you for delivering such an confident and impactful paper and poster presentation. Thank you so much, Doctor. And we next I'd like to invite Dr. Ruhatvi Riaz Mirkar for the paper presentation. I would like to invite Dr. Ruhatvi Mirkar for the paper presentation.
Good evening everyone. Myself Dr. Ruhatvi Mirkar, PG second year scholar, Department of Rog Nidan एवं विकृति विज्ञान आरे पोद्दार Medical College, Mumbai, under the guidance of Dr. Santosh Girbide sir, HOD and Professor, Department of Rog Nidan आरे पोद्दार Medical College. My topic name is Importance of Udak-Vah Srotas in Pathogenesis of Tamakshwas. So as we know that Tamakshwas is a Pran-Vah Srotas Vyadhi, but Charakacharya mentioned Udak-Vah as well as Anna-Vah Srotas in the pathogenesis of Tamakshwas. So Udak-Vah is also important in the Tamakshwas pathogenesis. So first we see the introduction. Tamakshwas is recognized as a type of Shwas Rog characterized by the predominance of Vata and Kapha doshas. It is a broad term with variety of conditions where dyspnea is a common symptom and is closely associated with bronchial asthma. In Ayurveda, srotasas means channels are vital structures and functional pathways which transport substances throughout the body. They play a fundamental role in both physiology and pathology. Udak-Vah Srotas is one of the important internal srotas and it has mool sthana in the talu means soft palate and the clone. It is essential for maintaining moisture means kledh and lubrication means sneha in the upper respiratory tract and participate in respiratory physiology alongside the Pranavah Srotas. Udak-Vah Sroto Dushti Lakshanas means signs of vitiation such as pipasa means excessive thirst, jivha shosha means dryness of
tongue. Talu shosha means dryness of palate, and Kantha shosha means dryness of throat, often accompany respiratory disorders. Now we see the Tamak Shwasa Hetu. So first we see the regimen: lack of exercise, excessive sexual intercourse, excess walking. Then diet: Atyambupan means excessive intake of liquid, intake of dry food. Then Vishamashana, regular intake of Nishpava, Masha, Pinnaka, Tila, Taila, Pishtha, Vishthambi, Anna, etc. So as we see, these Nishpava, Masha, Pinnaka, Tila, Taila, these hetus are aggravate the kapha dosh, as well as the dry food aggravates the vata dosh. As we see, the tamakshvas is predominantly vata kapha dominant. So these hetu collectively aggravate these two doshas. Then the conditions that accumulation of ama, anaha, rapid changes in exposure to heat and cold, kshata, inshaya, fever, vomiting, rhinitis, pandu, udavarta. These factors also aggravates vata and kapha dosha collectively. Then injury to the throat and chest and other hetus are various types of vibandha, means obstruction. Then we see the Udakvaha Srotas. The concept of Udakvaha Srotas in Ayurveda refers to the Srotasas, means channels responsible for the transportation, regulation and distribution of Udak, means water or body fluid within the body. Thus, Udakvaha Srotasas plays a vital role in maintaining kledha, means moisture, and sneha, lubrication, especially in the upper part of the body, including the respiratory tract and the oral cavity. These Srotasas are crucial for hydrating the tissues, maintaining the homeostasis, and facilitating the proper respiration by preventing excessive dryness or fluid retention. Now we see the Moola Sthana, means origin of the Udakvaha Srotasas. As mentioned in Charak Samhita, Talu and the Klom are the Mool Sthanas of the Udakvaha Srotas. Then Udakvaha Sroto Dushti Hetu. Charakas mentioned that Ushna Ahara, Vihara, Amadosha, Bhaya, Ati Madhyapan and Ati Shushka Anna Sevan as a Udakva Sroto Dushti Hetu. Then Udakva Sroto Dushti Lakshana. Jivha, Talu, Oshta, Kantha, Shosha means dryness of all these organs, and Pipasa means excessive thirst. These are the Lakshanas of Udakva Sroto Dushti. Then we see the Samprapti of Tamakshvas. Yada Srotansi Samruddhyam Marutah Kapapurvakah Vishak Brajati Samruddhas Tadha Shvasan Karoti Sah. As Charakas mentioned in Charak Samhita 17th Adhyay, that Marut and Kapha are the more important doshas in the pathogenesis of Tamakshvas. First we see the Nidan Sevan. After Nidan Sevan, Vata become aggravated and enter the Pranavaha Srotas, where it become vitiated. This aggravated Vata along with Kapha in Ura Pradesh creates Pranavayu Dushti, and Pranavayu become Udananugat, leading to two major diseases, that is Hikka and our Shwas. Now we see the importance of Udakvaha Srotas in Samprapti of Tamakshvas. First, Nidan Sevan, which includes Ati Ambupan, Guru Snigdha Ahar, Kapha Prakopak Ahar, which causes Agni Mande and Ama Utpatti, which ultimately cause Udakvaha Srotas Dushti, which causes Dushta Kleda Vruddhi in the body, Kapha Vruddhi and Abhishanda. And these Kapha Sanchay in Pranavaha Srotas causes Srotorod, means obstruction in the Srotas, and Vata Prakop causes Avaran of Pranavayu, which collectively causes Shwasaveg. Then we see the modern correlation of these pathologies. Fluid imbalance plays a major role in worsening the airway obstruction. First, airway inflammation. Trigger factors activates the immune system, which activates the mast cell degranulation and release of mediators such as histamines, leukotrienes and cytokines. Second is increased vascular permeability. Inflammatory mediators causes capillary dilatation and increased permeability, which causes plasma leakage into airway wall. Third is mucosal edema. Excess fluid causes swelling in airway mucosa, thickening of bronchial wall, narrowing of airway lumen. This together significantly increases the airway resistance. And fourth is mucus hypersecretion. Goblet cell hyperplasia causes excess mucus production, which causes thick mucus plug in the patient. Then we see the Udakvaha Srotas Chikitsa in Tamakshvas. First we see the Ahar. In Ahar, Ushna Jala, Shunthi Siddha Jala, Yava, Kulatha, Mudgayusha, Puranshali means 1 year old rice, Trikatu with Madhu. These are the Ahar which are indicated in Udakvaha Sroto Dushti Chikitsa in Tamakshvas. Then we see the Vihar. In Vihar, Pranayama, Ushna Sweda means steam inhalation, avoid cold exposure. sleeping with head slightly elevated, regular bowel movement, controlled fluid intake, and avoid diva swap. These are indicated vihar in tamak shwas. Now, last we see the Aushad in Tamak Shwas. First, we see the Deepan Pachan. For Deepan Pachan, we use Trikatu Churna and Panchakol Churna in the patient. Then, Kapha Shoshan and Sroto Shodhan. Talisadi Churna, Bharangi Churna, Kanthakari Churna, Pushkar Mool. These churnas are more important in Kapha Shoshan and Sroto Shodhan. Now, for women, we use Pippali, Madanfal, Vacha, Saindhav Yog in the patient of Tamak Shwas. Then Nasya with Anu Tail and Shadbindu Tail is also indicated, and Dhumpan with Vacha, Rasna, Devdaru, Erandamul is also indicated in Tamak Shwas patient. Then we see the conclusion. Tamak Shwas, though a Pranvaha Srotas Vyadhi significantly involve Udakvaha Srotas in its Samprapti, Dushta Kled Vruddhi and Kapha Ati Pravrutti due to Udakvaha Dushti lead to mucus hypersecretion and airway obstruction in Tamak Shwas. Ati Ambupan and Kapha Vardhak Ahar aggravates the Udakvaha Srotas, accelerating disease severity and recurrence. Sroto Dushti in the form of Sangha and Ati Pravrutti explains bronchial congestion and Shwasa Kruchrata. Correlation of Udakvaha Dushti through Kapha Shoshan and Drava Niyantran, Sroto Shodhan is essential for long-term management. And the last, thus understanding the Udakvaha involvement shifts treatment from symptomatic relief to Samprapti-based Chikitsa approach in the patient.
Thank you, Doctor. Thank you for delivering such a focused and meaningful presentation. And next we go to the another paper presentation. I would like to invite Dr. Kamlesh Shivaji Mahajan for the paper presentation. I would like to invite Dr. Kamlesh Shivaji Mahajan for the paper presentation.
Good evening, respected teachers and dear friends. I am Dr. Kamlesh Mahajan, PG student from Sri Saptaswangi Ayurveda Mahavidyalaya, Nashik, Maharashtra. Today I am going to present my seminar on the topic Role of Nidan Parivarjana in Early Identification and Prevention of Prameha, Prediabetes, and Preventive and Lifestyle Approaches in Prameha. Prameha is one of the major metabolic disorders described in Ayurveda. It is characterized by excessive urination, metabolic imbalance, and derangement of kapha, meda, and kledha. In modern terms, it is closely correlated with conditions like prediabetes and diabetes mellitus. Ayurveda offers a unique perspective by emphasizing early recognition and prevention rather than focusing only on treatment after disease manifestation. One of the most important preventive principles in Nidan Parivarjana, which means avoidance of positive factors. What is Nidan Parivarjana? The term consists of two words, Nidan, which means causes or etiological factor, Parivarjana, avoidance or elimination. Ayurveda clearly states, Nidan Parivarjana evam Chikitsa Prathamam. Avoidance of causes itself is the first line of treatment. This principle is especially powerful in lifestyle disorders like Prameha. The aim of this presentation is to evaluate the role of Nidan Parivarjana in the early identification and prevention. Why is Nidan Parivarjana important in Prameha? Prameha is primarily caused by improper diet and lifestyle habits such as excessive intake of sweet, heavy, oily foods, sedentary lifestyle, daytime sleeping, lack of exercise, overeating, psychological stress. These factors gradually disturb kapha dosha, meda dhatu, agni, that is metabolism, kledha, that is body fluids. Since the disease originates from daily habits, correcting those habits becomes the most logical preventive strategy. In Prameha Chikitsadhyaya, Charkacharya explains hetus of Prameha. Asya sukam swapna sukam dadini gramya dakanu parsa payansi navanna panam guda vaikrutam cha prameya hetu kapakrucha sarvam. By avoiding these hetus explained by Charkacharya in Prameya Chikitsadhyaya, we promote Nidan Parivarjana and prevent disease progression. Role in early identification. One of the most fascinating aspects of Ayurveda is its emphasis on Purvarupa or premonitory symptoms. Common early symptoms: excessive thirst, that is Trishna, increased urination, heaviness in the body, that is Gaurava, lethargy, that is Alasya, excessive sweating, sweet taste in mouth, obesity or weight gain, fatigue, especially after meals. These features closely resemble the modern prediabetes stage, where metabolic imbalance has begun but disease is not yet fully established. In Prameya Nidanadhyaya, Charkacara explains Pururupa of Prameya. Jatili bhavam kesheshu madhurya masasya karapadayo suptatadaho mukatalukantra shosha pipasam alasyam malam kaya chidreshu padeha paridaham suptata changeshu shatapada pipilika bhishya sharira mutra bisaranam mutre cha mutra dosham visra sharira gandha nidra tandra cha sarvakalam iti. Prabhuta mutrata, that is polyuria, avil mutrata, that is turbid urine, ati pipasa, that is polydipsia, shuddha adhikya, that is polyphagia, alasya gaurava, that is lethargy and heaviness, ati sweda, snigdha angata, mukha madhurya. How Nidan Parivarjana helps early detection? When applying Nidan Parivarjana, the physician performs detailed dietary history, lifestyle assessment, sleep pattern evaluation, physical activity review, dosha and dhatu analysis. By identifying unhealthy habits like excess sweet, frequent heavy meals, lack of exercise, day sleep, we can predict Prameya risk even before severe symptom develops. Thus, Nidan Parivarjana act as a preventive diagnostic tool. Role in prevention of Prameya. Once early warning signs or risk factors are identified, Nidan Parivarjana plays a crucial preventive role. First, stop disease progression. By removing causative factors, we prevent kapha aggravation, which develops into meda accumulation, which develops into increase in clay, which develops into prameya. This interrupts the samprapti. Second, restores agni. Avoiding heavy, incompatible food improves digestion, metabolism, tissue nourishment. Correct agni prevent further metabolic derangement. Third, reduce cough and meda. Lifestyle correction like regular exercise, controlled diet, avoiding day sleep helps reduce obesity and metabolic sluggishness. Prevent madhumeha. Early stage prameya, if neglected, progress into madhumeha, which is chronic and difficult to manage. Nidan Parivarjana prevent this progression. Example, dietary correction. Reduces sweet and refined carbohydrate. Prepare barley, that is yava, millet, and pulses. Avoid overeating. Lifestyle correction, regular physical activity, that is Vyama. Avoid sedentary habits, avoid daytime sleep, maintain active daily routine. Stress management, meditation, and pranayama. Modern relevance. Modern medicine describes prediabetes as a reversible stage marked by insulin resistance, mild hyperglycemia, metabolic syndrome. Ayurveda correlates this stage with early kapha medadushti and purvarupa of prameya. Criteria for prediabetes. Fasting BSL 110 to 125 mg per dl, postprandial BSL 125 to 199 mg per dl, and HbA1c 5.7 to 6.4. Conclusion. To conclude, Nidan Parivarjana plays a dual role in Prameha. First, in early identification, detects risk factors, recognizes early symptoms, predicts disease development. Second, in prevention, eliminates root causes, corrects metabolic imbalance, prevents disease progression. Ayurveda beautifully teaches us avoiding the cause is superior to treating the disease. In today's world of rising prediabetes and lifestyle disorders, Nidan Parivarjana remains a timeless and scientific relevant preventive strategy. Thank you. Good evening, respected teachers and dear.
Thank you, Doctor. Thank you for the well-explained presentation. Next, we go to the another paper presentation. I would like to invite Dr. Vanasri Umapati Herman for the paper presentation. I would like to invite Dr. Vanasri Umapati Herman for the paper presentation.
Good evening everyone, I am Dr. Vanishri Hiremat, third year PG scholar, Department of Shalatantra from Ramkrushna Ayurvedic Medical College. Today I am presenting the topic of clinical evaluation of Aragvada Gugulu Kshara Sutra in the management of Nadi Varna, that is pilonidal sinus. We will go to the quick introduction of the disease. Pilonidal sinus is an inflamed fibrous granulated tract between the buttocks, that is natal cleft, that can cause pain, embarrassment and employment disruption. It is also called as jeep bottom disease because it is very common in the jeep drivers because of their nature of the work, that is sitting for a longer duration. Men are more prone than women because of the fact that men have more hair. Due to friction between the cloths and body, hair will break off and collect in the cleft, and further it penetrates the soft and moistened skin at the region and enters the opening of the mouth of seudoriferous glands. After initial entry, dermatitis inflammation starts around the loose hair and sinus will be formed after. In Ayurveda, it is correlated with the Nadi Vrana. Improper management or negligence of management will lead the Vrana into the chronic stage. That condition is known as Nadi Vrana. Improper incision and drainage of the ripened abscess, and at the same time indulging in unsuitable foods, that is asatmya ahara, by the patient. The pus retained inside the ulcer and entering into the deeper tissues produces the tubular pathway of pus and or the channels inside them, resulting into the Nadi Vrana. We have taken a single case study. A 25-year-old Hirsuet male patient attended the Shalatantra OPD at Ramkrushna Ayurvedic Medical College with a registration number of 14669. He has the complaints of serous discharge from the mid-gluteal cleft since 4 months. Along with it is associated with occasional throbbing type of pain, itching sensation and discomfort at the natal cleft and low back region. Patient had the history of an abscess at the site of the opening before 4 months. For that, he took antibiotics and anti-inflammatory medicines from an allopathic doctor for the duration of 7 days and got relief from acute attack. Gradually, he developed a small opening near the gluteal cleft. Patient had no history of bleeding per rectum or painful defecation or mucus or any kind of discharge through the anus. There is no history of diabetes mellitus, hypertension, tuberculosis or any major illnesses. Patient had the good appetite, bowel habit, sleep, not any kind of addiction. Blood pressure, pulse rate, respiratory were in normal limits. On inspection, patient was hairy and had a small opening at the gluteal cleft with good amount of hair nearby. On palpation, a cord-like indurator structure was felt at the opening of the sinus. Mild tenderness and watery discharge were present while palpation of the local site. There was no any other opening or any lump near the gluteal cleft. Probing was done from the opening to assess its branching extension of the tract. About 7 cm tract was found during the probing in mid-gluteal cleft. Finally, we diagnosed it as a pilonidal sinuses. Preparation of the Gugulu Kshara Sutra. Gugulu Kshara Sutra preparation total there were 21 coatings, Gugulu extract 11 coatings, Gugulu extract plus Aragvada Kshara 7 coatings and Gugulu extract plus Haridra 3 coatings. Totally there were 21 coatings. And assessment criteria were unit cutting time, pain, discharge and size of the wound. These are the gradings of the pain. They are considered as 0, +1, +2, +3 and +4. And this is the grading of external wound size. This is also similar to previous. And grading of the discharge +1, 2, 3 and 4. Next, application of the Kshara Sutra. After taking all aseptic precautions and consent from the patient was kept in a prone position. Local anesthesia was given. The probe was pushed inside the tract till the tip of the probe was felt by the finger, and then tip of the probes were taken out through an artificial opening at the other end of the pilonidal sinus. Then Kshara Sutra was threaded in the eye of the probe. The probe was gently taken out in such a manner that entire tract was threaded by Kshara Sutra. During this procedure, tuft of the hair seen to come out of the pilonidal sinus tract along with the foul seropurulent discharge. After that, the two terminus of the Kshara Sutra were ligated outside. Then operated area was washed with the normal saline and bandaged with cotton pad. Post-operative management, the patient is advised to mobilize immediately after the surgery and instructed to take the warm fomentation twice in a day and to keep the operated area clean and dry. And Kshara Sutra was changed weekly by railroad technique and length were measured and recorded. The thread was changed weekly because the thread act as a ideal media for the drug delivery in the minute channels, and further presence of thread in the tract keeps the patent for the 7 days, enabling the infected material to drain out, which is essentially required for healing of the pilonidal sinus. Weekly local part preparation was ensured. These are the observation and results. On the day of the 70th day, pain, discharge, length of the tract and size of the wound was reduced completely. The patient has followed instructions strictly. From the 14th day onwards, there was remarkable relief in the pain, but the discharge of the pus was slightly increased. In the first 2 weeks, there was a profuse serous discharge and it got diminished of the progression of the cutting of the tract by the Gugulu Aragvatakshara Sutra. After 49th day, there was no discharge of the pus. Initial tract was 7 cm and cut through of the tract was occurred on 49th day. After cut through, there was a small wound and it was completely healed on 56th day. 100% relief was seen in 2 months. These are the images. This is the before treatment. This is the probing, and this is the primary threading. This is during the treatment, and it is completely healed after the treatment. Discussion. Acharya Shushruta has described Bala as the one of the Shalya. It is the main reason for the pilonidal sinus disease. Patient is obese with deep natal cleft and he is having the habit of riding the bike regularly. Because of overweight, there is a chance of friction of hairs between the gluteal region. Improper cleaning of anal region after defecation and excessive sweating in a particular area may contribute to the contributing factor for this disease. Also, improper drainage of the pus in Pakvavastha, and also Pakvavastha take the medicines for subsiding the condition and aggravated of the diseases. Kshara Sutra is one of the potential to treat the pilonidal sinuses. The Kshanana and Ksharana, these are the two properties of the Kshara Sutra, cuts the pilonidal sinus tracts from the inside and gradually and initiate the simultaneous healing. This is because of the wound healing, Ropaka, analgesic, Vedana Hara, anti-inflammatory, Shota Hara properties of Aragvada, Haridra and Gugulu. Gugulu Aragvada Kshara Sutra. Aragvada Kshara Sutra has analgesic property. This is probably due to the Vata Shamaka and Shulapahara karma of Gugulu Aragvada and chemical constituents of flavonoids and Gugulu sterones. Aragvada effectively pacifies the kapha and pitta dosha and chemical constituents like flavonoids, essential oils and beta cytosterol of the Gugulu. Curcumin of the Haridra possesses the antibacterial action, hence it alleviates the pus inflammation and which aids the wound healing. Conclusion. The modern surgical treatment of the pilonidal sinuses is often unsatisfactory. In majority of the cases, recurrence are common after the surgery. Kshara Sutra is a safe, cost-effective and minimally invasive procedure, promotes healthy healing with a negligible reoccurrence rate. Management of pilonidal sinuses with Gugulu Aragvada Kshara Sutra is found to be very effective and can be successfully used as a curative measure in cases of the pilonidal sinuses. Thank you, one and all.
Thank you, Doctor. Thank you for the conceptual understanding, detailed presentation. Thank you so much, Doctor. And next we go to another paper and poster presentation. I would like to invite Dr. Girish Vijay Solanki for the paper and poster presentation. First we go to the paper and then we go to the poster presentation. I would like to invite Dr. Girish Vijay Solanki for the paper and poster presentation.
Good evening everyone. Myself Dr. Girish Vijay Solanki. My guide name is Dr. Jayashree Katole ma'am. Co-guide Dr. Ashish Kishi sir. PG Scholar Chikitsa Department from Dr. VJD Gramin Ayurvedic College, Patur, Akola. Introduction. An integrated approach to Vatarakta, that is gout, is an case study. Introduction. Vatarakta is a disease of Raktavasthrutas and is a Madhyam Margagat Vyadhi. Prakrupit Vat along with Dushti Rakta travel in whole body and affect the Sandhi, starting with Parva Sandhi, especially Padangashta. It reflects the equal role of both Dosh and Dusha in causes of disease. Vatarakta is described as an independent disease as Vata Shonita in Charak Sanhita, Vangbhat and other Sanhitas. Vat gets aggravated by its own causes due to Ushna, Tikshna, Padartha Sevan, Rakta Dhatu gets violated, which in turn into Vyadhi like Vatarakta. The etiological factor responsible for gouty arthritis pathology and clinical features are quite similar to Vatarakta. Hence, Vatarakta can be correlated to gout. Methods. We take a case study of a 45-year-old male patient. Is a businessman by occupation, reported at hospital on date 9/6/2025 with complaints of severe pain and redness at first MTP joint since 1 month. Fever since 4 to 5 days, tenderness over the same joint since 15 days, mild ankle joint pain. There is no any past illness, no surgical history. The family history was also not significant with the patient disorder. Nidan Lavanakatu Rasasevan. General examination find to be good. CVS, CNS, RS are absolutely normal. Blood pressure, pulse are normal. Prakriti found to be Vata Pitta. Samprapti Ghatak as mentioned, Dosh, Vatarakta, Dushya Rakta, Tokamas, Agnitishna, Strotas, Rakta was Strotas, Maso was Strotas, Asti was Strotas, and Medo was Strotas. These are the Strutodushtis. After the lab investigation, we perform through uric acid, ESR, CRP, WBC count, platelets, and hemoglobin. Especially, we need to find out serum uric acid as an inflammatory condition. For that, we also count ESR. Before treatment, it was serum uric acid found to be 8.5, and after treatment, it found to be 5.2. And other conditions are preferably be normal. Treatment which we given to them are Kaishor Gugul 250 mg TDS after meal with lukewarm water for 15 days. Gudichi Ghanavati 500 mg BD after meal with lukewarm water for 15 days. Mahamanjishta Adikwat 15 ml BD after meal with lukewarm water for 15 days. Pinda Tela local application is given. Result. After undergoing a comprehensive Ayurvedic treatment plan, the patient showed significant improvement in symptom and quality of life. The results are in terms of pain reduction, swelling and redness, mobility. First we see pain reduction. The patient reported a significant reduction in pain from scores 8 of 10. Swelling and redness are also effectively reduced in affected joint, and their joint returned to normal size and color. Mobility. The patient mobility and range of motion improved, allowing him to perform daily activities without any difficulties. Uric acid, which was highly inflated, 8.5 mg DL to 5.5 mg per DL. Inflammatory markers such as ESR, CRP is significantly reduced. Joint function improved with a significant reduction in stiffness. How these drugs perform? Kaishor Gugul. Anti-inflammatory properties. Kaishor Gugul contain herb like haritki, amalki, which have potent anti-inflammatory properties, reducing swelling and pain in the joints. Also has an antioxidant property, uricosuric properties, which mentioned as above. Guduchi Ghanavati. Guduchi Ghanavati is a herbal formulation containing guduchi, that is Tinospora cardifoliae, as the primary ingredient in Vatarakta. Guduchi Ghanavati may work through immunomodulatory effect and rasayan properties. Guduchi may modulate the immune system, reducing inflammation and autoimmune response. The combination of Kaishar Gugul, Guduchi Ghanavati and Mahamanjishtadikwat has a significant effect in treating Vatarakta, that is gout, due to their individual properties and action. Now we see a combined effect. Enhance anti-inflammatory action. Kaishar Gugul and Guduchi Ghanavati's anti-inflammatory properties may be enhanced, reducing inflammation and pain. Antioxidant and immunomodulatory effect. Guduchi Ghanavati and Mahamanjishtadikwat are antioxidant and immunomodulatory properties. May also help to reduce oxidative stress and better the immune system. Rakta purification. Mahamanjishtadikwat, as we know, blood purifying agent, which helps to eliminate the blood and bad toxin, reducing risk of complications. Discussion. The case study highlights the effectiveness of Ayurvedic treatment in managing Vatarakta chronic and condition characterized by joint pain, inflammation and swelling. The patient's symptoms and quality of life improved significantly after undergoing the compressive treatment. As we know, Ayurvedic treatment as a viable option. The case study suggests that the Ayurvedic treatment can be a viable option for managing Vatarakta, particularly for the patient who may not respond to conventional treatment as prefer alternative approaches. Limitation. Single case study. This is a single case study and further research is need to be performed. The result may not be generalized to all the patients with Vatarakta and individual result may vary. Conclusion. This case study demonstrates the effectiveness of Ayurvedic treatment in managing Vatarakta through comprehensive approach to the herbal medication, lifestyle modification, combined Kashar Gugul Gulchi Ghana and Mahamanjishthadik Vata. The treatment approach may not elevate the symptom but also improve the patient's life. This case study contribute to the growing body of evidence supporting to the use of Ayurvedic medicine. Thank you so much.
Thank you, Doctor. Thank you for the paper presentation. And next we go to the poster presentation.
Good evening everyone. Myself Dr. Girish Vijay Solanki, PG scholar from the Department of Chikitsa and my college is GAM Akola. My topic for the poster presentation is an integrated approach to Katigatvat, that is lumbar spondylosis, is an case study. Need for the study. As we know, Katigatvat is one of the most important Vat Vyadhi which is described by Charak in 18 Nanatmach Vat Vyadhi. Lumbar spondylosis is one of the most emerging health issues seen nowadays. There are many reasons, but some of them are lifting heavy weights, lack of exercise, improper sitting posture, increased screen timing and excessive traveling. Keeping all this fact in mind, it is need of an hour to bring out the treatment modality with long-lasting relief and no adverse effect. Then we discuss about the methods, how we can do it. Different Ayurveda and modern textbooks, journal, research paper, articles are referred to the study concept of Katigatvat and its correlation to lumbar spondylosis. For that, we take a patient of 54-year male with following complaints. Repeated episodes of low back pain since 2 months, constant aching pain felt in the lumbar region since 20 days, mild stiffness of Kati Pradesh and pain sometime radiating to buttock, calf and foot. For this, we used a mechanism of rehab and also rehabilitation exercise, Katibasti procedure, etc. etc. Analysis. The resembling clinical feature of Katigatvat and lumbar spondylosis have correlation. In this study, common symptoms were relieved with Bayasnehan, Swedan, Katibasti and Abhyantar Chikitsa also. The interpretation of the efficacy and probable mechanism of action therapy can be explained by combined result of both the action drugs. That is, if you want to treat them, we also need to Katigat Basti as well as rehabilitation exercise. That is exercise which helps to cure the disease. This is mechanism how we can perform through it. Results are Hetu or causes of lumbar spondylosis and Katigatvat causing Vata Prokop. The Hetus, as we mentioned there, 18 Anatmaj Vata Vyadhis causing Vata Prokop, Dhatukshay are similar. Katigat Vata Vyadhi is classically treated with Snehan, Swedan, Katibasti. Abhyantar Chikitsa with the help of Trayodashanga Gugul, which helps in resolving degenerative changes and healing lumbar spondylosis. That is Trayodashanga Gugul for you. Then Maharasnadikvat is helpful for Pachan and Sandhimajagat Vatvyadhi. Chitrakadivat is also used for Dipan Pachan. Modern treatment initially for the first 5 days with muscle relaxant help in relieving the symptoms. But modern treatment just suppress the symptoms, not the disease, as we know it. There how Katibasti effectively procedure and how it perform can be shown in figure. Discussion. Hetu or causes of lumbar spondylosis and Katigatvat causing Vata Prakop and Dhatuksha are similar. Due to all the above etiological features, Vata dosh get locked in Kati, that is lumbosacral region. Combined result of action of drug like Trayodashanga Gugud 250 mg BD after meal for 7 days and Maharasnadi Kashaya 20 ml BD after food with warm water for 7 days. Tab Gandharv Haritki Vati days for HS1 after food and Katibasti. The similar control study with the comparative drug can be performed to prove better therapeutic efficacy and management of Katigat Vat. For the treatment or any procedure, we have a reference for Katigat Vat, that is Charak Sahita Ayurved Deepika commentary of Chakramani, edited by Vaidya Yadavji Digamdi Acharya, and many more. Thank you so much, gentlemen, for your valuable time. Thank you.
Thank you, doctor. Next, we go to the another paper presentation. I would like to invite Dr. Anjana Arnath for the paper presentation. I would like to invite Dr. Anjana Arnath for the paper presentation.
Good evening, everyone. Myself, Dr. Anjana, PG Scholar, Department of Ayurveda from STMCH Hassan, and I would be presenting the top cosmetic toxicology and its Ayurvedic considerations. Moving on to the contents and going to the introduction. In today's beauty-conscious culture, individuals, particularly women, try to achieve desired appearance through the use of cosmetics. Cosmetics are articles intended to be rubbed, poured, sprinkled, or sprayed on, introduced into, or otherwise applied to the human body. These formulations often include chemicals like talcum, paraben, coal tar, dye, phthalates, fragrances, and heavy metals such as lead, arsenic, and cadmium. A recent study found that 25% of the women use 15 or more cosmetics in their day-to-day life. A majority surpassing 90% of the cosmetic products in the market have not undergone any testing to evaluate their potential effect on human health. The prolonged and frequent use of cosmetics can result in the accumulation of chemicals in the body, leading to a spectrum of health concerns including cancer, reproductive disorders, skin issues, and allergies. In Ayurveda, these symptoms align with the concept of doshi visha, which are not necessarily fast-acting due to their mild potency and association with kapha. But as these substances can persist in the body for an extended period, contributing to the long-term health implication. Now coming to the adverse impact of cosmetics. Here are some of the cosmetics, their chemical compounds and their effect on the body. Foundation containing talc, silica, alumina and aluminum salt. Triethanolamine and parabens. Leads to respiratory irritants, toxicity to the nervous system, cancer-causing agents, disrupting the hormonal system, and it is even detected in the breast cancer tumors. Moving to moisturizers containing polypropylene glycol, lanolin, triethanolamine, retinyl palamide fragrances, leading to dermatitis, skin irritation, immune system toxicant, damaged skin triggering asthma. Moving to skin sunscreens containing cinnamate, salicylates, and zinc oxide, resulting in skin rashes. Next are lipsticks and lip glosses containing oil, petroleum waxes, and synthetic colors, including lead. causing skin irritation, allergies, malignancy, risk to the nervous system. Cleansers and body washes containing sodium lauryl sulfate, ammonium lauryl sulfate, paraben, fragrances, and as such as phthalates, causing irritation to the skin, carcinogenic effect, disrupting the hormonal system and causing reproductive complication. Shampoo containing formaldehyde, paraben, sodium lauryl sulfate, and sodium lauryl sulfate, causing the main agent resulting in the foaming, which result in carcinogen, endocrine disrupting chemicals. Next, moving on to the nail polish containing toluene, formaldehyde, tributyl phthalate, ethyl acetate, benzophenone, triphenyl phosphate, causing damages to the kidney, liver, and heart, respiratory irritation, carcinogenic effect, disruption in thyroid functions, irritate respiratory system, endocrine disrupting chemicals, and neurotoxins. Nail polishes, including acetone, causes damage to the liver, kidney, and nervous system. Amorphous silica and parabens and purified talc in talcum powder causes lung irritation when inhaled, endocrine disruption, and lung cancer. Now coming to the Ayurveda concept, the concept of Doshi Visha align with the concept of cumulative toxicity. On consideration, these symptoms align with the concept of Doshi Visha, which are not necessarily lethal to its mild potency and association with kapha. But as these substances can persist in the body for extended period, contributing to long-term health implications. And these toxic substances and disorders associated with Doshi Visha, spanning the skin, gastrointestinal tract, nervous system, and other systems, find parallels in the potential adverse effect of long-term cosmetic uses. Containing Thenathido, Gunnavid, Pinna Pudisha Varnum, Dushtasra Rogi, Jalaukavacharana, Murchan Baman Gadkada Mission, Babecha Dushodera Linkajushta. And when the poison enters the body, it vitiates the kafadi doshas, kafadi dhadus, leading to vitiation of the other dhadus. On emphasizing on the thermal manifestation, Rushi Visha, after staying in the body for a longer period, causes Rakta Dushti, leading to symptoms like Aru, Khoda, Kidipa, vitiating doshas one after the other, and ultimately leading to the death. Now, moving to the treatment aspect, the management of Doshi Visha. The primary steps involve preventing further exposure to the substance that cause or contribute to the condition. One who is exposed should undergo shodhanam. Doshi Vishatam susvinam udham adhasya shodhitam. Doshi Vishari magadam leheyen madhuna prada. First, the Swetana should be done, which results in the vilena of the accumulated toxin and the vilena doshas and then mobilized for Shodhana. Once the doshas are moved from Shaga to the Koshta, then these toxins should be expelled either through Adhomarga Shodhana by Virejana or Urthamarga Shodhana Vamana. Then once Shodhana is done, Shamana medicines such as Dushivishari Agada should be administered. Coming to the conclusion, despite the widespread use of cosmetics, the adverse effect of these substances are not always apparent to the consumers. The concept of Dushivisha aligns with the idea of cumulative toxicity, where there is a gradual accumulation of the toxin in the body, which over the time lead to harmful effects. This correlation is particularly relevant when considering the prolonged use of cosmetic, which can act as cumulative toxin, affecting various bodily systems. Shodhana can be considered as a specific treatment for Doshi Visha to address the cure and disorders arising from cumulative toxicity. These are the references, and thank you.
Thank you, Doctor. Thank you for the well-articulated presentation. And next we go to the another paper and poster presentation. I would like to invite Dr. Priyanka Babasaheb Kamble for the paper and poster presentation. First we go to the paper, then we go to the poster. I would like to invite Dr. Priyanka Kamble for the paper presentation.
Good morning, everyone. Myself, Dr. Priyanka Babasaheb Kamble, MS scholar in OBGY from Yashwantrao Chauhan Ayurvedic Medical College and Hospital, Chhatrapati Sambhajinagar. Today, I am giving on a paper presentation on the topic review study to see the effect of date fruit consumption in labor progress. Introduction. Promoting natural labor with less medical interventions is one of the main goals in modern obstetrics. Natural methods have gained more attention in recent years due to their potential to enhance cervical dilatation, decrease the need of labor augmentation, shorten labor duration. What is the aim of this study? This study aims to determine the effect of date fruits consumption on the onset and progression of labor. What are the objectives of this study? To maximize the efficiency of labor, and second one is shortening its duration. Then what are the properties of dates? Dates having micronutrients, vitamins and minerals. Micronutrients like carbohydrate, calories, many vitamins, minerals provides energy along with other nutrients. Dates having fibers. Many ANC patients having constipation is quite common in ANC. So dates having fiber is very important ingredient to relieve constipation. Then dates contains carbohydrate, calories, which provides energy to ANC patient from fatigue. Dates having folate, vitamin B, which is very important in first trimester because to avoid the serious birth defects like spina bifida, etc. 15 milligram of folate per 100 gram serving is content is present in dates. Like vitamin K also present in dates, which is essential for strong bones, and osteocalcin protein is present in folate. Which is increasing bone mineral density and strength. Also, potassium to maintain fluid balance and support regular cell functioning. Because in ANC patients having nausea and vomiting, so they reduces their fluid imbalance. So 96 milligram of potassium in 100 gram of serving 4 dates. Dates contain also magnesium. Magnesium is very important to regulate blood sugar level in ANC and also blood pressure level by decreasing the risk of like preeclampsia, hypertension, premature labor. Also helps in the formation of teeth and bones in the body. Along with these properties, dates have antibacterial property, antifungal property, antiatherogenic property. Also, dates having antioxidants that they help to protect the body from cell damage during pregnancy. Also, many ANC patients having GI problems due to iron, but dates having low glycemic index property because they digest more slowly and won't cause a rapid increase in the blood sugar level. Then dates having immunostimulatory property also. Then what is the mechanism of action? In dates cervical ripening, dates contain compounds that help to soften, thin and open the cervix. Then dates having second property, reduced labor duration. Dates consumption in late pregnancy, 6 to 7 dates per day from 37 weeks shorten the first stage of labor and increase spontaneous labor. Then third mechanism, prostaglandin-like effect. Dates contain fatty acids and compounds that mimic prostaglandin, which are essential for ripening of the cervix. Then fourth mechanism of action, oxytocin enhancement. Dates increases the sensitivity of uterus to oxytocin. so help in natural spontaneous labor. Then dates, fifth property mechanism of action, dates having nutritional support and energy. Nutritional support because dates have high energy, sugar, essential minerals, calciums, support uterine muscles and efficiency during the prolonged labor. Then sixth mechanism of action, postpartum hemorrhage reduction because presence of tannins which act as estrogens helps to control bleeding after childbirth. All these are mechanism of action. Then when to start? Dates consumption start around 36 weeks of gestation. Then quantity 6 to 7 dates per day or 60 to 70 gram dates per day given to the patient. If and benefits, what are the benefits? Promote shorter, more spontaneous labor, then cervical ripening and oxytocin sensitivity. Contraindication of dates, diabetic patients and obese patients, and those patients who have having allergy of dates, then you can stop date consumption in that patient. Then result, it was found that the consumption, many studies have done on consumption of date for natural labor. From that study it was found that consumption of around 6 to 7 dates per day for 2 to 4 weeks before the estimate date of delivery, the dates leads to increased cervical dilatation upon hospital admission. The studies have done and that results are found. The conclusion, date fruit consumption appears to be safe, easily accessible, and a natural intervention that may positively influence the initiation and progression of labor. So I am also doing this study on my patient. Thank you so much.
Thank you, doctor. Next, we go to the poster presentation.
Good morning, everyone. Myself, Dr. Priyanka Babasaheb Kamble. I am third year PG scholar in MS OBGY from Yashwantrao Chauhan Ayurvedic Medical College, Chhatrapati Sambhajinagar. Today, I am giving poster presentation on pregnancy-induced hypertension, that is preeclampsia. There are 5 types of hypertensive diseases that complicate pregnancy. Number 1, gestational hypertension. Number 2, preeclampsia. Number 3, eclampsia. Number 4, preeclampsia superimposed on chronic hypertension. Number 5, chronic hypertension. Number 1, what is gestational hypertension? The diagnosis of gestational hypertension is made in women whose blood pressure reaches 140 by 90 mmHg or greater for the first time during the pregnancy, but in whom proteinuria has not developed. That is called gestational hypertension. What is preeclampsia? Preeclampsia is a multisystem disorder characterized by development of hypertension to the extent of 140 by 90 mmHg or more with proteinuria after the 20th week in previously normotensive and non-proteinuric women. Then what is eclampsia? Eclampsia is the occurrence of seizures in women with preeclampsia that cannot be attributed to other causes. The seizures are grand mal and may appear before, during or after labor. Then what is chronic hypertension? The hypertension antecedent to the pregnancy. The hypertension detected before 20 weeks of pregnancy and persistent hypertension long after delivery. That is called as chronic hypertension. Then what are the causes of preeclampsia? The risk factors for eclampsia are obese patients, then family history, then primary gravida, then placental abnormalities, family history, etc. Then what are the etiological factors? Inflammatory mediators, then immunological intolerance between maternal and fetal tissue, vascular endothelial damage, etc. are the etiological factors. Then what are the types of eclampsia? There are two types of eclampsia, non-severe preeclampsia and severe preeclampsia. First, these include non-severe preeclampsia includes the sustained rise of blood pressure of more than 140 by 90 mmHg but less than 160 mmHg systolic or 110 mmHg diastolic without significant proteinuria. And in severe preeclampsia, persistent systolic blood pressure above or equal to 160 mmHg and diastolic blood pressure above 110 mmHg. Then oliguria, then platelet count less than 1 lakh, then proteinuria present, elevated liver enzymes, cerebral or visual disturbances, persistent severe epigastric pain, then intrauterine growth restriction of the fetus, pulmonary edema, retinal hemorrhages, then severe creatinine greater than 1.1 mmHg. These are all two types of preeclampsia. Then what are the signs and symptoms of preeclampsia? First of all, symptoms: swelling over the ankles, then headache, visual disturbances, disturbed sleep, then diminished urinary output, epigastric pain. These all are symptoms of preeclampsia. Then what are the signs of preeclampsia? Abnormal weight gain, rise of blood pressure, pulmonary edema. Then abdominal examination shows IUGR, intrauterine growth restrictions, etc. These are all signs and symptoms of preeclampsia. Then what are the complications of preeclampsia? Two types of complications. Number one, immediate, and then second, remote. In immediate complications, maternal complications and fetal complications. In the maternal complications, three types: during pregnancy, during labor, and in puerperium period. First of all, during pregnancy, eclampsia develop. Then preterm labor, HELP syndrome may occur. HELP syndrome, elevated liver enzymes, hemolysis, elevated liver enzymes, and then low platelet count. Cerebral hemorrhage during pregnancy occur. Acute respiratory distress syndrome during labor, eclampsia occur. In puerperal period, eclampsia, shock, sepsis. These are all symptoms during maternal period. Then fetal complications include intrauterine growth restrictions, aspexia, prematurity, etc. Remote complications include chronic renal disease, placental abruptions, etc. And then what is the management of preeclampsia? Management objectives are to stabilize hypertension and to prevent its prognosis to severe preeclampsia, to prevent complications, delivery of healthy baby in optimal time, to prevent eclampsia, restoration of health of mother in puerperium. These are objectives for management of preeclampsia. Then in hospital management, rest, diuretics, and antihypertensive drugs given. Diuretics only for pulmonary edema and cardiac failure. hypertensive drugs like labetalol 100 mg TID or QID, nifedipine, that is calcium channel blocker 10 to 20 mg for BID, methyl dopa 250 to 500 mg TID or QID, hydrolyzine 20 to 25 mg BD. These are the drugs for antihypertensive drug to manage preeclampsia. Then duration of treatment in preeclampsia. If the patient has near term greater than 34 weeks, then she should be kept in hospital for few days till completion of 37 weeks, and thereafter decision is to take either to deliver her or to wait for a spontaneous onset of labor. And if the pregnancy is beyond 37 completed, then delivery is to be considered without delay. Then method of delivery: induction of labor and cesarean section. If the cervix is ripe, then you can surgical induction by low rupture of membrane is the method of choice. And if cervix is unripe, then prostaglandin gels is used. When an urgent termination is indicated and cervix is unfavorable, then we can go for C-section. Thank you so much.
Thank you, Doctor. Thank you for the insightful paper and poster presentation. And next we go to the another paper presentation related to the PCOD. I would like to invite Dr. Krishna Sriram Jadhav for the paper presentation. I would like to invite Dr. Krishna Jadhav for the paper presentation.
Good evening everyone. Myself Dr. Krishna Sriram Jadhav, PG first year, Department of Rog Nidan and Vikruti Vignan at R.A. Poddar Ayurvedic Medical College, Varoli. Introduction to my topic, that is Ayurvedic aspects of PCOD. PCOD is one of the lifestyle disorder. Lifestyle disorders are associated with persons' improper way of living their life. A prevalent multisystem endocrine condition called polycystic ovarian syndrome affects approximately 1 in 5 young women of reproductive age in India. The prevalence of PCOS in world is 4% to 21%, and in India it is 3.7% to 22.5%. Modern view on PCOS. According to WHO, PCOS is common chronic hormonal and metabolic disorder in reproductive aged women characterized by elevated androgen levels, irregular menstrual cycle, and or polycystic ovarian morphology. Diagnosis of PCOS according to allopathy view: clinical or biochemical hyperandrogenism, that is high androgen levels, which causes the symptoms like hirsutism, acne, alopecia, or high blood levels of testosterone. Other hormonal tests like elevated AMH or LH. Ovulatory dysfunction. Symptoms involved in these are amenorrhea, that is absent menstrual cycle, and infrequent menstrual cycle, that is oligomenorrhea. Polycystic ovarian morphology. In ultrasound, ovary shows the 12 or more follicles, 2 to 9 mm per ovary, or an ovarian volume greater than 10 ml. Ayurvedic aspects of PCOS. Although PCOS is not specifically mentioned in Ayurveda, it can be linked to an imbalance of dosha, dhatu and upadhatu equally. It doesn't link the condition to specific disease or syndrome. Still, the symptoms are similar to those of anartha, similar to amenorrhea, yoniopathy is similar to arajaska, vandya is similar to infertility, pushpagni zatharini is similar to anovulation or hirsutism, artavadushti similar to menstrual abnormalities, insulin resistance similar to prameha, weight gain is similar to staulya. In Kashyap Samhita, Acharya Kashyap mentioned the pushpagni zatharini, that is vrutha pushpam tu ya nari yatha kalam pranashyati stula loma ganda va pushpagni. Shloka describes the anovulation and hirsutism, which is correlated with the PCOS. Hetus of PCOS. Mityahar includes excessive consumption of rasa like madhura, amla, lavan, as well as qualities like snigdha, guru, shita food, adhyashana, vishamashan, and attashana. Mityavihar includes improper sleep cycles, vegadharana, avyayam. Psychological factors like shoka, chinta, bhaya contribute to dosha involvement. Dosha imbalance. Samprapti of PCOS. Hetu 7 leads to Mandagni. Mandagni leads to formation of Ama and Kaphavritti. Due to Kaphavritti, Strotavrat and formation of cyst occurs. As a Kapha obstruct the movement of Apanavata, which is responsible for menstruation and ovulation. So Vata Dushti occurs. Pitta involvement. Suppressed pitta leads to poor hormonal conversion, that is, for example, failure to convert the androgen to estrogen. These dushta dosha settle in specific areas, that is, sthana shanshaya occurs, and dosha involved in PCOS are rasa, rakta, meda, artha. Primarily involves rasa, rakta, meda, and artha. Stroto dushti occurs are artha stroto dushti and meda strota obstruction occurs, which causes the anovulation and obesity. Dosh involvement based on the symptoms. In Artavakshaya, Vata is involved. In Anarthav, Vata Kapha is involved. Arajashka Univapat, Pitta is involved. Lohitakshaya, Vata and Pitta is involved. In Vandhya, Vata Pradhantri Dosha is involved. In Staulya, Kapha is involved. Prameha Purvarupa, Kaphavruta Vata is involved. Artavadushti, 3 doshas are involved. In Dhatu Dushti, Rasa, Rakta, Mausa, Meda, Asti, Maja, all these dhatus are involved in PCOS. If one dhatu is disturbed, it may affect the next in sequence. Uttar Dhatu Dushti refers to improper nourishment of or Dushti of successive dhatus due to disruption in their natural transformation process, which occurs sequentially. PCOS symptoms through Uttar Dhatu Dushti. Due to Rasa Dushti, Artavakshay or Nashtartav occurs. Rakta and Mausa Dhatu Dushti, acanthosis nigricans, generalized weakness, and acne occurs. Due to Meda Dhatu Dushti, inappropriate fat deposition, which is in turn cause obesity. Due to Asti Dhatu Dushti, hirsutism, graying of hairs, and alopecia occurs. In Majja Dhatu Dushti, mood swings, sadness, and hormonal imbalance occurs. And last, due to Shukra Dhatu, infertility occurs. Stages of PCOS on Dhatu's involvement. In early stages, Rasa and Rakta are involved, and symptoms like irregular cycles, mild weight gain, fatigue, and mild acne occurs. In moderate stage of PCOS, Rasa, Rakta, Mausa, Meda, and Asti are involved. Signs symptoms in moderate stage of PCOS are persistent irregular cycles, cyst, moderate weight gain, hirsutism, and insulin resistance occurs. In severe stage of PCOS, all these dhatus are involved like Rasa, Rakta, Mausa, Meda, Asti, Majja, and Shukra. And signs symptoms occurs are amenorrhea, infertility, severe weight gain, hirsutism, diabetes, and cardiovascular complication. Now let's see the management of PCOS. As PCOS is a lifestyle disorder influenced by a diet, physical activity, and stress, Dincharya offers the structured framework to address these factors by aligning the daily routine with the body's natural rhythm. Dincharya works as a preventive strategy by promoting Swasthya Rakshanam and minimizing the progression of PCOS related to complications like diabetes, cardiovascular disorders, and infertility. Dincharya helps to maintain the dosha balance. Dincharya optimizes the Vata by encouraging early rising, hydration, and grounding exercises to prevent the dryness and anxiety. Pitta is balanced with light dinner, midday meal when digestion is strongest. Kapha is managed by incorporating light physical activity in morning and afternoon to combat the sluggishness and lethargy. Following Dincharya supports the proper digestion, that is Agni enhance mental well-being, and prevents the disease by harmonizing the body's rhythm with the natural environment. This holistic approach promotes the health and vitality and emotional stability. So this is the Ayurvedic aspect of PCOS. Thank you.
Thank you, Doctor. Thank you for the well-explained presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. Next, I would like to invite Dr. Guriraj Eknath Alavekar for the paper presentation. Dr. Guriraj Alavekar for the paper presentation.
Good evening. I'm Dr. Gururaj Eknath Alavekar, final year PG scholar from Shweta. Today I am presenting a randomized controlled clinical trial evaluating the efficacy of Fistula-in-Ano Visha in the management of Shatkriyakal with special reference to lacerated bone. Introduction. Puraneti अस्माकं हृदये अपि वायुस्थितिः तद्हिनात्मक अस्माकं हृदये literally means a distant condition of push or a condition which will not complete healing. The use is that over the area which stays as long as person alive. Food and its management are prime important in surgical practice generally when created by surgeon is considered as a clean, which is their primary intention, but there are many other groups which follow secondary or tertiary stage of healing. Some would are difficult to manage and considered as non-healing ulcers. It also shows the mention of only mainly two types of major and aganthus. చిన్న భిన్నంత విధం శతవిచ్ఛేదనయోగ శ్రీమావస్థత షష్ఠంతేషు క్షణలక్షణం సమగం క్లాసిఫికేషన్ వ్యాప్తిని శతీశ్వరం 46 13 పరిష్కృత పుస్తకం describing yoga ratna santoran chikitsa శతీశ్వరం నాతి చిన్న నాతి భిన్నం ఉభయ లక్షణంతో విషమృణంగే యక్షరం తోభి నిర్దేశం one which neither acute injury nor perforation but involves the nature of both with even shape is called Shatajura. Need of study. Subdhuran is correlated with traumatic wound caused by accident to injury. Lacerated wounds are common in day-to-day surgical practice. Prevalence rate of lacerated wound is 12%. In modern medicine, topical agents like clothing ointment are widely used. However, long-term use may cause irritation, burning, sensation, or allergic reaction in some patients. Therefore, it is necessary to evaluate classical Ayurvedic formulations that are easily available, cost-effective, safe, and clinically effective. In the study, esteemed group Parishik, usually Santoran Chikitsa, will be evaluated for its healing efficacy. The first question: there is a significant effect of esteemed group Parishik in the management of Shatajuran with special reference to lacerated wound. No hypothesis, there is no significant effect of esteemed group Parishik in the management of Shatajuran with special reference to lacerated wound. Alternative hypothesis, there is significant effect of esteemed group Parishik in the management of Shatajuran with special reference to lacerated wound. This is removed in Charak Samhita, Sushruta Samhita, and Bhagavad Samhita all have special description of Purana, but among them they mention that different types of take on for Siddharana, Dishtorana, Nijoran, Agantajoran. Kshatriyakal is a subtype of Swasthyabodha, and there is a Parishad of Vishnudeva with Parishad in mentioned in Yoga. Satyam Chikitsa Program is a proven antiseptic own healing property and somehow allergic to it, so suicide to control physical Pournima and estimate with Kshatriyakal. In Kshatriyakal with special reference to lesser grade own. Vrana Gatri Vichurnati Vrana. The destruction, different unit of tissue called a Vrana Gatri Vichurnati the means even causing destruction or dismemberation of tissue with the particular body, which termed as Vuran, whereas Vuranati means discoloration. As the definition of Vuran implies damage of the part of the body leading to discoloration. Shabdavaran have 6 types in the Viddha-agnikarma, which Ramkrushna. W estimated reparation, Sadhyakshatavana, Social Parishad Shweta, estimated Mishranati Shitana Sarpisha. In case of Sadhyavarana, Sadhyakshatavana, the religion is advised to perform parishad. For this purpose, ghee processed or mixed with estimated should be used. The house should be slightly warm at least, or at least not excessively cold, as extreme cold may prevent the pain and obstruction properly. Drug estimated रसमधुर विपाकमधुर विरिषे गुणगोरस्निग्ध चर्म वेदनाशामक दाहशामक अनुशोधर भोग्य मधुरस मधुर विपाक शीतवीय स्निग्ध गुण सुपोषण. Method of drug preparation. First, one part of estimated will be taken. 16 liter water will be added in local. Heat will be given slowly to the mixture at 1/4. Water should be remain, which is called as quart. Then the quart plus estimated 1 liter carb will be mixed. Heat will be given slowly to the mixture till the water gets evaporated and only estimated the growth was remaining. Pournima will bind blood antiseptic for minor cuts, laceration, burn, surgical wound care. It has long-lasting antiseptic effects due to slow hiding release. Procedure. For estimated group parishad, Purana should be done with normal saline. Then a sufficient amount of estimated group should be taken in a stainless steel bowl and heated on spirit lamp. One estimated group parishad of portion estimated group should be done over the wound daily once for 15 days in the morning. Sterile pad should be covered in the wound and dressing will be done with sterile bandage. For group B, Purana should be done with normal saline and sufficient amount of covered and get over the wound and sterile dressing, sterile pad and sterile dressing will done. And this usually to the daily for 15 days. Primary objective to evaluate the effect of estimated group parishad in the management of Kshatriyakal with special reference to lacerated. Secondary objective to access the change in the signs and symptoms of Kshatriyakal and improvement by the relation of assessment group criteria treatment given for 15 days. To study the mode of action of estimated group is often effect in Kshatriyakal, where easily available, cheaper and safer treatment for Kshatriyakal. Flow diagram, study flow diagram, randomized control clinical study. Randomized control clinical trial, removal of the patient, inclusive criteria, counseling will be done, informed consent will be taken, patient will be divided into 2 groups. Okay, 40 patients of parishad, 40 patients for estimated parishad, and group B 40 patients for Pournima. Follow on first, third, 6, 9, 12, 15 days. Final assessment at the end of the treatment, data collection, statistical evaluation, information and result, discussion and conclusion will done. Study location, OPD and IPD of Shriniwas department of our institute. Study duration 18 months. Duration of treatment 15 days. Follow on first, third, 6, 9, 12, 15 days. Method of selection of study subject, inclusive criteria. Patient have age group between 15 years. Patient irrespective of gender, economic class, caste, religion. Wound size approximately 5 to 5 centimeter, and maximum weight of up to subcutaneous tissue, exclusive criteria, none case of HIV, hepatitis B, TB, VM, bleeding disorder, each patient on antiplatelet, tubercular ulcer, venous ulcer, including ulcer, malignant, sunburn, etc. It makes it excluded. Drug criteria. If patient is not willing to continue the treatment, unable to tolerate the treatment, and unknown drug, adverse drug reaction of treatment on patient. Criteria for assessment. Subjective criteria. Pain graded by mass score of 0, no pain, 1 mild pain, 2 moderate pain, severe and continuous pain. Burning sensation, 0, no burning sensation, 1 slightly localized and occasional feeling of burning sensation. Second, more localized and full burning sensation, no continuous burning sensation. Objective criteria. According to base tension assessment, ages 1, indistinct, diffuse, non-clearly visible. Second, distinct outline, clearly visible. Attached to be even with base. Third, well-defined and not attached to own base. Fourth, well-defined and not attached to base. Ruled under the thickness. Fifth, well-defined and fibrotic, style or hyperkaryotic. Surrounding skin color. First red, pink or normal for ethnic group. Second, bright red and for branches to touch. Third, white or gray. Fourth, dark red or purple with the lack of hyperpigmentation. Exhibit amount. First, full dry. Second one, moist, no observation. Third, small amount. Fourth, moderate amount. Fifth, large amount. Peripheral tissue edema. First, not swelling or edema. Second, non-pitting edema, action of 4 cm around the bone. Third, non-pitting edema, extend more than 4 cm around bone. Fourth, pitting edema, extend up to 4 cm around the bone. Fifth, pitting edema, extend more than 4 cm around the bone. Follow up with the now first or 6 times per day. Treatment plan for group A is to group receive once in a day, which normal as per size. For group 10 days duration of treatment. Group B, local application of fluid management in the day as required amount as per size of bone. 15 days of duration. Discussion and conclusion. The observed phenomena will be discussed and conclusion will be drawn. Stick and the basis of statistical analysis. Thank you.
Thank you, Doctor. Thank you for the thoughtful presentation. And next we go to the another paper presentation. I would like to invite Dr. Karishma Egnath Bensode for the paper presentation. I would like to invite Dr. Karishma for the paper presentation.
Good evening everyone. Myself Dr. Karishma Eknath Bansode. I am PG first year student from Rognidan department at Podar Ayurvedic Medical College, Varali, Mumbai. My paper presentation topic name is Nidan Panchak of Arbuda with its modern perspective. First, introduction to Arbuda. Definition: the word derived from the root herb, that is to hurt or kill. Arbuda refers to a large, deep-rooted, that is non-suppurative, that is non-pus forming fleshy mass. Classical reference of Arbudar, Acharya Sushruta defines it as a mouse pradoshaj vikara, that is disorder of the muscle tissue. Key characteristics of Arbuda are: first is Vrittam, that is circular or globular. Second is Thiram, that is fixed or immovable. Third is Mandarujam, that is slightly painful or painless. Fourth is Chiravruddhi, that is slowly growing initially. The Nidan Panchak of Arbuda, first is Nidana, that is etiology. Aharaj Nidan, that is dietary are, excessive intake of heavy, that is Guru, fatty, Snigdha, and non-vegetarian diets, that is red meat. Viharaj Nidan are lack of physical exercise, chronic irritation, or trauma to a specific organ. Modern correlation are causes of tumor are carcinogens, that is exposure to chemicals, tobacco, and radiation. Genetics, that is hereditary mutation, and biological causes are chronic inflammation and viral infections. Puravarupa of Arbuda are, first is localized heaviness or mild swelling. Second is generalized fatigue and loss of appetite, that is Agrimandal. Rupa, that is clinical signs are Vataj Arbuda, blackish, rough, painful and stretching sensation. In Pittaj Arbuda, there is a reddish burning sensation, quick growth and heat. In Kaphaj Arbuda, there is a stony, hard, pale, cold and severely itching. In Medoj Arbuda, soft, fatty and increases or decreases with body weight. Samprapti, Ayurvedic process, vitiation of three dosha, that is primarily Kapha and Vata, affliction of mouse, that is muscle, Rakta and Meda, Dhatvagni-mande, that is low tissue metabolism, it leads to abnormal tissue accumulation. Modern pathogenesis, cellular mutation, which leads to damage to DNA, leads to uncontrolled cell division. Angiogenesis, that is creation of new blood vessels to feed the tumor. It can be correlated with the Rakta Arbuda. Samprapti, the mechanism by which the disease progresses. First is Dhatu Shaitila, that is weakness in the tissue, that is mouse and Rakta. Second is Dhatvagni Mandya, that is derangement of tissue level metabolism. If the fire of the tissue is low, cells do not mature or die properly. Modern correlation, failure of apoptosis, that is programmed cell death. Strotorodha, that is obstruction of channels leading to localized accumulation. And third is Van-Vata involvement, that is leads to rapid cell division. The types of Arbuda, first is Vataj Arbuda, the dominant dosh is Vata. Clinical features are rough, blackish, hard, prickling pain, stretches like a bladder. Modern correlated with the serous carcinoma or neurofibroma. Pittaj Arbuda, the dominant dosh is Pitta. The clinical features are burning sensation, reddish or yellowish, rapid growth, may ulcerates. It can be correlated with the inflammatory malignancy or hemangioma. Kaphaj Arbuda, the dominant dosh is Kapha. The clinical features are the swelling is stony, hard, painless, cold to touch, skin colored, very slow growth. It can be correlated with the benign tumors, that is fibroma or adenoma. In Raktaj Arbuda, Dhatu is Rakta, that is blood. It is rapidly growing, fleshy, sprouts, bleeds easily, involves blood vessels. It can be in modern correlation, it can be correlated with angiosarcoma, that is malignant metastasis. Mausaj Arbuda, the dominant Dhatu is Mouse, that is muscle. Clinical features are deep rooted, smooth, painless, huge size, firm consistency. It can be correlated with the myomas, that is muscle tumor or soft tissue sarcomas. Medoj Arbuda, the dominant Dhatu is Meda, that is fat. Clinical features are soft fatty growths, moves slightly, increases or decreases in size with body weight changes. It can be correlated with the lipoma, that is fatty tumor. Upashaya and Arishta, that is prognosis. Upashaya is relief through the Shodhana, that is detox, and Lekhan, that is scraping herbs. Sadhya, that is curable Arbudar, Vata, Pitta, Kapha and Medoj in early stages. Asadhya Arbuda, that is incurable or malignant, are Raktaj Arbuda, which is rapidly growing, vascular and bleeding, that is malignant or angiosarcoma. And second is Mouse Arbuda, which is deep rooted, stony, hard and non-healing, that is advanced sarcoma. These are Asadhya. Upashaya involves using specific treatments or diets to confirm the diagnosis based on the patient's response. Upashaya, if the growth shrinks with the lekhana, that is scraping or depleting herbs, or alkaline treatment, that is kshari, it confirms a kapha-meda dominance. Anupshaya, if the growth worsens with heavy oil or growth promoting substances like excessive dairy or sugar, it confirms the proliferative nature of Arbuda. Modern synchronization, observing how a tumor responds to initial intervention, for example hormone therapy or lifestyle changes, to understand its behavior. Arbuda Samanya Chikitsa. First is Upanaha with the dosha shamak medicine accordingly. Second is Raktavasechan, that is with the Shringa, Alabu, Jalokar, Siravet, Vaman and Virechana, Kshar Karma, Lekhan Karma, Agnikarma, Shastra Karma. If there is a wound, then treatment of Rana Chikitsa. Now modern correlation. Arbuda can be correlated with the tumor. Tumor is defined as tumor or neoplasm is the growth of new cells which proliferate without relation to the need of body. This occurs due to abnormal reproduction or abnormal differentiation. The tumor must be used for the new growth, only not for any swelling. Classification of tumor. Tumors are broadly classified as benign and malignant. Benign, that is any capsulated tumor which has no tendency to invade the surrounding tissue. These tumors proliferate slowly and have little evidence of mitosis. The cells are usually well differentiated. In malignant tumor, invasiveness is the characteristic feature of malignant tumors. The age is therefore ill-defined in contrast to well-defined in benign tumors. The term cancer is exclusive for its invading property. Few terms should clearly understood in respect to tumors. First is metaplasia. There is a change in one well-differentiated tissue into other differentiated cell. This usually occurs due to chronic irritation. For example, squamous metaplasia occurs as a simple coronary epithelium of gallbladder changes into squamous epithelium, which is a precancerous condition. It is considered as a metaplasia. Second is dystrophy. This is defined as a disorder, usually congenital, of the structure, function of any organ or tissue. Term dysplasia may be used sometimes for the abnormal development of the tissue. Third is anaplasia. This is a condition where collection of the cell which does not resemble to any kind of tissue. And fourth is teratoma. These are the tumors arising from the totipotent cells, that is the cells which are capable to differentiate into any kind of tissue. That's why in teratoma there is a presence of all three germ layers, that is ectoderm, mesoderm and endoderm. Some benign tumors are papilloma, lipoma, adenoma, fibroma, hemangioma and neurofibroma. The malignant tumors of the skin and epidermis are: first is basal cell carcinoma and second is squamous cell carcinoma. Malignant tumors of secreting epithelium or underlying glands are glandular carcinoma, and malignant tumors of transitional epithelium are transitional cell carcinoma. And third is melanomas. Thank you.
Thank you, doctor. Thank you for the detailed presentation. Next, we go to the another paper presentation. I would like to invite Dr. Karthik Vahandesh Gaudar for the paper presentation. I would like to invite Dr. Karthik for the paper presentation.
Morning, everyone. Myself, Dr. Karthik Gaudar, third semester PG scholar, Department of Agatantra and Viddha-agnikarma, Sri Dharmasthala Manjunatheshwara Ayurvedic Medical College and Hospital, Hassan. Today I am going to present the topic on dermatological manifestation of Visha, which is guided by Dr. Ashwin Kumar S. Bharati, Professor and HOD of Department of Agatantra and Viddha-agnikarma, Sri Dharmasthala Manjunatheshwara Ayurvedic Medical College and Hospital, Hassan. Contents. These are my contents. Coming to the introduction, skin is an integumentary system, consists of the largest organ of the human body and plays a crucial role in maintaining homeostasis by forming a protective interface between the internal and external environment. Due to its direct exposure, skin is the first often organ to manifest due to exposure of toxin substances. In Ayurvedic literature, toxic substances are systematically classified under the concept of Visha, which includes Stavara Visha and Jangama Visha, and Dosha Visha and Gara Visha. Ayurveda recognizes as a specialized branch, Agatantra, devoted to the study of toxicology, encompassing the nature of poisons, their systematic effects, and the management, including the dermatological manifestations of Visha. Coming to the classification of Visha, Visha is classified into Stavara Visha, Jangama Visha, and Kritrima Visha. Stavara Visha is again classified into Upavisha and Mahavisha, and Kritrima Visha is again classified into Gara Visha and Dosha Visha. Coming to the Samprapti of Visha, विषयीदेह सम्प्राप्यं प्राग्दूषितं शोणितं कफ पित्तानिलश्चानु समदोषं सहाशयं ततहृदयास्ताप्यं देहेच्छदे कल्पते स्थितं रसादिश्वतं यथोक्तं करोति धातु प्रभावानिकरन्. As Visha enters into the body, it first vitiates the Rakta Dhatu, and simultaneously, in case of Dushi Visha, it resides into respective Dhatu and causes the respective Dhatu Gata disorders. In case of dermatological manifestation, the Doshi Visha or Visha resides into the Rakta Dhatu and leads to different Rakta Dhatu Gata vikaras such as Kushta, Visarpa, Pidika, Mashaka, Neela, Tilakalaka, Nacha, Venga, Visarpa, Vidradi, Gulma, Vata, Shonita, Arbuda. कुष्ठविसर्पपीडिका गुदमेढ्रास्य पाकश्च गुल्मविद्रदे नीलिका व्यङ्ग पिप्पल्व तिलकालक दद्रुचर्मदल श्वित्रपाम कोटाश्रमण्डल. These are the different Raktadhatugata vikaras mentioned by Sushruta and Charaka respectively. Coming to the Sthavar Visha. Sthavar Vishas such as arsenic will cause alopecia, hyperkeratosis, altered male lines on nails, syndrome pigmentations. Mercury cause acrodynia, itching, rashes, desquamation of palms and soles. Lead leads to pallor of face, alopecia. Copper leads to contact dermatitis, bluish greenish discoloration of skin and gums. In case of irritant poisons, Jayapala causes burning sensation, redness, vesictions, whereas Gunja causes inflammation, oedema, oozing, and necrosis. Arka causes redness, blisters, excoriations. Pallata causes bruises and blisters. Coming to Jangama Visha, in case of Arvikara, that is cobra snake bite, it causes the crawling sensation in first vega and wound formation in second vega and suppuration in fourth vega. In case of Mandali bite, that is viper snake bite, it presents with yellowish discoloration of blood in first vega and yellowish discoloration of skin, burning sensation and swelling over in second vega and suppuration of the tissue in third vega. In case of Rashika, that is scorpion sting, it presents with a burning sensation and throbbing pain and pricking pain with blackish discoloration. In case of Lutha, that is spider bite, causes lesions like a ringworm, white, black, reddish, yellowish, soft and elevated lesions, which is blackish at the center and thread-like at the periphery. These lesions are the fast spreading and painful and burning. Suppuration is formed and new lesions develop to whichever part of the body and comes in contact with the existing lesion. In case of wasp bite, wasps causes swelling, pain, and skin tissues may fall off. Coming to Makshika, that is bee sting. In case of Makshika Visha, elevated lesion appears which discharges immediately, bluish black in color and associated with a burning sensation. In case of Mushika Visha, that is rat, the dermatological manifestation includes the pallor of the skin, nodular or glandular swelling, edema, skin, eruptions and ulcers, circular shaped lesions, herpelations, and oozing or discharge from the affected skin areas. Coming to Dushi Visha produces diseases such as skin disorders like eruptions, skin lesions, and rashes, that is Dushta, Aro, Kitiba, Kota, respectively. And in case of this is according to Charaka and this is according to Shishruta, Slokabodhas, Mandala manifests as a circular skin patches. Kota appears as articular eruptions or wheels. Vaivana presents as a discoloration of the skin. Pada, Kara, Asya, Shofa causes swelling of the feet, hands and face, and Kushta refers to the chronic diseases. Coming to the Garavisha, dermatological impact of a pesticide exposure. Fungicides cause irritant contact dermatitis, that is ICD, eczema and pigmentary changes. Organophosphates cause irritant contact dermatitis, ICD, and allergic contact dermatitis, ACD, and inflammation activation. Pectoroids causes urticaria, allergic dermatitis, irritant dermatitis, and herbicides cause photosensitivity and eczema. In case of cutaneous adverse reactions resulting from the targeted cancer therapies such as acneiform eruptions, which leads to the papulopustular rashes resembling the acne commonly involving face, scalp, and chest. Neutrophilic dermatosis, painful erythematous plaques, pustules, and nodules. And secondary cutaneous malignancy, development of squamous cell carcinoma and keratomas. The targeted cell therapies act on specific molecular pathway involved in tumor growth and cell growth. These includes epidermal growth factor inhibitors and triokinase inhibitors, and some are MAPK pathway inhibitors, etc. Coming to the conclusion, skin acts as one of the principal target organ for any poisonous manifestation. When Visha enters into the body in form of initially Visha-Rakta, and in turn causes Vishishin of Kapha and other dosha, give rise to diverse clinical manifestations, particularly affecting the skin. It may either spread all over the body or only part of which is exposed on the environmental toxin. Dermatological manifestation plays an important role in clear-cut diagnosis of the poison. In addition, skin findings often serve as a warning sign of a systemic toxicity and may precede involvement of vital organs. Thus, careful examination is essential in the comprehensive evaluation, diagnosis, and management of poisoning. These are the reference of my PPT slides. Thank you.
Thank you, Doctor. Thank you for the thoughtful presentation. And next we go to another paper presentation. related to the surgical timing in Shalyatantra. I would like to invite Dr. Prerna Prakash Kagnale for the paper presentation. I would like to invite Dr. Prerna Prakash Kagnale for the paper presentation.
Hello everyone, my name is Dr. Prerna Kaknale, final year PG scholar, Shalyatantra Department, YAMC Kodoli. I am presenting my topic of concept of surgical timing, a Shalyatantra perspective with modern surgical correlations, guided by Dr. L.M. Narhare ma'am, Professor of Shalyatantra Department, YAMC Kodoli. Introduction. Surgical success depends not only on the skill of the surgeon and the method employed but also on the appropriate timing of intervention. The Sushruta Samhita, the foundational text of Shalyatantra, repeatedly emphasizes Kala as a decisive factor in diagnosis, surgical decision making, prognosis, and post operative recovery. In Ayurveda, Kala signifies more than chronological time. It represents the appropriate movement determined by disease stage, patient strength, dose status, season, and urgency. Acharya Shushruta regarded Kala as an essential determinant of surgical outcomes, stating that even correct procedures performed at the wrong time can result in failure or complications. All concepts explained by Acharya Shushruta remains highly relevant in modern surgery. Concept of Kala in Ayurveda. Kala is not merely time, but it is stage of disease, that is Vadi Avastha, strength of patient, that is Rogi Bala, seasonal influence, that is Ritu Kala, urgency of intervention, that is Atyaik Avastha. Shalyatantra uniquely integrates all these aspects into operative decision making. Importance of Kala. कालेन युक्तं क्रियते यत् कर्म न तद् विपद्यते अकाले तु कृतं कर्म विपरीत फलप्रदम्. An action performed at the proper time does not lead to failure. However, an action carried out at an improper or untimely moment produces adverse or opposite results. So, the kala, that is the timing of the surgery, should be proper. Disease maturity and timing. आमविपच्यमानं च सम्यक् पक्वं च योभिषक् जानीयात् स भवेत् वैद्यः शेषः तस्कर वृत्तयः. Acharya Shushruta says that a doctor or a surgeon should know the exact avastha or maturity of the disease in order to treat it well. Do not operate on an immature condition, and once matured, do not delay the surgery. This can be correlated in modern science as abscess drainage after maturation, avoiding surgery in acute inflammatory phase. Emergency surgical timing. प्राणान् रक्षेत् प्रथमं ततो धर्मार्थ साधनं दग्धं गृहं यथा दृष्ट्वा कूपं खनति पंडितः. A wise physician protects life first because all other goals depend on it, just as a sensible person does not dig a well after seeing the house burn, but acts in time. Prananam atteya sarvam karma tvaritam bhavit. When life is in danger, all therapeutic measures must be undertaken urgently. Emergency surgery, trauma, and acute abdomen protocol, golden hour concepts are some of the modern correlations. रोगी बल and surgical readiness. बलवंतं समाहितं शुद्धदेहं विचक्षणः भिषक्कर्म समारभेत. Operate only when the patient is physically strong, mentally prepared, and properly purified. As in modern time, we take special care about preoperative assessment, correction of anemia, infection, nutrition, psychological readiness, and informed consent. Comparative summary between Kala, Shalyatantra, and modern surgery. Vyadhi Avastha, that is disease staging in modern surgery. Pranahar Avastha, that is surgical emergencies. Rogi Bala, that is fitness of the patient. Kalakarma is optimal timing of the surgery. Akalakarma, ill-timed surgery. Discussion. The Ayurvedic concept of Kala represents a multidimensional surgical timing framework integrating patient factors, disease evolution, urgency, and environmental influences. Modern surgery, though technologically advanced, continues to rely on the same foundational principles through protocols, scoring systems, and outcome based guidelines. Modern surgery follows the same principles as Ayurveda, only using protocols and guidelines. This demonstrates that Shalyatantra is not merely historical but conceptually contemporary. Conclusion. Kala is a cornerstone of Shalyatantra. Right surgery plus right patient plus right time is equal to success. Sushruta's timing principles are scientifically valid even today. Classical wisdom complements modern surgical science. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. Next, we'll go to another paper presentation. I'd like to invite Dr. Ninad Rekhuan Rannavare for the paper presentation. I would like to invite Dr. Ninad Rekhuan Rannavare for the paper presentation.
Good evening, everyone. Myself, Dr. Ninad Raghunath Ranavare, final year PG scholar, Department of Shalyatantra, YIMC Kodali. Today I am going to present my topic, Informed Consent in Shushruta Samhita, exploring the classical foundation of consent beyond signature. Introduction. Informed consent is cornerstone of modern medical ethics and medical legal practice. While often perceived as the contemporary concept, its philosophical and practical foundations are deeply rooted in classical Ayurvedic literature, particularly in Shushruta Samhita. Informed consent is not limited to the written signature. It contains disclosure, understanding, voluntariness, and continuous communication. In Shalyatantra, where surgical intervention inherently involve risk, Sushruta Samhita provides ethical guidelines that reflect an advanced understanding of patient autonomy and responsibility of the surgeon. Here we are trying to bridge classical Ayurvedic principles with contemporary medical legal standards. Modern informed consent definition: a process in which patient is informed about the nature, risk, benefits, and alternative of medical procedure before agreeing to it. The core elements for this are information, comprehension, voluntariness, decision, and agreement. Concept of consent in Ayurveda. Ayurveda emphasizes yukti, rationality, dharma, that is ethical duty, and karuna, that is compassion in patient care. Consent is not exactly termed as informed consent, yet its elements are clearly described through instructions on explaining the procedure, assessing patient suitability, obtaining permission, ensuring mental preparedness. Consent is seen as a process and not just a document. Physician's duty. Physician's duty to explain the procedure. Yathavadupadish karma tat kuryat vichakshana. The intelligent physician should first properly explain the procedure and only then perform the action. This is the foundation of information disclosure. Medico-legally, prior explanation is mandatory. This aligns with modern principle of informed decision making. The disclosure of prognosis and surgical risk. Sadhyata va asadhyata va rogasya purva nivedayet. The physician should inform the patient beforehand where the disease is curable or incurable. This is for transparent communication of prognosis, prevention of false assurance, and basis of risk disclosure in consent. Consent of family and authorities. Radnya ज्ञातीनां च अनुज्ञा Prapya karma samarabhet. Surgical procedure should be undertaken only after obtaining permission from the king, that is higher authorities, and the relatives. Guardian consent in case of minors or mentally retarded. Institutional permissions while working at institute level. These are some examples. Mental preparedness of the patient. Bhayasho-kavimuktam tu rogim samupacharet. The patient should be treated only after freeing them from fear and the grief. This emphasizes voluntary consent, mental clarity essential for ethical treatment. Also, the content is invalid if the fear or doubt exists. A Shushrut perspective where we can correlate Shushrut Samhita to the modern concept. And the disclosure of procedure can be considered as Purvameva Achikshit, the explain beforehand. The voluntary consent as Bhiti Varjitam, free from fear. The capacity and understanding as Prasanna Chitta, mental clarity. Proxy content as Nyatinam Sampradarya, ethical duty of surgeon as Dharme Sthiti Bhikshak. Shushruta's approach emphasizes continuous dialogue, trust, and ethical accountability, making consent a process, not a document. Discussion. There are some similarities. Similarities are ancient texts stresses ethical communications, prognosis disclosure, and permission before surgery, aligning it with modern principle of informed consent. There are some differences are ancient references tends to involve family or king's permission rather than individual autonomy. Ayurveda focuses on the trust over the documentation. Evolutions of these are modern informed consent puts the individual patient at the center of the decision making. Conclusion. Shushruta Samhita contains ethical guidelines that foreshadow aspects of informed consent, notably disclosure of risk and permission before intervention. While not identical to today's legal ethical framework, these references reflects early medical ethics and respect of patient well-being. Studying these ancient foundations enrich our understanding of modern concept and its ethical evolution. We should adapt Ayurvedic emphasis on communication and compassion. Thank you.
Thank you, Doctor. Thank you for the remarkable presentation. And next we go to another paper presentation. I'd like to invite Dr. Akshay S for the paper presentation. I'd like to invite Dr. Akshay S for the paper presentation.
Namaste all. Myself Dr. Akshay S, second year PG scholar from the Department of Chikitsa, Sri Jayendra Saraswati Ayurveda College and Hospital. I am here to present on the topic concept of gene therapy and Ayurvedic perspective. So coming to the Human Genome Project, it was an international research project which aimed in sequencing the entire human genome. It was started in the year 1990 and by 2003, the project officially completed by sequencing the entire human genome. And by 2022, the final gapless high quality sequence of entire genome was achieved. So coming to the table of the contents, biology, indication, importance, ethical issues and challenges, and role of Ayurveda will be going through. So coming to what is gene therapy. Gene therapy is a gene therapy in biology is a revolutionary science. Here, the genetic material, either DNA or RNA, is used to treat or cure a disease by correcting the root cause. Here, the faulty gene is often replaced using a healthy copy or by adding a new functional one to the pre-existing one using a vector like viral, chemical, or physical method, such that the defect is being corrected. So coming to the biology, here by early 1960s, the concept evolved, like viruses can be used to deliver the genes inside human cells, mammalian cells. So by 1970s to 80s, David William and David Nathan showed that viruses could can insert a gene into the stem cells. By 1990, the first human trial was successful. It was conducted by William French Anderson. It was a successful trial. Here, ADA deficiency was treated in this condition. By 1990s, the first case was reported because of gene therapy. And in 2000, advanced techniques were developed. And still the research is going on in this field. And he's William French Anderson, father of gene therapy. So coming to the types, somatic and germline. Here, somatic cells are being corrected in somatic cell gene therapy, such as bone marrow, bone cell, blood cells, skin cells. Whereas coming to germline, the target will be either the eggs or the sperm, but due to technical and ethical issues, it is not being attempted. Coming to the approaches, in vivo and ex vivo, as the name suggests, in vivo, here direct delivery of the genes are done into the cells using a viral or a non-viral vector. Whereas ex vivo, here the targeted cells are taken out, cultured. The defect is being corrected, it is cultured and then reinserted back. That is ex vivo method. Coming to the vectors used, it can be either viral or non-viral. Viruses have high reproducibility and it has the ability to infect many cells. So viruses are being preferred. And coming to types of viruses, based on the virus which we select, the types are according to that. So retrovirus, adenovirus, herpes simplex viruses, lentivirus, HSV, these can be used. Coming to non-viral methods, either chemical or physical methods. Under chemical methods, pure DNA construct can be used, or human artificial chromosomes, or nanoparticles, inorganic nanoparticles, or lipoplexes can be used. Coming to physical methods, needle and jet injection, electroporation, sonoporation, photoporation, magnetofection can be done. Here, basically, the cell membrane permeability is temporarily reduced either using a laser light or electric field or ultrasound, such that the uptake is improved. So it takes up the DNA particle when infected. So coming to the strategies involved, either gene augmentation therapy or targeted killing of specific cells, or targeted inhibition of gene expression, or targeted gene mutation. These are the 4 strategies used in the gene therapy. So coming to the importance, it corrects the underlying cause and treats incurable diseases like hemophilia, muscular dystrophy, SCID, and potential one-time cure. It may offer a lasting benefit with a single treatment, and targeted monogenic disorders, ideal for single gene defects. So it helps in that condition. Example, in case of Duchenne muscular dystrophy, the defective protein formation is the cause. So that is being corrected such that it finds a cure. Coming to the indication, example in case of PD, Alzheimer's are showing good benefits because of gene therapy. Coming to other conditions like hemoglobinopathies, immunodeficiency conditions, SCID, gene therapies are showing good results. In hemophilia B, where the factor 9 is injected into the body using gene therapy like adenoviruses, viral vectors are used. They are showing some promising results. In case of cancer also, these are effective. CAR T cell therapies are showing good results in case of gene therapies. Other promising effects of gene therapy are in osteoarthritis, DMD, and diabetes. other advantages and disadvantages of viral vector. Coming to advantages, they provide greater gene transfer efficiency in both in vivo and in vitro methods, and persistent for longer periods compared to other methods. It can target large number of cells. A variety of viruses are available to choose, and accordingly that can be used. An innate ability of tropism towards infection. Coming to disadvantages, it can trigger severe immune responses and inflammatory reactions. Their cloning capacity is very limited and low capacity of tropism in some specific target cells, and it can cause mutagenesis by inserting their exogenous DNA into the host genome. Ethical issues and challenges. The main ethical issue is off-target mutation. Very little is known about the gene regulation and mechanisms in embryogenic development. And human embryos has a high risk of causing pathological disease and disabilities, genotoxic effects leading to neoplastic transformation that are prone to tumor development. Other ethical issues are informed consent, genetic mosaicism, enhancement, and eugenics. So few control boards are there. In India, GTAEC governs the gene therapy, and it controls the clinical trials that are happening in India. Along with that, other boards like Institutional Ethics Committee and RCGM and CDSCO has a role in controlling all the trials which are happening. Role of Ayurveda. Coming to the role here, the concepts are told by acharyas in the under the topic like Bija Bhaga Aveva Drishti. Acharyas described inherited and genetic disorders under Sahaja, Kulodbhava or Adibala Pravritta Rogas. So Kulaja Vikaras are asadhya by prognosis. So when there is no specific therapeutic option, it is preferable to follow the precautionary methods. So in Charkam Shariram second chapter, 5 reasons for genetic disorders they have mentioned. Bija dosha, Atma karma, Ashaya dosha, Kala dosha, Matu Ahara Vihara are involved. So following Dinacharya, Ritucharya and Garbhini Charya may have a role in preventing the hereditary disorders. Anuvamshika Vyadhis are also mentioned. Here the role of Bija Bhaga and Bija Bhaga Aveva Drishti are explained. So coming to Ayurveda and epigenetics, it is proposed that the genotype and phenotype, that is which can be correlated to the Prakriti and Vikriti, and the mRNA, tRNA and the proteins can be correlated to the Vata, Pitta and Kapha. So the mRNA moves, it carries the information from one place to another. So it can be correlated to the Vata, whereas the tRNA, which undergoes changes, which has the information which helps in DNA replication. So it transforms, undergoes changes. So that can be correlated to the Pitta. And the final protein, which is formed because of this DNA, that can be correlated to the Kapha. Coming to Ayurgenomics, this is a developing branch in Ayurveda. Here, the concepts of Ayurveda, it integrates the concept like Prakriti with the modern genetic research. So it correlates the combination of Vata, Pitta and Kapha with the expression of specific genes and physiological characteristics. So the researchers observed a correlation between the HLA types and the Prakriti type, with the complete absence of HLA DRB02 allele in Vata type and B113 in Kapha type. Furthermore, 110 had a higher allele frequency in Kapha type compared to that of a Pitta and Vata type. And in a study in 2012, in patients of RA, they found that the inflammatory genes were upregulated in Vata type, whereas in Pitta and Kapha, the upregulation of oxidative stress pathway genes were found to be more. And physiological differences were found in Kapha, Pitta and Vata type. For example, in Kapha type, they have higher levels of triglycerides, total cholesterol, and high levels of LDL and low level of HDL. Whereas in compared to that of a Pitta and Vata type. In case of Pitta type, they found that hemoglobin and RBCs were higher, whereas in Vata type, the serum prolactin were higher. And genome-wide analysis correlates with Ayurvedic Prakriti. Here in this article, it was mentioned that first the composition of Prakriti was determined by senior Ayurvedic physician, and it was confirmed using Ayusoft application. Further, 52 markers were used to find the genotype and phenotype correlation. And these were the following observations made. The two markers, that is 915 and 4846, were associated with two different prakritis. 915 with Vata and Pitta, while 846 with Kapha and Vata. And this observation prompted to believe that different alleles of a same locus might be influencing a different prakriti. And these data also suggested that the SNP ending with the number 257 in PGM1 gene is linked with one of the main feature, that is which is involved in the energy production, which is more homologous and constant in Pitta Prakriti people rather than Vata and Kapha. So this was one of the notable points which they came up with this research. And Ayurgenomics and epigenetics are upcoming field in Ayurveda, and much exploration is needed in this field. And thank you for this wonderful opportunity. Thank you.
Thank you for the remarkable presentation. Next, we go to the another paper presentation. I would like to invite Dr. Srilakshmi CN for the paper presentation. Next, I would like to invite Dr. Srilakshmi CN for the paper presentation.
Good morning, everyone. Myself, Dr. Srilakshmi CN, Assistant Professor in the Department of Travyaguna from SBSS Krishna Ayurveda College, Baliram. The topic of my presentation is the concept of Viddha-agnikarma and its relevance in the present era. These are the contents of my topic. Coming to the introduction, Viddha-agnikarma is the principal concept mentioned only in Ayurveda classics, and it is the cause for many metabolic as well as systemic disorders in our body. Acharya Charaka, Chakrapani, and Gangadhara have detailedly explained the concept of Viddha. Coming to the Nirukti, Visheshena Rodhanam Karudiri Virodha, that which obstructs or opposes is known as Viddha. Coming to the definition, it kinchit dosha mastravya na nirharati kayadah ahara jadam tat sarvam ahidam upajayate. This is a reference from Charaka Sutra, which mentioned that one which vitiates the dosha but it doesn't expel it out of the body, it is known as ahita. According to Chakrapani, Sharira Dhadu Virodhanam Kurvandi idi Vairodikaha. That which opposes the Sharira Dhadu or the Sapta Dhadus are known as Virodha. This is the concept. Acharya Charaka have explained the 18 types of Viruddha which are mentioned here. And when we closely analyze the 18 types of Viruddha, we can classify it under the headings like concern with food, concern with the consumer, and other factors. These are elaborately explained or can be concluded in like Matra and Matra, Samskara, Virya, Rasa, Samyoga, Paga, Viruddha under the concern with food. Agni Viruddha, Sadmi Viruddha, Dosha, Koshta, Hrid, Avastha Viruddha concerned with the consumer, Desha and Kala are the other factors. Let's analyze the Samprapti of Viruddha Ahara. Viruddham Abhicha Aharam Vidyad Visha Garopo, that which acts like Visha or Gara can be said as Viruddha. Viruddha Ahara when consumed, it causes Rakta Dushti, which in turn can cause death, just like anaphylactic shock. Or the Rakta Dushti, which in turn lead to Dhatu Dushti, and Dhatu Gada Rogas can occur, which is similar to Visha. Viruddha-ahara causes Ama, which in turn causes the Agni Mandya, which leads to Srodha Dushti, and again Dhatu Gada Dushti. In long term, it can be similar to Garavisha. Coming to the effects or complication of Viruddha-ahara. Shandhyanta Visarpa Dakotaranam Vispoda Unmada Bhagandaranam Mursha Mada Atmana Galagrahanam Panduamayasya Vishasya Cheva Kilasa Kushta Grahani Gadanam Shodamla Pitta Jvara Pinasanam Santana Doshasya Tadeva Mrityu Viruddhamanam Pravadandi Hetu. This is the reference from Charakam Sutra. If we analyze the effects of Viruddha-ahara, we can classify it under the Saptadhadus as well as Indriya and Mana. that is Clivia, Jwara, Penisa, Pandu belongs to Rasapradoshaja Vikara. Visarpa, Vispoda, Kushta, Kilasa, Rekta, Pitamla, Vita, etc. comes under Rekta Pradoshaja Vikara. Hagandara comes under Mamsagada, Jalamaya under Medas, Vidradi under Asti, Mursha comes under Majja Pradosha Vikara. Sandana Dosha and Shandada comes under Shukra Pradosha Vikara. Andya again comes under the Indriya Pradosha Vikara. Mada and Vinmada due to the Visheshan of Manas. From the above list, we can conclude that even death may result from the consumption of Viddha-ahara, and also even impotency and infertility can occur due to Viddha-ahara intake. That is from Rekta Pradoshaja Vikara to Sandana Dosha, that is up to the genetic level, Viddha-ahara can affect our body. Some of the dietary incompatibilities that we see in our day-to-day lives. These are Samyoga Viddha, we can say for example shake, which is milk and again amla dravyas or amla phalas, puddings, biryani, salad and different preparation of chicken. Like curd will be used for marinating the flesh of the chicken. This can be correlated to Samyoga. Next is Samskara Viruddha. Again, smoked and barbecued food products which contain high levels of lipid peroxide, which in turn produces free radicals in our body, which plays a vital role in diseases like cancer and Alzheimer's. Again, the fats and oil, when heated in excess, can turn carcinogenic. For example, in the case of French fries and potato chips, these can occur. Next is Samskara and Paga Viruddha. The food preservatives and the food adulterants which we use in our day-to-day, not day-to-day life, but still which is seen in our day-to-day life, can cause our Viruddha-ahara and cause many adverse effects on our body. Coming to Matra Viruddha, the Kesari dal, that is the Lathris sativus, contain an immense amount of BOAA, which is a neurotoxin, and if it is consumed in excess means this neurotoxin can cause lathrism in our body. Therefore, we must check the matra which we are taking in of the kesari dal. Otherwise, it can cause lathrism. Next, some of the scientific reasoning. Like if we take ghee and garlic together, both are having anticoagulating properties. Like tea is having coumarins, whereas garlic is having anti-clotting properties. If they are taken together means there is an increased chance of bleeding, either internal or external. Next is pomegranate as well as grape juice. Both these juices can block cytochrome P45-384, which is the enzyme for the metabolism of the drugs which we intake. If these drugs along with these juices are consumed means there is a chance of synergistic action. Next is again French fries. A recent study have found that 4-hydroxyl trans 2, that is HNE, is formed when the oils are reheated. That is, the oxidative rancidity can occur when fatty acids are exposed to oxygen in the presence of heat, which in turn forms aldehyde. And these aldehyde have an increased risk of causing cardiovascular diseases, Parkinson's diseases, Huntington's diseases, various liver and cancer can occur in our body. Next is heated honey. It is also mentioned in Ayurveda text that heating honey is samskara viruddha. But we all know that the honey which comes in our market, that is the Agmar honey, are thoroughly or strongly heated just before packing in order to ensure its sterility. So it is important that we must not heat the honey for use. Next is high temperature cooking. Food which is cooked especially in high temperature can cause AGE, that is advanced glycination end product, which damages the functioning molecules, especially when proteins are cooked with sugars in the absence of water. Water prevents the sugars from binding the aldehyde, thus by preventing the AGE formation. Next is fast food. Fast food is high in energy density and low in essential micronutrient density, especially zinc. Zinc deficiency is positively correlated with the deficiency of testosterone and antioxidant vitamins, and negatively correlated with the CNF, that is TNF, that is the tumor necrosis factor, as well as the C-reactive proteins. Trophology, the science of food combination, is a new emerging branch in the case of modern science. It is based on the idea that certain food combination can improve digestion, nutrient absorption, and overall health, while poor food combination can lead to indigestion, bloating, and toxic buildup in our body, which was already dealt in our Ayurvedic science many years. Some of the basic principles of trophology are mentioned in these. Relevance of Viddha-ahara in the present era. Viddha-ahara is one of the reasons behind various skin diseases, diabetes, hypertension, etc. Food-food interaction along with food-drug interaction is an important factor which changes the properties of food articles as well as the action of the drug, which in turn causes various ailments in our body. These are some of the complications of Viddha-ahara. And I would like to conclude my topic saying that think before you eat. Like ahara is mentioned as a Mahabhaishya according to Acharya Kashyapa, but still we have to think before having each bit of food. Thank you.
Thank you, Doctor. Thank you for the well explained, wonderful topic and wonderful presentation. Thank you so much, Doctor. And next we go to the another paper presentation. I'd like to invite Dr. Aparna Chindarla for the paper presentation. I'd like to invite Dr. Aparna for the paper presentation.
Good evening, respected ma'ams and sirs. I'm Dr. Aparna Chindarla, third year PG scholar from Chikitsa Department, Dr. NRS Government Ayurvedic College, Vijayawada, Andhra Pradesh. My topic is concept of Marma Chikitsa in Prameha, and my guide is Dr. Kurup, Shriniwas, Professor of Chikitsa Department. Coming to Marma, it's a vital part and it's an important area where energy resides, and this is called Pranasthana. 107 Marmas are mentioned in Bruhatrayi. This is the classification according to Acharya Sushruta, and then one more extra classification is there in structure by Marma Chikitsa. This is the concept. Definition of Marma. Marmani Pranayadanani according to Sushruta. Any stimulation at Marma Pradesh is equal to direct influence on Marma. Nature and supremacy of Pranavayu. Prana is sthiti, sarve sthita. Prana is stable, all other vayus are stable. Hence regulating Pranavayu automatically regulates Udana, Samana, Vyana and Apana. Location of Pranavayu. According to Ashtanga Hridaya, Pranavayu resides in head, heart, ura, kanta. And these are the marmas that are located here. Marma stimulation acts on prana. Marmani nama mamsasira snayu asti sandhi sannipatastedu swabhavateva visheshena pranastishtanti. So, marma is a site of conjunction of muscles, vessels, ligaments, bones, joints. Because of this structural convergence, marma are highly sensitive, rich in prana flow, easily responds to stimulus, awakens dormant or obstructed prana. Mechanism. Removal of Vata Avarana. Marga Avaranajam Vata Vaikrutam. Vata gets vitiated due to obstruction of its pathway. In many disorders, Kapha and Ama obstructs Pranavayu, especially in Urus, Hrudi and Sreras. Marma stimulation. Normal movement of Vayu ensures proper function. When prana regains its pravruta gati, it removes Shrotarodha, restores gati, destroys kapha and ama obstruction, re-establishes vata. Prana Udana Samana Vyana Apana. So prana is the leader of the Vayu. Once prana is activated, Udana regains speech and effort, Samana restores digestion, Vyana normalizes circulation, Apana resumes elimination. This ends Vata Avarana. Coming to prana removes kapha dominance. How? Balanced prana keeps kapha in check, disturbed prana allows kapha dominance, activated prana mobilizes stagnant kapha, restores prana in prana Vahasroth, breaks avarana at functional level. Specific action on prana function. Urakanta charo buddhi hrudayendriya chitta druk stevana kshavadudkara nisvasanna praveshakrita according to Ashtanga Hridaya. Pranavayu controls intellect and senses. Heart functions, respiration and swallowing. Hence marma stimulation helps in dyspnea, anxiety, insomnia, autonomic imbalance, metabolic control law. Prameha Samprapti in Panchamahabhuta level, Tridosha level, Panchavata involvement. Coming to Panchamahabhuta level, imbalance of Panchamahabhuta due to improper Ahara and Vihara. Coming to Tridosha level, Kapha increases first, later Pitta alters, later Vata increases. Kapha Mahabhuta dominance is there mainly Jala and Prithvi. How? Prameha Nidana Sevana mainly Snigrha Guru Pichla Drava taken continuously makes the Kapha Vritti, which leads to Jataragni Visheshan. Here the Prana Vayu Dushti occurs, next Vayu Udana, so Udana Vayu Dushti occurs, next Vayu Samana, so Samana Vayu Dushti occurs. The increased kapha vishers the Jataragni disturbs Avasthapaka leads to the Kleda Utpatti. Here the normal ratio of the Prithvi and Jala Mahabhutam alters. Here Jala Mahabhuta increases more in this Kleda and it is called Vaikruta Kleda, which disturbs the normal function of Kleda. Process of Anna Kledana and Anna Virodan, it disturbs the normal function of Kledika kapha and Agni. How? Vaikruta Kleda vishers the Kledika kapha, decreases the function of the Pachaka Pitta, leads to the Agni Mandya. Here the formation of Ama occurs, which leads to the Ajirna. So Vaikruta Kleda affects the Anna Pachana Kriya. Then the Vyanavata Dushti occurs here. Here Vaikruta Kleda vishers the Mamsa Dhatu and Medho Dhatu. Because of this Shrotarodha occurs, leads to the Dhatu Shaitilya. Here the proper nourishment will not be happens. Here the Mala or Mutra and Sweda. Coming to Mutra, it has its function, Kleda Avahan. Because of this Vaikruta Kleda, which comes to the base along with the V-sheeted Mamsa and Meda. Here the Apanavayu Dushti occurs. So the Vaikruta Kleda along with V-sheeted Mamsa and Dhatu hampers the functions of the Mutra, which leads to the Prabhuta Avila Mutrata, which is the Lakshana of the Prameha. These are Kapha dominant, which leads to Kafacha Pramehas. After continuous taking of Kafacha Ahara Vihara, it's in our body Viruddha Guna Ichha develops. Because of this, we will take the Pitta Vruddhikara Ahara and Vikara. Continue taking of Pitta Vruddhikara Ahara and Vihara and followed by its Samprapti leads to Prameha, which is Pittacha Pramehas. Later, when Kapha and Pitta are diminished state, the Vata gets aggravated, and by taking the Ahara Vihara of Vataja continuously and Samprapti follows leads to Vataja Pramehas. Here the Udhana Vayu Dushti occurs. So here Oja depletion is there, Dhatu Kshaya is there. Further chronic progression leads to the Madhumeha. This is the Prameha Samprapti at Panchamahabhuta level, Tridosha level and Panchavata involvement. Marma Chikitsa. Here these are the marmas that we are going to stimulate in the imbalance of Panchamahabhuta Tridosha and the dysfunction of Prana, Samana, Vyana and Udhana. These are the marmas that we are going to stimulate in Prameha. Identify marmas. These are the marmas on our body. These are the marmas on back, on foot. This is Simanta Marma, Adipati Marma, Kshipra Marma, Talahrudya Marma. These are the rules that we should follow. First, the marma should be stimulated on the right side in males and vice versa. Marma should be stimulated by sitting position on Vajrasana, maybe Sukhasana also, but we should not stimulate in standing position. Everyone should wear a Rudraksha while doing the marma stimulus to avoid the negative energy. So we should do pranayama and chant Mahamrutyunjaya mantra by waking up in a Brahmi Muhurta. Stimulation time in a healthy person 5 to 8 times per minute and in a sick person 15 to 18 times per minute. Press release is the stimulation process. Here the press and release counts 0.8 seconds plus 0.8 seconds. You should be counted by Om Namah Shivaya. Marma rolling Prameha. Coming to Stapani Marma. This is a major prana regulatory marma, and rolling Prameha is regulates stress induced hypoglycemia, improves autonomic balance and enhances prana control over samana. Coming to Adipati Marma, it's supreme controller of prana and role in prameha. Improves hormonal coordination, supports pancreatic endocrine regulation, activates central metabolic control. Coming to Hrudi Varma, Pranavayu is major, it coordinates prana and Vyanavayu, and role is improves peripheral glucose transport, helps diabetic angiopathy, improves cardiac autonomic function. Coming to Nabhi Marma, chief seat of Samana Vayu, regulates the Agni and digestion, and role is improves Jataragni, enhances nutrition, metabolism. Nutrient metabolism reduces kapha and medha accumulation. Coming to Basti Marma, it controls Apana Vayu, and role in Prameha is improves urinary regulation, helps polyuria, supports elimination of metabolic waste. And Gulfa Marma and Kucha Marma serve the supportive, which improves the peripheral circulation by supporting Dhyana Vayu, and role is prevents diabetic neuropathy and improves circulation, and which helps in diabetic foot condition. Talahrudi Marma, it is a peripheral seat of Dhyana Vayu, and its role is mainly enhances microcirculation. And coming to Kshipra Marma, this is the rapid regulator of Dhyana Vayu and circulation. Its main role is enhances circulation to distal tissues, helps reduce stiffness and heaviness of limbs, supports tissue nutrition and wound healing. Kanta Marma, this is a seat of Udana Vayu, mainly supports metabolic rate regulation, helps chronic fatigue and weakness, enhances tissue vitality and ojas preservation. Action of above marmas. These are the action of the above marmas, which control the prameha. Marma stimulation restores the leadership of pranavayu. Thank you.
Thank you, Doctor. Thank you for the well-explained presentation. And next we go to the another paper presentation. I would like to invite Dr. Anjali Piyus for the paper presentation. I would like to invite Dr. Anjali for the paper presentation.
Good morning, everyone. Today, here I am going to speak about Ayurvedic insights into the integrative management of celiac diseases, guided by Dr. Pradeep Kumar Moharanas. So, celiac disease is a chronic immune-mediated enteropathy precipitated by gluten ingestion in genetically susceptible individuals. Globally, the pooled seroprevalence of CD is approximately 1.4%. In Ayurvedic terms, it corresponds to Anavaha Shrododushti, with ama accumulation progressing to ama Visha. The increasing prevalence, atypical clinical presentations, and long-term complications underscore the need for holistic and integrative management approaches drawing upon the comprehensive principles of Ayurveda. These are the methods I followed, and the result: celiac disease is a serious autoimmune disease that occurs in genetically predisposed people where the ingestion of gluten leads to damage in the small intestine. And its pathogenesis is it always associated with other autoimmune disorders, also with the genetic predispositions like Down syndrome, HLA-DQ2 and 8, and exposure to prolamins, that is the proteins found in wheat, rye, oats, and barley. And it causes inflammation of the intestinal epithelium, and it leads to two manifestations: extra-intestinal manifestation and intestinal manifestation. So here we can see in celiac diseases, the normal villi of a healthy intestine become atrophied. We can see in the picture. Exactly, there is no medication that treats celiac disease. So, according to modern management, mineral and vitamin supplements, enzyme therapy, folate supplements, iron supplements, and the healthy gluten-free diet limit high sugar intake, increase micronutrients, increase intake of polyunsaturated fatty acids, limit consumption of ultra-processed food, etc. are the ways to control celiac disease. According to Ayurveda, it can be correlated with Anavahasrodho Dushti. So the Ulbhavasthan of Anavahasrodhas is Amashen Vamaparshva, Dushtinidana Asar, Adimatrahara, Agalahara, Hidabhojana, Agni Dushti or Agni Madhya. And Dushti Lakshanas are Annabhasha, Arichi, Abhibhaga, Chardi, etc. And also Marana is mentioned by Susrodha. It also we can see in celiac diseases at the last stages if treatment was not done. So Annavahasrodho Dushti Chikitsa, that is Pranodaka Annavahanam Dushtanam Shwasagikriya Karyatrishno Bashamani Tadeva Ama Pradoshaki. So Ama Pradosha Chikitsa, Ama Visha Chikitsa, Lenkana, Devana Pachana, Shodhana Patyahara and Rasana therapy are the main treatment protocols for celiac disease. So in Ama Pradosha Chikitsa, we can do Abhadarpana, that is Lenkana, Lenkana Pachana, and Doshavasechana. In Doshavasechana, we can do Vamana, Virechana, and in Bahudoshavastha, mainly this Shodhana can be done. And for Lenkana, Vamana, Virechana, Niruhanasya, Vibhasa, Marutadapa, Pajana, Vasa, Vyayama, etc. we can do. And in Alpadoshavastha, Lenkana can be adopted. And treatment of Samanavada also can be adopted in the case of celiac disease. The classical preparations to tackle celiac diseases are Jeerakati Churna, Hinguashtaka Churna, Vaishwandra Churna, Bhaskara Lavana, Indukanda Grida, Panchukola Grida, Bilwadi Gudiga, etc. The Rasayana Prayogas which can be used here are Amalagi Rasana, Pipalya Digrida, Brahmi Grida, Guduji Satu, and Chavana Prasha. So, as a discussion part, celiac disease represents a chronic relapsing condition with a persistent Agni Madhya and Navahasrodho and Amavisha leading to Grihani dosha and progressive Dadukshaya. Ayurveda emphasizes a stage-wise approach where Ramapachana and Shodhana form the foundation, followed by Rasana Prayoga for long-term restoration. The initial therapeutic focus should be Ama Pradosha Chikitsa, wherein Abhadarpana serves as the primary line of management to reduce metabolic load and clear Ama. Abhadarpana missions such as Lankana, Peya, Vilevi, Takra, and control of fasting also help in restoring Agni. After the Ama Nirharana and Agni stabilization, Rasana Prayoga promotes Rodha Pushti, mucosal healing, Vyadikshamatwardhana, and correction of the Dadukshaya by correcting root pathology rather than symptom suppression. Rasayana therapy may reduce recurrence, improve nutritional status, and enhance quality of life. An integrative approach combining gluten-free diet with Ayurvedic Rasayana appears rational and patient-centered, especially in chronic and refractory cases. As I conclude, Ama Pradosha Chikitsa with Abhadarpana and appropriate yogas forms the cornerstone of early management by eliminating pathogenic Ama and correcting metabolism. After stabilization of Agni, Rasayana Prayog plays a pivotal role. Further systematic clinical trials are required to validate and standardize Ayurvedic protocols in the management of celiac diseases. These are my references. Thank you.
Thank you, Dr. Kanji, for the insightful presentation. Next, I'd like to invite Dr. Sudesh K for the paper presentation. I would like to invite Dr. Sudesh K for the paper presentation.
Good evening. Thank you, the organizing committee, for giving me an opportunity to present a case. So today I'm going to present a case on the skin condition. So it's a single case study on the efficacy of Panchakarma in skin disorder. So as all of us know, Kushtaroga or skin condition It's a chronic condition and it's a challenging case because of its recurrence. It's mainly because the three doshas are involved in that. Though there will be dominance of one or two doshas, because of the involvement of all the three doshas, it is really challenging. So here we used the traditional conventional treatment method only to remove the root problem. So our objective was to see the rapid clinical improvement through our normal Panchakarma Shodhana Chikitsa. So the patient profile is like this. He was a 31-year-old male having severe itching and it lead to the sleeplessness also. And there was profuse oozing of white transparent fluid since 3 years. And the condition was a rounded patch, which was more reddish in color and which was spreading to the surrounding areas also. Patient was also complaining of irregular bowel movement, fluctuating appetite, and also severe anxiety because of this problem. So it was mainly in the lower limb and also in the inguinal region, but small patches were there all over the body. So we diagnosed it as a Kushtaroga with Kapha Rekta dominance. Though all the doshas were there, Kapha and Rekta was more dominant in that case. And we have followed the Kushtaroga line of treatment. So first we prepared the patient by doing Dibana-Pachana Chikitsa, Dibana-Pachana procedure. After that, then Snehapana was done. Then Vamana, Virejana, and after the main procedure, in the Shamana Kriya, we did Takradara. So in the Dibana-Pachana, we used Chirivilladi Kashaya and Vaishwanara Churna. So it was mainly to improve his Agni and also improve the digestion. Because after that we are going to do the medicated ghee procedure. In Snehapana we used Mahatiktaga Grida. So we did Snehapana for 6 days. From the 5th day evening onwards, we could see the changes as Samyak Snigdha Lakshana. And on the 6th day, proper Samyak Snigdha Lakshana we observed. So we stopped the Snehapana on the 6th day. In the Pradhana Karma, we did Vamana and Virejana. So one day prior to Vamana, we did a Kaphotkleshagara Ahara diet in order to excite the Kapha, to provoke the Kapha for deep cleansing. And the Vamana procedure was very successful, very effective. We got Uttama Shuddhi. And because of that, the planned Virejana we did in the Avara Matra because the patient had a proper Vamana. And also after that, he had 3 subsequent bowel movement also. So we did Avara Matra Virejana Kriya with Avipatti Churna. In the Sansarjana Krama, we followed 2 days of proper diet plan. And externally, after the Pradhana Karma, externally we did Takradara to manage local inflammation and oozing. So internal medicines we have given him Aragvadadi Kashaya and Nishotamadi Kashaya. It was mainly for the blood purification purpose to support the metabolism and liver. We have given him Arogyavardhini Vadi also. Then Manibhadra Gulam for mild detoxification, 1 teaspoon at a bedtime. And for external washing as a medicated bath, we have given him Siddharthaga Snana Churna. So in the clinical result side, we assessed him pre-treatment and as well as in the post phase. So there were mainly itching and oozing. That was his primary complaint, which was very severe and that disturbs his sleep. So after the treatment, we could see 100% change in the itching and oozing. Then the skin lesions were also very active and red in the beginning. Then in the post-procedure, we could see it is slowly healing and fading. And appetite, it was fluctuating, but after it became a little bit more stable and strong. And bowel movement was also irregular and constipated. So after the treatment, we could see it is getting more towards the normal side. And because of all these problems, his mental state was also very very difficult. He was in anxious condition. He was depressed also. So we could see significant change in his mental status also. We have assessed his condition week by week. So the first phase, it was oozing, and there were a lot of reddish, itchy kind of condition. Then slowly it changed, and you can see here, it became completely faded, and the itching was also completely stopped. So this is right leg comparison week by week. Initially it was oozing also, and at the end it's completely faded. And also in the body we have seen the same changes happen, including the inguinal region. So in Ayurveda, Vamana is considered as the gold standard for kapha problems and Virejana for the pitta or rakta problems. And by following proper the classical procedures, we could see very good change in the condition, especially here, the reduction in the itching and all. It shows that the toxins were there and we could properly remove it from the body through proper Panchakarma procedure. So individualized Panchakarma is highly effective for chronic condition, especially chronic dermatitis. It offers a holistic, root cause oriented management protocol that restores both physical health and physiological stability. Thank you.
Thank you, Doctor. Thank you for the well explained and wonderful presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Kamle Savida Potalaji for the paper presentation. Next, I would like to invite Dr. Kamle Savida for the paper presentation.
Everyone, I am Dr. Savita Kamle from SST Ayurvedic College, Sangamner. Today I am going to present paper on randomized controlled clinical trial to determine efficacy of Argodamutadi Kashai in management of Amla Pitta with special reference to non-ulcer dyspepsia. Introduction. Amla Pitta is a common disorder of Anuvasvartasi in Ayurveda caused by mutation of Pitta and Kappadosha. Symptoms of Amla Pitta include avipaka, utklesha, tiktamla, udgara, utkanta daha, aruchi, klamma, etc., which reflect imbalance of Agni and accumulation of Am. Amla Pitta resembles non-ulcer dyspepsia of modern. Non-ulcer dyspepsia includes symptoms like epigastric pain, bloating, nausea, heartburn. There is no structural abnormalities found in non-ulcer dyspepsia. Ayurveda links it to disturbed Agni and Am formation due to improper Ahar Vihar. Modern lifestyle contribute to increased incidence like spicy food, stress, sleep deprivation lead to Agni Dushti and Pitta Prakop. This results in Amla Pitta formation and irritation of Annavasrota. Chronic cases of Amla Pitta may lead to gastritis, ulcer and acid reflux. Need of study. Rising digestive disorder due to poor diet, stress, irregular lifestyle. Amla Pitta prevalent across age group, especially in adult. Modern drug offer temporary relief with more side effects. Ayurveda provides root cause correction but lack of scientific validation. Hence, study aims to evaluate efficacy of Argodamutadi Kashai as compared to Patola required in managing Amla Pitta. Aim and objective. To evaluate the therapeutic efficacy of Argodamutadi Kashai in the management of Amla Pitta and to compare its result with those of Patola required, a standard Ayurvedic formulation indicated in Pitta Swati. Objective. To determine the efficacy of Argodamutadi Kashai in management of Amla Pitta with special reference to non-ulcer dyspepsia. Primary research question. Does Argodamutadi Kashai provide significant therapeutic benefit in the management of Amla Pitta? Study design. It's a randomized controlled clinical trial, blinding technique and open label. It contains two groups. Group A, trial group, contains 40 patients given Argodamutadi Kashai and group B, which is control group, contain 40 patients and given Patoladiquat. Sampling technique. Sample was selected by randomized probability sampling method. Methods of selection of study subject. Inclusion criteria. 18 to 15 years age group patient irrespective of sex. All the patient with sign and symptoms of Amla-Pitta like विपाक उत्क्लेश तिक्ताम्ल उद्गार गौरवता रथकंठदाह अरुचि patient who are ready to sign the informed consent form. Exclusion criteria: known cases of bleeding disorder and carcinoma of stomach, known cases of severe systematic and endocrine disorder like DM or thyroid disorders, lactating and pregnant women, known cases of TB, HIV, hiatus hernia or calcia cardia, known cases of Helicobacter pylori infection. Materials: sample source, diagnosed patient of Amla-Pitta from OPD and IPD of Ayurveda Rugnala were taken as sample. Raw drug collected from market, its verification and authentication was done as per API guideline. Drug is paid as per standard operating procedure. Quality control of prepared drug done and finished drug quality control analysis carried out. These are the standardization charts of drug. Mode of action. Argadamutadi Kashaya has Deepan, Pachan, Pitta Shamak and Raktashodak properties which causes detoxification of Pitta, improves Agni, reduces burning and swarbelching. Patoladiquat has Pitta Kapha Shamak and Deepan Pachan Tushna Nigraha properties which causes digestive enhancement and relieve nausea, heaviness and acidity. Treatment protocol. In this treatment protocol, 80 patients divided into two groups, experimental group and control group. In experimental group, Aragvadamrudadikashai given to patient and patient 40 ml orally twice daily in divided doses at morning and evening time with Koshnajalayanupan up to 4 weeks and follow up on 7, 14 and 28 day. In control group, Patoladiquat given to patient 40 ml orally twice daily in divided dosage at morning and evening time with Koshnajalayanupan up to 4 weeks on 7, 14 and 28 day. Parameter for assessment includes subjective parameters like Tiktamlodgar, Radkantadaha, Aruchi, Utklesha, Avipaka, Klama, Gauravta. Oral assessment. It is carried out on the basis of percentage of improvement of symptoms and grade of relief. Complete relief, that is 100% in group A occur in one patient and group B no patient found. Mark relief, that is 75% to 99.9%. In group A about 28 patient found and group B 15 patient. Moderate relief 15 to 74.9%. In group A 8% found and group B 21 patient. Mild relief, that is 25 to 49.9%. In group A 3 patient and group B 4%. There is no patient in poor relief and no relief group. Result and conclusion. Result. Both showed significant symptom relief, but group A had a higher average improvement, that is 79.56%. Mechanism of action of drug. Arvadamrutadikashaya correct Agni and purifies Pitta, while Patoladiquat offers symptomatic relief only. Conclusion. Both are safe, but Arvadamrutadikashaya is more effective and prevent recurrence better. Thank you.
Thank you, doctor. Thank you for the presentation. Next, we go to the another paper presentation. I'd like to invite Dr. Kalpraj Anil Kodari for the paper presentation. Dr. Kalpraj for the paper presentation.
Namaskar, good evening. Myself, Dr. Kalpraj Anil Kothari, third year PG student, Prajkta and Visha Kalpana Department, PMT Ayurved College, Shegaon. Guidance of Dr. Renuka Suryavanshi, Professor and HOD of Rasashastra and Bhaishya Kalpana Department, PMT Ayurved College, Shegaon. Management of kidney diseases through the Ayurveda. Kidney disease and Ayurveda. Ayurveda is an ancient study of treating body, brain, and soul. As Chikitsa like Shaman and Shodhan Chikitsa and Daiva Apashya Chikitsa, the aim of Ayurveda is eradication of disease and maintenance of health of healthy individuals. Kidney disease or kidney failure is a condition in which kidney may suffer difficulty or fails to filter the toxin and other impurities from blood. Nidana, Tikshna Aushadha, Ruksha Madhyaprasan, Ati Vyayama, नित्य द्रुत पिष्टान्न अनुपमत्स्य अध्यासन अजीर्ण मूत्रवेक धारण क्षीण पुरुष पूर्व रूप ऑफ विक्क रोग दैट इज निद्रानाश अग्निमांद्यता नेत्र शोथ हास्य शब्दता नाड़ी शब्दता नाड़ी वेगा नाड़ी उष्णता एंड वृक्षता ऑफ स्किन रूपा छर्दी शोथ शीरशूल ज्वर रक्तर्षा पांडु स्वेद अभाव त्वचा अग्निमांद्यता पीड़ा कट्टय उदर पीड़ा रुकेश पीड़ा नाड़ी वेदता नाड़ी न्यून्य बिंदु रूपा मूत्रता पीड़ा युक्ता stage of CKD stage 1 and 2 decreased GFR renal parenchymal disease polycystic disease glomerulonephritis parenchymal vascular disease stages of CKD organs affected anemia associated with easy feasibility low appetite sodium potassium water and acid base hemostasis. Stage 5 disturbance in nutritional status and water electrolyte hemostasis. Mutrava Strotas, Mulstan by Charaka, Basti and Vangshana. Sushruta, Basti and Medhar. Medra. Sign of puncturing of Strotomula of Mutrava Strotas, Basti Anaha, Mutrauro, Mutrendriya Stabdata. Alternative treatment of kidney disease. Kidney are made up of Rakta and Meddhatu. So treating these two dhatus is effective. According to Ayurveda, human body is made of three dosha, Vata, Pitta, Kapha. When they are synchronized from its depicts a healthy body system, this is caused by vitiated dosha. In renal impairment, Kleda, Kapha, Apan Vayu and Pachak Pitta are vitiated. Ayurveda works to synchronize these three doshas. With the Ayurveda medicine, kidney damage can be either partially or fully resolved. Herbs have active ingredients which acts repair and rejuvenate renal epithelium. The herb also eliminate toxin from the body. They decrease also the complication of CKD, atherosclerosis. Frequency of dialysis can be reduced. Where multiple action of Ayurvedic treatment, renormalization of urinary pH, diuretic, antimicrobial, antioxidant, decreasing protein in urine, playing the role of kidneys, repairing renal parenchyma. Goals of Ayurvedic treatment for kidney disease: support the kidney until they have healed and can work properly, prevent or treat any complication caused by acute renal failure, correct or treat the cause of kidney failure. मूत्रवह स्त्रोतदुष्टि चिकित्सा स्वेदना द्रवास्वेदा अवगाहना अभ्यंग औपीडकनस्य अनुवासना मूत्र रोग सामान्य चिकित्सा निदान परिवर्जन वात अनुलोमन संशमन मूत्र विरेचनीय मूत्र संग्रहणीय मूत्र विरजनीय मूत्र विशोधनीय Ayurvedic management of renal disorder निदान परिवर्जन avoid the causative factor. The group kidney are form of the essence of blood and fat, that is rakta and meddhatu. So sera plays vital role in transport of urine. Sera are upadhatu of rakta. Hence treatment of renal disorder should be done with the rakta dhatu drugs. Treatment of vitiated samanvayu is shaman. Formation of urine is from food with the help of pachak pitta and samanvayu. Samanvayu is near to agni. Hence treatment like agni dipana, am pachana are useful in renal disorder. Upon vayu should be laid downwards. Seed of all the disease related with the urine is basti and cost factor is urine is movement of vayu in opposite direction. Drugs from various groups. Charak Samhita explain mutra virechiniya gana, that is गर्भ कुक्ष काश कोक्षुर वासुक मूत्र विरजनीय गणा पद्म उत्कला नलिमा Kumuda, Mutra Sangraniyagana, Jambu, Amra, Palash, etc. Treatment according to Bhavishaja Ratnavali, Rakta Mokshan, Virechan, drug increase formation of urine, that is Mutral drug administration, drug and dietary regimen causing purification of blood, increasing potency of rasa and rakta dhatus, as mercury is nephrotoxic and increasing disease of kidney. So avoided in the treatment of kidney diseases. If patient is suffering from obstruction of feces or constipation, Sneha Basti have important role. Treatment according to Bhaishya Ratnavali, Sarvanga Bhadravati, dosage 2 tablet of 125 mg, morning and evening, Anupan Varunatak Path, where Maheshwarvati, that is 1 tablet of 250 mg 2 times a day. In case of renal disease, life of patient should be preserved by carefully examining factors like Kala, Bala, Kal, Bal, and treatment should be given under the close observation of experienced Vaidya and food which are easily digestible. Treatment of renal disorder, that is Nidan Parivarjan, Samshodhan, Samshaman Chikitsa, palliative remedies, Pathya Pathya. Conclusion, ancient Ayurveda text has mentioned exactly and correctly about site, appearance, and number of kidneys. Digestion of food proceed two part, that is Sar Bhag and Kitta Bhag. Feces and urine are Kitta Bhagas, and they are occurs at Amasya and Pakvasya and done by Pachak Pitta and Samanvayu. Mala and Mutra are the waste product of food. Formation of urine occur in Amasya and Pakvasya. Urine is carried to up to the basti by minute channels, and Hetu seven causes whitation of Medho and Mutra Strotas. Whitation of Mutra Strotas cause disease related with the urine formation. Whitation of Medho Strotas may cause disease related with the Vrukka or kidney as its root of Medho Strotas.
Thank you, Doctor. Thank you for the energetic and well-explained presentation. Next, we go to the another paper presentation. I'd like to invite Dr. Vijayalakshmi Karimani for the paper presentation. I would like to invite Dr. Vijayalakshmi for the paper presentation.
Namaste. Myself, Dr. Vijayalakshmi Karimani, third year PG scholar, Department of Rachna Shahira, Rajiv Gandhi Educational Ayurvedic Medical College, Hospital, and PG Research Center, Rona. So today's my topic for presentation is a review on preservation techniques of dead body. Let us see the introduction. Preservation of the dead body is essential for anatomical education, surgical training, research, forensic investigation, cultural and religious practices. What are the goals of preservation? It is to prevent decomposition, maintain the structural integrity, reduce the microbial growth, minimize the health hazards. What are the basics of decomposition? Autolysis, putrefaction, rigor mortis, livor mortis, algor mortis, and role of bacteria and enzymes should be controlled. What were the preservation techniques used in the past? It was practiced in ancient Egypt. Organs removed and stored in the canopic jars. Body was dried using the nataron, that is sodium salts. Resin wrapping with the linen was used. It was aimed at spiritual preservation after life. What are the other ancient practices used? Chinese preservation, that is zinzui or lady dye, was preserved in this manner. Peruvian mummies, that is Inca method, was used. Natural mummification in the desert and cold climates were used, and use of herbal oils and spices in India was used. Now, what is the preservation technique in the present era? And modern need for preservation is for the sake of cadaveric dissection in the medical curriculum, organ transplantation, forensic autopsy, medical legal storage, and body donation programs. What is the medical preservation technique used? So, formalin based embalming is the most common technique used worldwide. Here, the arterial injection of formaldehyde of 4 to 10% is used, along with the methanol, glycerin, and phenol. What is the mechanism is here the protein cross-linking microbial inhibition is done. Now, what are the advantages? It is the long-term preservation and cost-effective. Whereas, what are the disadvantages is it is having toxicity, carcinogenic risk, tissue rigidity and odor, very strong odor. Now let us see about the soft embalming or Thiel method. Here it was developed by the Walter Thiel. Here low formaldehyde concentration is used along with the boric acid, ethylene, glycol and salts. It is having excellent tissue flexibility, natural color retention, and it is ideal for laparoscopic training, microsurgery practice, but the only limitation is it is very expensive and technically demanding. One more method is plastination. It was invented by the Gunter von Hans. What are the steps is, first fixation is done, dehydration along with the acetone, forced polymer impregnation is done, and lastly curing. What are the advantages is the specimen will be dry, odorless, and it can be stored for long term. And educational display for purpose it can be stored. What are the disadvantages? It is very expensive and complex equipment is required for plastination. One more method is refrigeration and freezing. Here, the short-term preservation of the dead body can be done at the temperature of 2 to 4 degrees Celsius or minus 20 degree or lower than that. And it is used in mortuaries, forensic departments, organ transplant units. Only the limitation is ice crystal tissue damage. Ice crystal causes the tissue damage. Next method is cryopreservation. Here the ultra low temperature is used, that is minus 196 degrees Celsius along with the liquid nitrogen, and it is used mainly for preservation of gametes, embryos, small tissues, whole body cryonics. It is experimental nowadays to preserve the whole body. Next method is what are the alternative chemicals used instead of formalin? Glutaldehyde, phenoxyethanol, ethanol, glycerin mixtures, eco-friendly embalming solutions, and reduced formaldehyde techniques. Now, discussion part, we shall see the comparison of all these techniques. We'll see the technique, the tissue flexibility attained by that technique, the toxicity level, the cost involved, and the duration to which the preservation can be done. In the formalin, the tissue flexibility is very poor, toxicity is very high, cost is very low, and the duration it can be preserved for a longer period of time. In the Thiel method, the tissue flexibility will be excellent, toxicity will be low, it can be stored for medium duration, but the cost is very high. In the plastination, the tissue flexibility is very rigid, toxicity is minimal, cost is high cost, duration is permanent. In the freezing technique, it is tissue flexibility for short period of time. Toxicity is none, but cost effectively it is moderate, but the duration it can be stored only for the short period of time. Now, ethical and legal considerations. The body donation consent should be taken, institutional ethics approval to be taken, safe chemical handling should be done, environmental disposal of chemicals should be properly done, and cultural sensitivity is also accompanied. Now, occupational hazards are formaldehyde exposure causes eye irritation, respiratory issues, carcinogenic effects. What is the need is PPE, ventilation systems, and monitoring formaldehyde levels should be maintained. What are the future directions is green embalming should be done, 3D digital cadavers can be used, virtual dissection tables are already available, reduced toxicity preservation and hybrid preservation models can be used. Conclusion is preservation techniques evolved from ritual mummification to the scientific embalming. Formalin remains standard but has limitations due to its side effects. The Thiel method is superior for surgical simulation. Plastination is revolutionized anatomical education. The future focus should be on safer, eco-friendly, and realistic preservation methods. So these are the references I used. Thank you so much.
Thank you, doctor. Thank you very much for delivering such a remarkable presentation. Thank you so much, doctor. Next, we go to the another paper presentation. I would like to invite Dr. Santosh Nirli for the paper presentation. I would like to invite Dr. Santosh Nirli for the paper presentation.
Myself, Dr. Santosh Nirli, third SEM PG scholar, Department of Agatatantra and Viddha-agnikarma. Today I am presenting a topic on revisiting a prameya in the context of Dushi Visha toxicity perspective. These are the contents of my slides. Coming to introductions, prameya is a Varnamada Astamahagada. One of its unique feature of prameya is involvement of the multiple dushas in its samprapti. Prameya can be considered as a diabetes mellitus in the current era. National level wise prevalence is 10 to 11.4% according to ICMR and Lancet 2023 and 2024. Agatatantra explains that chronic exposure to environmental pollutions and incompatible diets and food adulterants and the chemical toxins acts as a dushu visha and contributing to the initiation, progression and complications of prameha. Coming to the next slides, bird's eye view of prameha. Tatra avila prabhuta mutra lakshana sarva eva prameha bhavanti. Tatmatmaka lakshana of the prameha is prabhuta avila mutrata, that is abnormal excretion of the urine and the derangement of the dosha and dushas. Prameha classifications as classifications, doshik wise, Kafaja 10, Pittaja 6 and Vataja are 4, and based on Utpatti, Sahaja and Apatti Nimittaja. Apatti Nimittaja again sir, Santarpanajanya and Dhatukshayajanya, and based on Sadhya and Asadhya and Apya. Samprapti Gatakas. Samprapti dosha is Kapa Pradhana, dusha is Rasarakta, Mamsa, Meda, Majja, Shukra, Vasalasika, Oja, and Kleda. Agni is Jatragni. Shrotas is Rasarakta, Mamsa, Meda, Majja, Shukra, and Udaka, Mutravasrotas. Shrota Dushti is Sangha, Vimarga Gamana, and Ati Pravrutti. Udbhavasthana is Amashaya. Vyaktasthana is Basti and Sarvasharira. Roga Marga is Madhyama Roga Marga. Coming to the concept of Dushi Visha, let's we see the how the concept of Dushi Visha is plays a role in manifestation of prameya in coming slides. Dushi Visha Dushitam Desha Kalana Divasapnar Abhikshane Yasma Dushate Tasmat Dushi Visham Smutam. With these references for the current relevance, we may consider the Dushita Desha as environmental pollutions and to the industrial smokes and exposure to the heavy metals and toxins, and the Kala is impairment in the climatical conditions, and Dushita Anna is currently considered as incompatible diets and preservative foods consumptions, and Divasapna is the day sleep and improper daily activities. If persons indulge in these kinds of activities, and then he will be afflicted with a Dushi Visha. And another references from Ashtanga Hridaya Uttara 35 chapter 33 sloka. Swabhavata vana gunesuyuktam dusha vishakyam vishamabhipaiti viryalpa bhavat abhibhavametat kapavrutam varshagananubandhi. If a person is exposed to a low potent toxins over a period more than the 1 year, and then it will accumulate in the bodies, and it will manifest as a dusha visha. Some of the endogenous toxins and exogenous toxins examples, metabolic waste and dysfunction of the GIT, inflammatory cytokines and stress are the endogenous toxins, and exogenous toxins are air pollutions, heavy metals, pesticides, industrial chemicals, and drugs, and certain food contamination and microbial toxins. How the toxins causes the diabetes. Endocrine disruptors interferes with the body endocrine systems by mimicking, blocking, and altering the actions of the natural hormone, and these chemicals can disrupt the hormone synthesis, transport, metabolism, and receptor binding, leading to the range of adverse health effects. They also interfere with the glucose metabolism, pancreatic beta cell functioning, and insulin signaling. Nidana, coming to Nidana, प्रमेय निधन अस्य सुखम स्वप्न सुखम दधिनी ग्राम्योदक अनुपरसः पयांसी नवान्नपानं गुडैकृतं च प्रमेय हेतु कपाकृतं. These are nidana prameya. Coming to the dushivisha nidana. Dushivisha nidana desha kalanna diva swapna avikshana yasmat dushitam tasmat dushivisham sruptam. The both the nidanas are the santarpana and kapakaraka. Coming to lakshana, Sitam Rasadishwar Yatoktam Karoti Dhatu Prabhavan. First, it will affect the Rasadi Dhatu and leads to the Uttarottara Dhatu's manifestations. Yatoktan means the Acharya in Dalana commentary is expressed that previously explained diseases. In Sushruta Sutrasthana, Dhatu Pradesha while Vikaras, while saying that Madhumeya as the one of the major Pradeshas of Vikaras. Coming to the Chikitsa through the Agatatantra principles, by considering the proper history and the exposure to the toxins, significant exposure to the toxins involvement, we may consider the Agatatantra principles for the treatment. Nidana Parivarjana, Shodhana, Shamana, and Patya follow. And Chikitsa Sutra is Dushi Vishartam Susvinnam, Udascha Adasoditam, Dushi Visharam Agadam, Lehena Madanaputam. For Amapachana, the drugs which are having the Vishagna property as well as Deepana Pachana, such as the Bilvadi Gulika and Murvadi Agada, may be considered. For Snehapana purpose, Mahatiktaka Kruta or Kalanaka Kruta or Tiktaka Krutas, both are the drugs have the Vishagna properties as well as for the Snehana purpose. And Swedana and Shodhana. Shodhana is Urdhva and Adas Shodhana can be planned. These are the some yogas, Agada yogas can be have the Kapagna properties as well as the Vishahara and Medhahara actions. And this is the Patya in the. And coming to conclusions, Prameya represents the multifactorial metabolic disorders involving the dysregulations of glucose metabolism, lipid metabolism, and endocrine functions. Chronic exposure to the cumulative low-grade toxins contributes to the initiation, progression, and complication of Prameya. Integrating the Agatatantra principles such as the Nidana Parivarjana, Shodhana, Shamana, Patya offers the broader toxin eliminations and metabolic regulations. This knowledge supports the improved prevention, early interventions, and the development of the therapeutic strategies. These are the references. Thank you.
Thank you, Doctor. Thank you for the well-explained presentation. Next, we go to another paper presentation. Next, I'd like to invite Dr. Priyanka Baliram Kable for the paper presentation. Next, I invite Dr. Priyanka for the paper presentation.
Hello everyone, this is Dr. Priyanka Kamble and today I am going to present on the case presentation of physical and mental well-being in healthy conception, understanding the role of Achar Rasayan. Ayurveda views conception as a multidimensional process involving the balance of body, mind and spirit. Healthy conception requires purity of Rutu, Kshetra, Ambu and Bija. Achara Rasayan described by Charaka promotes ethical conduct, emotional stability and mental clarity essential for the reproductive health. Also, the classical text describe that the healthy conception requires appropriate state of Rutu, Kshetra, Ambu and Bija. Any disturbance in the physical and mental equilibrium disrupts the reproductive capacity, leading to infertility, pregnancy loss and compromised fetal development. Psychological well-being is increasingly recognized in modern science as a critical determinant of reproductive success. Chronic stress, emotional strain, and altered behavioral pattern dysregulate the HPO axis, impairing the hormonal secretion and infertility outcomes. Achar Rasayan, described by Acharya Charaka, offers behavioral guidelines promoting emotional stability, ethical conduct, and mental clarity, all of which have a direct role in shaping the reproductive health. Now, in the concept of healthy conception, the Garbha Nirman, as described by the Ayurvedic view, describes the four constituents, that is the Rutu, Kshetra, Ambu, Bij, for which Rutu means the optimal fertile period conducive for conception, which can be correlated as the ovulatory window or the hormonal readiness in the modern correlation. Kshetra describes as the healthy reproductive organs and the uterine environment, as well as the uterine receptivity and endometrial thickness. Ambu describes as a nutritional and metabolic support, nutritional status and metabolic health of the patient. Bija describes as the healthy ovum and sperm indicating genetic vitality, gamete quality, and the DNA integrity. Also, disturbances in Vata, Pitta, Kapha, especially Vata, affect the follicular growth, ovulation, implantation, and fetal development. Then, the role of mental health in conception, like mental equilibrium, is vital. Like dominance of Raja and Tamas leads to anxiety, anger, and Vata, Pitta vitiation, hampering fertility. Achar Rasayan concepts, as the Achar Rasayan refers to the rejuvenation through behavior, personality refinement, and mental discipline. Charaka describes individual who follows righteous conducts as equivalent to consuming Rasayana itself, gaining benefits such as longevity, intelligence, memory, and disease resistance. It includes ahimsa, sannyas, shama, prasanna chitta, dhyana, sadavritta, and regulated sleep-wake cycle and avoidance of excessive anger, stress, and grief. These practices elevate the sattva guna and reduces the raja and tamasa in enhancing the mental stability beneficial for the conception. In this, the satya stabilizes the mind and enhances the sattva. Ahimsa reduces mental agitation and pitta. Dhyana improves clarity and mental calmness. Pranayam balances the vata and ojas. Mitahar maintains the digestive fire, and sadavritta promotes the ethical lifestyle, which in modern correlation we can describe it as which reduces the stress biomarkers, improves emotional regulation, activates the parasympathetic pathways, improves the HPA axis stability, and supports mental metabolic health and also the psychological well-being of the patient. The physical and mental well-being. Now, the physical is described as either satmya ahar consumed by the patient, vihara, rasayan therapy, and enhances the ojas, vata shama regimen for menstrual regulation, shodhana therapies for before the garbhadharan samskara. A well-nourished reproductive system ensures the proper bija shuddhi and supports fertilization. So, as we can see from the chart, the effect of stress on the HPO gonadal excess hormones shows that the increase in the stress leads to the decrease in the hormones of the humans, and also the mental disturbances like chinta, krodha, shok can impair the fertility by aggravating vata and reducing the ojas. Achar Rasayan helps restore the emotional balance through regulation of the stress responses, improving in the cognitive and emotional resilience, enhancing the interpersonal hormonal harmony between the partners, and promoting mental calmness conducive to the conception. Now, if we compare it with the modern correlation, the psychoneuroendocrine mechanisms, stress increases the cortisol secretion through the hypothalamic pituitary adrenal axis, which suppresses the HPG axis, responsible for the reproductive hormones, which leads to the anovulation, luteal phase defect, reduced sperm count, altered libido, and disruption in the menstrual regularity. Emotional stress and infertility studies show that the women with chronic stress exhibit reduced chances of conception and increased time to pregnancy. High anxiety levels correlate with altered gonadotropin secretion and decreased ovarian reserve. Behavioral interventions in modern preconceptional care, cognitive behavior therapy, mindfulness and meditation, yoga and pranayam, stress reduction strategies, and positive psychological practices are something which are the modern equivalents of Achar Rasayan, which improve the infertility outcomes by regulating the neuroendocrine pathways. Now, integration in the preconceptional care, Garbhadharan Sanskar and Achar Rasayan, the Ayurveda recommends preconceptional rituals to purify and enhance the reproductive health physically and mentally. Achar Rasayan enhances the psychological readiness, emotional bonding, and ethical conduct, supporting ideal conditions for the Garbha Nirman. Now, what are the practical applications for couples is the meditation and pranayam, observing sadvritta, cultivating positive emotions, avoidance of alcohol and tobacco, emotional bonding between the partners, practicing gratitude, forgiveness, and kindness, which includes the benefit that it improves the ojas and immunity, regulates the neurohormonal pathways, enhances the emotional stability, supports ovulatory function, improves the semen quality, and promotes successful implantation and fetal development. This classical concept of Achar Rasayan aligns with the modern psychoneuroendocrine science. Ayurveda recognized long ago that behavior, thoughts, and emotion directly influence the internal physiology, including reproduction. Modern research affirms that psychological stress impairs the reproductive function through endocrine disruption, inflammatory responses, and oxidative stress. Behavioral rejuvenation practices such as meditation and mindfulness improves conceptional rates, reflecting the essence of Acharasaya. So, as we can conclude that the healthy conception requires a balanced interplay of physical vitality and mental harmony. Acharasaya provides a timeless framework for emotional well-being, fostering conditions conducive to healthy conception. Integrating Acharasaya with the contemporary preconceptional care ensures a holistic approach to Sukha Santati. These are the references for my article. Thank you.
Thank you, Doctor. Thank you for the well explained and energetic presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Snehal Devanand Elon for the paper presentation. Next, I would like to invite Dr. Snehal for the paper presentation.
I'm a third year student of the Ayurvedic Department of Ayurvedic Medical College, Mumbai. My topic of presentation is efficacy of Ayurvedic management in spastic cerebral palsy, a case study. So, aim is to evaluate the efficacy and safety of Ayurvedic management in a case of spastic cerebral palsy and to assess improvement in spasticity, muscle power, reflexes, and developmental milestones. Objectives are to correlate spastic cerebral palsy with Vata and Sarvangar, to evaluate the role of Panchakarma therapies, abdominal Pindaswan, Nasya, etc., to assess improvements using objective clinical parameters, to document overall improvement in motor function, milestone, speech, and quality of life. Definition of cerebral palsy is a cerebral palsy is a non-progressive disorder of movement, posture, muscle tone, or fat, damage to the developing brain, usually before birth, during birth, or in early childhood. Types of cerebral palsy are few: spastic cerebral palsy, dyskinetic cerebral palsy, ataxic cerebral palsy, and mixed cerebral palsy. So, spastic cerebral palsy shows symptoms like stiff and tight muscles. Dyskinetic involves involuntary movements. Ataxic involves balance and coordination issues. Mixed involves combination of symptoms. So, introduction is cerebral palsy is called the abnormal development or damage to the parts of the brain that hinder movement, balance, and posture. Most cases arise during pregnancy, since upper moving birth and throughout. Cause is often unknown. Risk factors include prematurity, twin birth, pregnancy infections, difficult delivery, oxygen exposure, and early health trauma. Ayurvedic perspective about disease, this being a vata predominant condition, could be included under the Sarvanga perspective. Sarvanga vata is the condition of vata predominance that affects all over the body associated with stiffness and difficulty in the joint movement, including contractures. Vata management with Snehan, Svedana, Nasya, Shugar, and Guna helps reduce symptoms and improve function. Case discussion is, as we can see, basic information of vision. Mentioned in, I have mentioned in the PPT. So chief complaints are continuous excessive cry, twisting of hands during cry, unable to respond any sound, hypotonia of both limbs, complete hook line, unable to speak. Past illness are patients suffering from septicemia with meningitis, convulsions with mons with typhus before 1.5 months. Patient was admitted in KM Hospital, Mumbai, Maharashtra. So treatment history was, I have given the slide. Family history, no history of any possibility, no history of TB and HIV, no any drug allergy or major illness. Blood test was normal, no history of NICU stay, no history of birth asphyxia. Immunization, all immunization are completed as per the schedule. Examination only shows per abdomen slightly tenderness. CNS examination I have shown in the PPT, higher mental functions and motor system. So level of consciousness was a conscious, tone of MC was hypotonic. In the motor system, memory was not able to examine and muscle power was decreased as I have mentioned in the PPT. So like the stage as a shape of head was normal. So developmental milestones were before illness, all developmental milestones achieved according to age, but now all milestones diminish. In investigation में मैंने PPT में डाल दिया, वहाँ पे हम देख सकते हैं. सो मेनली ये सब चीजें से इनके पास जैसे इनके सिम्टम्स है, हम ये पता कर सकते हैं कि उनका डायग्नोसिस जो है वो क्रोस एंसेफेलिटिक सेरेब्रल पाल्सी है. It is the muscle fiber issue that would have led to the condition here. Klebsiella infection, Aganthunilla, cause मस्तिष्कावरण शोध leading to slow to regular and pratilom gati of Vayu with Pranavata, Sthana Sanshara, and Sirat. Vitiated doshas impair brain function, causing limb stiffness and restricted movements along Vana, leading to delayed developmental milestones. Materials and methods were used here. Cerebral palsy is a Vata Pradhan Valley. Hence, treatment plan according to Vata Valley, Samanya Chikitsa Siddhanta, Agnidipan, and Anuloma. Then Bahya and Abhyantara Snehan and breathing therapies. Started with Deepan Pachan for 7 days, followed by Sarvanga Prana for 21 days, along with Pratimarshan for 7 days, and 8 days Dashimulagi Yoga Basti. Total 3 consequences of 21 days schedule with 10 days interval between. So procedure done externally नहीं टूरिस्ट अब एक्सटर्नली पहुंचने से प्रोसीजर हमने किए अभियान में किया 21 डेज के लिए शिरोधारा किए 21 डेज के लिए शस्त्रशाली प्रिंसिपल 21 डेज के लिए दशमूलागी योग मस्ती किया 8 डेज के लिए एंड प्रतिमर्शनस्य किया 7 डेज के लिए उसका कंटेंट मैंने वहां पे लिखा है सो उसके इंटरनल मेडिसिन के लिए हमने क्या किया उसके यूनिक वास्तव चुनना त्रिशुद्ध चुनना सारस्वत वाक शुद्धि का चुनना पानी हो गया संवर्धन उसका डोज और अनुपात मैंने पीपीटी में वही ऐड किया है कि क्या क्या यूज करना कितना डोज में मैंने यूज किया है एंड अनुपात क्या यूज किया So observation results was spasticity was assessed using the modified Ashworth scale, a widely accepted clinical tool. It grades spasticity from 0 to 4. Comparison before and after treatment showed improvement in mass force. Muscle strength was assessed using the MRC manual muscle testing scale. Measured muscles of both upper and lower limbs were graded from 0 to 5. Post-treatment, muscle power improved in both limbs. Deep tendon reflexes are important parameters of neurological examination used to assess the degree of felicitation of spinal cord centers. Grading of spasticity using modified Ashworth scale, जो मैंने पीपीटी में डाला है. Grading of muscle strength research council manual muscle testing scale ये भी मैंने पीपीटी में डाला जो कि हम देख सकते हैं body part before and after treatment upper limb and lower limb का upper limb में भी दो right hand and left hand and right leg and left leg इसके वजह से हमने वहाँ पे इसको स्केल के जरिए हमने उसका प्रोटोकॉल फॉलो किया उसके बाद डीप टेंडन रिफ्लेक्स असेसमेंट भी हमने किया है जो कि बाइसेप ट्राइसेप नी जर्क एंकल जर्क एंड प्लांटर के ऊपर किया जो कि बिफोर ट्रीटमेंट एंड आफ्टर ट्रीटमेंट भी हमने देखा उसमें चेंजेस आए हैं उसके बाद हमने कुछ पैरामीटर देखे जो बिफोर ट्रीटमेंट एंड आफ्टर ट्रीटमेंट जिसमें कुछ चेंजेस आए जैसे कि स्लीप जो पहले डिस्टर्बेंस थे वो उसके बाद वो आफ्टर ट्रीटमेंट इट वाज डिस्टर्बेंस वाज एब्सेंट एक्सेसिव क्राई शुरुआत में काफी ज्यादा था लेकिन आफ्टर ट्रीटमेंट इट वाज एब्सेंट उसी के जैसे लाइक अदर कुछ सिम्टम थे जिसके जो पेशेंट में प्रॉब्लम आए जैसे कि सिटिंग विद सपोर्ट नेक होल्डिंग जो कि पहले एब्सेंट थे और वो बाद में जाके प्रेजेंट थे मतलब उनमें इंप्रूवमेंट आया ये भी बहुत जरूरी है कि डूइंग एंड रिस्पॉन्ड टू वर्किंग जो एब्सेंट थे लेकिन वो बाद में आफ्टर ट्रीटमेंट इट वाज प्रेजेंट सो डिस्कशन कैसे बोलते हैं इसमें स्पास्टिक सेरेब्रल palsy वात प्रदान न्यूरोशिफ्ट विद इन्वॉल्वमेंट ऑफ अस्थि स्नायु कंडरा इस मध्यम मार्ग रूप सर्वांग शरीर अलॉन्ग विद अवर बल एंड विषमूला ट्रीटमेंट अप्रोच क्या था हमारा पहले सबसे पहले अग्निदीपन उसके बाद अनुलोमन स्नेहन दीनन एंड लोक चिकित्सा अग्निदीपन किया अग्निदीपन करने के बाद हिंगवास उसमें क्या है उसके हिंगवास तक चुनना है त्रिकोण उसको हमने उसके बाद अभ्यंग में क्या किया बलातेल किया जो कि वात शमन करता है बल्लों एंड इम्प्रूव को मसल को षष्टिक पिंड सर किया जो कि स्निग्धन है बुहन करता है स्निग्धन मसल चोर किया जो कि काम स्माउट इम्प्रूव रिलैक्सेशन बस्ती बेस्ट फॉर वात सिस्टमिक रेगुलेशन ऑफ वात नस्य पंचेंद्रिय वर्धन तेल से किया हम संवर्धन गृह जो कि मेदन सपोर्ट्स मेधा स्मृति एंड बुद्धि So conclusion क्या होता है इस सेक्शन in the present case was managed exclusively with the Ayurvedic medicines appropriate Panchakarma procedures and supported to the people. Significant improvement was observed in spasticity of all limbs along with better muscle strength and improved deep tendon reflexes. Though cerebral palsy is not is incurable, Ayurveda will help in improving the growing functional ability and overall quality of children in the quality of life in children. No adverse reactions were noted during the entire treatment schedule. Hence, those cases suggest that Ayurvedic management is safe and effective in the management of spastic cerebral palsy. Thank you.
Thank you, doctor. Thank you for the insightful presentation. Next, we go to the another paper presentation. I would like to invite Dr. Suprajyoti Moharana for the paper presentation. I would like to invite Dr. Suprajyoti Moharana for the paper presentation.
I, Dr. Subhrajyoti Maharana, second year PG scholar, Department of Swasthyabodha, KHC BMK Kankarwadi Ayurveda Mahavidyalaya, hereby presenting my seminar, Different Saman Ausadi Prayog in Obesity under the guidance of Dr. Sanjeev Vaishnuni, Professor, Department of Swasthyabodha and Yoga. Introduction. Excess of fat is disadvantage rather than an asset. It may lengthen the waistline but shorten the lifeline of the individual by imposing an extra burden on all system of the body. The world total is approximately 2.1 billion, which make up to 30% of the total population. This number continues to rise. Over 3 million people each year die from obesity. Overweight and obesity are fifth leading risk of the global death worldwide. Obesity is mostly the result of the factor like hereditary, metabolic syndrome, lifestyle, environmental, or diet, but it's difficult to determine the involvement of the primary factors. Stolya, Sariram Adhikrutyashta Purusarinita Bhavati Adhistulacha. Like according to Acharya Charaka, Ashtadindita Purusha have mentioned Atistula is one among them. The word originating from Stula, that is Stula Paribrahmanam Amarkosa, that means which expand. Stolya is Santarpada the Vyadhi plus Nanatmacha Vyadhi of Kapha. Definition Medamansa Ati Vruddhaya, Tvacha Swik Udarastaram, Ayodhapachaya Utsaha, Naro Atistula Uchete. That means the person is said to be Atistula, that which increase in the case of Meda and Mamsa, and increase in buttocks, abdomen, and sthana. And the person is said to be a lethargic and less strength. Chikitsa Sutra, Guru Chapatarpanam Chesta Stulanam Karsanam Prati. That means Guru Ahara we should give. That means the person should feel the satiety, but at the same time, it should not be much nourishment to the body. Bhatagna Anya Anna Panani, Slesmameda Haranicha, Ruksha Ushtam Basta Stikshnana, Rukshan Udvartananicha. That means Vatagna, Sleshma, and Medohara Annapana we should give. Then Ruksha, Ushna, Tikshna Basti should be given. Then Udvartana should be administered. Then Chikitsa like Nidana Parivarchana, Samana, Sodhana, Povasadi Langara Karma, Karsana, Vyayama, Patya Patya. Here we are mainly focusing on Samanausadi, Churna Kalpana, Vidangadi Churna, Amritadi Churna, Gomutra Haritraki, Triphala Churna, Trikatu Churna, Vyasadi Gugulu Churna. Rationality of, like here I am explaining how Churna is Kalpana, so I have given one example. Rationality of Vidangadi Churna. Vidangadi Churna, Laguguna, hence shows emaciation in the body. It's relief in Gaurava, Alasya, Chudra Swasa, symptoms like Java Paroda, Angasada, but in Chalaswik Udarasthana Krucha Vevayavata, Vidanga doesn't work due to extreme vitiation of Medhatu. It is more effective in subjective Lakshana rather than objective. Due to its chemical property, it is effective in serum triglyceride but not more than the cholesterol level. Acharya Chakrapani has simply stated it is useful in the disease by the virtue of its Gaurava Nirapeksha Prabhava. Contraindication, it should be contraindicated to Pitta Raktanavandi bleeding disorder. Similarly, Gugulu Kalpana like Amritadi Gugulu, Kanchanara Gugulu, Nabaka Gugulu, Triphala Gugulu. Rationality of Gugulu in obesity. The synonym Palanaksha that relieves obesity particularly. That means it is saying that the gum resin is useful in the many ailments, particularly in obesity. Two types, like that is Nabina and Purana. Purana is very useful. Gugulu in Charaka, it is mentioned like Medo Anilahara. That means in case of obesity associated with urinary disease and joint pain, we can give Yogaraj Gugulu, and obesity associated with joint pain and arthritis, we can give Triphala Gugulu, and obesity associated with the digestion and rheumatoid arthritis, we should give Nabaka Gugulu. It was demonstrated that administration of gum Gugulu significantly lowered the serum cholesterol level of hyperlipidemic and prevented the cholesterol-induced arteriosclerosis and decreased the body weight. Kasaya Kalpana, like Asanadi Kasaya, Varsanadi Kasaya, Chitrakadi Kasaya, Gugulatiktakam Kasaya, Lodradi Gada Kasaya, Mahamanjishtadi Kasaya, Rasonadi Kasaya. Here I'll give one example of Asanadi Kasaya, how it particularly works. Asanadi Kasaya is a Kleda plus Amabahula Samprapti Janya Badi. In this formulation, most of the drug have Rukshaguna and Lekhana as well as Chedana Karma. Useful in Kapameda Varna Janya condition. The ingredients are hepatoprotective and anti-hypercholesterol. Hence, it can be understood that the action of drug primarily affects the endogenous hepatic pathway of the lipids. properties like Arjuna has cardiotonic, anti-hyperlipidic, anti-atherogenic, and antioxidant properties. Similarly, Daruhadra like hypoglycemic, hypolipidemic. Darva is having hypolipidemic, hyperprotective. Khadira is like anti-dyslipidemic and anti-diabetic properties. Similarly, Gulika Kalpana like Chandraprabha Vati, Panchanimbadi Gulika, Siva Gulika, Silajatari Vati. Bhasma Kshara like Kalyanaka Kshara, Loha Bhasma, Banga Bhasma, Tamra Bhasma is useful in Medoroga condition. Similarly, like Rasa Rasayana Kalpana, like Arogya Vardhan Rasa, Mahalakshmi Milasa Rasa, Trimurti Rasa, Vada Vingi Rasa. Discussion. Depending upon the Lakshana, both Vyadhi Pratyanika, Avastika Chikitsa should be adapted. Treatment principle like the use of Lekhana, Chedana, Kapavata, Dosara, Ushtavirya with Guna Chikitsa Siddhanta adapted. This observation is useful to treat Meda Dushti or Meda Bahas Vikara. Its complication through multifaceted pharmacological properties and action. Conclusion. Obesity is preventable, manageable condition when approachable with proper diet, lifestyle regulation, rational use of Samanosini. Classical formations such as Bidangati Chuna, Sibagulika, Gugulkalpan act through the Lekana, Medara, Kapavata Samaka properties, thereby reducing complications of Meda Dushti. By integrating Ayurveda principle with preventing major obesity can be effectively controlled and offering a safe and holistic solution of long-term health. Hereby I am acknowledging my guide, Dr. Sanjana S. Tony, and thank you.
Thank you, Doctor. Thank you for the detailed presentation. Next, we go to the another paper presentation. I would like to invite Dr. Seema Dilip Dongde for the paper presentation. Next, I would like to invite Dr. Seema Dilip Dongde for the paper presentation.
Respected chairperson, judge, my guide, teachers, and dear colleagues. Very good evening. I am Dr. Seema Dhonge, PG scholar from the Department of Dravyagun Vigyan. Today I am presenting my topic Rasa Panchak and its correlation with pharmacological action, a systematic review of classical Ayurvedic property and contemporary pharmacodynamics. The main background of that study is Dravyagun Vigyan explained drug action using Rasa Panchak, which mainly predicts dosha effect, dhatu effect, agni interaction, therapeutic outcome. In other word, modern medicine drug action is explained through receptor, enzymes, chemical pathway, pharmacokinetics. Both systems describe drug action differently, but aim is the same: therapeutic results. The need of the study is that Ayurveda describes drug property qualitatively, while modern science require measurable mechanism. And the present gap is that Ayurvedic drug actions appear experience based on modern science, lack of scientific translation, limit acceptance, no common explanatory model. Ras Panchak may act as a predictive pharmacological model, but systemic correlation is limited. Therefore, comparative evaluation is required. The main aim of the study is to study the relationship between Rasapanchak and experimentally proven pharmacological action of selected Ayurvedic drugs. Objective of study is review Rasapanchak in classical text, collect modern pharmacological data, compare mechanism of action, concept of Rasapanchak. Actually, when we think about ras, that is taste, perception, gun, that is physical qualities, virya, potency, ushna or sheath, vipak is the post digestive effect, and prabhav specific unique action that we can't describe but it is there, and these all together determine therapeutic response. Research gap is that classical texts describe qualitative biological action while modern science describe molecular mechanism. Very few study connects Ayurvedic pharmacodynamics, molecular pharmacology. This review attempt to bridge this gap. Methodology. This was systematic review study. I studied classical texts like Charak, Sushrut, Ashtang, some research articles from PubMed, Scopus, Google Scholar. The main inclusion criteria is the clear Rasapanchak experimental pharmacological with experimental pharmacological evidence. We take 10 representative drug as a study that you can see in the PPT. While studying, we find that we correlate Tiktaras. Mainly observed actions are anti-inflammatory, hepatoprotective, antimicrobial, antioxidant, and the interpretation of Tiktaras is classical action is Shotahar, Krimigna, Lekhan, Dipan. Modern parallel like reduce TNF-alpha and IL-6, interleukin 6, reduce oxidative stress. Tiktaras predict that anti-inflammatory profile. Madhu Ras correlation. Observed effects are immunomodulatory, adaptogenic, tissue regenerative. Constitute is polysaccharide, steroidal saponin, and withanolides like this. Madhu Ras interpretation is that mechanism cortisol regulation, antioxidant enzyme activation, cytokine balance. Classical action mention is that Balya, Rasayan, Bruhan mainly indicate anabolic and restorative effect. Katuras correlation is observed action is digestive stimulation, increased bioavailability, thermogenic action, anti-inflammatory. This is the bioavailability mechanism that piperine or gingerol, how it works, like piperine inhibits glucuronidation, enhance drug absorption, and gingerol improve circulation, reduces inflammation. Classical meaning is that only Dipan, Pachan and Srotoshodhan. Then Virya correlation. Ushna Virya, that is hot potent drugs, increases metabolism and they improve circulation. And Sheet Virya drugs, that is cold potent drugs, mainly reduces inflammation. They are having cooling effect and reduces fever. This matches metabolic activation and suppression in modern science. Vipak interpretation is that Katu Vipak drugs increases metabolic activity. Madhur Vipak drugs nourishes tissue. This can be compared to metabolic changes after digestion. I explain here only Katu and Madhur Vipak because the drugs which we are selected are mostly Madhur and Katu Vipak drugs. Then Prabhav, that is the special action. Prabhav is the unique effect that cannot be explained by other factors. Modern science explains this as a multi-target action, synergistic phytochemicals. Example, Triphala antioxidant network effect. Correlation summary. I tried to correlate this where Ayurveda explained rasa, modern equivalent is phytochemical profile, guna, physiochemical properties, virya, thermodynamic activity, vipak, metabolic processing, and prabhav, network pharmacology. Multi-pathway drug action we can say. These show that the Raspanchak is logical and predictive. Key finding is that the strong relationship is seen between Ayurvedic property and modern pharmacological action. Tiktaras show anti-inflammatory effect, Madhuras show immune strengthening effect, Ushnavirya increases metabolic activity, Vipak reflects post-digestion metabolic changes, Prabhav act through multiple pathways similar to system biology. Conclusion is that Raspanchak is not just a traditional idea, it is structured, scientific, predictive, clinically useful. It can be act as a bridge between Ayurveda and modern pharmacology. In future, more lab studies, molecular research and clinical trials can strengthen this connection. I would like to conclude by saying Raspanchak is the foundation of Ayurvedic pharmacology and a pathway toward integrative medicine. Thank you.
Thank you, Doctor. Thank you for the well-explained presentation. Next, we go to the another paper presentation. I would like to invite Dr. Nikhil Subhash Deshmukh for the paper presentation. I would like to invite Dr. Nikhil Subhash Deshmukh for the paper presentation.
Good evening, everyone. My name is Nikhil Subhash Deshmukh. I am PG student. Subject Rasshastra एवं भैषज कल्पना. Title. My title is In Vitro Assessment of Arkakshar Yavakshar Saindhav for its anti-cancer activity in HIP G2 cell line. My rationale of study. Traditional knowledge. Arkakshar and Yavakshar is a traditional Ayurvedic medicine derived from ash of tree obtained in the form of alkaline crystals. Hepatic carcinoma significance. Hepatic carcinoma or liver cancer is a significant global health concern due to its high mortality rates. Exploring alternative or complementary treatment is valuable, especially if they are derived from traditional source. Research question. Does Arkakshar, Yavakshar and Sindhu possess anti-cancer activity in HIP G2 cell line? Hypothesis. Null hypothesis. There is no significant anti-cancer activity of Arkakshar, Yavakshar and Sindhu against HIP G2 cell. Alternative hypothesis. There is significant anti-cancer activity of Arkakshar, Yavakshar and Sindhu against HIP G2 cell. Objective. Primary objective to assess the anti-cancer activity of Arkakshar, Yavakshar and Sindhu against human hepatic cancer cell line HIP G2 cell line. Secondary objective to review in detail Kshar Kalpana through Ayurvedic test, to review in detail anti-cancer cell line study through modern test, to study the pharmaceutical preparation of Arkakshar, Yavakshar and Sindhu with the reference of Rasatarangini, to study the physiochemical analysis of Arkakshar, Yavakshar and Sindhu. Study design. Experimental in vitro study. Preparation. Kshar Kalpana is one of the method of medicinal formulation. Dravyas which possess Ksharan and Shanan property is called as Kshar. Preparation of Arkakshar. To prepare Arkakshar, Arkakasta is taken, then it should be cut into small pieces and allowed to dry at the place that it is that is not exposed to direct flow of wind. Once dry, then total plant material get burned and reduced to ash. Then ash of Arka is allowed to cool and it is collected carefully. After then, 4 parts of water are added to the ash and mixed properly and left undisturbed overnight. Then next day, supernatant water is collected carefully without disturbing the sediment. Then supernatant water is filtered by using a fine cotton cloth. Then filter is collected and heated until white powder is left. After that, white powder present at the bottom of the vessel is collected and stored. Next, preparation of Yavakshar. Yavakasta is taken, then it should be cut into small pieces and allowed to dry at the place that is not exposed to direct flow of wind. Once dry, then plant material get burned and reduced to ash. Then ash of the Yavakasta is allowed to cool and it is collected carefully. After that, 4 parts of water are added to the ash and mixed properly and left undisturbed overnight. Then next day, supernatant water is collected carefully without disturbing the sediment. Then supernatant water is filtered by using a fine cloth. Then filter is collected and heated until white powder is left. Then white powder present at the bottom of the vessel is collected and stored. Parameters. Physiochemical parameters. First, foreign matter, pH, total ash, acid soluble ash, water soluble extractive, test for alkali, alcohol soluble extractive. Reference. First, World Health Organization Global Report on Breast Cancer 2016, available from www.who.int. Cancer Global Report, last assessed on 2017 December. Second, HJ hepatocellular carcinoma in India, Indian J Surge 83 2021. Third, Dr. Sharma A.R. Reader Shushruत संहिता of महर्षि सुश्रुत volume 1 सूत्रस्थान क्षार पक्व विधि अध्याय वर्ष 4 चौखंबा सुर भारती प्रकाशन वाराणसी. Fourth, Dr. Tripathi B. Editor अष्टांग हृदय of श्रीमद वाग्भट सूत्रस्थान क्षार अग्निकर्म विधि अध्याय वर्ष 1-2 चौखंबा संस्कृत प्रतिष्ठान दिल्ली. Fifth, Sri Sadanand Sharma Rastarangani test with descriptive English commentary by Dr. Ravindra, first edition, Chaukhamba, Sur Bharati Prakashan 2015. Thank you.
Thank you, Doctor. Thank you for the well-organized presentation. Next, I would like to invite Dr. Renju S for the paper presentation. I would like to invite Dr. Renju S for the paper presentation.
Namaste and a very warm good evening to everyone. Myself, Dr. Renju S. I am currently doing my PhD in Rasashastra and Vaishya in Sumati Bhasha Ayurveda Mahavidyalaya, Hadapsar, Pune, under MUHS. Today, I am going to present a topic on a comparative pharmaceutical, analytical, and experimental study of Simhasyadik with its modification as Avaleha and Vadi with special reference to anti-inflammatory action. Need for the study. In India, about 80% of rural population uses medicinal herbs. There are many formulations mentioned in Ayurvedic classics to treat different ailments. Many simple formulations mentioned in the classics are not available in the market. Simhasyadi Kashaya is one of the formulation mentioned in Chakradatta, possesses the properties of Shodhahara in Shodha Rogadhikara. It contains only 3 herbs, Vasa, Guduji and Brihati, which are easily available, but mostly are Tikta Rasapradhana Dravya. So to increase the palatability and to increase the shelf life of Simhasyadi Kwada, it is modified into Avaleha and Vadi. Anti-inflammatory activity is commonly perceived to be in vivo, experimental, or clinical study. On screening through internet and research journals, in vitro method and in vivo methods are available to observe the anti-inflammatory activity. So, the study was planned to conduct anti-inflammatory activity by protein denaturation inhibition method and carrageenan-induced hypoedema method. The aims are to compare and evaluate the anti-inflammatory activity of Simhasyadi Vata and its modifications as Avaleha and Vadi by in vitro method and in vivo method. Objectives are same. Materials and methods, it consists of 5 broad headings: conceptual study, pharmaceutical study, analytical study, in vitro study, and in vivo study. Conceptual study contains the literature review of drug, disease, pharmaceutical kalpanas, and experimental. Pharmaceutical study, analytical study, in vitro, and in vivo study. Conceptual study contains drug reviews regarding the Simhasya, that is Vasa, Amrita is Guduchi, and Bhandaki is Brihati. Its botanical name is Adathoda vasica. It comes under the family Acanthaceae. Amrita is Stenospora caudifolia, comes under the family Menispermaceae, and Bhandaki, that is Brihati. Its botanical name is Savanam indicum, comes under the family Savanaceae. The properties of Vasa are Tikta, Kashaya, Virusnigdha, Ushna, and Madhura. Vasa, properties of Vasa, Tikta Kadurasa, Shetavirya, Katuvipaka, and Brihadi, Kadutiktarasa, Lekharuksha Guna, Ushna Virya, and Katuvipaka. This is review regarding the Shofa. I'm not explaining it much because of lack of time. Pharmaceutical review regarding Kashaya Kalpana, Avaleha Kalpana, and Vadi Kalpana are done. Pharmaceutical study, the preparation of Simhasyadi Vata, 50 grams of Guduchi, Vasa, and Brihati has taken, and 800 ml of water is taken and boiled till it reduces to 1/8. Observations: color of the liquid change gradually from light brown to brown. Consistency becomes slightly thicker. The drugs become soft, and the volume of the Guata prepared is 800 ml. Preparation of Simhasyadi Avaleha. The drugs were taken 500 grams each, and water is 8 liters. Sharkara is 1 kg, and Maghi is 1 kg. Viddha is 500 grams. Pharmaceutical preparation of Simhasyadi Avaleha. Kashaya is prepared with Vasa, Guduchi, and Brihadi. Sharkara or Guda is taken and made to dissolve the same quantity to Kashaya. It is then filtered through a clean white cloth to remove the impurities. This filtrate is poured into a pan kept over mild fire. Heating is continued till one thread consistency is obtained. At this stage, the ghida is added and stirred continuously. Heating is continued over mild fire until 2-thread consistency is obtained. At this stage, fire is put off and homogeneously mixed with continuous stirring. After self-cooling, madhu as per the mentioned quantity is added to it and stirred to form a homogeneous lehya. This is stored in an airtight container. Next one is preparation of Simhasyadi Vadi. The ingredients are same, and the fine powder of medicinal drugs of Simhasyadi Vata is triturated well in Kalvayantra and Simhasyadi Vata until it attains the required consistency and pills are rolled. Organoleptic study, characters of Simhasyadi Kashaya are Tikta and Kashaya. Simhasyadi Avaleha is Madhura Rasa Pradhanam. Simhasyadi Vati is Tikta Rasa Pradhanam. Simhasyadi Vata is liquid. Avaleha is semi-solid and Vati is solid. Colors: brownish black color for Simhasyadi Vata, black color for Simhasyadi Avaleha, and brownish black color for Simhasyadi Vati. Order: characteristic smell of Guduchi and Vasa for all the 3. Analytical study, the test for Kashaya, organoleptic study already conducted. Physical and chemical analysis of Kvata contains pH, specific gravity, acid insoluble ash, and chromatography. Body, ash value, uniformity in size and shape, uniformity in weight, loss on drying, hardness of tablet, friability, disintegration time, dissolution time, chromatography. And test for Simhasya Avaleha contains loss on drying, total ash, uniformity in weight, alcohol soluble extractive, water soluble extractive, pH, total sugar, and chromatography. In vivo study, mainly rat is taken as the animal for the purpose, and inclusion criteria includes 200 to 250 grams of albino rats, male and female rats included, and active and healthy rats are included. Procedure, rats were grouped into 6. Each group was consisting of 6 rats. These rats were kept under fasting for 18 hours prior to the commencement of the experiment. Next day, per volume of all the rats were recorded with the plethysmometer. This provided the initial reading. After recording the initial reading, the inflammation was induced to all the rats by injecting 10% carrageenan solution subcutaneously on the paw. Massage was done at the site of the injection in order to spread the suspension beneath the skin. The dose of carrageenan solution administered was 1 ml per 200 gram of body weight. After inducing the inflammation, again per volume of each rat was noted to confirm the inflammation. The treatment protocol control is given distilled water 1 ml, standard ibuprofen suspension 0.1 ml, test group A, Simhasyadik test group 2, Simhasyadi Avaleha, and test group C, test group Simhasyadi Vati, 1 ml each is the dosage. After recording the inflammation, the corresponding medicines were administered to all the groups. Per volume measured at 30 minutes, 1 hour, 2 hour, 4 hour, 12 hour, 24 hour after the administration of the medicines. And the results of 4 groups were compared statistically by following one-way ANOVA followed by post-hoc test. In vitro study, it is the principle behind in vitro study is the protein denaturation inhibition method. Materials required is bovine serum, albumin, hydrochloric acid, normal, phosphate buffer, and distilled water. Procedure. Calculation, the percentage inhibition of protein denaturation can calculate as percentage inhibition is equal to 100 minus optical density of test solution minus optical density of product control divided by optical density of test control into 100. The optical density was measured by spectrophotometry. Result, modified forms showed acceptable analytical standard, significant anti-inflammatory activity observed. Avaleha and Vadi showed better patient acceptability. And conclusion, pharmaceutical modification improves palatability and shelf life. Anti-inflammatory activity retained in modified forms. Study supports rational Ayurvedic drug modification. These are the references.
Thank you, Doctor. Thank you for the well-explained paper presentation. Next, we go to the another paper presentation. I'd like to invite Dr. Darshan Pradeep Akhade for the paper presentation on the topic chronic heel pain. I'd like to invite Dr. Darshan Pradeep Akhade.
A very good evening, everyone. Myself, Dr. Darshan Pradeep Akhade, PG Scholar 3rd year, Department of Rognidhan Evan Vikruti Vidyan, Arepodar Medical College, Mumbai. Today I am presenting topic on an Ayurvedic management of chronic heel pain, a case report under the guidance of respected Dr. Santosh Girbide, HOD and Professor, Department of Rognidhan Vikruti Vidyan, Arepodar Medical College. Chronic heel pain, as you know, chronic heel pain can be due to plantar fasciitis, calcaneal spurs, Achilles tendinitis, calcaneal fractures, apophysis, heel pad atrophy, and many conditions. These are the disease through which patient will present to us as a chronic heel pain. In Ayurveda, chronic heel pain can be compared with Vata-Kantaka, which is typically a calcaneal spur. We can be compared to calcaneal spur, Amvata, Sandhigat Vata, and Vatarakta. This case report describes a 65-year-old male patient with occupation related to heel pain. These are the second slide. These are the patient preliminary data. Age 65-year male patient, occupation as a labor, married, and his desha is Anupadesha. Male patient 65-year came in Nidhan OPD at M.A. Poddar Ayurvedic Hospital in the month of January 2026. He was suffering from chronic heel pain 6 to 7 months. Patient presented in OPD with the following complaints: pain at heel region, pain during walking since 7 months, unable to walk freely after waking up in the morning, pain radiating towards calf during walking since 7 months, both knee joint pain, history of present illness. The patient was apparently normal 7 months ago, then developed heel pain during walking and radiating pain towards calf. Then he consulted some general physician, and after the doctor prescribed him as NSAID and some local application. But her pain is subside, but after some time the pain relapse again. So he came our OPD. Here is the detailed history of this patient. There is no any such major history. The drug history is tablet Naptol, which is an naproxen combination, 500 mg 1 tablet BD, tablet omeprazole 20 mg 1 OD, and diclofenac gel for local application. Ashteth Pariksha patient. Nadi is Vata Kapha, rate 82 per minute, regular rhythm. Mal Sakashta 1 to 2 times per day, unsatisfactory. Mutra Srushta 5 to 6 per day, pale yellow. Jiva Alpasam, Shabda Prakrut, Sparsha Shamushitoshna. In this patient, I have made assessment criteria based on the VAS scale, that is visual analog scale for heel pain. For 0 there is no pain, 1 to 2 there is a mild heel pain, 4 to 6 moderate heel pain, and 7 to 10 severe heel pain. This is the activity assessed. Morning first step pain before treatment was 8 score, pain while standing the score was 7, and pain while walking the score was 8 before treatment. This is a Nidan Panchak of patient. Ahara Jetu, fermented food eating habit like idli, dosa, medu vada, which is a amla, vipaki and amla paki, causes vata dosa dushti and agni mandya. Paryushit ahar, that is in Marathi we say shira ahar khane. Paryushit ahar 3 to 4 times a week, causes agni mandya and vata dosha dushti, which is in ruksha in nature. Ruksha and Vishtambi ahar again causes vata dushti. Ruksha and Vishtambi ahar, there is some pulses like chana, vatana, harbara, rajma, chole. All that pulses comes under Ruksha Vishtambi ahar. Pratasami Koshna Jala Sevan and Nisha Kali Jalak Sevan causes Kleda Ruddhya and Agni Mandya. Pulses specifically chana flour, that is besan, 2 to 3 times a week causes Vata Ruddhya and Agni Mandya. Vihara Jetu, Ati Chankraman Chirakala Ekasthanam. Chirakala Ekasthanam means standing at one place for longer time. As he labor, so he is standing at one place for longer time for an approximate 3 to 4 hour duration. Causes vitiated Vata Dosha. Ratri Jagaran causes vitiate Vata Dosha and Agni Mandya. And Mansik Hetu, stress, Ati Chinta due to family issue causes Vata Dosha Tushti. Here are some sampratya I have made from this Nidan Panchak. From above mentioned Hetu, Agni Mandya, vitiation of Vata Dosha and Kledava Sotadushti occurs. The Kledava Sotadushti occurs due to Pratasami Kosha Jala Sevan and Attemupan. We can call it as Attemupan. From Agni Mandya Apachit Ahar Rasa Nirmiti, that is Ama in the form of Kleda, that is Dushta Kleda get produced. This Dushta Kleda and Vata Dosha get this Dushta Kleda and Vata Dosha get saturated in the heel region. The Vata Dosha get vitiated in his Ruksha, Katin and Chalaguna and causes Vahan of Dushta Kleda. So there is a Gati of Vata Dosha, that is Chalagun, which is increases, and this Chalagun of Vata causes the Vahan of Dushta Kleda from Udakva Sotas to the heel region. Sthana Samshaya in the heel partial region due to its Ati Chankramadi Hetu, that Ati Chankramanan, Ati Ekasthanasan, causing heel pain, Parshni Shula. This is the intervention for first 7 days I have given for this patient. Agnikarma at Parshni Shul due by Mrittika Shalaka for 15 minutes with hot red Mrittika Shalaka, duration 4 setting on alternate day, that is for 1 week. There will be 4 after a gap of 1 day. Gokshadi Gugul 250 mg tablet for 7 days, 2 tablet thrice a day with lukewarm water. Mahavat Vidons Ras 125 mg for 7 days, 1 tablet thrice a day with lukewarm water. Agnitundi Vati again 250 mg for 7 days, 2 tablet thrice a day with lukewarm water. This is a intervention for next 7 days. Agnikarma at Pashashul, same as, but the duration here is reduced. For first 7 days, the duration was 15 minutes. After 7 days, next follow-up, the duration was reduced to 10 minutes. For setting on alternative, duration was same, dose was reduced. Gokshwadi Gugul, 250 mg, 7 days, 2 tablets thrice a day. All doses are same, all medicine are same. This is the photo of Agnikarma. Results after 7 days of Agnikarma and herbochemical medicine, patient gets some relief from pain and morning stiffness or immobility. Patient local swelling and tenderness were reduced. After 14 days, all symptoms of patient get gradually decreased and patient get almost relief from heel pain. Total 8 setting of Agnikarma by Mritika Shalaka reduced its VAS score from 8 to 2. Here is VAS follow-up schedule. At first column I have made time point at the baseline day 0, day 7, day 14. His morning first step pain was 8, standing 7, walking 8. Day for first day. For 7 after 7 days, the morning first step was reduced to 5. After 14 days, was reduced to 2. For standing at baseline, the VAS score was 7. After day 7, it is come to 4, and after 14 days, to follow-up was reduced to 1. For walking, baseline was 8 VAS score. After 7 days was 5, and after 14 days it is 2. So discussion: Agnikarma has been practiced for a long time in the management of various acute and chronic disorder affecting joint, ligament and bones. The main pathophysiology or main karya karan bhav here is it effectiveness may be attributed to increased local temperature produced during the procedure, which leads to dilation of blood vessel over local area, that is heel pain, improves tissue perfusion and subsequent reduction of inflammation and pain. Additionally, from an Ayurvedic perspective, the localized heat is believed to help mobilize, that is a Ushna Guna of Agni, causes the shamans the Shita Guna of Vata, and causes the normal or Gati or Anuloma Gati of Vata, facilitating movements through the proper channel and thereby relieving pain caused by its entrapment. Agnikarma is a parasurgical procedure included in Shushu Samhita as an Anushastra. An increase in local temperature raises the basal metabolic rate, enhancing tissue perfusion and oxygenation as the painful site, improving circulation and reducing pain and inflammation. According to Acharya Charaka, Agni is considered the Shrestha treatment for pain, as it is Ushna Guna counters the Shita and Chalo Guna of Vayu. Here is the form tablet. Gokshad Gugul Rogadikar is Bhaisha Ratnavari Pramay Adhikar, act as Dipanan Pachan, has Kledagna action, reduce excess kleda from joints and heel through urine, clears Udakva Sotas by its mutual properties. Mahavatudans Rogadikar is Vatavedic Adhikar. Main action is Shulagna. It is a Vata Shaman and Vatavahi acts on Vatavaha Nadi and causes Vatavaha Nadi Shamana. Agnitundi Vatti, Rogadikar Vaishyaja Atnavali Ajina Adhikar, contains Kuchala, that is strictness, Nasomika, acts as Vata Shamaka, nervous system stimulant, useful in Ama condition due to its deepen Pachan action. Conclusion: chronic heel pain correlated with Vata Kantaka or Ama Vata in Ayurveda is mainly due to aggravated Vata associated with Ama and Stotarodha. In this case management with Agnikarma, along with internal medicines such as Gokshad Gugul, Mahavat Vidons Ras and Agnitundi Vatti was adopted. Agnikarma, owing to its Ushna and Vata Shamaka properties, effectively relieve pain, reduced tenderness and improved functional mobility. Thus, Agnikarma, along with appropriate internal medicine, proves to be an effective, safe and cost-efficient modality in the management of chronic heel pain, with minimal recurrence and improvement quality of life. Thank you.
Thank you, Doctor. Thank you for the thoughtful and well-executed presentation. Next, we go to another paper and poster presentation. I would like to invite Dr. Vaidehi Jain Kadam for the paper and poster presentation. First, we go to the paper presentation. I would like to invite Dr. Vaidehi Jain Kadam.
Good evening everyone, myself Dr. Vaidehi Kadam, third year PG student, Kriya Sharir, RAPMC. Today my topic of presentation is an Ayurvedic management of post-chikungunya symptoms, a case report under the guidance of Dean Dr. Sampada Santa ma'am. Chikungunya is a viral disease caused by chickpea virus which is transmitted by Aedes albopictus mosquito. Then common symptoms: fever, rash, nausea, headache, severe joint pain, etc. Post chikungunya syndrome, persistent arthralgia which is more than 3 months, which resembles rheumatoid arthritis. Symptoms commonly like RA, morning stiffness, swelling, etc. In Ayurveda, this condition can be correlated with Amvat, Sandhigat Jwar as mentioned in Bhavprakasha, and Vatpitta Jwar, that is Abhishangat Jwar. Preliminary date of patient: a male 65 years of age, was visited OPD at M.A. Poddar Ayurvedic College for following complaints: pain at ankle and wrist region, swelling since 6 to 7 months, unable to walk freely after waking up in the morning, pain during walking, morning stiffness since last 5 months. History of present illness: patient was apparently normal. 6 to 7 months ago, he developed a febrile illness, which was later diagnosed as chikungunya fever. Then after 1 week of the onset of fever, he started experiencing pain and swelling in both ankles and wrist. Since last 5 months, he also experienced morning stiffness and pain at affected joints after waking up. The patient sought Ayurvedic treatment and conventional allopathic approach proved ineffective. Informed consent was taken for the treatment of the patient. General examination was normal, everything is normal, heart rate, RR, etc. Then Ashtavid Parikshan. Nadi was found to be Vata Pittatmak, Mala Asamyak, Mutra Samyak, Jivha Sam. Patient was experiencing constipation since 3 to 4 months. Shabda Spashta, Sparsha Kinchit Ushna. History: no major history was found, just he was known case of chikungunya 6 months ago and typhoid 5 to 6 years ago. No allergies, no surgical history. Drug history for this arthralgia or joint pain: tablet naproxen 500 mg 1 tablet BD, tablet omeprazole 20 mg 1 OD, diclofenac gel for local application. Aims and objective: to evaluate the efficacy of Ayurveda treatment modalities in managing post chikungunya symptoms. Materials and methods: VAS scale for pain, pitting edema scale for swelling, gradation for stiffness. Assessment criteria: I have used visual analog scale, that is VAS scale for pain. VAS score interpretation is as follows: 0 to no pain, 1 to 3 for mild pain, 4 to 6 for distressing pain, and 7 to 10 for unbearable pain. After the assessment, it was found that pain, morning first step pain, the score was 9, pain while standing score is 7, pain while walking the score is 5. Pitting edema scale for swelling, after assessment it was found to be +3, which indicates 6 mm deep pitting edema, 10 to 12 seconds to rebound. Stiffness grading: grade 0 for normal, 1 for mild, 2 for moderate, 3 for severe. Here the stiffness score was grade 2, that is moderate, and stiffness that lasts for 3 to 6 hours. Acute phase: Vata Pitta Jwara with Ama. Subacute chronic phase: Vata Pitta Jamvat. Chronic persistent arthritis: Vata predominance with residual arm. These are the 3 phases of chikungunya fever or post chikungunya symptoms. Then Vyadhi Ghatak. Dosha: Vata Pitta Pradhan Tridosh. Dusha Rasa Rakta Asti Majja Sandhi. Sandhi is the major adhishtan of the disease. Strotas Asti Vaha. Vyadhi Marga was Madhyam, as all these Asti Majja Dhatu and Sandhi is involved. Adhishtan: joints of both limbs, primarily ankle and wrist. Samprapti: Agantuk Hetu, that is Chikvi virus, as we have seen. Viral infection via mosquito bite, which leads to Agni Mandya, which leads to Am Utpatti. Then there is a Vata Pitta Prakop, that is Abhishangat Jwara, as the Hetu is Agantush. Then this Jwara leads to Jwara Utpatti. Then this Jwara causes Ama plus Vata Sangha, and this Am and Vat delocated at Sandhi. Then after Sandhi Sthan Shanshray, that is Sandhigata Jwara, it leads to severe joint pain and stiffness, Amvat-like condition. Chikitsa: intervention for the first 14 days were like Deepan Pachan, Am Pachan, Agni Vardhan, Vedana Shaman. So, Dravyavar: Gokshuradi Gugur 2 tablet TDS, Mahavat Vidvansras 1 tablet TDS, Asti Majja Pachak 2 tablet BD, Amrutottar Kashay 15 ml BD with lukewarm water and good. Intervention for next 14 days aims at Bruhan, Balya, Vedna Stapan and Strotoshodhan Chikitsa. Panchatikta Ghruta Gugul 2 tablet TDS, Mahavat Vidvansras 1 tablet TDS, Asti Majja Pachak 2 tablet BD, Sarivachuna 1 teaspoon TDS. Along with Shaman Chikitsa, patient is advised to have Valuka Potli Swet at affected joints daily. Throughout the treatment, patient was advised to follow Pathya and Apathya Apatya being fish, curd, cheese, paneer, maida, bakery items, fermented item, preservatives, junk food, etc. Observations. Symptoms: pain first few steps. Before treatment it was 9, during it went to 5, and after it becomes 1. Pain on standing, initially it was 7, then during treatment it becomes 3, and after treatment the symptom gone completely. Pain while walking, it was 5, then it becomes 3, and then 0. Stiffness was grade 2, then during treatment it becomes grade 1, and it becomes 0. Swelling, before treatment it was +3, during treatment +2, after treatment it was +1. Results: after 14 days of treatment, patient gets some relief. After 28 days, all symptoms get gradually decreased and gets almost relief from the pain. Shaman Chikitsa and Valuka Potli Swet reduces its VAS score from 9 to 1. Valuka Potli Swet has been practiced for a long time in management of various disorders affecting joints. Its Ushna Guna, increase in local temperature produced during the procedure, leads to dilatation of blood vessels, improved tissue perfusion, and subsequent reduction of inflammation and pain. Ayurvedically, it helps to mobilize the accumulated or obstructed Vata with arm, thus facilitating its movement through proper channels, thereby relieving pain caused by the entrapment of Vata due to arm. Dravya Gokshuradi Gugul acts as a Deepan Pachan. Indicated in Amvat, it is Kledagna due to its mutral properties. Mahavat Vidvamsras, its main action is Vedna Stapan. It acts as Shulagna, Shotahara, Vata Kapha Shamak, and have Balya effect. Asti Majja Pacha, it has Asti Majja Dhatvagni Vardhan properties. Then Asti Majja Dhatu Shodhan, Vata Pitta Shaman, Deepan Pachan, and Stroto Shodhan. Panchatikta Grut Gugul acts as Lagu Lekan plus Stroto Shodhan. Asti Dhatu Poshan and acts as Rasayan and have Balya effect. Amrutottar Kashai, as this disease has its root in Jwara Utpatti, or the basic of this disease is Jwara. So it is essential to act on to work on Rasa Dhatu. So Amrutottar Kasha acts on a Rasa Dhatu. It leads to Am Pachan, Rasagat Am Pachan, Deepan Pachan, Vata Pitta Shaman, Stroto Shodhan, Rasayana, and Anuloman. Sariva Churna, Am Pachan, Pitta Shaman, Sandhi Balya, Mutral, and Shotahara Rasayana. Conclusion: chronic joint pain or Sandhigat Jwara or Amvata. In this case, management with Valuka Potli Swet along with internal medications such as Gokshuradi Gugul, Mahavat Vidvams Ras was adopted. Ayurvedic medications proves to be effective, safe, and cost efficient modality in the management of post-chikungunya symptoms. Thus, it demonstrated both safety and efficacy in addressing the condition. Thank you.
Thank you, doctor. And next we will go to the poster presentation.
Good evening everyone, myself Dr. Vaidehi Kadam, third year PG scholar, Kriyasharir Department of R.A. Poddar Ayurvedic Medical College. Today my topic for poster presentation is Ahar Chikitsa for PCOS, balancing dosha, boosting fertility and restoring cycles. Under guidance of Dr. Sampada Santa, Dean RAPMC. Introduction: Polycystic ovarian syndrome, commonly known as PCOS or PCOD, is a common endocrine disorder in women of reproductive age, marked by three things: hormonal, metabolic, and reproductive imbalances. While conventional treatment often targets symptomatic relief, Ayurveda provides holistic approach aimed at correcting the root cause through dietary regulation, detoxification, and herbal therapy. This integrative strategy supports long-term hormonal balance and overall well-being. Hetu of Stri Rog is mentioned in Charak Chikitsa 30th Adhyay, which are Aharaj, Viharaj, Mansik, and Mithya Maitun. We'll see Aharaj Hetu. First is high carbohydrate intake like poha sweets. Second, excessive fat intakes like non-veg, cheese, etc. Third is inflammation causing food like stale food, sour foods, tomato, lemon, etc. Fermented items like idli, dosa, vada. Heavy to digest foods like non-vegetarian foods, gluten containing products, besan, maida, bakery products, etc. And pathya is whole grains like millets, jawar, bajri, nachni, quinoa, barley, moong dal, and sweet fruits. This helps stabilize blood sugar levels and reduce insulin resistance. Healthy fats from sources like nuts and seeds, flax seeds, chia seeds, ghee in moderation. Anti-inflammatory foods such as turmeric, ginger, garlic, these have properties that can help reduce inflammation in the body. Lightly cooked vegetables, soups and easy to digest grains like moong dal and millets. So the conclusion is Ahar acts as both prevention and cure in PCOD, targeting the underlying pathophysiology through dosha pacification, Agni Deepan and Strotoshodhan. Thank you.
Thank you, Doctor. Thank you for the well explained and wonderful paper and poster presentation. Thank you so much, Doctor. Next, we go to the another paper and poster presentation. Next, I'd like to invite Dr. Nekha Bhaviskar for the paper and poster presentation. First, we go to the paper and then we go to the poster presentation. I would like to invite Dr. Nekha Bhaviskar for the paper presentation.
Good evening, everyone. Myself, Dr. Neha Bhaviskar, PG Scholar, Department of Chikitsa, JM Patripakola. I am presenting the topic of paper presentation is in an integrated approach to Vatarakta. Abstract. Vatarakta is disease explained in Ayurveda involving the Vata dosha imbalance affecting Rakta Dhatu, where the Vayu gets aggravated due to long distance rides on animals like elephants, camels, horse. On the other hand, the Rakta or blood gets lighted by the consumption of Lama, Amla, Katukshar, etc. The Vata passage are blocked by the Rakta further undergoes the vegetation and further contamination of Rakta or blood. The keywords are Vatarakta, gout, Vatdosha, Rakta Dhatu, etc. Introduction: Vatarakta is painful condition. Condition develops suddenly and recurs after treatment. When the aggravated Vata is obstructed by aggravated Rakta, this obstructed Vata again sedated the Rakta. This pathological state is known as a Vata Shonit or Vatarakta. Types of Vatarakta are Vaspradhan Vatarakta. When Vata is severely whited in Vatarakta, symptoms like a pain, twitching, pricking pain, swelling, which is dry and black. Rakta-pradhan Vatarakta. When the Rakta is severely whited in Vatarakta, the symptom like a swelling and pricking pain, copper color of the skin, itching and moistness predominant. Pitta-pradhan Vatarakta. When the Pitta is severely whited in the Vatarakta, the symptom like the severe burning sensation, sweating, fainting, thirst, tenderness, pain, swelling and suppression will predominantly found. Kapradhan Vatarakta. When the kappa is severely whited in Vatarakta, the symptom like the numbness, heaviness, moistness, coldness will prevail. Vatarakta is also two types based on its location, Uttan Vatarakta and Gambhir Vatarakta. Uttan Vatarakta, the disease is pathology afflicts the superficial tissues, that is the skin and muscles. The symptoms are also limited to the skin. In this type, the symptoms more or look like a skin disease, but with skin lesions and muscle pain. The disease Gambhir Vatarakta, the disease pathology involves the blood and other deeper tissues like the bone, joints, and also the internal viscera. Case report as follows. A 50 years male patient approached to the OPD with a chip complaints of left middle finger swelling along with the discoloration, left foot swelling, leg feet swelling along with a burning sensation of bilateral sole, left shoulder joint pain along with a difficulty movement, personal history, generalized weakness, all above complaints were this since 4 months and no history of DMHT and asthma. The patient was normal. History of personal illness. The patient was normal 4 months before he developed the swelling in the left middle finger along with the discoloration and left swelling along with the bilateral sole, burning sensation and lumbar pain. Patient was admitted for the same 4 days and was under multiple treatment one after the other. After the latter treatment, the patient finally got admitted in the Gramin Ayurved Mahavidyalaya, April. Objective: to study the effect of Ayurvedic treatment in the management of Vata. Materials and method. The center of study is Viddha-agnikarma Ayurveda Mahavidyalaya. Simple random single case study. Material with a daily treatment and prognosis. Clinical examination of the patient revealed the regression of symptoms due to Ayurvedic management. Table number 1 showing the gradation of symptoms according to WHO scoring pattern is swelling, discoloration, burning sensation, and pain. Material used in the study are the Sanchumani Vatti, Kaishur Gugul, Amrutadi Gugul, Ekang Ras, Dashmur Bhanvati, and Lakshya Kashan. पंचकर्म डाल सर्वांग पत्र पुट्टली स्वेदन सर्वांग धारा मात्र बस्ती निरूह बस्ती सिद्धक्षर बस्ती लेप and रक्तमोक्षण. The table number 4 showing the daily treatment. Table number 5 showing the prognosis of treatment. Table number 6 showing the changes in the symptoms before and after the treatment. Before treatment, left middle finger swelling show the gradation 3 and after treatment showing the 1. Discoloration before treatment 4, after treatment is 1. Left foot swelling before treatment showing the 3 gradation and after treatment showing the 1 gradation. Burning sensation in bilateral solid before treatment showing the 3 gradation and after treatment showing the 0 gradation. Left shoulder joint pain before treatment showing the 4 gradation and after treatment showing the 1. Uric acid level before treatment is 8.45% and after treatment is a 4.7%. Result: the patient had started improving during hospital stay, and at the end of 8 days, there was overall recovery as well as heart disease. At Upadrava, so it's need time to cure, but with Ayurvedic treatment, it has a relief in all subjective and objective parameter. Discussion hetu and Vatarakta. In proper and irregular diet, Raman Amla Kashan food. 7. So, the Nasya 7. संप्राप्ति हेतु 7, वात प्रकोप हेतु 7, रक्त प्रकोपक हेतु 7, वातरक्ता and रक्त प्रकोप, सर्व शरीर संचार, अंगुष्ठ मूल ठिकाणी स्थान संचय and वातरक्ता. Table number 8 showing the action of medicine and other panchakarma procedure. Mode of action of Snan. Snan help in the proper gati vatra brings the vatra mardatva and removes the srotarut. Mode of action of Svedha. Ushna guna of Svedha does Srota Shuddhi and Anupajana, so it relieves the stiffness due to elimination of the clay. The lightness is Hichu. The mode of action of Basti. Basti is a base self-controlled vata and thus it controllable the pitta and kapha also. From mode of action of Rakta motion. In Vatarakta, the aggregated vata located in the shaka and joint causes obstruction to the Rakta marker. Then the Vayu and blood centers and causes the obstruction of each other, giving rise to pain and even death. Therefore, depending upon the doshas, even and the strength of the patient, mediting was done with the Jalaukavacharana and Sira with respectively. Conclusion. Since therapy for Vatarakta and its complication has limitation in other patients, Ayurvedic management of the chronic Vatarakta can be effective to therapy. On understanding proper Nidan, Lakshan, and Samprapti of Vatarakta, one can very well keep it under the heading of Vatvadi and treat successfully with the Panchakarma treatment. With a proper understanding of dosha, dusha, and Vadi avastha, we can manage the Vatarakta. The medicine given to the patient mainly fall under the categories of Tikta Kasharis, Laghu Rakshagna, Ushna Virya, and other Kapvatahara or the Pittatva mainly used for Dipan Pachan and Rakta Prasad with a Shula and Shota Karma. The patient had a 80% relief and laboratory finding of the serum uric acid had lowered significantly. Therefore, the given Ayurvedic treatment was successfully in curing the disease without landing into further complication. References are given like the Charak Saita and many other references are collected for this paper presentation. Thank you.
Thank you, Doctor. And one more poster presentation is pending. Next, we go to the poster presentation.
Good evening, everyone. Myself, Dr. Neha Varam, PG student from the Department of Chikitsa, JM Patur, Akola. I am presenting the topic of poster presentation is prevention of Madhumeha type 2 diabetes through Ayurveda. Introduction. Charak Samhita and Sushruta Samhita define Madhumeha as a type of Pratyaj Prameha characterized by frequent passing of estrogen and sweet taste urine. The global prevalence of diabetes has nearly doubled since 1980, rising from 4.7% to 8.5% in the adult population. Diabetes is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputation. And to explore the different aspects of diet and lifestyle mentioned in the Ayurvedic literature for the manifestation as well as the prevention of Madhumeha. Materials and method. Charak Sahita, Sushruta Sahita, and other relevant materials available in the internet were thoroughly screened for the present well. निदान of मधुमेह. जास्ती सुखम स्वप्न सुखम दधिनी ग्राम्य उदकनुप्रसाकायांसच नवान्न पानम गूढवैकृतच प्रमेय हेतु कपकृतच संप्राप्ति of मधुमेह निदान सेवन जाठराग्नि मांद्य आमरूप श्लेष्म उत्पत्ति पृथ्व्याग्नि आणि जलाग्नि दृष्टी ओव्हर प्रोडक्शन ऑफ विकृत कप मेघधात्वाग्नि मांद्य अतिद्रवत्व दोषास and धातूस व्यान and अपान वायू दृष्टी द्रवीभूत धातूस and ojas excreted in urine and मधुमेह is happened. Diabetes of complication are heart attack, kidney failure, diabetic food like cataract, etc. Discussion. Ayurveda has identified two types of prameha, samaj prameha, sahas prameha, and apatya nimittach prameha. In all types of prameha, there is an involvement of shleshma as a dosha and meda as a dosha with the increase of kleda in the body. So one should apply the proper regimen to balance the kleda, considering the factor which will not aggravate the rukshatva in the body, as madhumeha itself is a type of pratish prameha. Prevention of madhumeha. Just we can take the in diet swastik chali, yoga, dudumukta, kulatha, chana, patasi tela, vayam, and pranayama. Conclusion. The prime objective of Ayurveda is to protect the health of healthy individual. So the prevention of madhumeha can be achieved by strictly adaptation of wholesome diet, exercise, and yoga. Reference Charak Sahita, Sushrut Sahita, and Sushrut Chikitsa. Thank you.
Thank you, Doctor. Thank you for the intellectual and well-explained presentation. Thank you so much for the better and post presentation, Doctor. Next, we go to the another presentation. I would like to invite Dr. Snehal Anil Jaitha for the poster presentation. Next, I would like to invite Dr. Snehal Anil for the poster presentation.
Hello everyone, myself Snehal Zaibek. I'm doing PG in Kamarnritya from Sumatibai Shah Ayurvedic Mahavidyalaya, Hadapsar, Pune. Here I am presenting poster on the topic of Swarna Prashan. It is said that golden drops for growing immunity because it is essential for growth and development of growing child, and it also boosts immunity. It is mentioned in Kashyap Samhita Sutrasthan, chapter number 1, Lehadhyay. It is made from gold, honey, Aushadhi Siddha Gruta, and it is given oral drops to children from age group of 0 to 16 years. It is considered to be given on every Pushya Nakshatra day. The rate of child mortality and morbidity reflects the standard of nation's health status. And today's scenario, in spite of the latest health technologies, the disease occurring rate in preterm is still high. Hence, it is pretty worth to protect the health of children, and it is well known fact that sufficient immunity could prevent diseases to occur. Therefore, to improve the immunity and other benefits to children, Swarnaprashan is essential, beneficial, and still practiced in India. Swarnaprashan is one of the 16th sanskaras described in Kashyap Samhita, Sutrasthan Lehadhyay. It is a mixture of gold bhasma and herbs, cow ghee, and honey. Swarnaprashan is one of the most Ayurvedic regenerative preparations placed under Rasayana, which is considered as the ultimate topic preparation in Ayurveda. It was previously given in the form of a pure rubbed gold. It enhances longevity, immunity, boosts positive physical, mental health by decreasing the disease processes. According to Kashyap Samhita, it is said that Suvarna Prashanam hi etat meta agni balavardhanam. आयुष्यं मंगलम पुण्यम वृषम वर्णम ग्रहापहम नासात् परम मेधावी व्याधिर्विघ्न च दृश्यते षड्भिर्नासे श्रुतधर सुवर्ण प्राशनात् भवेत्. That means Viddha-agnikarma improves intellect, promotes digestion and metabolism, promotes immunity and physical strength. Ayushyam mangalam punyam risham varnyam grahapaham. It means promotes longevity, improves complexion, fertility, protection against infectious diseases. Then it is said that Masat Param Medhavi, it means in 1 month, daily use of Swarna Prashan can improve child's cognitive function, intellectual ability, and Shadbir Mase Shrutadhara. Excellent memory retention achieved by using it for 6 months daily. Thank you.
Thank you, Doctor. Thank you for the clarity and impressive presentation. Next, we go to the final presentation. I would like to invite Dr. Ulka Ashok Sangalage for the poster presentation.
Respected chairperson, judges, and colleagues, I am presenting the topic Pranavas Dushti as a cause of respiratory distress in children. Respiratory distress is one of the most common emergencies in pediatric practice. In modern medicine, it presents as a tachypnea, chest retractions, wheezing, and hypoxia. In Ayurveda, respiration is governed by Pranavas which maintains the pranavayu, oxygenation, and life-sustaining functions. When this Srotas undergoes the Dushti, it leads to the breathing difficulty, resembling the modern respiratory distress. Thus, this topic attempts to bridge classical Ayurvedic concepts with the modern pediatric understanding. The aim of this presentation is to understand the respiratory distress in children through the Ayurvedic concept of Pranavasrotas Drishti and to explain its etiopathogenesis and management in Karmargupta. So, now we are going to see the concept of Pranavasrotas. According to the Ayurveda, the Mulasthana of Pranavasrotas are Rudra and Mahasrotas. This clearly correlates with the heart and lungs and respiratory passages, which it has the functions like regulation of respiration, maintenance of pranavayu, oxygenation, and vitality. Therefore, Pranavasrotas is responsible for the maintaining normal breathing and life force. Any obstruction or dysfunction here directly affects the respiration. Now we are going to see the hetu of the Pranavasrotas. The important causes which includes the Pranavasrotas Dushti are Shita Guru Abhishandi Ahar, Vegadharam, exposure to dust, smoke, cold air, recurrent respiratory infections, Mandagni leading to the arm formation, Kapha-vata Prakop in children due to immature immunity, means alphabala, Kapha predominance in the childhood. They are more prone to the Pranavasrotas Dushti. Now we can going to see the Samprakti. Now coming to the most important part, which has the Samprakti. Hetu 7, which leads to the Kapha-vata Prakop, then which leads to the Kapha-vata Prakop and also arm formation due to the weak Agni, which causes the Strotorod in Pranavasrotas. So, irritation of the Pranavali, which causes the respiratory distress in the children. Kapha causes the obstruction. Vata causes irregular and labored breathing. Anu further blocks the channels. This leads to the difficulty in airflow. Thus, the respiratory distress is mainly due to the kapha iron of pranavayu, strotorodha. This beautifully correlates with the airway inflammation, mucus plugging, and bronchospasm in modern science. So, now we are going to see the clinical features. That means the Lakshana, the clinical feature described in Ayurveda, which correlates with the modern concepts, includes Shwasa, means dyspnea, Kasa, which correlates with the Kapha, Shwasa Krushata, means difficulty in the breathing, Gurgura Shabda, which relates with the wheezing, Urashula, which correlates with the chest discomfort. Ayasana Shasa means mouth breathing. Avila Varna, it correlates with like sinuses-like features. This corresponds to the modern science. Ayurvedic correlation means tachypnea, which includes the pranavayu vagunya. Wheezing means kapha avarana. Chest retractions means srotorod. And hypoxia, which causes the pranava srotas dushti. This shows a strong conceptual correlation of lakshana in between the Ayurveda and modern science. So now we are going to see the management as per the Ayurvedic approach. So Ayurvedic approach management focuses on the removing kapha obstruction, correcting the agni, clearing the strotas, and restoring the pranavayu. So we use mostly drugs like Vasa, Kantakari, Yashtimadhu, Pippali, Sitopaladi Churna. So Vasa, which act as a bronchodilator, expectorant, anti-inflammatory, immune modulator, Pippali means used for the Deepan patching. So these drugs are useful in the Ayurvedic management of respiratory distress. Those should be according to the age and bala of the child. If there are any recurrent cases, Rasayan therapy is mostly beneficial. So we know always there is a prevention is better than cure. So as per for preventive aspect, prevention is very important in the children, which includes the strengthening of the bala, means to increase the immunity, proper ahar and vihar, avoidance of the cold exposure and allergens. Rasayan in recurrent respiratory illness since childhood is kapha dominant stage. Preventive care plays always a key role. So, from this presentation, I am going to conclude that Pranavastrotas Dushti plays a pivotal role in the respiratory distress in the children. Kapha-vata imbalance, armor formation, and srotorod are the major mechanisms involved in the respiratory distress and Pranavastrotas Dushti. Understanding this concept helps us correlate the ancient knowledge with modern respiratory pathology, provide holistic Ayurvedic management, focus on the both treatment and prevention. Thus, the Ayurveda offers a comprehensive and preventive approach in pediatric respiratory disorders. So, by understanding the prana, we understand the life, and by protecting the pranavastrotas, we protect the breath of the child. Thank you so much.
Thank you, Doctor. Thank you for the insightful presentation. As we come to the end of today's sessions of the Swasthyabodha National Seminar presentation, I would like to take a moment to reflect on the remarkable academic journey we experienced today. It has truly been an enriching and inspiring session. All the presenters have performed exceptionally well. Each presentation reflected sincere effort through preparation and strong subject knowledge. We witnessed a wide range of highly relevant and contemporary topics that contributed meaningfully to academic discussion and professional growth. The clarity, confidence, and commitment demonstrated by every presenter today deserve sincere appreciation. Your dedication to research and academic excellence has elevated the quality of this seminar. We are proud of each one of you for utilizing this platform effectively. On behalf of the organizing committee, I would like to express our heartfelt gratitude to our respected panel members. Your careful evaluation, constructive observation, and valuable time has ensured the academic integrity and success of this program. Your continued support and guidance are deeply appreciated. I would also like to extend our sincere thanks to all the participants who presented today. Your enthusiasm and willingness to share knowledge made today's session vibrant and meaningful. Our gratitude also goes to everyone who stood behind this initiative, those who supported us in organizing, coordinating, verifying, guiding, and encouraging participants. The success of this seminar is a collective achievement. And finally, I thank every individual who contributed directly or indirectly to making today's program a grand success. With this, we officially conclude today's session. Thank you all once again for your active participation and cooperation. We look forward to your continued association in the upcoming sessions. Thank you all. Thank you so much. And good night.